today. Do you want to start, Heather?
All right, we're ready to go, Senator.
Good morning, everyone. So I want to welcome you this morning. We have a public hearing. We have a very hefty agenda and we have a lot of speakers. So I'm going to ask if my co-chair would like to say anything before we start. Representative Abercrombie.
Good morning, everyone, and welcome. And to our members, we have some interpreters today for non-English speaking members. So we're going to be giving everybody a little bit more time. So if we could all be a little bit more patient today, that would be appreciative. Thank you, Madam.
Representative Case.
I'm good. Let's get going.
Is my ranking senator here?
I'll be a little late as usual.
That's fine. So as Kathy said, we have this public hearing. We have over 150 speakers today, and we're going to keep within the 3 minutes, except for the agencies. The agencies will have the first hour, and then we'll alternate between our guests from the public and the agencies. We have several interpreters helping those who don't speak English, and Heather's been really great about trying to make that flow and make sure everybody has access to saying something, but we're going to hold them to, with the interpreter, 6 minutes. I'm asking my colleagues, because we have so many people want to speak, if we cannot, if we cannot expand it, asking questions, multiple questions, I think it's a good idea if we go around, if there's a lot of questions, we ask one question with a follow-up. And then if you have additional questions, we'll come back around a second time. I'm asking you to refrain from too much commentary so we can get the speakers in. And if we get that done, we should get out of here by midnight. All right? Okay. Well, thank you very much. So, and I've got plenty of coffee here, fresh pot on the stove. We're all set. I'm going to call on number one is Commissioner Deidre Gifford. Good morning, Commissioner. Thank you for being here.
Good morning, Senator Moore, Representative Abercrombie, and members of the Human Services Committee. Thank you very much for the opportunity this morning to testify before you. I'm Deidre Gifford, and I'm the Commissioner of the Department of Social Services. I'm very happy to be here to offer remarks on several of the bills on today's agenda. You do have the department's written testimony, which is more extensive than the brief remarks that I will offer. So I'll just give a brief summary of each, and then the team from DSS and myself will be here to answer any of your questions. I see a number of team members: John Dillon from Child Support, Kay McAvoy from Health Services, Peter Hadler from our community programs, Director of Finance, Nick Vendetto, Dan Giacomi from SNAP, and there may be others that aren't appearing on my screen at the moment. So shall I dive right in, Senator?
Yes, please.
Okay, thank you. With respect to SB 956, an act providing medical assistance to certain individuals regardless of their immigration status. This bill seeks to extend Medicaid and the Children's Health Insurance Program coverage to individuals who do not meet the required federal immigration status to receive such benefits under the federal program. For these individuals, CMS will provide federal Medicaid matching funds only for the treatment of emergency medical conditions under the current program, as long as the person meets other eligibility requirements, for example, residency and income. The Children's Health Insurance Program does not pay for medical services for any child that does not have a qualifying immigration status. To be clear, under this proposal, the state would not be able to claim federal match for these adults and children. For Husky A, parents and children, that federal match is 50%. For Husky B, that's 65%. And for the adult expansion population, Husky D, that's 90% federal match, which we would be unable to claim. This means that any additional program costs and administrative costs would be borne entirely by the state. We estimate those costs to be approximately $195 million per year. Absent additional funding that is not currently in the proposed budget, the department is unable to support this bill. I would note that Governor Lamont has proposed HB 6447, an act creating the Covered Connecticut program to expand access to affordable health care. If passed, that bill would sustainably fund a $50 million per year program to reduce Connecticut's uninsured rate, including through focused Medicaid expansions like this proposal. SB 957, an act expanding access to in-home counseling. This act proposes to require the Department of Social Services to add rates to our home health agency fee schedule for behavioral health counseling provided by a licensed social worker. Although DSS definitely supports improving access to behavioral health services in home and community-based settings, we are unable to support this bill because it is inconsistent with current federal Medicaid law, would increase costs, and we believe is unnecessary given the coverage that's already provided through Husky. It attempts to add rates that are not allowed, as I said, under federal law to the home health agency fee schedule. Right now, that fee schedule is limited to nursing services, home health aid services, medical supplies, physical and occupational therapy, and speech pathology and audiology. However, under the state plan, we already cover in-home mental health counseling provided by licensed behavioral health clinicians that are enrolled in Medicaid as either an individual or a group practice. That includes psychologists, clinical social workers, marital and family therapists, professional counselors, and alcohol and drug counselors that are already covered for in-home services in the Medicaid program. These services would also be available in the Connecticut Home Care Program for elders and are provided by licensed social workers and professional counselors. Therefore, the department respectfully does not support this bill. SB 979, an act expanding access to medical specialists for Medicaid beneficiaries in southeastern Connecticut. This bill would require DSS to develop a plan to increase access to medical specialists in the southeastern part of the state by expanding telehealth services. Again, DSS believes this bill is unnecessary because the aims of the bill are already being satisfied. We have seen the number of both primary and specialty providers participating in Husky continue to increase over time, although we, again, support making sure that there's adequate access to specialists and primary care providers for all of our members across the state. As many of you know, over the course of the public health emergency, DSS has implemented a broad portfolio of telehealth coverage in Husky Health across many services, including specialists. We are now paying for telehealth services at parity with in-person visits to enable the use of telehealth, and this practice has been widely adopted already by primary care and specialists. Over 18,000 providers have rendered one or more telehealth services to almost 400,000 Husky members between March of last year and January of this year. So rather than codify language specific to one geographic area of the state, we recommend continuing a statewide approach to implementing telehealth services to focus on fostering access for all Medicaid beneficiaries throughout Connecticut. SB 980 is an act eliminating income and asset limits for the MedConnect program for persons with disabilities. This bill eliminates the income and asset limits for eligibility to qualify for the MedConnect program for persons with disabilities. The current income limit is up to $75,000 per year, which would be eliminated. The current asset limit is $10,000 for an individual or $15,000 for a couple, which would also be eliminated. Under the current program, a home, certain retirement accounts, and accounts maintained for increasing the individual's employability are not considered assets for calculation. So those are already not counted for the eligibility process. And they are already substantially higher than the limits for other types of Husky C coverage, which is for adults with disabilities. In the MedConnect program currently, individuals above 200% of the federal poverty level pay a premium to receive coverage. The monthly premium amounts are based on 10% of the amount of income over 200% of the FPL. As of February 2021, there are approximately 4,000 MedConnect enrollees, and about 760 of them have a premium obligation. Because we don't have the income and asset information for individuals who currently don't qualify, it's difficult for us to estimate the fiscal impact of this change. And although we support the bill's intent, we do not support the bill at this time. SB 981, an act concerning payment parity for health and human service providers. This bill requires DSS, in collaboration with DEMIS and Housing, to study whether state contracted providers of human services receive disparate payment rates. The language defines human services to include, but not be limited to, physical and behavioral health and housing and shelter services provided to homeless persons. As a point of information, the department pays for Medicaid and CHIP services already using a uniform statewide rate with very limited exceptions. There are not differentials in Medicaid rates on a regional basis. And as you all are aware, we do not provide direct housing or shelter services. We are available to discuss the committee's intention with this bill in order to determine the appropriate role for the department in such a study. HB 6560 is an act concerning timely payments to personal care attendants. This bill mandates that a fiscal intermediary provide timely communication to a personal care attendant about payment discrepancies, payment confirmation, or a change in consumer status that might affect timely payment. And in this case, the consumer is the employer. The bill would fine the fiscal intermediary $25 a day for each day timely wage payment has been delayed. To be clear, the department fully supports the legislature's desire to ensure that our personal care attendants are paid timely and accurately. And we have been engaged with the PCA Workforce Council to make improvements in the payment methods. DSS and our current fiscal intermediary, Allied, have been changing our procedures and payment and have put several procedures in place to fulfill the aims of this bill. We've been continuing to do education with our PCA Workforce Council and SEIU on the requirements for completion and submission of timesheets by PCAs. We've changed the billing cycle to biweekly to reduce the number of payment cycles, and implemented a number of procedures that ensure accurate timesheet submission and timely payment. We have also undergone a comprehensive review of all of our Medicaid department policies to make sure that we could modify any practice that was not facilitating or was compromising the integrity of the payment process, while maintaining the integrity of this program and ensuring federal match, which is also very important that we do. And these improvements have resulted in a measurable change. We've had a 50% reduction in pay delays, I'm glad to say, due to timesheet errors. And lastly, as many of you know, because we work with you on it, we are implementing an electronic visit verification system for all of our personal care attendants that will ultimately replace the need for paper timesheets, and that has been one of the challenges in order to reduce errors. And this implementation is being phased in and is expected to be completed by mid-2021. As a result of this work, the department does oppose the imposition of automatic penalties that would be implemented without consideration of our obligations to ensure that the timesheets are accurate and timely. On HB 6561, an act concerning Medicaid reimbursement for marital and family therapists permitted to practice without licenses during a public health emergency. This bill would require Medicaid to cover services provided by unlicensed marital and family therapy associates while they are authorized under a governor's executive order to practice without a license. Just to be clear, currently Medicaid does cover services provided at a licensed behavioral health clinic, including services provided by qualified non-licensed clinical staff under appropriate supervision from applicable licensed practitioners. This current coverage is provided at freestanding behavioral health clinics, outpatient behavioral health clinics, and federally qualified health centers. We cover outpatient behavioral services outside of clinics only when they are personally provided by clinicians who are licensed to practice independently. And this policy helps ensure quality and appropriate oversight. This bill specifically cites the governor's executive order 7V for Victor, which has temporarily modified some of the statutory requirements to practice as an MFT. Because that order will expire at the conclusion of the declared emergency, we have some concern that reference to that specific executive order will lead to confusion and statutory conflict after the public health emergency has expired. Therefore, because of the existing provisions and that potential confusion, the department opposes this bill as written. HB 6562, an act concerning child support enforcement. This would establish a task force to study technological and other initiatives that could be implemented to maximize the collection of child support. I'm happy to tell the members of the committee that the department believes this bill is not necessary because we have been working on development and implementation of a new computer system for our child support enforcement program that will satisfy the aims of this bill. We have selected a contractor to do so, and negotiations should be underway soon. This process has been in planning for some time. It was somewhat slowed by the pandemic, but we do expect a full system replacement and federal certification of the system over the coming years. HB 6563, an act eliminating administrative barriers to a community's participation in federal emergency food assistance programs, or TFAP. This bill proposes the department, to the extent permitted by federal law, not require community food providers located within communities with schools that provide free meals to collect, submit, or retain forms requiring persons receiving food assistance in order to receive the USDA's emergency food assistance program. The department contracts with Connecticut Food Bank and Food Share to distribute the TFAP foods currently to eligible pantries, shelters, and soup kitchens. As a point of information, federal law does require the department to establish income-based and residency criteria for TFAP recipients to ensure that only households in need of the assistance actually receive the commodities. It also requires that each distribution site collect and retain records on households that have received TFAP food, including but not limited to their name and address, the number of persons in the household, and the basis for determining the household's eligibility. So those are two federal requirements with which we are obligated to comply. However, over the course of the pandemic, because of the needs and because of the needs for social distancing, et cetera, while fully meeting our federal obligations, we have instituted a process and forms that minimize the amount of paperwork that providers are required to collect, essentially only requiring a verbal attestation that the pantry then documents and retains in order to meet the federal requirements. So we'd be happy to provide you the details with that, but the department believes that the requests in this bill have been substantially met through our current modifications. That concludes my testimony, and we are available to answer any questions that you may have. Thank you very much.
Thank you, Commissioner. I'm looking for questions. Representative Mastro Francesco.
Thank you,
Good
Madam
morning.
Chair. Good morning. How are you today?
Good, thank you.
Thank you, Commissioner. As always, I always enjoy your testimony. You're so thorough, and I say that every time. So thank you very much. Just two quick questions, because I'm sure others have questions and I don't want to hold everybody up, but you had mentioned in your testimony the cost on Senate Bill 956 would be a cost to the state of 195 million per year. Right, so compounded over years, obviously that would have to fall through other years going forward. But you also mentioned in the governor's budget 6447 that there was an included in there $50 million. Is that $50 million specific to covering undocumented people in Connecticut for health insurance? Would you know?
It would cover certain targeted Medicaid expansions, but the details of that have not been fully articulated, but there is this sustainable $50 million per year fund that could fund targeted Medicaid expansions, such as some of those proposed in this bill.
Okay, thank you. And then on 6460, I believe it is, yes, House Bill 6460, the timely payments to personal care attendants. You had mentioned in your testimony that there is policies in place for training. Can you give me an example of what type of training they are offering to the personal care attendants
I'd be
to
happy to.
make sure records are reported correctly? Thank you. Through you, Madam Chair.
Yes, and with respect to the thoroughness of the testimony, I'd like to say thank you to the team at DSS. They get full credit for that, but I appreciate the comment. And I would turn to Kate McAvoy, our Director of Health Services, to respond to your question on the PCA training.
Thank you so much, Commissioner and Representative Master Francesco. Kate McAvoy, Director of Health Services. So as you are no doubt aware, personal care assistants in Connecticut have collectively bargained a series of rights associated with their wages and their fringe. Also in that package is a set of training requirements that are conducted jointly by the PCA Workforce Council, which is convened by the Office of Policy Management, and the SAEIU Training and Education Fund, or TUF Fund. So there's an established curriculum to orient personal care assistants to their responsibilities that includes a very specific and detailed overview of the submission of timesheets. There are graphics, illustrative examples of how the timesheet must be completed. There's a set of guidelines in terms of submission. For instance, if you're submitting by fax, there's tips and tricks. This has also been translated, like I said, into pictures, so it can be useful to people with different learning styles. And it's also translated into Spanish. And this is reinforced over time. We also have a set of procedures that is used on a weekly basis. We have a weekly payroll for PCAs used by our fiscal intermediary, Allied. So there are specific points during the week where Allied will issue confirmation of receipt of the timesheet, prompt employers, so Medicaid members who are self-directing their services, we refer to as employers of personal care assistants, prompt them on the need, if any, for corrections to the timesheet and automated processes that go with that. But again, there's an extensive written and training process for helping people understand the payroll process.
Thank you so much for that answer. I was just curious, and that you broke up a little bit and I couldn't hear you, might have mentioned it. Is the training a document that is just out there on the website where they just read it and kind of figure it out? Or is there a webinar or a video or one-on-one or a group training that they had to take for a couple of hours to ensure that the records are filled out correctly? Through you, Madam Chair.
Representative, thank you so much for that question. It is all of those things. We have materials that are posted on the PCA Workforce Council website, but also it is conducted now virtually through a webinar format. And there are, as I mentioned, graphics that show examples of complete and correct timesheets. So really try to take an approach with lots of different modes of reinforcing this information. This information is also distributed to SEIU, which represents the personal care assistants, and they're our partners in helping to broadcast this information.
Thank you. And is there, through you, Madam Chair, is there, how long is that webinar or the training? Is it so many hours? Would you know?
Representative, it's part of a larger training for personal care assistants. So I can't personally speak to the extent, the amount of time that's required, but it is embedded in the overall training for personal care assistants.
Okay. Thank you so much for your answers. Thank you, Commissioner, as always. And Madam Chair, I have no further questions. Thank you very much.
Thank you. Representative Hughes.
Thank you, Madam Chair, and thank you, Commissioner, for, again, your thorough testimony. I want to go to SB 956. As the commissioner that has, had to deal with this public health emergency, is it your position that if we could expand Medicaid, basically, Husky, to all income eligible, regardless of status, that it would be an important good policy and savings from a public health standpoint in the middle of this, public health emergency, but also to reduce catastrophic health costs at those hospitals and after compounded health conditions are left untreated. Because currently we know that about 52% of this community that we would be extending eligibility to currently is uninsured. And we know what that cost is when we had that before from the entire Connecticut community before the ACA, compared to the rest of the Connecticut community, which is 5.9%. Could you speak to the health policy of covering all eligible?
Well, certainly reducing uninsured is a laudable goal, which is why the governor has introduced the bill that he did. We have been, with respect, Representative, to the public health emergency, I'm happy to say that we have been able to extend a number of our services without regard to coverage. So the community testing program, which has been supported through federal and state funds, as well as now the vaccination program, are provided to all individuals, and we've been pleased to be able to do that. I recognize the challenge that you're discussing, which is that individuals who are uninsured often are unable to have their primary care and preventive services covered, and that can result in increased healthcare costs down the road, as well as, more importantly, poorer health outcomes. So I appreciate the point that you're making.
And finally, if we, you said currently there's no federal match for expanding Husky A, B, and D. But if we position Connecticut to be ready and start covering those, and that federal match changed under this administration with the advocacy of our congressional delegation, would that be something the department would support?
Well, certainly the department follows the eligibility requirements that are set by, the federal government. Mm-hmm. So as we did with the expansion under the Affordable Care Act, Connecticut was way out in front on that. And so if federal rules were to change, of course, the department would expand our program in alignment with that.
Yeah, and I appreciate that the department has expanded testing and vaccination program, but we are talking about like compounded health conditions that, again, the state does pay for when they end up in the hospital, because the hospitals must cover, regardless of status, emergency, treatment. But that's way costlier than compounded preventative health conditions that we're not treating because people are uninsured, and there's just extreme barriers to getting basic healthcare coverage. And again, I'd just like to underscore that in a pandemic, but beyond, it is good public policy to ensure that everyone has access to good, affordable healthcare coverage, especially preventative care for their families, but also to keep from transmitting to the community. So I just wanted to underscore that we have not done a good economic analysis of whether we're already paying 195 million per year in emergency and, you know, health, uncompensated hospital treatment and uncompensated services that the state does pay for, right? We have not done that economic analysis about how much that is, right?
You are correct. Our
Okay.
testimony does not include a cost avoided analysis, Representative.
Okay, great. Okay, that's my question. Thank you.
You're welcome.
Was that really a question, Representative Hughes?
Oh, Senator, you know me a little too well.
Okay, so I don't see any other, yes, Representative Master Francesco, I see your hand up.
I'm sorry. Thank you, Madam Chair. Commissioner, I just had one more quick question just to understand. Talking about the $195 million cost to the state on the first bill, Senate Bill 956. And I don't even know if this is a fair question and you would even have the answer, but can you tell me the cost per year the state pays for citizens under the same program that are, you know, documented, just American citizens? Would you know that answer by any chance?
And I believe it's in our full testimony. I'm just pulling that up now. And I believe that we put the per member per month cost of those programs into the full testimony. I don't see it. Nick, do you have those PMPM average costs for the programs for the representative at the tip of your fingers?
Yes, I do. Hi, thank you. Nick Venditto, Chief Financial Officer, DSS. In order to develop the estimate, what we did is we based on the different programs, Husky A, Husky B, and Husky D. We used our current per member per month cost that we see in our current population, which for Husky A, both the parents and children, it's a blended PMPM, was approximately $305 per member per month. For Husky B, the CHIP program, children coverage is approximately $169 per member per month. And for Husky D, our low-income adult population was approximately $593 per member per month. So that was the basis for the cost estimate in those three programs. And I think the specific estimates regarding the estimated population for each one of those programs is listed in the testimony. So we took those estimated populations, applied them to those per member per month costs that I gave you in order to come up with a rough annual estimate. And I think we also noted that, you know, those costs are indicative of the current population, which may not be exactly a one-to-one on this group. Without more data, it'd be tough to confirm that, but that was the basis of the estimate.
Thank you. And through you, Madam Chair, what is the total annual cost to the state on that? You gave it to me broken down per month per resident. What is the total annual cost? Because in this bill 956, we're saying the total cost per year is 195 million to cover undocumented people for healthcare. What is the total cost of the others?
Are you asking the total cost of take care of the Husky program?
Yes, the same coverage that we are doing for documented for residents in this state, the same a comparison side by side. What are we paying exactly per year for that? And now we're saying for undocumented, it will cost us 195 million. I'm just trying to figure out what is the difference. Thank you.
So let me just roughly gross costs for the entire Medicaid program, which would also include the Husky C population, is in the 6.6 billion range. If you give me a second, I can pull the cost only for the A, B, and D populations. I just don't have it readily available. But roughly 6.6 billion across the entire Medicaid program, gross costs. But again, that includes the Husky C group, which wasn't costed out here for other reasons. But I can get you the breakdown of what we spend on A specifically, on B specifically, and D.
Thank you. And I don't want to hold anybody up. If you can send that to me, that information would be very helpful. I appreciate it.
Will do.
That's all I had, Madam Chair. Thank you so much.
You're welcome. Commissioner Gifford, that number that we're talking, is that the state's contribution or is that state and federal dollars that we're talking?
The 195 million, Senator?
Yes.
Right, there would be no federal contribution in this case because these individuals are not eligible for federal match. So that 195 million would be borne solely by the state. So that is the full cost, our estimated full cost of insuring that population.
Thank you. Are there any? Yes, Representative Case.
Thank you, Madam Chair. Just real quickly. So the number that Nick just put out there, the 6 billion or whatever, does that include the reimbursement or is that just the cost, the raw cost, and then we go after the reimbursement?
That would be the gross cost, and then we would be reimbursed the federal share, right?
So then we have money coming back from that 6 billion.
Yes, yes.
Okay, so it's not really a total 6 billion cost to the state of Connecticut.
No, but I was just trying to give a gross to gross comparison on the 195 million.
Right,
Nick,
and
what's the state share on that, Nick?
State share SFY 21 is estimated at roughly 36.5% with the enhanced FMAP. So roughly 63.5% is the federal share and 36.5% would be the state share. But that includes, again, the enhanced FMAP for this year.
okay, because I think that's what Representative Master Francesco was getting at, what the actual cost was to the state for that program, but the 6 billion is your gross, and then we have reimbursements. But with this bill, there is no reimbursement.
That's
Right.
Thank you, Madam Chair, and thank you,
You're welcome.
Commissioner and Nick.
Yeah, I was trying to get to that number also. Commissioner, I might not have made myself clear. That's what I was trying to get to.
Okay.
I see Representative Wood's hand up.
Great. Thank you, Madam Chair, and thank you, Commissioner. It's always a pleasure, and boy, you've done God's work this year with both the commissions you've been in charge of. A quick question related to Representative Hughes' good point about the preventative care under that 956 would cover. I mean, I understand the point about why it would be difficult to pass that. But the bigger picture is, do we know, in addition to the economic analysis under this, do we have the numbers on that? And no, the point is no, we don't. But I also wonder along that, how many people are getting services from organizations like AmeriCares who do serve the undocumented community quite well, at least down in southwestern Fairfield County. So I wonder how many of the undocumented are receiving appropriate preventative services through local nonprofits. It's probably more of just a question out there rather than a question that has an answer to it, but I think that should be part of the discussion too.
Yes, federally qualified health centers, and they do, as part of their core mission, receive funding from the Department of Health and Human Services to provide services to everyone, regardless of their immigration status. And we do know that some services are provided there. That wouldn't necessarily cover, all services, but that is part of the core mission of the federally qualified health centers.
Great. Thank you very much. Thank you, Madam Chair.
You're welcome. Commissioner, I don't see anyone else's hands up. Am I missing anyone?
Before we go, I want to make sure we've given you the number you're looking for. So Nick, can you give the committee the actual state share of that in dollars of that 6.6 billion for fiscal 21, the 36%? Just, you're on mute, Nick. You're still on mute, Nick.
Sorry, yeah, I'm just trying to pull that right now for you.
All right, we can send it, if you don't have it at your fingertips, we'll send it to the committee, Senator Moore, so you have that number.
Thank you. I want to thank you once again and your team for coming to us with that information. Have a great day.
You're welcome. Thank you. Same to you.
Next, I have Representative Jeff Luxembourg. Is he here? Followed by Representative Candelara. I don't see them. I'm going to move on to David, Representative Michelle. David Michelle, are you here? Followed by Kate Farrar.
Madam Chair, Vincent is in the waiting room. I'm not sure if he can't hear you, the minority leader.
I see him there, but I don't see any, his microphone is muted. Representative Candelara, are you there?
If he does come on, we will just yield the time to him.
Well, that's not what we decided. We decided to put them to the bottom to be able to move through this quickly. Kate Farrar? Tammy Exum. Perla Villequaz, and then followed by Jamie Myers McPhail.
Representative
Liliana-
Wood, you're not on mute. Representative Wood.
Liliana Lopez. Parisa Chamichi Goodwin. This hearing is today, isn't it?
Madam
It's
Chair, if I could
Laura.
interrupt, Heather, are these
Yes.
people in the waiting room? Are we having
No.
a technical problem
No,
or they're really not here?
I don't know if they're not hearing. Representative Candelara's in the panelist section, as is Parisa should be there, and I sent her a request to unmute, so she should be here, and then after her, so
I
she's
see-
number 13 and number 14. And the other folks that Senator Moore called are not here yet, so if they come, then
Okay.
we will add them.
I just want to make sure we weren't having a technical problem because
Yeah,
that's a
no.
lot of people.
It
Okay,
is a
sorry,
lot.
Madam Chair.
Representative Candelara. Good morning.
Good morning, Madam Chair. I guess just a point of inquiry before I speak. There was some discussion over one of my constituents being unable to register today. And I wasn't sure if that was finally resolved to allow her to be able to testify.
I don't know who that is. Heather, can you help us there?
Madam Chair, I could respond to that. As far as we were concerned, the policy that was put forward, that the time would not be allowed to be yielded is still active through you, Madam Chair.
Representative Candelara.
Okay, thank you for that. And then I guess what I will do is, with the indulgence of the committee, is just pull up her testimony and provide it on her behalf. And I just think, generally speaking, it is disappointing that she's not able to speak. She's probably one of the few individuals that are here today to testify on House Bill 6560. That her testimony was submitted. She never received a link and was never signed up. But these are the voices, the consumers that are the beneficiaries of our wonderful PCA program. And frankly, we have two bills that were raised, one in labor and one here, that focuses on the unions. And I am concerned that our patients who are receiving these services, their voices are really shut out of this process. Sam and Alex Bodie are constituents of mine. They have had employers of PCAs for a number of years. And one of their concerns, obviously, is that this bill erodes the employer-employee relationship that PCAs do have with their clients. And they're generally concerned about that position. Additionally, they had asked me to put a bill forth that sadly this committee didn't raise, but addressing the issue of the training for the PCAs. Right now, the way our statutes are written, it's a sweetheart deal for one union to provide for the training. I think there's, because of that, there is no real oversight or opportunity for the PCA Workforce Board to make sure that that training is robust for our PCAs. And I frankly think if that training had better oversight, we wouldn't have the issues that we're seeing here with individuals being paid. Because at times I think there is a lot of confusion over how those bills are submitted on the employee side as well, or the PCA side as well. And so it would be nice to be able to have that robust conversation going forward. And I thank you for your time.
Thank you, Representative. Any questions? Yes. Representative Mastro Francesco, your hand is up.
Thank you, Madam Chair. Thank you, Representative. Appreciate you coming in today and explaining the issues we're having with our personal care attendants. And it's unfortunate we couldn't hear from your constituent where this is really affecting. And I'm just wondering if you've had a conversation with them as to what type of support they are getting through the SEIU when they do have an issue with the payment processing part of it. Have they expressed any concerns to you about that process?
Well, as I think as the testimony will indicate, they don't get a lot of support on their side of the equation. So I think generally they do feel unsupported. But in their situation, they're very meticulous about submitting the payrolls and making sure those issues are addressed. And over the years, they've had very little problem with making sure that their employees get paid. And oftentimes when there are issues, it's really on the issue of the PCA properly submitting the paperwork. It's not on the employer side. And certainly that is something that needs to be looked at. But, you know, generally speaking, I think the PCA voices, you know, they're heard loud and clear, but what we don't hear from is our community of people who have disabilities and a need for the PCAs to be heard on that issue. And so they continue to struggle along and submit the paperwork. But they also feel that if we make the employer being the payroll company, essentially, that it disconnects that relationship from the PCAs and is only going to make their situation worse.
Thank you. I agree. I think proper training obviously is the key to the success of any program, and you know, just to make it easier for them. So I definitely believe that we need to focus on the training aspect to make sure that they are getting the proper training, whether it is for filling out the forms or even for any disputes or questions that they have. I think it's very much important that we certainly focus on that, and I hope we can certainly work on that and get this legislation moved forward. Thank you. Thank you, Madam Chair.
You're welcome. Thank you, Representative Candelara. I don't see any other questions for you. Oh, I do. Representative Abercrombie.
Thank you, Madam Chair. Good morning, Minority
Good
Leader.
morning.
So nice to see you before us. Just for a little bit of clarification, in our bill, we do not make the third-party vendor the employer. So just so you know, that was taken out of our bill because I agree with you. I don't believe that it's good policy. So just, you might not have had the opportunity to read our bill, but it's in our bill, we did not add that in there. I do agree with you that training is very, very important to this process. I think that we have a lot of issues with Allied, and we are really trying to address them. So if you want to give Representative Case, who is always in our screenings, your language, we would be more than happy to consider that in this bill. For the record, we did tell that to Representative Case and Senator Berthel because there was some communication on your bill. So I will apologize on behalf of myself and Senator Moore on that, but there was no disrespect intended with that language. So thank you for being here, and thank you for bringing that issue to our attention.
And I do appreciate that. And Representative Case did convey that information to me. I hadn't had a chance to read this bill. I did read the labor bill. And so I do apologize if it's a sort of a different version that is trying to appropriately address it. I had anticipated that my constituent would testify instead. So I sort of, as you know, you hurry up and run and try to figure this out. But I want to just put those points on the record, and I would be happy to make my constituent available to all of you if you want to have conversations offline. I think she has some really good input that might help the process. And thank you very much, Chairman.
You're welcome. And we did have a conversation, Representative Case and myself this morning. And, you know, I don't want to speak for my co-chair because her and I did not have the opportunity to have this conversation this morning. Like everyone that's on this Zoom, our day starts really early. So we do the best we can with communication. But for myself, I told Representative Case I would be more than happy with either just looking at the language or having a meeting. So with respect to you as our minority leader, I want to offer that to you also, sir. Thank you, Madam Chair.
Thank you. Anyone else? Representative Case.
Yeah, real quick. Thank you, Madam Chair. And Vinny, thank you for coming on. And thank you, Representative Abercrombie. You and I had to talk last night. We talked this morning. So we're trying to straighten this all out. But Vinny, it is a concern that we all get about the PCAs and the payments. And I think that's why this is in front of us now. And, you know, the training portion of it, it's very difficult. And tell me if this is part of your constituents issue too, is when the client is the person who's doing the payroll. It's difficult because the training and what the client knows and is able to do can change from situation to situation. Is that part of the issue that your constituent has?
Well, I think there's two issues. One is when the training is done, which is done through the union, the workforce board that we have established does not have input on what that training constitutes. And so I think it would be more helpful if there was some dialogue between the workforce group and the union doing the training, that there are certain minimum guidelines put forth. And then, you know, so I think that's sort of the overall issue that she would like to see addressed.
Okay, and we'll have some conversations. And once again, thank you yourself and Rep Abercrombie for being involved with this, and we'll try to get something you know, together. But thank you for coming forward. Thank you, Madam Chair.
You're welcome. Thank you, Representative Candelara.
There's somebody else up there.
Excuse me? It's not it's a panelist. It's not a representative.
Thank you.
All right, thank you, sir. So next, let's see. I think it's, well, you know, I'm going to go back through those names since there were so many people missing to make sure we've gotten everybody and there wasn't a glitch, okay? So I had Representative David Michelle, Representative Kate Farrar, Representative Exum, Perla.
Okay.
Good morning, Perla. How are you?
Fine.
You can, all right, you have 3 minutes, please.
Okay.
Representative Senator Moore, Perla, are you requesting to have a translator? Because I do believe we have a translator available to you. Would you like that?
I don't know.
Yo estoy aquí, Perla, para traducir, si quiere.
Ok. Ya puedo hablar, ¿verdad?
Sí, ya puede hablar. She's asking
Ok,
now, right?
So
Okay.
you have, excuse me, so you have a total of 6 minutes.
Ok, en total, usted
ok,
tiene 6 minutos para hablar.
ok. ¿Cuántos minutos?
6 minutos.
Ok. Estimados miembros del Comité de Servicios Humanos de Connecticut,
Esteemed members of the Human Services Committee of Connecticut,
me llamo Perla Villescas, soy madre y vivo en Hartford, Connecticut desde el año 2003 y soy indocumentada.
my name is Perla Villasquez, y I am an undocumented mother who's lived in the city of Hartford since 2003.
Estoy a favor de CB 956, una ley que proporciona asistencia médica a ciertos individuos sin importar el estado de migración.
I'm in support of SB number 956, which is a law that will provide certain medical assistance to certain individuals regardless of immigration status.
Ya hace 3 años que estoy con mi tráquea desviada y no me han podido hacer la endoscopía por no tener seguro médico. Es muy caro, son 7,000 para nomás empezar el proceso.
For the past 3 years, I've been suffering from a deviated trachea due to the lack of health insurance. I have not been able to do the endoscopy because it's very expensive. It's a process that costs around $7,000. Go ahead, Perla.
Si me dan medicinas o tratamientos o una operación, me cobrarán más. Lo que más me preocupa es que me vaya empeorando o que me pueda pasar la comida.
And if they were to give me medicine or treatment, or if I were to need an operation, that would be even more money.
Un día y que se me vaya la respiración. Por eso evito la comida dura para que no me pase. Ya perdí 20 libras por esto. Si hubiera husky, yo no hubiera esperado todo este tiempo.
And my biggest fear is that if I get worse, then one day I won't even be able to swallow food. I try not to eat things that are too hard to swallow because I'm afraid that I'm going to choke. And so I because of this, I take a lot of care in the food that I try to eat.
Me cambiaría mucho la situación. Es un estrés muy grande a la hora de comer. Estar pensando que si tengo hambre me puedo ahogar. No puedo comer en la calle. No disfruto porque me da miedo ahogarme.
It's very stressful because every time I eat, I think about what I'm about to swallow, and it's very traumatic for me. I can't enjoy food when I'm outside or in restaurants because I'm so scared that I'm going to choke and die.
Si me invitan a comer, digo que no. Es muy traumante. Yo no conozco a personas que tienen el problema de salud muy graves, como el cáncer, que están sufriendo más que yo y están pasando por lo mismo. El Estado tiene que darnos seguro médico. Gracias por tu tiempo. Mi nombre es Perla Villescas y tengo 3 hijos y tengo un niño con autismo. Y a mí eso me da mucho miedo.
And so whenever if someone invites me to eat out with them, I say no because I'm just afraid of the entire situation. And I know there's people out there, for example, who have cancer, who have it worse than me and who are suffering more than I am because of the lack of health insurance. And so for this reason, I need health insurance, and so does everyone else who are in my situation. I'm a mother, I have 3 children, one of them which has autism, and they also need health insurance. So with that, I cede my time. Thank you so much.
Thank you, Perla. Can I ask her a question? Would you ask her, does she access the federal qualified health centers for services?
Le quieren hacer una pregunta, Perla. Si
Sí.
usted ha ido a una clínica comunitaria.
Yo estoy yendo a San Francisco. Antier fui y me hacen muchas preguntas con el hecho de que no tengo seguro médico y si los doctores no me atienden, si yo no hago ¿cómo le diré? Un seguimiento como para pagar esos $7,000, los doctores no me pueden atender todavía. Ellos tienen que saber que me tienen que estar ayudando con un plan médico, pero por ahorita ellos no me pueden hacer la endoscopía, por lo mismo de que no tengo nadie que me cubra, no tengo seguro médico que me cubra.
So she says she goes to St. Francis, and that every single time she's asked for her health insurance when she goes there, and she can't advance in her care because she needs an endoscopy, and she can't get that covered in the current moment. So every time she goes to her doctor, they cannot help her, and she can't progress to the next stage of her treatment.
Well, thank you for your testimony.
Gracias por su testimonio.
Por nada. Eso es todo, ¿verdad?
Is that it?
Yes, thank you.
Sí, gracias.
¿Yo puedo salir de la reunión?
Yeah, sí puede salir. Yeah.
Ok, muchas gracias,
Very welcome. Thank you.
Thank you.
Next is Jamie Myers McPhail. Followed by Liliana Lopez. Are you here? Hi, Liliana.
Hi, how are you?
Good. You can give your testimony. Do you need an interpreter?
Yes, please.
Heather.
Yes, Rebecca, you're ready to interpret for her?
Gracias. Buenos días, ¿cómo está?
Thank you. Good morning.
Bien, me llamo Liliana López y vivo en New Haven.
My name is Liliana Lopez and I live in New Haven.
Yo no tengo seguro porque soy inmigrante.
I don't have health insurance because I'm an immigrant.
Estoy en favor de la propuesta SB 956, un seguro médico para indocumentados a bajo precio.
I'm in favor of the Senate Bill number 956, which will provide health insurance at a low cost to undocumented immigrants.
Yo lo estoy apoyando porque mi familia y yo hemos vivido las dificultades por no contar con un seguro médico.
I'm in support of this bill because me and my family have experienced many hardships for not having health insurance.
Hace algunos años, yo perdí un bebé por no contar con seguro médico.
A couple of years ago, I lost a baby because I did not have health insurance.
Alrededor de la semana 24, yo me puse muy mal y fui a la sala de urgencias.
When I was at 24 weeks, I got really sick and I went to the emergency room.
Lo primero que hicieron fue preguntarme si tenía seguro médico.
And the first thing they asked me was if I had health insurance.
Me hicieron esperar hasta el último.
And they made me wait until I was the last one in the waiting room.
Cuando por fin pasé, solo me hicieron preguntas y no me revisaron. Me dijeron que lo que yo sentía era normal.
And when I finally got in, all they did was ask me a couple of questions, and they didn't even take a look at me. They didn't do any physical exam, and they told me that what I felt was normal.
Ese mismo día volví a urgencias por la noche porque yo me sentía muy mal.
So that same day I went back to the emergency room because I was feeling very bad.
Tuvieron que practicarme un legrado porque el bebé ya había muerto dentro de mí.
And I had to get a curettage because my baby had already died inside of me.
En el hospital las enfermeras, la mayoría, fueron muy groseras. No me hacían caso.
And when I was in the hospital, the nurses were mostly rude to me. They ignored me when I asked them for help.
Cuando yo les pedía ayuda, simplemente me ignoraban. Si yo les pedía algo para el dolor, no me hacían caso.
And when I asked them for pain medication, they also ignored me.
Yo me acuerdo que cuando mi esposo intentó grabar y cuando se dieron cuenta, fueron con el security.
And so seeing this, my husband tried to record what was going on, and then that's when they realized and they called security.
Y lo amenazaron. Le dijeron que si no paraba de grabar y que si no borraba la grabación, lo iban a arrestar.
And so they started to threaten him. They told him if he didn't stop recording or if he didn't erase the recording, they're going to arrest him and they're going to stop giving me care.
Y que a mí me iban a dejar de dar la atención.
And that I wasn't going to be able to get my care there at the hospital anymore.
Mi esposo hizo caso. Él borró la grabación, paró de grabar y tuvo que salir porque le dijeron que si no lo hacía, ya no me iban a atender.
And so my husband listened to them, he erased the recording, and he had to leave because he was afraid he was going to be arrested.
Fue muy difícil, de verdad, fue muy doloroso.
And that for me was really, really difficult and very painful.
Después, mi hija hace unos años se puso muy mal.
A couple of years ago, my daughter also got sick.
Ella tenía una infección muy fuerte, estaba muy mal, tan mal que empezó a vomitar sangre.
And she had a really bad infection that it was so bad that she started to vomit blood.
Tenía diarrea, empezó incluso a convulsionar.
She had diarrhea and she also started to have convulsions.
La llevamos a la sala de urgencias, sabiendo que nos iba a costar mucho.
And so we took her to the emergency room despite knowing that it was going to cost us a lot of money.
Lo primero que hicieron fue preguntarnos si teníamos seguro.
And again, the first thing they always asked was, did we have health insurance?
Nos hicieron esperar mucho tiempo. Mi hija realmente se sentía mal, pero no le hacían caso.
And we waited a very long time, and although my daughter felt very sick, they did not listen.
Al fin entró, la tuvieron en una cama como por 16 horas.
And at the end of it all, she was stuck in a bed for 16 hours.
Nada más hicieron preguntas sobre el seguro médico y nos dijeron que como no teníamos seguro, les iba a costar mucho trabajo.
And the only thing that they had asked her was if she had any health insurance, and they said that because she did not, it would have been a lot of work for them.
La ingresaron en el hospital. Lo primero que nos dijeron fue que los análisis y estudios que ella necesitaba eran muy caros y que nosotros no teníamos seguro.
And specifically, when they finally admitted her to the hospital, they said that the tests that she was going to need were going to be very expensive.
Mi esposo dijo que no importaba, nosotros íbamos a ver cómo lo pagábamos. Aún así, no nos quisieron dar la atención.
And even to get the referral to the specialist, it would have been really hard because they didn't have health insurance. And so my husband said, that's okay, whatever it takes, we're going to try and get my daughter help, the care that she needs. But even then, they refused to provide her service.
Tampoco querían mandarnos con ningún especialista.
They didn't want to send us to any specialist.
En otra ocasión, mi esposo buscaba psicólogo para mí y para mi hijo.
And on another occasion, my husband tried to find psychologists for me and my son.
Psiquiatra también.
Con permiso, señora López, el tiempo se ha terminado. Favor de concluir su testimonio, por favor.
Sí, claro. Yo no pido que sea gratis. Yo solamente pido que por favor nos ayuden, que nos den un servicio médico a bajo costo para que nos puedan ayudar.
I'm not asking that you give us things for free. I'm just asking for something that is affordable, that is low cost, that could help me and my family.
Thank you, Liliana, and thank you to the interpreter. You know, no one, regardless of whether you have insurance or don't have insurance, deserves to be treated with anything other than respect and shown some dignity. So I apologize for that behavior, and it's not acceptable under any circumstances. So I apologize for the treatment that you received. Representative Hughes, you have your hand up?
Yes, Madam Chair, thank you so much. First, I want to say to Liliana, I am so sorry for the loss of your baby. And I am so sorry that our state treats any parent this way and any child that we turn away from basic care. And I hope that this committee has the determination to change that going forward. Thank you for your bravery and your testimony.
Thank you, Liliana. Are there any other questions or comments? There's not. Thank you for taking time today.
Gracias, Liliana. También, is it okay if I just translate quickly what Rep. Hughes said and what Senator Moore?
Yes. Yes.
Entonces le quieren pedir disculpas porque nadie merece pasar por lo que usted ha pasado, y también quiere pedirle disculpas por la pérdida de su bebé y que lamentan mucho que el Estado pueda permitir que alguien como usted no reciba la atención médica que necesita. Gracias.
Gracias a ustedes por la oportunidad.
Thank you for
Have a
the
good
opportunity.
day.
Que tenga un buen día.
Thank you.
Gracias igualmente.
Next is Parisa Karmati Goodwin.
Thank you, Senator Moore. Good morning,
Do
Senator
you
Moore.
want to correct me for how I pronounced your name?
Sure. My name is Parisa Charmchi Goodwin. You made it a little fancier, which I kind of liked. So good morning, Senator, Representative Abercrombie, Senator Berthel, Representative Case, and all members of the Human Services Committee. Thank you for the opportunity to testify this morning. I'm testifying on behalf of the Connecticut Oral Health Initiative in my role as Executive Director. We are an oral health advocacy nonprofit with the mission of increasing access to quality, affordable oral health services for all Connecticut residents. So I'm here before you to testify in support of Senate Bill 956, opening Husky to income eligible residents regardless of their immigration status would make Connecticut a safer and healthier state, we believe. In this horrible pandemic, we saw that our neighbors' health also impacts our own. And I do want to just mention what Representative Hughes said earlier about the cost of uncompensated care, I think is exactly right on. And we know that for oral health care, since it is such a great upstream service and preventative health service, really important for lowering other risks such as preeclampsia and other adverse maternal health outcomes. It actually lowers your risk of heart disease and risk of stroke if you have regular preventative oral health care. It also helps keep your A1C levels down, really important for diabetes management. So there's a number of things where if you're getting preventative oral health services regularly, your overall health will be better, and also the cost of your general health services will be lower as well. So not having oral health care is the main reason, not having that insurance is the main reason that people don't get preventative dental care. And we have seen cases, unfortunately, where something that starts as simple as a cavity can turn into an infection that travels to the heart or travels to the brain. And then people are at the hospital, at times getting brain surgeries that they may or may not survive from. And so sometimes the hospital and then the state eats those costs. And there's also a human tragedy for families that are completely unavoidable by things that are preventative, routine, and frankly cheap. Cleanings are not that expensive when they're insured, and same as a cavity filling is not that expensive, certainly less so than a hospital stay or surgery. So we believe that it's important for health, and it's also something that is financially reasonable to make sure that people are getting those preventive services. And for that, we believe that all income eligible immigrants should have access to Husky. It provides comprehensive care without copays. It's a really wonderful service and program we have in the state. And I think it is fair and sensible to have undocumented immigrants, many of them taxpayers themselves, enrolled in care. So I do have some more details and some statistics in my written testimony that is submitted. And I also did want to just mention, Representative Wood had mentioned AmeriCares, which provides amazing services. I have worked with some of the folks in Bridgeport actually trying to help them connect people to dental care because unfortunately they don't have oral health services. And so some of the FQHCs in that area, Optimus and Southwest, have been trying to take on patients, but it's much more complicated when they are uninsured to do those referrals. So that's just one example of something that would be much simpler if people were linked to the Husky program.
Excuse me, your 3 minutes are up. Thank you. Can you please summarize? Thank you.
Yeah, that's really all I wanted to say. So thank you so much. I'm happy to answer any questions that you might have. Thank you again for the opportunity.
Thank you for your testimony. I know very well of AmeriCare and the work they do, and the federally qualified health centers are such a great help. But I think back to the young lady who was here with the help that she couldn't get and that she would not be able to get in the health center or through AmeriCare. So they're, I have a problem because these are more than stories. These are the lives of people who are suffering. Many of them pay taxes and have jobs that pay taxes. So thank you for what you do, and thank you for coming this morning for your giving testimony. I don't see any questions for you, so just thank you.
Thank you very much. Have a wonderful day.
You're welcome. Next is Annie McGovern, followed by
Senator Moore. Senator
Is it
Moore,
Examara?
I believe, yeah, number 14 is next.
Examara Fugan, and then Annie McGovern. I see you, Examara.
Sorry, yes, I am here. Sorry. So my little dog
Pronounce your name for me, please.
Sorry. Okay. Hello, my name is Xiomara Fugon. I need to talk my testimony. So,
would you say your first name again, please?
Sí. Mi nombre es Xiomara Fugon.
So you'll need an interpreter?
I could interpret for her.
Sí.
Thank you. Go ahead, go forward.
Mi nombre es Xiomara Fugón, soy residente de Bridgeport, Connecticut. Soy inmigrante, tengo 12 años de vivir en Bridgeport. Soy de Honduras, tengo 4 hijos. 3 de mis hijos son nacidos en Honduras y 1 es nacido aquí.
Xiomara,
Yo apoyo mucho a la SB. ¿Sí?
Yo voy a traducir para usted para que luego haga inglés. So my name is Xiomara.
Okay.
I am a resident of Bridgeport, Connecticut. I have been residing there for 12 years, and I have 4 kids. ¿Puede?
Soy de Honduras. Yo apoyo mucho al SB 956, el seguro médico para personas indocumentadas. Yo he tenido...
I am from I am from Honduras, and I support SB 956.
Tengo experiencia he tenido malas experiencias en el aspecto cuando voy al médico y me preguntan de mi seguro y no tengo.
I had a bad experience when I go to the doctor because I do not have health coverage.
Muchas veces no he podido pagar por lo cual yo opto a automedicarme y hacer cosas naturales en casa.
I have a lot of difficulty paying for the treatments, and in turn I resort to at-home remedies.
Cuando mi hijo pequeño que sí tiene seguro, él lleva o sea, él lleva su procedimiento como es, pero cuando mi hija, las otras niñas necesitan ir a la clínica, pues a mí me da pesar porque no puedo llevar el mismo seguimiento por el motivo que si puedo pagarle a una, no le puedo pagar a la otra.
For one of my kids who was born here and has health coverage, when he goes to the doctor, he does have health coverage, so it can be taken care of. But for my other 2 children who don't have healthcare coverage, I fear going to take them to the doctor because of the cost that it will come out of my pocket.
Me gustaría que los miembros del Comité de Servicios Humanos de la Asamblea General de Conérico tomara en cuenta el host para nosotros los sean los días, no esperar que nos den a un bajo costo. Sí.
Simona, discúlpame, la conexión no la podía oír. ¿Puede repetir para que luego pueda traducir? Discúlpame.
Ok. Ajá. Que yo le pido a los
Excuse me, is that her connection?
I
I'm
believe
talking
she's
to-
having, I believe she has a bad connection, Senator.
Servicios Humanos de la Asamblea General de Conérico que nos apoye. Está mala la conexión. No sé.
Yo la puedo escuchar un poco. So yeah, the connection is a little bit bad, but she said that I asked that the members of this committee please support SB 956.
Thank you for your testimony.
Simona, ha terminado. Disculpe,
Okay.
la conexión.
Está mala.
Sí, un poco
Have a
más.
good day.
Gracias.
I didn't see any questions for her. So next I have Annie McGovern. Good afternoon, Annie.
Hi. Hi, yes, thank you. Thank you, Senator Marilyn Moore and Representative Catherine Abercrombie and other distinguished members of the Human Services Committee. My name is Annie McGovern and I'm a student at Wesleyan University as well as an intern at NARAL Pro-Choice Connecticut. I'm testifying today in strong support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status. While Connecticut is considered to be a relatively progressive state, there are many communities that are continually excluded from our policies, such as undocumented immigrants. And Connecticut houses a growing population of immigrants from a variety of countries and cultures that contribute to our state in innumerable and vital ways. It is our duty as a state and as compassionate neighbors to care for and protect all members of our community. And additionally, immigrants pay taxes that are then allocated to Husky, so they should absolutely have access to these benefits. In 2020, there were 120,000 undocumented immigrants living in Connecticut, meaning that passing this bill could positively impact so many lives. Specifically, as an intern at NARAL Pro-Choice Connecticut, I support this issue because without appropriate healthcare coverage, immigrants are unable to access necessary medical care, such as abortions. Although I believe Husky only covers abortions that are deemed medically necessary by a physician, this service should be available to all residents of Connecticut. If you don't pass this bill, you're upholding a major barrier to care, and barriers to care, as we know, don't eliminate the problem, but exacerbate it. Inaccessibility often forces people to make drastic and dangerous medical decisions, especially when it comes to abortions. People seeking abortions will simply turn elsewhere if they can't receive high quality, safe care. Moreover, lack of care can also induce the development of other physical and mental health issues that, without Medicaid, may be left unaddressed. Even if private health insurance is an option, many are unable to afford it. And regardless, immigrants should be provided the same benefits and opportunities as all other citizens that partake in our system. This is a matter of reproductive justice. Access to healthcare, which includes access to abortion services, is a human right. So let's work together to provide Medicaid to all humans living in Connecticut. To close, I support SB 956 with clear language to extend current Husky eligibility rules to all CT residents, regardless of immigration status. And I ask the committee to do the same. Thank you so much.
Thank you, Annie. Appreciate you taking the time in your testimony. Very well thought out. Are there any questions? No comments. Thank you very much. Have a good
Thank you.
day.
You too. Thank you.
Roger.
Hi,
Censor?
good morning.
Good morning.
Good morning. Well, first of all, dear members of the Human Services Committee, thanks for letting me testify. My name is Roger Senserik, and I am the Communications Director at Connecticut Working Families Organization. We are an anti-racist, multiracial, progressive political organization that builds power for working people. We stand in support today of SB 956, the act that provides medical attention to undocumented immigrants. And we do so for many of the reasons that have been exposed already. But I wanted to especially stress the fact that what we have learned from the pandemic, what we have learned for what has happened for the past year makes the need for having a bill like this pass especially clear. COVID pandemic has had a disproportionate impact on people of color, and especially on immigrant families. We know that undocumented immigrants, more than half of undocumented immigrants in the state have no health insurance, meaning that in the worst health crisis in more than a century in this country, they have been living, many of them being frontline workers, many of them being the people that are restocking our shelves, that are delivering our groceries, that are working in frontline jobs, cleaning shopping malls, cleaning, basically being our neighbors, being part of the community, being part of their economy. But we have asked them to do all this without having access to insurance. They pay taxes. As I stated in the testimony, undocumented immigrants pay at least $120 million in estate taxes every year, and yet we deny them coverage. We don't let them have Husky. We don't let them have the same access that we do to healthcare. And in a year where having healthcare or not made such a big difference, and the fact that it's an infectious disease, it doesn't look at our immigration status if we get sick or not. It's not a matter of personal responsibility of getting COVID or not. You get infected, you get it, you pass it to your family. This is something that it's not to any fault of your own, especially if you are being forced to work as an essential worker. So I'm an immigrant. I have my citizenship now. I've had insurance most of my stay here, but I remember every time that I had no insurance, how deadly afraid I was every time that I got a bad cold, that I slipped and fall and hurt my knee and had anything that might mean a visit to the doctor, because it meant that it could be thousands of dollars if it was something worse than I thought. And I did not have the money. And we have been asking undocumented immigrants in this country to do this for a whole year in the middle of the pandemic. It's not acceptable. They are our neighbors. They pay taxes like us, and they should have access to the same health care that we do. And as Representative Hughes was saying earlier on, we pay for their care anyway. If they go to the emergency room when they get really sick, we are going to be the ones paying for the health care at the end of the day. So giving them access to health insurance, it's not a cost. It's something that it's a way to lift this burden both from them.
Excuse me, your 3 minutes are up. Can you please summarize?
Yes.
Thank you.
So lifting that burden, that fear of living without insurance, and also helping the state in the long run. Thank you.
Thank you, Roger, for that testimony. Any questions? Seeing none. Thank you.
Thanks.
Next is Estela Jimenez. Followed by Veronica Webb.
Hi there.
Hi, Veronica.
Hi, how are you?
Good, thank you.
Good. So first, I want to thank everybody, Senator Moore, Representative Abercrombie, everybody here today for listening. So my name is Veronica. I'm a social worker in Bridgeport with Jewish Senior Services. I do home care and hospice. So today I'll be testifying for the Bill 957, expanding access to in-home counseling. Currently, Medicaid does not reimburse and cover in-home behavioral health services and social work. Meanwhile, Medicare does. In-home health social workers work with an interdisciplinary team, including registered nurses, physical therapists, occupational therapists, speech therapy. And all of these clinicians are licensed, highly educated, mostly master's level trained, educated professionals. And this gap in service is really detrimental to our patients. There are patients who are on Medicaid and need social services are told to go to the Department of Social Services. And of course, due to high caseloads and long wait times, sometimes services are delayed for folks who really truly need it and are homebound. These homebound recipients will use social work to assist in acquiring and managing their access to community resources, anticipatory guidance with their evolving medical conditions and mental health counseling, as many of these patients, since they are homebound and given COVID, are isolated and deal with the mental health and emotional health issues that surround COVID that we're all kind of dealing with right now. So these interventions and skills are pertinent to our patients as they're homebound. Their access to behavioral health services are significantly limited, especially when Medicaid does not reimburse. A large majority of our patients are elderly, homebound, food insecure, and very low income. This population struggles with resource management, difficulty getting assistance due to high wait times, like I said. So allowing home care social work to visit and continue to revisit Medicaid recipients will not only improve services to these patients, but it'll include improvement of quality of life, continuity of care, and less frequent hospitalizations. Passing this bill would have immediate effect on many of my patients that I see. One who comes to mind first is a man living in subsidized housing in Bridgeport, a Medicaid recipient. As a paraplegic and a single person who was never married, never had children, he relies on his one sister to provide him personal care because he cannot care for himself. He recently lost his mother, which was the most important relationship in his life. And he so desperately needs some bereavement counseling, community resource management, and help getting personal care in his home through home health aides and through DSS services. Due to these restrictions, providing continuity and continuous care was very challenging for me, as I was only allotted a couple visits to see him and to get him the services that he really needs. So with the passing of this bill, this gentleman, along with hundreds and hundreds of other people, would be directly benefited from this and getting the services and care that they need. So thank you for listening.
Thank you, Veronica.
Thank
I know
you.
of your services and your location. You're my
Thank you.
neighbor,
Oh, good.
as does Rep. Hughes. Thank you for your testimony. I don't see any questions for you, but I appreciate you taking the time to come.
Thank you. I
today.
appreciate it. Thank you.
Take care.
You too.
Matthew?
Hi, good morning, and thank you for holding this hearing. My name is Matthew Meislish. I'm an MD PhD student in my final year at Yale School of Medicine. I'm testifying in support of SB 956 with language that clearly extends eligibility for all Husky programs to all Connecticut residents, regardless of immigration status. When I was in college and medical school, I volunteered at Haven, a student-run free clinic that serves uninsured, mostly undocumented immigrants in New Haven's Fairhaven community. And let's be clear, patients come there because they have no other options for healthcare. The students there do critically important work, but they're trying to plug a hole that simply should not exist. You don't need to look any further than this clinic to see that our system is not working. Is there any legislator that really believes that this is an adequate solution? That a student-run free clinic open 1/2 day per week should be the only avenue to obtain healthcare for any member of our community? You're going to hear a lot of individual stories today, hopefully enough that the human consequences of our policies will be clear. I want to use part of my time to read a letter to the Human Services Committee signed by 306 healthcare providers in Connecticut to make clear how widespread the support is for this bill among those who are responsible for caring for our community. Connecticut General Assembly, Human Services Committee. We write to you to express our strong support for legislation being considered by the Human Services Committee that would expand Husky eligibility to all low-income Connecticut residents without regard to immigration status. As healthcare providers, we recognize our responsibility to care for all patients, regardless of race, income, or immigration status. Unfortunately, our state laws do not reflect that same commitment. While the uninsured rate in Connecticut is roughly 5.9%, an estimated 52% of undocumented immigrants in our state are uninsured. Undocumented immigrants are prohibited from participating in Husky or from purchasing private health insurance on Access Health CT, the state marketplace established by the Affordable Care Act. Our laws have eliminated the pathways to reliable health insurance for undocumented individuals. Instead, immigrant communities are forced to rely upon under-resourced clinics and emergency care through hospitals. We as healthcare providers have all seen the consequences when our patients' illnesses go untreated, causing catastrophic complications and, it is important to note, requiring expensive hospital-based care that is ultimately supported by the state. These consequences are preventable, but the prescription must be written at the level of state policy. Connecticut has already begun to recognize the moral responsibility and sensibility of making sure all communities in the state have access to healthcare. During the COVID-19 pandemic, Connecticut has used emergency Medicaid funds to cover COVID-19 testing and treatment for residents who didn't qualify for Medicaid based on immigration status. This was a wise decision, both to prevent illness and treat it early. It almost surely saved lives. But the wisdom of this decision is not restricted to COVID-19. Preventing disease and treating it early is always the right approach to community health from both a fiscal and moral perspective. As healthcare providers, we understand the devastating human consequences of restricting access to healthcare. We ask you to support legislation that would remove immigration status from Husky eligibility rules and would finally allow our most vulnerable community members to access quality medical care. We thank you for your thoughtful consideration. This letter was signed by 4 healthcare organizations and 306 individual Connecticut healthcare providers. To conclude, I'd like to point out—
Excuse me, actually, I thought you had finished up. Your 3 minutes are over, so thank you for summarizing.
Okay, thank you very much.
Thank you, Matthew. I see Representative Hughes has her hand up.
Thank you, Doctor. And I really appreciate you bringing attention to this policy solution, the policy prescription, if you would. And I think it's important to tell us a little bit more that the half-a-day clinic once a week run by student, resident physicians was the only access for these folks because they cannot purchase healthcare on the exchange. Is that right?
Yeah, that's right. I mean, they're shut out of multiple avenues for obtaining health insurance. On the exchange, Access Health CT, even from purchasing private insurance without subsidies, they're not eligible. As you all know, as we're talking about today, they're shut out from Husky. So we've basically created a system where there are no avenues. Some undocumented immigrants have health insurance through an employer. Most employers, or many employers, don't actually provide health insurance. So that's our state laws and federal laws are the reason 52% of undocumented immigrants are uninsured. And, I think we have the responsibility to act on it at the state policy level.
And can you tell me a little bit about what you see with untreated or compounded health conditions that come to you in late stages?
Yeah, absolutely. So, one patient that stands out to me is a patient who I'll call Armando. He came to our clinic 4 months after an injury at work. He was a construction worker and had broken a bone and tore cartilage in his hand. And he had his hand stabilized in a splint in the emergency department, but because he was undocumented and uninsured, he was unable to get definitive care. So when he came to us, he had lost most of the function of his hand. He had a stabbing pain in the center of his hand that radiated all the way up to his forearm, and it prevented him from working. He had no income, so he ultimately lost his home and was unable to support his family. These are the consequences of not treating illnesses and injuries immediately when they should be treated. And ultimately, he required procedures that were more expensive, in addition to kind of allowing his life to unravel because he wasn't able to access care upfront.
And through you, Madam Chair, sorry, I forgot to say that. Thank you for that, Doctor. And also, I just want to be clear to my colleagues that those procedures are not available if they cannot pay for them upfront, right? Like the hand surgery, that is not part of emergency surgery that is offered in an emergency room that is uncompensated care, for instance. Would you say that's true?
Yeah, absolutely. I mean, emergency Medicaid ultimately means that the state is paying a heavy cost for illnesses that become true emergencies and have to receive, expensive hospital-based care. But it does not cover anything that isn't life-threatening typically. Ultimately, some care is provided uncompensated by the hospital, and the state also subsidizes that care, which is important to note. So, we are bearing these costs in addition to the community members who are bearing the costs of not having these illnesses appropriately treated.
And through you, Madam Chair, one final question is, what have you seen in terms of the cost of untreated folks not having access to, the impact of COVID, I guess is my question. What have you seen through the clinic or whatever, the impact of COVID on these folks?
Well, COVID has had a disproportionate impact on immigrant communities in our state. And you can ask any healthcare provider, who are the people that they're treating in the ICU? And a lot of them are immigrant individuals, and Connecticut did the right thing to cover that care and to cover testing. And I think, recognizing the disproportionate impact of not just COVID, but many health conditions on these communities is really important. And taking the appropriate actions like Connecticut did for COVID to make sure that they have access to the testing and the care that they need.
Great, but it's in the global scheme of things, it doesn't go far enough. Is that your testimony?
Currently, absolutely.
Yep.
I mean, it doesn't. I think that it is a window into what's possible, and a window into the fact that this is a decision that we're making not to cover these conditions outside of the very limited scope of COVID. I think COVID is an example of what we should be doing more broadly.
Great, thank you so much. Thank you for your testimony. Thank you, Madam Chair.
Welcome. Thank you, Matthew. I don't see any other questions for you.
Thank you very much.
Have a good day. Next is Camila Bartoletto, followed by Georgiano Niez Aponte, followed by Carlos Navarro. Hi, Camila.
Yes, hi everyone. Thank you all so much for having this hearing. I've had so many computer troubles today, but I'm glad to be on with you. So thank you, members and chairs of the committee. My name is Camila. I am co-director of Connecticut Students for a Dream. We're a statewide youth-led organization that fights for the rights of undocumented youth and their families. We, Connect Students for a Dream, stand in support of SB 956 to expand access to Husky to undocumented folks, regardless of status. We submitted a longer testimony, so today I'm going to summarize some key points. Today, as we've heard and we'll continue to hear, many stories from undocumented folks and families on how they struggle with access to healthcare. I'm undocumented myself, so I know the struggle within my own family, some of whom will be testifying later today. In Connecticut, as you all heard, the undocumented community is prohibited from buying it to access self-CT, ineligible for Medicaid and Medicare and other forms of coverage, and undocumented immigrants can't acquire insurance to their employer. And often private insurance companies deny or reject even access to purchase off the market private health insurance. As a result, the health coverage options for undocumented families are very limited and people cannot seek the care they need. As we've heard mentioned already, the COVID-19 public health crisis is magnifying the daily and systemic inequities that undocumented communities face. The lack of access to healthcare means that chronic health issues that could be treated, like diabetes or heart disease, go unmanaged, which puts people at a much higher risk of severe COVID and death, which is a very real concern in our community. Connecticut's Husky Health Program restricts applicants based on their immigration status. This includes both undocumented folks without status, and it includes recent quote-unquote legal immigrants who have a green card but have been here for less than 5 years. So there's a good chunk of people in Connecticut who are unable to access healthcare, even though they're low income, through the Husky program. As we've also heard mentioned, the uninsured rate in Connecticut is quite low. It's 5%, which is good compared to the rest of the country. However, in the undocumented community, that percentage is 52%. So that's a staggering gap in lack of access that Connecticut needs to address if it hopes to reduce the uninsured rate even more here in Connecticut. And as you heard, the healthcare providers mentioned, providing people preventive and stable health coverage has been shown to reduce healthcare costs and save money by ensuring individuals and allowing them to receive the preventive care they need to treat issues earlier on. When issues are treated earlier, they're of course cheaper to resolve, and people live healthier lives and they become cheaper to insure. So providing healthcare at the beginning of their illness is a much better option than treating after the fact when they show up in the emergency room. I would also like to mention that undocumented residents in Connecticut do pay taxes. There's around 120,000 undocumented immigrants in Connecticut, which pay a combined $145 million in state and local taxes in Connecticut and $253 million into federal taxes. Again, this is only the Connecticut population. As undocumented taxpayers, we're contributing to these health programs, so we deserve a chance to be able to access them when we need it. The numbers of undocumented people who would be eligible if Husky were to be expanded is a hard question to answer.
Excuse me, your 3 minutes are up. Can you please summarize?
Yep. Last point is that we estimate that around like 32,000 undocumented folks may be eligible for Husky, but that's on the upper limit, at least for more estimates. Thank you.
Thank you, Camelia. We've met many times at the Capitol, and you continue to fight the good fight. Representative Hughes.
Thank you, Madam Chair. Thank you so much for your testimony, Camilla. Can you tell the committee and the public a little bit about this impact, especially on children? If the children were able to get immediate preventative care, if we were able to expand this from your standpoint in the trenches, if you will.
Yeah. So I think you heard one of the providers mention earlier that some states do offer their Medicaid version of the state program to undocumented children or minors under 18 or 19, which is a great first step. So if Connecticut were to be able to do that, that would be great. But research has shown that when families are insured as a whole, like when the parents are insured and the parents are provided coverage, the kids are also healthier. So providing health coverage to just minors, just people under 19, it doesn't pay off as much in the long run, because when the parents lack access, they're much less likely to take the child to the doctor. So whole families being insured is the best option to go.
Yeah, thank you for that. And through you, Madam Chair, this pandemic has definitely showed our interconnectedness in terms of health, not just in families, but in the whole communities. And I think that you raise a really good point, and that's one that the World Health Organization really adopted as a policy practice in the 80s, was ensuring health access for moms especially, but families, like you say, definitely had a direct impact on those children's health. So we should follow in that well documented, well researched, good policy legacy.
Thank you. Are you finished, Representative Hughes?
Yes, I am. I see Representative Santiago's hand raised.
I see that. Camelia, you mentioned there's a couple of states that offer 18 and 19-year-old undocumented. Do you know what states they are?
Off the top of my head, maybe not, but some of them. California offers it to people under 25, and this year they're trying to open it up to seniors. So they're doing it in stages. And I believe Oregon and Illinois, someone please correct me if I'm wrong, but those are two other states that provide coverage, their Husky-like program to minors under 18 or 19.
Thank you. Thank you for your testimony. Representative Santiago.
Thank you, Madam Chair. Thank you, Camila, for coming to testify. Like the senator said, can you hear me? You are one of the biggest voices up at the Capitol. But I have one specific question. How do you see the vaccine and the testing of COVID in the undocumented population? Because I think that has a lot also to do to people having access to healthcare. In just your words, as far as people getting it or not getting it or scared to get it. But I know that there are a lot of articles coming out in Spanish-speaking television and newspapers where there is a lot of misinformation, specifically within the Latino community, about the vaccine. So what do you, I just want to hear what you might be what you've experienced.
Yeah, the vaccine issue is
Thank
tricky. Thank you. So yeah, the vaccine issue is it's tricky for a lot of folks. People we're very glad that in Connecticut and across the country, right? Nobody's tracking status. Like everyone can get the vaccine regardless of their status, regardless if they have insurance. So that is a great thing that's happening here in this country. However, a lot of people don't know that. So a lot of people do think that you need to be a US citizen or you need to be not undocumented to be able to get the vaccine. So that is discouraging a lot of people from seeking that out. People are concerned what will happen if I show up there, which means that there's a lot more education that's required in the community. My own parents just got the vaccine in the last 2 weeks or so. They're over 65, that's why they got it. And even my dad asked me, I have a drive-only license. Are they going to let me take it for a drive-only license and not a full license? So if my own parents have those concerns, I can't imagine what the misinformation is in the rest of the community. I will say that this will be also an issue that we need to tackle if and when hopefully the Husky program is expanded, is that there will always be the hesitation from the immigrant community to be able to access these programs because they have historically not been able to. So that does show that there is a need for education in the community. And it also shows that the uptake, once the program is hopefully expanded, will be slower than it was for the general American community, which is good and bad, right? On the good side, it means that it'll probably be cheaper to open up the Husky program to undocumented folks because the uptake will be slower. But it's also bad because we will need to do the community education needed to make sure that people are opting into that program and taking advantage.
Thank you for that. And I also want to mention that it also affects housing. When people are 10, 12 people living in an apartment and trying to quarantine, how people will be getting sick from each other. A lot of our undocumented also are frontline workers that are working in restaurants and kitchens and working in landscaping and doing some other jobs in the community. So it was good that you brought in the issue about how much they're paying in taxes at state and federal level, but also the issues that I'm also worried about is mental health and behavioral health within the undocumented population. What's going in the school system? How are they getting services? Are they being referred? Are they not being referred because they have no insurance in order to go seek counseling? So, I mean, it's a trickle down effect, and you have to treat this whole issue as holistic. That is not just for regular insurance to get operations and to make sure you seek help if you have a disease or illness, but it also extends to mental health, behavioral health, housing, and the regular healthcare. So I just wanted to make that statement. Thank you, Camila, for being here and always being a voice for the community. And thank you, Madam Chair.
Thank you. I don't see any other questions for you, Camila, but once again, thank you. Appreciate you. Georgina Nieves Aponte. I'll go to Carlos Navarro. Hi, Carlos.
Hi there.
Thank you, Senator Moore and Representative Abercrombie and all legislators for having me here today. Can everyone hear me well?
Yes.
Okay, awesome. So I'm Carlos Navarro of Norwalk. I'm also a journalist, a graduate of the Connecticut School of Broadcasting. I'm currently a student at NCC, and I'm also a C4D member. And I'm in support of the bill SP 956. I'm here to testify on the behalf of thousands of immigrants, undocumented families across the state of Connecticut, who together make up thousands of people left without healthcare coverage, therefore not being able to afford healthcare. Not having healthcare coverage leaves many individuals across the state not being able to access affordable healthcare. I ask myself, how many people are vulnerable to getting sick and not being able to get the treatment they need to help them get better, therefore not being able to return to work without a doctor's note? How many immigrant women can't get a mammogram because it's not affordable to them, therefore not being able to treat breast cancer on time or other diseases because they don't know they have it in an early stage of development? How many individuals can't afford a COVID test or perhaps even the COVID vaccine because they cannot afford it, therefore not only putting themselves at risk, but their fellow neighbors as well? I asked folks on my social media, why is healthcare coverage and important to them and their families? Here's what some of them had to say. My mother suffers from high cholesterol and she cannot afford to get the medication she needs to help her stay balanced. I fear for her life because people with very high cholesterol are at high risk of stroke and heart attack. And somebody else said we shouldn't have to choose between rent or an urgent visit to the doctor's office. Another person said Yale New Haven Hospital was denying my dad treatments for his leukemia because he didn't have health insurance. We had to set up a GoFundMe page and we didn't want to ask people for money, but we were left with no choice. So with that being said, please listen to what I have to say because I can only say this once. I'm here today to tell you that healthcare is a human right. No one should have to pay for healthcare regardless of their immigration status. Just like no one should have to pay to go to a public school regardless of their immigration status. Despite what people think, undocumented people do pay taxes in the state of Connecticut, taxes that are going to the very same healthcare program they don't have access to, and that is very inhumane. Our immigrant families need access to healthcare coverage now, regardless of the immigration status. That is all I have to say. Thank you.
And you said it very clearly and distinctly, Carlos, so I can tell your voice is being well used. Thank you. Let me see if I have any questions for you. I do. Rep. Dathan has a question for you, followed by Rep. Hughes.
Thank you very much, Madam Chair. And thank you so much, Carlos, for your eloquent discussion here. I think your testimony was very on point and very succinct. And right now I'm worried about my seat here in Norwalk with you testifying like this. So thank you so much. And I really wanted to ask, with some of your peers, how has it, your undocumented peers, how has it personally affected them in terms of getting the healthcare, the coverage that they need, and the ability to get vaccines, not just for COVID, but for other areas and kind of student checks, because you do need that in order to go to school.
Yeah, so for example, here at NCC, a lot of people, who are undocumented, who cannot afford to go to get their vaccinations that they need, cannot even attend college courses for these semesters because they don't have their vaccines, and that is a huge issue. I think it's affecting education as well. So people don't realize that that without healthcare coverage, it also affects education. And education is something that's free. Healthcare coverage is not. And we need both of those to work together.
Yes, I agree. And that was what I was concerned about. So thank you for communicating that. And it's nice to see people like yourselves standing up for what's important to you and taking time out of your schedule to come and testify. Thank you very much, Madam Chair.
Thank you. Representative Hughes.
Thank you, Madam Chair. Carlos, thank you for testifying. Can you speak to the impact on frontline workers and what they have, your peers, but people who have been working throughout this pandemic and not able to work from home, what that impact, stress, and fallout from that has been? Yeah,
well, actually, I try not to speak personally on my life, but I want to take my mom, for example. My mother, she is a US resident. She has her green card. She was undocumented before, but she is a housekeeper. And, luckily her boss has been very nice to allow her to come back to work throughout this time. But it's things like that that really concern me because, people like that, like housekeepers, for example, they're the most vulnerable to getting hurt and things like that. They could get hurt when they're at work and things like that. So it worries me a lot for my mom because the other thing is she just got her green card, but she has to wait 5 years to be able to get her to be able to qualify for Husky. So that's another thing that concerns me. Like I think that once somebody gets a green card, they should be able to access Husky immediately. But on top of that, I think everybody should have access to Husky.
Yeah, thank you for that. And through you, Madam Chair, I just am trying to explore that economic access is health access, right? They're so interdependent. And when folks can't work during the pandemic and they don't even have economic access and they don't have health access, it basically it basically accelerates the catastrophic health risks and deaths for people in that situation. So thank you for sharing your mother's story with us. Thank you for sharing yours.
Thank you for the platform.
Thank you, Carlos. Continue the good work. Stay in good trouble.
Of course. Thank you so much.
You're welcome. Next is we'll have an interpreter. I think it's Jose Guzman. Is that correct? How about Megan
Actually,
Fontaine?
yes.
Megan?
Hi, I'm Megan Fountain.
Okay. Are you
Good
the
morning.
interpreter?
I am an interpreter, but right now I'd like to give my testimony. Is that okay?
Yes.
Thank you. Good morning, Senator Moore, Representative Abercrombie, and members of the committee. I would like to, so my name is Megan Fountain, and I coordinate advocacy and partnerships with ULA, Unidad Latina en Acción, which is a grassroots organization that defends the rights of workers and immigrants. I want to share with you, I want to tell you a little bit about one of the members of ULA who has sent his written testimony to the committee, but he cannot testify today because his phone bill was cut off. But let me tell you a little bit about Mario. About Hector. So Hector is a long-term, and I'm giving my testimony today in support of SB 956, in support of free healthcare as a human right for everyone, regardless of immigrant status. So Hector is a long-term resident of West Haven and a taxpayer and an immigrant who puts food on the table for Connecticut residents. In 2018, he suffered an accident on the job. He worked in a New Haven food packing plant. At 7 o'clock in the morning, he fell from the forklift and he injured his spinal cord and he damaged his knee. The company refused to call an ambulance. They asked him to wait for a whole hour so that they could send him to a clinic where they send workers after accidents occur. In the end, he had to go to the hospital, Yale Hospital, and he was hospitalized for 4 days, and then he got a bill for $30,000. He could not pay because he had no job. He couldn't even do light work. And the lawyer told him that if he could no longer work, there was no support for him, that he should leave this country. But he did not feel that that was correct because he had worked here in Connecticut. He had put food on the table for the residents of the state. He was injured on the job. He was a taxpayer. And now he could not get any health care or government assistance. So he paid for medical treatment for 3 years. He got a lawyer to do a workers' compensation claim. The lawyer encouraged him to settle for $60,000. But that did not even cover the pre-operation, the operation, and the post-operation costs. For people like Hector, there are many people that you'll hear from today who are calling on you to use your power and your voice to make sure that healthcare can be public as a human right for every human being. And
excuse me, your 3 minutes are up.
Yeah.
Please summarize.
So thank you very much for hearing these testimonies. And I think it will be a long day and you'll hear many stories. Let's move forward and make sure that healthcare can be a human right for all. Thank you.
Thank you, Megan. And thank you for doing the interpreter for us today also. Next is, I don't see any questions for you. Jose Guzman. Good afternoon.
Hola, buenos días.
You have an interpreter?
Yeah.
You can begin. Thank you.
Hi, I will be interpreting for Jose.
Okay.
What is your name?
My name is Anthony Barroso.
Thank you, Anthony.
No problem.
Hola, buenos días a todos, estimados miembros del Comité de Servicios Humanos de Connecticut. Mi nombre es José Guzmán y soy residente de Hartford y también soy documentado.
Dear members of the Human Services Committee of the Connecticut General Assembly, my name is Josue Guzman. I am a resident from Hartford and I am undocumented.
Estoy a favor de la SB 956, una ley que proporciona asistencia médica a ciertos individuos sin importar el estadio migratorio.
I stand in support of SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all residents in Connecticut regardless of immigration status.
Estoy a favor de que se los beneficie a todos con un seguro médico sin discriminar a nadie de cual sea su estatus migratorio.
I am in favor that the Husky health insurance benefits everyone regardless of their immigration status.
Yo tuve una situación el año pasado donde llegué a una clínica con un dolor de muela.
Last year, I experienced a situation where I went to a community health clinic with a very bad toothache.
Un dolor muy fuerte donde ellos me atendieron, pero me dieron medicamentos. Pero yo quería extraerme la muela, pero en la clínica donde fui no podían sacármela.
They could not do the extraction of the tooth. They gave me a referral to go to the hospital.
Me dieron medicamento por mientras se me calmaba el dolor, pero me hicieron un referido por si yo quería sacármela para un hospital.
They gave me medicine for the pain and they also referred me to the hospital.
Pues para que me dieron el número para que yo llamara y pues cotizara a ver en cuánto andaba el precio para hacerme la extracción de la muela.
Before going to the hospital, they gave me a number that I could call, and I called them to get an estimate of the surgery I needed.
Yo llamé y me dijeron que me podían sacar la muela, pero que el costo andaba en $1,800, ya que era un costo que no lo podía hacer para lo que estaba en mi bolsillo.
When I called, they told me that the surgery I needed costs about $1,800. It was a very expensive surgery.
Debido a la situación que estaba pasando, pues tuve que acudir al hospital, en el cual todavía me hicieron una extracción, pero tal vez por no tener un seguro, pues creo que el costo se hizo y pues todavía tengo esa deuda con el hospital.
It was a very expensive surgery, but due to the emergency I was facing, I had to go to the hospital. Until this day, I'm still in debt.
Creo que sí pasaría en esta ley, en toda la comunidad indocumentada de Connecticut, puede tener acceso a aplicar a un seguro médico y tener una mejor atención y para todas las personas
If this
indocumentadas.
law were to pass, I and all of the undocumented community in Connecticut would be able to have access to affordable health insurance.
Ya. Gracias por todo su tiempo. Si hay alguna pregunta, pues estoy para...
Thank you for your time, and if you have any questions, please let me know.
Thank you, Mr. Guzman. I don't have any questions for you. I appreciate you taking the time to come today. Thank you. Next is Jay Siklik, followed by Sonia Hernandez.
Good afternoon, Senator Moore. Thank you. Representative Abercrombie, members of the committee. Thank you for providing me with an opportunity to testify today in favor of SB 956, an act providing medical assistance to individuals regardless of immigration status. My name is Jay Siklik. I'm the Deputy Director of the Center for Children's Advocacy and the Director of our Medical Legal Partnership, which is our interdisciplinary medical legal advocacy program with many clinical partners around the state. I've submitted detailed written testimony, and I wanted to just highlight a couple of points. To piggyback a bit on, I believe, what was the intent, and I don't mean to put words in her mouth, but Representative Hughes's question to the commissioner. I think we need to frame this, and we do it in the world of our constituency, which are children and youth under the age of 19. We need to frame this as a healthcare access issue and a healthcare right issue, like Camilla was talking about as well. This is not really about the insurance, it's about health equity. And we know that 7 other states have provided and cover undocumented children and youth under the age of 19 through their state-funded Medicaid programs. There is no reason, as we testified 2 years ago in Bill 1053, that we can't do this here in Connecticut, especially when health issues are so exacerbated by the pandemic. So that's the first point. The second is, for that population, thanks to a very comprehensive and detailed study that was written by Kelly Whitener and that was commissioned by the Connecticut Health Foundation, we know the actual cost that this will be. It will be about $25.3 million for the biennial budget. And that is data that is driven by modeling on particularly the state of Oregon that did exactly what we should be doing here, which is expanding our Medicaid programs to children and youth under the age of 19. It's a drop in the bucket compared to the $6 whatever billion that DSS has in its budget. Third, we know, because our office deals with countless families with undocumented children, that there is no legal option and there's no safe medical option for preventative care and even for acute care, absent this emergency care that hospitals are legally mandated to provide through emergency medical treatment and labor acts, but they can't seek services in the community. You heard about the Haven Clinic about half a day a week. This is critical healthcare that we can provide, and we know that it makes a difference, especially when it comes to comorbidities in the COVID era. And finally, how can we not pay for this, both from a financial and from a moral point of view? We have over 288,000 individuals who've tested positive for COVID. We know that we've lost 7,700 of our friends and families and colleagues and workers and individuals in Connecticut over the last year.
Excuse me, your 3 minutes are up. Please summarize.
Will do. Thank you. It's time to correct that and make this a health equity issue and not just focus on the fact that we can or can't get federal reimbursement. Anyway, thank you so much for your time and thank you for your attention.
You mentioned the Connecticut Health Foundation report. Could you share that information?
Yes, I can. In fact, I actually sent a copy to Ms. Ferguson yesterday. I can send it to you folks directly. It's a 6-page policy brief that the CHF issued. It is incredibly detailed and thoughtful. What it does is it models the exact number of the estimated 13,000 children and youth under the age of 19 who are undocumented. And it takes a look at the per member per month cost, both in Husky A, Husky B, and it models the uptake based on state data that, for example, Oregon had when it expanded its Medicaid program. And it really boils down the actual cost, because if you'll remember 2 years ago, when we came for the same issue and the state issued a $52 million fiscal note, we decided that we would work with the foundation to do so. And I'll make sure you get a personal copy and perhaps we can send it around to the committee as well again.
Well, if you send it to Heather Ferguson, she'll make sure that we all get it.
Okay, she should have a copy, but if you don't, Heather, I'll send it
She's
again.
saying yes in the affirmative that she has it.
Thank
So
you.
thank you.
You're welcome.
Representative Hughes has a questioner for you.
Thank you, Madam Chair, and thank you for this incredibly important data so we can really do an economic analysis, but more importantly, to really view this as an access issue, as an access right. And my understanding is that in CMS, we have qualified Medicaid access and eligibility support as a service to those who are who we do qualify as eligible. And that means that we have an incredibly economically effective low administration rate to our access to our program, low overhead. And we'd like to extend that and really evaluate the cost analysis. So I'm hoping that your report drills into that a little bit in terms of framing the access as and opening up eligibility as an essential service.
I think I'm not really quite as qualified as Professor Whitener is, but she is on the list, I think, somewhere after Jeopardy this evening. You may see her, but she's 137, I think. We tried to squeeze her in earlier. She's actually lives out west, but she is going to participate. And if you're around and she's able to quantify some of that data and use some of that method analysis, she'd be happy to do so. She's also really familiar with the other ways states have done this very thing in a cost-effective way. I appreciate the commissioner's intent in terms of kind of pulling out the $195 million fiscal analysis for the entire program. But that's, I think we're missing the point if we only focus on the federal reimbursement, right? We're missing the cost benefit analysis, especially, and I'm not even a kind of paid advocate for individuals who are not children and youth, but if you look at cost benefit for older individuals, you are going to save tons of money by preventative care, because it is people over a certain age that create the greatest burden on the Medicaid program. We know that.
Exactly.
But for children and youth, it's a drop in the bucket. If we do this, we know what the costs are, and we are setting ourselves up for greater success, greater educational opportunity, greater workforce development, all the things that come with healthy children in a time of crisis. And we can do that. We can do that now, if, again, if not now, when? I don't want to seem to be trite about that, but this is the opportunity we have. I mean, the federal government just issued something called the $2 trillion. We're getting 10 billion here. I think we can work on the 25 million to ensure kids and to look at health equity.
And so to be clear, you're talking about that piece of insuring kids, which I lifted before, but also some of our testimony was really about how you can, in a pandemic and public health emergency, but beyond that, separate the health of the family from the health of the children, and the likelihood that insuring those parents will be much more likely that supporting those children's preventive health care needs.
Sure. I mean, the maternal child health dyad is kind of at the crux of well child development and the ability of parents to appropriately kind of set children off on the right path. I didn't mean to exclude that by any means, but that's a exceptionally fair point. That maternal child health dyad, there's tons of literature about the importance of doing that. And that is, I think, a great starting point for this committee.
Thank you so much. Thank you, Madam Chair.
You're welcome.
Thank you. We look forward to reading that information. I appreciate your time, Mr. Cizik.
It's my pleasure.
I see no other questions. The next person is Sonia Hernandez. Molly Markowitz.
Hello.
Hi, Molly. How are you today?
Good.
Good. You can give your testimony.
All right. Well, thank you so much for giving us the opportunity to speak today. My name is Dr. Molly Markowitz, and I'm a pediatrician who works in New Haven, Connecticut. I'm here today representing myself, and my views don't reflect that of my employer. I am speaking today in strong support of Senate Bill number 956. Today, I want to share a story about how the lack of health insurance for children can lead to great harm and negative health outcomes. As a pediatrician, I care for children regardless of insurance coverage. My story begins while I was working on the general pediatric floor. A young boy was transferred to my care from the Pediatric Intensive Care Unit, also known as the PICU. Children admitted to the PICU are the sickest patients, but the good news was this boy was on the mend. After receiving a few more days of treatment in the hospital, he would have been able to be discharged home to complete treatment. However, I would soon learn that this patient was not able to return home as expected. In fact, he would spend the next 3 months living in the hospital. The reason for this extended stay was lack of health insurance. Lack of health insurance made it impossible to discharge this patient home because he could not receive life-saving medical treatment. Health insurance would have allowed him to return home and attend school. His parents could have been able to return to work, and his family would have been able to live together. As a result, countless classes were missed, hours of wages were lost, and the patient spent many days separated from his family. A child living in a hospital is costly, and it is not just the cost due to medical care. The cost is on the patient's and his family's well-being was great. They all experienced great social and emotional harm as a result of being in the hospital. This story is the story of many. Due to lack of health insurance, children, often the most vulnerable among us, experience poorer health outcomes. Research has shown that individuals who lack health insurance experience so many different consequences, such as worsening of their medical conditions, increased levels of stress,
Molly, you lost
Senate
on us.
Bill 956, and I'd be happy to answer any questions. And thank you so much for listening for my testimony today.
Molly, we lost like the last 30 seconds of what you said. I'm sorry.
Okay, where was I?
Just your last sentence.
Okay, I was just saying that I'd be happy to answer any questions, and thank you so much for taking the time to listen to my testimony.
You're welcome. Let's see if we have any questions for you. We don't, but I certainly appreciate you taking the time out of your busy day, doctor, to be with us. So thank you.
Thank you so much.
Next is Orlena Piedra, and there'll be an interpreter. Yes, thank you. Welcome.
Buenos días, buenas tardes.
Good afternoon.
Mi nombre es Orlena Piedra. Soy madre de New Haven y no tengo seguro por ser migrante.
My name is Orlena Piedra. I'm from New Haven and I am a mother, and I also don't have health insurance due to my legal status.
Apoyo la ley SB 956, una ley que proporciona asistencia médica a determinados individuos sin importar su estatus de inmigración.
I stand in support of Senate Bill number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language so that it clearly extends eligibility to all Husky programs to all Connecticut residents.
Soy una persona que se suma a apoyar esta noble propuesta para que se pueda acceder a un seguro gratuito, ya que considero que el tema de salud es bastante importante a nivel mundial para todos.
I support this cause because I believe that access to affordable healthcare is a human right and should be afforded to everyone worldwide.
El hecho de estar saludable es un inicio para poder ser productivos, no solamente aquí, sino en cualquier lugar.
On this bill.
Continue, I apologize.
Ok. Todos tenemos derecho a tener una vida digna y con todos los servicios de salud y lo que sea necesario. Y yo creo que este país es uno de los primeros que se debe preocupar por eso.
We all deserve access to being healthy and being able to live prosperous lives.
No obstante, quisiera compartir algunas de las experiencias que he tenido con respecto a mis opciones de salud en el pasado, en los cuales yo creo que me sentí rechazada, denigrada y hasta maltratada.
I would like to share with you some of my personal experiences when I felt rejected and overall humiliated as a human being.
Hace unos meses tuve la oportunidad de acudir a emergencia y con un fuerte dolor en mis pies. Tenía meses llevando con este dolor y luché por conseguir una cita médica. No obstante, me negaron por la atención, ya que no contaba con un seguro médico.
A couple of months ago, I experienced severe pain in my legs, and I held on until I could no longer stand it. When I went to the hospital, they rejected treating me because I did not have health insurance.
Insistí que yo quería pagar la consulta, sin embargo, no me tomaron en cuenta. Así que mi última opción fue tomar la opción de emergencia, en el cual con mucho dolor ingresé alrededor de las 12 del día para poder atenderme, pero estuve saliendo casi a las 10 de la noche.
I insisted that I would pay out of pocket, but they did not listen to me. So in last resort, I had to go to the emergency room.
Luego de la atención, más o menos de que fueron 9 horas de espera, es frustrante ver cómo la gente con seguro pasa tan rápido y unos más rápido que otros. Y al último ver la sala vacía y darse cuenta que eres marginado y rechazado. Esa fue la primera mala experiencia que tuve para la atención. Y yo, pues, bueno, yo tuve y podría considerar que no fueron más de 10 o 15 minutos en que se me realizó la revisión. Y la doctora ni siquiera me tocó en la zona del dolor, solamente me dijo que tenía un antecedente y que no era para tanto la situación.
After waiting for over 9 hours and watching people who had insurance being looked at, I realized that I was being rejected and I was being marginalized due to my status. And once I was finally seen, it only took 15 minutes. The doctor wouldn't even touch the site of my pain.
Me dieron en ese lapso de tiempo una pastilla y me mandaron a casa. Me dijeron que no era una emergencia y que no hacía falta estar ahí.
In that time, they gave me pain medication and told me that it was not a big deal and that I should go home.
Consideraría una falta grave el hecho de tener que revisar el estado de cuenta después de un mes y darme cuenta que por esos 10 minutos en los cuales no me considero fui atendida correctamente y ahora tengo que cubrir una cantidad de $1,600.
After only being attended to for 15 minutes and not being attended to properly as a human being, I received a bill for over $1,000, $1,600 for subpar care.
Estoy tratando de cubrir y yo me inclinaría porque también con mi hijo he tenido situaciones similares donde yo he pedido que se me otorgue un appointment y para la desventaja nuestra el hecho de no tener documentos y tampoco tener un seguro es un determinante enorme para tener acceso e ir a hacer, no sé, cuidar.
My son has faced similar experiences where both him and I, due to our status, have been rejected and have been discriminated against because of our lack of legal status.
Entonces yo quisiera que por medio de esta propuesta y por medio de los que están representando la iniciativa, que son muchas personas humanas y conscientes sobre la importancia de un buen seguro médico.
And so I urge the committee and all the folks who are part of this hearing to support this initiative because access to healthcare is very important.
Con la importancia de la atención médica a tiempo para ser preventivos y previsivos, para que nosotros podamos tener una mejor calidad de vida y salud.
And to also have access to timely and preventative care so we can live long, prosperous lives.
Yo me sumo y pido de favor que lo consideren en base a lo que mucha gente en todo este país sufrimos por muchas condiciones médicas y no podemos hacernos atender.
I conclude, and I hope that you understand the many struggles that undocumented people in this country face because of lack of status and not being able to access affordable care.
Es todo lo que puedo
Señora,
decir.
perdón, señora, su tiempo ha terminado. Gracias.
Gracias. Buen día. Gracias por su tiempo a ustedes también.
Thank you, everyone. Take care.
Thank you, Orlena. I appreciate you coming, telling your story and sharing that with you. And I apologize for the lack of dignity and respect for you as a human being. So thank you. Please share with her what I said.
Muchas gracias, señora, por atender y compartir su historia con nosotros. Y lo siento mucho por sus experiencias y en sentido de falta de respeto como una humana.
Gracias a ustedes todos.
Representative
Thank you to all.
Abercrombie, you're welcome.
Thank you, Madam Chair. Up next is number 29, Magali Garcia. Magali? Okay, we will move on. Maya Shepherd, I see Maya, welcome.
Hello, good afternoon. Thank you for having me. Dear members of the Human Services Committee of Connecticut General Assembly, my name is Maya Shepherd, and I am the organizing director of Hearing Youth Voices, youth-led community organizing organization based in New London, Connecticut. We stand in support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status, but with the modifications. SB 956, as it currently is written, leaves out many in our immigrant community. It leaves out low-income parents and children under Husky A, and low-income elderly and disabled folks under Husky C. We support modifying SB 956 to include all Connecticut residents that qualify under the full current Husky eligibility. We are here today because lives depend on our states and really our nation's willingness to see healthcare as a basic human right for all people. And when we say all people, that does not exclude undocumented people. our undocumented neighbors, frontline and essential workers, caretakers, families. These words are said in an attempt to further humanize the people standing behind them. Within the last year, we have all experienced the challenges an international pandemic has created. The most vulnerable to these circumstances are undocumented people. Speaking with members of our community here in New London, we've listened to truly terrifying accounts. Stories of people opting to ail and even preferring to die in their own homes out of the fear of what financial strain and displacement a medical visit and in turn medical bills will create. This is not an issue of judgment. It is an issue of constitutional flaw. Tax-paying members of our community deserve dignified care. When the health of our community members deteriorate at an accelerated rate due to lack of adequate coverage, so does our societal and economic strength as a state. A study done in 2008 reveals that 181,377 people in our state are uninsured. That was 6.3% of our population at the time. And we asked you to consider how COVID-19 has exacerbated these numbers and also who is left uncounted and unconsidered. An expansion of language in this bill can transform healthcare for all people in our state and create healthier and more equitable communities. We support SB 956 with the modifications above and hope the committee will make those changes. Thank you for your time. Maya, Hearing Youth Voices.
Thank you, Maya, for your testimony. We do appreciate it. Not seeing any questions. Have a great day. Up next is number 31, Daisy Leon Martinez. Daisy. I don't see Daisy. Moving on. Asherwa Williams.
Excuse me, Representative Abercrombie. I think she was misnumbered in the attendee panel. I just found her and just promoted Daisy, so hopefully she's here now.
Yes,
Okay.
I'm here. Thank you.
Hi, Daisy. Welcome.
Thank you so much. Dear Senator Moore, Representative Abercrombie, and distinguished members of the Human Services Committee, my name is Daisy Leon Martinez, and I'm an OBGYN physician at Yale New Haven Hospital. I stand in support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status. I moved to Connecticut in 2015 in order to start my training in obstetrics and gynecology. As an employee of the largest referral hospital in the state, I care for some of the most high-risk pregnancies. And while I strive to provide the same quality for care of all patients, the current state legislation prevents me from doing so. About 30 to 40% of our general OBGYN clinic patients are undocumented. Under current legislation, if an undocumented person becomes pregnant, they do not qualify for Husky and are prohibited from purchasing private insurance. They must pay for all medical costs out of pocket or forego care altogether. Ultimately, this creates wide disparities in healthcare outcomes, placing some of our most vulnerable communities at a disadvantage. To provide some insight, I would like to share the story of my patient, whom I will refer to as Jane. Jane is in her mid-20s. She has 3 children and was recently pregnant with her 4th. She is an undocumented person with no formal education and limited financial resources. Due to her family's inability to pay, she delayed seeking prenatal care until the 8th month of pregnancy. Unbeknown to her, during the course of this pregnancy, she developed overt and severe diabetes. Due to her lack of insurance, we were unable to emergently manage her disease in a way that she and her baby deserved. Exactly 3 weeks before her due date, Jane came to our labor floor for evaluation. When we put the fetal monitor on her abdomen, there was no heartbeat. The baby had succumbed to the effects of diabetes. Jane was admitted to the hospital where she delivered an otherwise perfect but stillborn baby girl. I wish I could tell you that Jane's story ends here, but unfortunately she suffered another known complication of diabetes in pregnancy. And at the time of her delivery, Jane developed a life-threatening hemorrhage immediately after. In order to save her life, we performed an emergency hysterectomy, which you can imagine is devastating for a woman in her 20s. When she regained consciousness, Jane found herself in the ICU without her baby and without her uterus. I share this story not to bring sadness, but to encourage action. Jane's disease is common. It is treatable. Her outcomes were completely and undoubtedly preventable. And while we cannot change the course for her, we can help others like her. By extending Husky to all residents, we are sending a clear message to all people of Connecticut that we value their health and well-being. We are helping them access a critical healthcare need so that they may be a healthier and more productive population. And for this reason and many more, I support SB 956, I truly appreciate the committee's time and consideration and hope the committee will vote favorably. Thank you.
Thank you, and thank you for sharing your story. We really do appreciate your service to the people that we represent and for sharing your story as difficult as it was. So thank you very much. Thank you for being here. We do appreciate it. Up next is Ashwa Williams. I think I saw her.
Representative
in the-
Abercrombie,
Yes.
excuse me, Representative Hughes has her hand raised.
Oh, go ahead, Representative Hughes.
Thank you, Madam Chair, and thank you, Doctor, for your testimony. I just wondered if you could, it echoes such the provider trauma during this pandemic that I'm seeing and compounded from service providers like yourself. I'm just wondering if you can speak to, you spoke to this one family, and I'm wondering how many more, I guess my question is, what percentage of preventable, treatable conditions are you seeing that are going untreated?
That is a great question. So just for context, I'm a specialist training in maternal fetal medicine. So in our division, we take care of high-risk pregnancy. So I only see a subset of the pregnant population in New Haven. And we get referrals from the entire state of Connecticut. Sometimes there are emergency referrals where people are transported by helicopter or by ambulance to our hospital in critical condition. I can tell you that I have a ballpark number of what that looks like for the community of New Haven specifically, but the state at large, I have a little bit of a harder time ascertaining. And the reason is this: the Yale New Haven Hospital System has currently a program called Me and My Baby, which is actually a remnant of a program that the DPH funded from 88 to 94. This program no longer exists, but when it was in existence, the Department of Public Health of Connecticut was providing some coverage of costs for prenatal care for women that were undocumented in the state. And when this program ceased to exist in 1994, the Yale New Haven Hospital System decided to continue it. And it's a free care system of sorts that we have in New Haven. Unfortunately, it's only available to women who reside within the county of New Haven. For those women, every year the number varies, but I just looked at the numbers for the last 7 years, and the number of women who we are able to identify as undocumented and are able to successfully enroll into the program for some form of financial assistance, the number ranges from 180 to 220 women from the New Haven community. That does not account for people from Norwalk, from the Hartford system, from Waterbury, which is a much larger number of people who do not qualify for this system. I would say that the bulk of undocumented women are young and healthy. The bulk of them have preventable disease that presents in pregnancy, such as diabetes or hypertension that is mismanaged or missed. And I would say that unfortunately, the outcomes that we are seeing in this population, the bulk of which is preventable. This patient is just one example, but I can name you many of women who just were identified too late or were too scared to present to care sooner, or had a lot of other barriers that didn't allow them to come to us at a time where we could have prevented this type of outcome. It's a huge burden on the healthcare system, as other colleagues have mentioned. Diabetes care is pretty simple. You give them insulin and you manage their blood sugars, and you can avoid an ICU stay, an emergency operating room, surgery, multiple units of blood that were, donated by people in Connecticut to keep this woman alive. It really took so many resources, and yes, she lived, but I can tell you that it was a devastating thing for her and her family. Unfortunately, they didn't even have the financial resources to bury her child in a way that they saw fit. And I think it's really hard to tell a mother that they cannot let their child's remains rest in peace. So it is a young, healthy population overall. These are preventable things. And if we just gave them a little bit of help and support, we could go a long way to save a lot of these stories from happening.
Thank you so much. That's all, Madam Chair.
Thank you, Daisy, and have a great day.
Thank you.
Ashwa Williams.
Hello, I'm Asharia Williams. I'm a student at University of Connecticut. I stand in support of SB 956. As someone who has come from a family of immigrants, my family has worked hard to allow me to achieve the same dreams that they were never able to accomplish. Their immigration status has always held them back from doing things that they struggle with access to many things, one of them being healthcare. My family has had to endure the pain of a million injuries and serious life-threatening conditions that could have easily been avoided. because they couldn't afford the expensive cost of the hospital system. No one should ever have to feel intense pain because of the cost or citizenship. A family's first reaction to anyone in pain shouldn't be that they don't have the medical assistance to be able to go to a hospital. Definitely shouldn't dictate whether a person dies or lives or be in suffrage until they're able to afford it or just come to an end. Healthcare is a human right, and there shouldn't be a question of whether or not one receives access to an ability to pay or immigration status. Sickness doesn't go away with no help or attention provided to it. The hospital is not a pick and choose who gets the necessary attention that one needs. They are designed to help people, and when they don't due to income or immigration status, it defeats the whole purpose. It makes people not want to go, and it makes them spare in their life to go to a hospital because they don't know if they go in for a broken leg and they come out with over $1,000 bill and they just can't afford it, and they have to feed their family on the table. Access to healthcare is also an economic issue. Immigrants deserve a fair and equal opportunity to the programs that are funded. Without coverage, immigrant families will fall into debt just because they wanted good help. Having access to healthcare shouldn't be a matter of, should I keep my loved ones from dying or should I keep food on the table for everyone else? Access to healthcare will save money and lives, and there should be no hesitation as to why this bill should be supported. I support SB 956 with clear language to send current Husky eligibility rules to all Connecticut and hope you all vote in favor.
Thank you. Thank you for your testimony. Seeing no questions, have a great day. We appreciate you being here. Up next is Shamit Sengupta.
Thank you. Good afternoon, Senator Moore, Representative Abercrombie, and members of the committee. My name is Shamit Sengupta. I live in West Hartford, and I work as a PCA and companion, and I've been doing that for 3 years. I come before you today in support of HB 6560. Later in this hearing, you'll be hearing from other colleagues of mine who, testifying about Allied. I heard before that we're calling for training, improvements of training, and while I do agree with that, it does not absolve Allied of its problems. Yes, sometimes consumers can make mistakes, but as you'll hear from others, Allied still has issues even when people submit correct timesheets. That said, however, the fact that Allied absolves itself of any responsibility by blaming consumers is troubling because they classify consumers as employers and mandate that timesheets be completed by them. But if they blame the consumers, then why do they mandate that? Before my home care agency switched entirely to EVV, I was responsible for doing my own timesheets. The consumer would verify the hours and put a signature on it if it was correct. But it was my job to fill it out. It is my job to make sure that it gets sent to the office at the end of the week. And I've never, ever had any pay issues with them. And as if Allied's incompetence wasn't problematic enough, they make it incredibly difficult to get anything resolved. They always take 45 minutes to an hour to answer the phone. And when you do reach someone, they're rude and condescending. In addition, they have actually inserted language into the PCA new hire training that instructs PCAs not to contact Allied if there's an issue. So they are incompetent, they blame consumers, and they don't want anyone to be able to contact them. And if they were a regular business, they wouldn't be around anymore. They'll be out of business a long time ago. And yet we continue to support them. It is embarrassing. It's absolutely embarrassing that we keep doing this. I call for you to terminate their contracts. Thank you for your time.
Thank you very much for your testimony. Seeing no questions, have a great day. Up next is Tracy Wodach.
Hi, can you hear me? Yes, okay. Senator Moore, Representative Abercrombie, and members of the Human Services Committee. My name is Tracy Wodach. I'm the president and CEO of the Connecticut Association for Healthcare at Home. Home healthcare agencies are licensed by DPH and certified by Medicare to provide skilled medical services, including nursing, social work, physical, occupational, and speech therapy Both our federal and our state DPH regulations require that we provide social work services which are reimbursed by Medicare and commercial insurances. However, in-home social work services are not covered by Medicaid. We support SB 957 to implement a Medicaid rate for home health social work services. The committee heard from Commissioner Gifford at the beginning of today's hearing that DSS does not support this bill, as such social work services are not covered under the state plan federally. She further stated attempts to add rates are not allowed, and that DSS already supports behavioral health social work services through clinics. SB 957 is specifically for home health social work counseling, assessment, and support services. You will hear from several home health social workers today regarding their value and why the in-home expertise is needed versus a clinic setting. Let me explain the expertise of a social worker in home health. They're highly trained, minimally master's prepared to provide support and resources to patients and their families. They work closely with the home health team. They advise on a number of home and community-based issues, including assisting with community and state support programs and services, helping to find financial assistance resources, including assistance with applying and reapplying for state-funded waivers and Medicaid, offering coping strategies for patients and their families while being keenly aware of the social determinants impacting their lives and decisions. And they provide counseling for emotional difficulties, including depression, anxiety, and other mental health issues. These are all skills and services that help people stay in their homes, the least costly setting. In addition, the patients served by the licensed home health care agencies are often the sickest, most chronically ill, and have extenuating medical and psychosocial issues, necessitating social work services to evaluate and recommend appropriate resources and supports. There is no other role, including the Department of Social Services suggested clinic setting, that can skillfully address a client's social determinants than a social worker who assesses the client in their own home. Social determinants of health have long been addressed by the home health care agency staff, especially social workers. This is not new. Finding a way to support payment for such services through Medicaid is needed now more than ever, and it will quickly realize further cost savings across the care continuum, particularly through reduced hospitalizations, ED visits, and institutionalization. Thank you for the opportunity to provide testimony.
Thank you, Tracy, and thank you for your work. So is your testimony, you believe that we could get this as a covered benefit under Medicaid?
Well, you know, based on what Commissioner Gifford is saying, she says at the federal level, it's not possible. I can't see why, when we have a Medicare rate for it, it is supported through Medicare, and we are certified through Medicare, Medicaid, Centers for Medicare and Medicaid Services. So I'm not sure why she's saying it's not allowed federally.
Can you reach out to some of your colleagues, because I know you're a part of the association, and get a confirmation that Medicaid will pay for this? That
Yes.
would be helpful.
I will
Thank
do
you.
that. Thank you.
Thanks. Representative Hughes.
Yeah, thank you, Madam Chair, and thank you, Tracy, for your testimony as a fellow social worker. Can you just speak to real quick why so much of these eligibility services are only accessed through like a social worker case management service, especially for folks that are cognitively impaired, mobility challenged, all those reasons? They can't even access it through the federally qualified health center or anywhere else. Can you speak to that?
Well, I'm going to start. Thank you very much for that question. I'm going to start by letting you know that submitted through written testimony is Alara Caring. And unfortunately, they were unable to have anybody testify today. They have some significant details within their testimony that speak to the applying for re-eligibility. Alara Caring cares for 3,500 Medicaid clients throughout the state, and about 80% of them have behavioral health, and many with severe mental illness. So what the social workers there do, they have 2 dedicated social workers that there's no reimbursement for them, but they are constantly working to help the clients whose eligibility is coming due, helping them stay on track, because what happens is if they miss it, then the agency doesn't get paid for the visits, all the other visits, the nursing visits, et cetera. And it could be sometimes 5 months before they're getting their eligibility reinstated if Elara Caring doesn't do this particular process. The clients themselves, you mentioned their vulnerabilities, but mental health is one of the biggest vulnerabilities. And they just are so challenged by the system, waiting on the phone to ask questions, long wait times, and also just the moment they don't have one little thing done, a T crossed and I dotted, they go to the bottom of the list again. So it's vital for our social workers to be able to get out there and help them obtain their re-eligibility so they can continue to get services, so they don't end up in the institutional settings.
Thank you, Madam Chair, and thank you, Tracy. It's so clear that it shouldn't be that difficult, especially for our most vulnerable patients, essentially, to get eligibility reorganized. And I know, as a licensed master level social worker, I have difficulty navigating that very, very convoluted process. I can't imagine people are actually, sick with all kinds of symptoms and cognitive impairments doing it themselves. It's just impossible. It's quite frankly, deliberately impossible. And once we deny that eligibility and they fall off care, it's catastrophic. So, and costly. It's very costly.
Yeah, they get lost in the system. Definitely.
Yeah. So I look at it as like fall prevention. This investment in Medicaid reimbursement for social workers is like fall prevention, fall in a whole bunch of different realms. But thank you. Thank you.
Thank you, Tracy. I just want to remind my colleagues, we are on number 35, which means we have about 160 more people to testify, just to make sure everybody's aware of that. Up next is number 35, Juana Valle, who has an interpreter, and I will turn it over to Senator Moore.
Thank you, Representative Abercrombie.
Juana Valle está allí.
Estoy aquí.
Buen día, empiece, yo le voy a interpretar. I am going to be interpreting for Juana.
Ok, hola, muy buenas tardes, mi nombre es Juana Valle, vivo
Good afternoon, everybody. My name is Juana Valle.
Vivo en New Haven hace varios años.
I live in New Haven for many years.
Soy trabajadora del hogar y soy miembro de Unidad Latina y de la Alianza de Trabajadoras del Hogar de Connecticut.
I am a domestic worker and I am a member of Unidad Latina en Acción and of the Domestic Worker Alliance.
Doy mi testimonio a favor del proyecto de ley SB 956 por el derecho a la salud para todos, sin importar su estatus migratorio.
I am providing my testimony in support of SB 956, granting access to health care to all people, no matter their immigration status.
Perdí mi trabajo por culpa de la pandemia. Mi esposo trabajaba en una pizzería, la cual se cerró y hasta hoy estamos esperando una reparación económica. Él ahora trabaja en una empacadora de carne.
I lost my job because of the pandemic. My husband also lost his job. He worked at a pizza place. And to this day, we're both unemployed and we're waiting for economic reparations because of our experiences.
Para mí sería muy importante que se diera este proyecto legislativo para nosotros los indocumentados.
For me, it is very important that they vote favorably for this bill that would benefit our undocumented community.
Porque muchas veces nos enfermamos y tenemos mucho miedo de ir a las emergencias sabiendo que no tenemos seguro médico.
Because many times we get sick and we are afraid of seeking care and going to the emergency room because we don't have health insurance.
Porque después no tenemos cómo pagar las facturas que nos llegan. El solo hecho de entrar significa que gastaremos entre $300 y $600.
Because then we have no way of paying the bills that we receive. The sole fact of entering the emergency room means that they charge you $300, $600 to start.
Cuando uno gana a lo mucho $300 por semana,
When
si
we are
pagamos,
making $300 a week,
si pagamos eso, ¿con qué comemos? ¿Con qué pagamos las utilidades?
if we pay $300 for a visit, how are we going to eat? How are we going to pay for our utilities
Y el alquiler.
and our rent?
En este tiempo de pandemia, mi esposo se enfermó con COVID. Todos entramos en cuarentena aislada.
In this pandemic period, my husband contracted COVID and we all had to quarantine and be isolated.
Después me enfermé yo y la segunda cuarentena se hizo.
Then I contracted COVID and we had to quarantine again for a second time.
Y después mi hija también se enfermó y tuvimos que hacer otra cuarentena.
And my daughter contracted COVID and we had to quarantine for a third time.
Fueron 3 aislamientos completos, 3 meses de no ganar un solo dólar.
We had to do 3 periods of isolation, complete periods of isolation, and we were out of work for 3 months.
Realmente tuvimos muchísimo miedo. No queríamos ir al hospital a recibir ayuda porque sabemos que al salir de ese hospital, si no nos mata el COVID, pues nos mata la deuda que vamos a tener en el hospital.
We were very afraid of seeking care. We didn't want to go to the emergency room. We felt that if COVID didn't kill us, the debt would kill us.
Por eso estoy levantando mi voz, porque todos tenemos derechos, tanto la gente indocumentada o la gente con estatus regular.
That's why I am raising my voice, because we all have rights, undocumented people in this state, and everybody deserves health care.
Al final todos somos seres humanos y tenemos derechos de tener un seguro para poder acudir a las salas de emergencia.
We are all human beings and we have the right to have access to health insurance so that we can go to an emergency room when we need it.
Y no tener más miedo, ya que es hora de tener justicia.
And no longer live in fear. It is time to have justice.
Nosotros venimos a Estados Unidos a trabajar y a hacer algo por el país.
We came to the United States to work and to do something for this country.
Aportamos, damos nuestro trabajo, pagamos impuestos.
We contribute with our labor and our taxes.
Pero el país no está haciendo nada por nosotros.
But the country does nothing for us in return.
De ustedes depende que se apruebe esta iniciativa.
It is up to you what will happen with this initiative.
Perdón, señora Vales.
Ajá, dígame.
Favor de resumir su testimonio, por favor.
Esta iniciativa queremos que nos den un seguro básico para estar tranquilos. Cuando una se enferme puede estar con garantía de ir a un hospital. Muchísimas gracias.
We want the basic assurance that we'll have health insurance and that we can go to an emergency room when we have a medical emergency. Thank you very much.
Thank you, Mrs. Valle. How is your family doing now?
Gracias, señora Valle. ¿Cómo está su familia hoy?
Hoy estamos un poquito más mejor con secuelas realmente por lo del COVID, pero ya vamos poco a poco, pero por eso queremos el seguro para poder seguir chequeándonos en el hospital porque las secuelas siguen.
Today we are doing better, but unfortunately we all have remnants of COVID and we are still, that's why we need health insurance so that we can continue monitoring our health because of those remaining effects of COVID.
Well, give her my appreciation for sharing her story about her and her family and 3 people in the family being diagnosed with COVID. And she's right, because we don't know the implications or aftershock when it comes to COVID, what's going to happen to the body. And you will probably need some type of service. So thank her for me.
La senadora le agradece mucho su testimonio, Juana, y dice que usted tiene razón, que estamos todos aprendiendo y que hay que ver cuáles son los servicios que se van a necesitar para personas como usted y su familia que han sufrido el COVID y todavía van a necesitar apoyo médico.
Ok, muchísimas gracias.
Okay, thank you very much.
Interpreting for us. Next I don't see any questions for her. So next I have Jose Casco. Jose?
Good afternoon.
Good afternoon. How are you?
You hear me? You hear me?
I can hear you.
Okay. Good afternoon, Ms. Moore. It's very nice seeing you.
You also.
My name is Jose Casco, and I'm a resident from the city of Bridgeport since 2003. I'm an immigrant. I was born in Puebla, Mexico, and arrived to Brooklyn, New York when I was 21 years old. They are members of the Human Services Committee of Connecticut General Assembly. I stand in support of the SB number 956 and not providing medical assistance to certain individuals regardless of immigration status. With clear language that extends eligibility to all HASKIP programs to all Connecticut residents, regardless of immigration status. As I mentioned before, I arrived from Mexico while I was 21, living in Brooklyn, New York, struggling, trying to find a job where nobody knew me, learn and speak a new language. Finally, after a few months, I found a job in a restaurant where I can stay less than a month. I had an accident. Unfortunately, I burned my right foot with hot water. And because I had no health insurance at that time, I had to walk away from doctor's office, even from hospitals. I was frustrated for months. Finally, after a few years later, I started to have access to a full health coverage, but it's not the same story for everybody. I have family in Connecticut, 2 brothers and their wives without health insurance, and I see how they suffer when they got sick and they have no access to a medical coverage. Members of this committee, for years, have been working in the state of Connecticut doing community services. I'm a director and founder of the Latino Advocacy Foundation of Fairfield County and former city council from the city of Bridgeport. It is cruel and inhuman when you see people crying at the hospitals, requesting medical services due to serious health issues and problems, or see them walk away from the state office trying to apply for public medical coverage. Many times they prefer not visit a hospital or doctor's office. And I'm sure that will cost more money to the state. During last year, about the pandemic, the COVID-19 pandemic, hundreds of persons decide to stay home. They get they get to COVID test. They not even get to the COVID test. Why? Because they were afraid of not having medical coverage or because they were requesting a medical coverage. And a lot of them died. Working closely with the Mexican consulate, they receive about 1,000 cases of deaths at hospitals in Connecticut without adding the rest of our community. It is really uncomfortable see why immigrants have no access to many benefits when we all know that a lot of them, they pay and file in local, state, and federal taxes, and they do not receive any refund. They are very hard worker people. Life for many of these peoples will change. We together support this bill. Just to let you know and remind you, before 2012,
Excuse me, sir. I'm sorry, your 3 minutes up. Can you please summarize?
Sure. I support this bill number 956 with a clear language that extends current HASKI eligibility rules to all Connecticut residents. Don't forget that we already have access to a Connecticut driver license, and people are not complaining. Immigrants, they buy their own cars, they pay their own auto insurance, and they doing a better work and living better with the driver license. So let's work together and have access for medical coverage to all of them. Thank you.
Thank you, Jose, and thank you for the work you do with your foundation. I appreciate it. I know you've been out there a long time, and I know you as a city council person fighting for them also. So I appreciate that. I don't see any questions for you, so I just want to say thank you.
Thank you. Thank you, everybody.
Day.
And I hope you too.
Thank you. Next is Mario Diaz, and there's an interpreter for Mario.
Yes, I'm here.
Is Mario here?
Mario, ¿está ahí para dar su testimonio? Mario Díaz.
I see him. Mario?
Te vemos, pero no te escuchamos.
Creo que Mario tiene que salir y volver a entrar y activar el micrófono, porque en ese momento no tiene micrófono.
Is that Mario or is that the interpreter?
That was another interpreter that knows Mario, I think. But the message was that Mario has to leave the Zoom and come back in because he doesn't have a mic, it seems. The audio is not on.
So I'll go to the next one and I'll come back to him, okay?
Okay, Mario, van a saltearlo por ahora y volver, pero salga y entre, por favor, así lo escuchamos.
So next is Monica Dashi, followed by Keisha Daly.
Good afternoon, everyone. This is Monica Doshi. Dear members of the Human Services Committee of the Connecticut General Assembly. As I said, my name is Monica Doshi. I'm a resident of West Hartford, a member of the Hartford Deportation Defense, and a public health professional. I stand in support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status. At a convention of the Medical Committee for Human Rights held in Chicago in March of 1966, Dr. Martin Luther King Jr. declared, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Today, in the 21st century, the human right to health continues to be differentially realized, with undocumented immigrants disproportionately affected. Legislative failure to institute equitable and humane national immigration reform, coupled with state and other local level inaction, has resulted in undocumented immigrants facing reduced options for healthcare coverage, a key determinant in healthcare access, utilization, and retention. As you know, undocumented immigrants are currently ineligible for federally funded public health insurance programs such as Medicare and Medicaid. Moreover, recent and comprehensive healthcare reform, the Patient Protection and Affordable Care Act, ACA, has had far-reaching expansion of healthcare coverage for a large number of uninsured individuals in the United States, marking a potential pathway to eliminating racial and ethnic health disparities and advancing the human right to health. The ACA, however, explicitly excludes undocumented immigrants from purchasing healthcare coverage through the state health insurance exchanges. Except for emergency medical care, you've heard these stories today, federally qualified health centers are among a patchwork of healthcare provision sites available to those who are underinsured or uninsured, including undocumented immigrants. However, these sites are often overburdened and limited in the provision of services that they can provide, referring patients in need of specialty care to organizations that result in prohibitive out-of-pocket costs for many, including undocumented immigrants. In the absence of healthcare coverage and the presence of many other barriers, undocumented immigrants experience differential access to healthcare services. This contributes to delays in needed care, signals potentially high levels of unmet needs, and likely leads to downstream disparities in morbidity as well as mortality. Moreover, delays in entry and fragmented retention in care can exacerbate health issues, produce financial burdens for families, and potentially pose serious public health threats, a prevailing concern, particularly within the context of global pandemics. The most recent study from 2017 by the Institute on Taxation and Economic Policy estimates that undocumented immigrants in Connecticut contribute roughly $125 million in state and local taxes. They cannot, however, access many of the programs their tax dollars support, including healthcare coverage. This is unconscionable. It is time for Connecticut to do the right thing. It is time for Connecticut to expand its Husky programs to all its residents, independent of immigration status. The right to health is an unalienable human right. Connecticut is long overdue.
Excuse me, your 3 minutes are up. Can you please summarize?
Sure, Connecticut is long overdue in upholding the right to health universally among its residents. I support SB 956, and I hope that this committee can also support this legislation. Thank you.
Thank you, Monica. Are there any questions? Thank you for your testimony. Have a good day.
Thank you.
Okay, is Mario back?
Mario, ¿está ahí?
Okay, I'll go on to Keisha Daly. Is
Sorry,
Mario here?
Yeah, it seems like he's connecting right now. Mario, ¿lo vemos que está conectado? No lo escuchamos, Mario.
I'll come back again. Keisha Daly. Hi, Keisha.
Hi, how are you?
Good, thank you.
Hello, good afternoon, dear members of the Human Services Committee. My name is Katia Daly. I am a resident from Vernon, Connecticut, and I'm formerly undocumented, and I'm coming from a family of mixed immigration status family. I am also an organizer with Connecticut Students for a Dream, and I stand in support of SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all Connecticut residents regardless of immigration status. So I'm coming here today to give you my story in a personal level as to how not having insurance has affected me in my childhood. I came from Peru when I was 13 years old, and I enrolled in Rockville High School right after that, and I became an athlete on the volleyball team of the high school. And I want to tell you all about a specific accident that happened during that. At one of the away games, I had just finished warming up with my teammates, and when I had retrieving the ball, I jumped in an awkward way, and when I landed, I sprained my ankle. It hurt so much, but I didn't say anything. I knew what would it mean to my family if I said something, if I needed to be rushed to the ER, or if the coach will figure it out. I played the first set without complaining, but my coach had already figured it out. I was already limping. My ankle was already swelling up. She pulled me out of the game and asked me why I was limping. I kind of had to tell her that it seemed that I had sprained my ankle and it was hurting very bad. There was in pain. And she was, of course, furious because I had hidden this from her and took me out of the game. I started crying, of course, and my teammates tried to calm me down because they thought that I was crying because of the pain. I was crying because I was not playing in the game, but it was letting them know that the pain, the tears were not for that pain. It was how I was gonna tell my parents that I had an accident, how I was gonna tell them that I had needed an X-ray, needed physical therapy, needed a pain relievers to ease up this accident. I thought that would be a financial burden to my family. It scared me so much to the point that I had that reaction. I'm letting you all know about this story, although no life-threatening, but as we have heard in other testimonies. But I wanted to let you all know that I had to mature very fast at a young age. I needed to understand that my actions could have a great impact on my family's finances, that not being able to have access to healthcare would be detrimental to my family at that exact moment. With my story, I have only covered the mental and emotional strain that undocumented immigrants face due to the barriers to healthcare that they need. There are more barriers, such as lack of coverage, no language.
Excuse me, your 3 minutes are up. Please summarize. Thank you.
So with that being said, I want to make sure that I ask all of you to think about your children, grandchildren, nephews, nieces. When you hear my story, think about them shutting down in fear due to not being able to pay for an injury that happened in the court. I support SB 956, and I hope that you all, I ask the committee to support this legislation as well. Thank you.
Thank you, Keisha. Very nice job. I don't see any questions for you, so I'm just gonna say thank you and have a great day. Next, is Mario able to talk?
Mario, ¿puede intentar hablar a ver si lo escuchamos? Todavía no se escucha. We still can't hear him.
Okay, we'll come back, and if he is, we'll take him when he can get on. So I have Eileen Lawler, followed by Michael Gordon, followed by Lynn Zimmer. Is Eileen here? I see, how about Michael Gordon? Then Lynn, are you there? Lynn? I see you on the screen. I'm going to move on. Kristen Reese.
Hello, hello.
Lynn, you there?
Yeah, Miss Lynn is here.
Okay, Lynn, then you're next there.
Hello. I'm in the hospital. Did you hear me?
Is this Lynn?
Yes.
Yes, I can hear you, Lynn. You're in the hospital?
Yes.
Oh, I'm sorry to hear that.
It's okay. I had a stroke, another stroke.
Did you just have it today, or did you register while you had it?
Sunday, I had it.
Okay, then. Are you able to talk?
Yes.
Okay.
It affects my speech. It affected my optic nerve. But I'm for healthcare. My caregiver doesn't have healthcare, and they should. They all should, even immigrants and people who don't have healthcare should be covered because it's a human right. If you don't have healthcare, it's people suffer from not going when they have bad diseases or they go to the hospitals, and the hospitals get overrun by non-payment. With the COVID, there are so many people that have now related comorbidity of the COVID. So to not receive health care, Connecticut is denying so many people for what they need with COVID and with our caregivers. They put their lives at risk, and they put my life at risk. I need a healthy caregiver. I don't need somebody who doesn't have health care. If my caregiver gets colds and they come and care for me and I get a cold, I get sick and I have to go to hospital because I need a new heart. And if I get a cold, it compromises me. So they need health coverage. They need sick leave. They need more pay. This is ridiculous that this state doesn't offer this, because this is and even you, if you have kids like a disabled child, you can get a caregiver. If you have health care, you have health care, you don't likely see the need for everybody else that doesn't have health care.
Excuse
But
me, your 3 minutes are up. Can you please summarize?
yes, this state needs to give health care. I'm sorry. Thank you so much.
Lynn, I just want to thank you because that's very unselfish of you, that you're in a hospital and you're thinking about somebody else. And I know it's your caretaker, but it's very generous of spirit. So thank you for doing
You're
that. I
welcome.
hope that you heal. Representative Hughes.
Thank you, Madam Chair, and thank you, Lynn, I'm so sorry you're in the hospital, but I just wanted to thank you for pointing out the connection between the caregiver's health and your health and the community's health. There is, by denying access to a whole sector of our community and caregivers, we are putting at risk all those who are, immunocompromised and in vulnerable health situation.
Yes.
So I'm so sorry you're in the hospital, and thank you for showing up to testify in spite of it all. Bless you.
Thank you.
Thank you.
Thank you so much.
Be well.
I will.
All right, so I'm looking again for Mario Diaz. Are you here, Mario?
Mario, estamos buscando su testimonio nuevamente. ¿Está ahí?
I saw him for a moment.
Lo vimos por un momento y después se fue.
I'm going to Kristen Reese now, followed by Anthony Lagon. Kristen?
Hi, can you hear me?
I can. How are you?
Awesome. I'm good. How are you?
Good.
So my name is Kristen Reese, and I'm a physician specializing in pediatrics in New Haven, Connecticut. This testimony reflects my own personal opinion and does not reflect the opinion of Yale University or Yale New Haven Children's Hospital, where I work. As a resident of New Haven and a pediatrician, I strongly support SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language to extend coverage to all low-income residents regardless of immigration status. Healthcare is a human right, and no person should be denied that right due to an inability to pay or immigration status. Undocumented residents in Connecticut are currently unable to access any healthcare coverage. They're prohibited from buying into Access Health Connecticut and are not eligible for Medicaid or Medicare. And private insurance companies are either too costly or refuse applications from undocumented individuals. And for undocumented children, lack of health insurance can lead to poor health outcomes. As a pediatrician, I see kids at regularly scheduled intervals to ensure proper growth and development, to ensure common childhood diseases such as asthma and diabetes are being managed appropriately, and to check in on mental health, which right now is especially important. Uninsured children are much less likely to get necessary medical care, preventative care, or timely treatment for illness or injuries. Lack of access has broad implications too. Healthcare affects their school performance, their lifelong health, and future earning potential. Last year, I took care of an undocumented child for many months in the Children's Hospital. Although his parents were both undocumented immigrants and working full-time, they did not have health insurance. This child's illness was so severe, he required a lengthy stay in the pediatric ICU. Thankfully, he recovered. However, due to his lengthy illness, he had residual impairments that required outpatient care at a rehabilitation facility. Because this family did not have health insurance, this child spent many unnecessary months in the hospital instead of being able to go home and get the services that he needed to optimize his recovery. We really have to do better for our kids in Connecticut. 6 states, including our neighbors in New York and Massachusetts, have already expanded their programs to cover all income eligible children, regardless of the immigration status, and we should be next. Every child should have the right to access healthcare and look forward to a safe, healthy, productive future. In summary, I support SB number 956 and hope the committee will vote favorably. Thank you for your time, and I'm happy to answer any questions.
Thank you, Doctor, taking time out of your busy day. Thank you, I appreciate it. I don't see any questions for you. Take care. Next is Anthony Lagon, followed by Sandra Figueres. Hi, Anthony. I can't hear you. You're muted.
Oh, so sorry about that. Hello, everyone. Good evening. Thank you so much for allowing me to testify today. My name is Anthony Pina Lagon Jr. I am from New Haven, Connecticut. I'm actually in the hospital right now visiting Miss Lynn. I am her caregiver. I'm here to talk about Allied. We've been having so many problems with Allied for years before the pandemic happened. We need more pay. We need health insurance, like Miss Lynn has said, like for the COVID and everything like that. I had an individual who actually caught COVID and I had to bring him to the hospital in my car. And the result of that, I had to be out of work for 14 days, which left my other people with no caregivers. Allied has just been really giving us a problem when they even calls for just calling and checking on your timesheets. They don't pay us on time. It's just been very, very a hectic journey with them. Even when I got signed up with Miss Lynn, it took them over a month to process my application. Over a month. This is a lady who has a heart condition. She's in heart failure and she needed help immediately. Someone who was working with her just quit on her abruptly, no notice, no 2-week notice or anything like that. And I literally volunteered with her over a month until Allied supposedly found my application. I had to go through hoops and holes. I had to contact the case manager, all for her to call and get me hired in an emergency hire. And also, like Ms. Lynn was saying, healthcare is very important. I was one of the lucky individuals in Connecticut whose parents worked for the state of Connecticut. My mom works for DDS and my father is a retired correctional officer. So I had state health insurance all my life up until I was 27 years old. Now I have 3 individuals I take care of. I can't qualify for Obamacare. I can't qualify for Husky. They say I make too much, but my job doesn't offer any health insurance. So where do I go? I've been without a health care for over a year now. Ever since the pandemic started, I haven't had health insurance. It was even crazy just trying to get tested. They were making it hard. We had to go through all these hoops. We had to go through negotiations with the state all last year. All last year, we're still even in negotiations with them. They wouldn't even give us PPE to protect ourselves, to go into our consumers' homes. What type of crazy mess is this? We're supposed to be living in Connecticut. This is supposedly supposed to be one of the richest states in America, but it's hard to tell. It's very, very hard to tell. I sit and talk with Miss Lynn all the time. When she came from Washington State, her caregiver started off with $19 an hour, and they even have health insurance. What's the problem over here? I don't understand. And it even took her over a year to find a caregiver. That's ridiculous. We need something else put in place. We need a registry list where these people, they can find us, the people who are qualified like me. I have a whole bunch of certifications in this industry. I'm an ILST worker. That means independent living skills trainer. I'm a recovery assistant, also a personal care assistant, and also a companion. I don't even have a job description. When I came in here to visit her, they were giving me a hard time because I don't even have a badge that says I'm a healthcare professional. That's ridiculous. I'm a Black man in the United States of America. I've already have a whole bunch of stipulations against me. And then I'm gay. So I already have that against me. People don't like me being Black. People don't like me being gay. And now I'm trying to be in the field of a healthcare professional, and I can't even get acknowledged as being that. You guys
Excuse me, Anthony. Excuse me, I'm sorry to interrupt. Your 3 minutes are up. Please summarize.
Okay, thank you so much. So I'm just going to summarize by saying, can you please support this bill that puts pressure on Ally to either get them fired and replaced? And can you please support giving healthcare workers like myself health insurance? I believe it's very dire in the state of emergency that we're in right now. And yes, that's all I'm going to say. Thank you so much for allowing me to testify. You all have a wonderful and blessed day. If you have any questions, I will feel free to answer.
Thank you, Anthony, and thank you for taking care of your clients so that you're not able to come into the hospital. Whether we do have someone who would like to ask you a question, Representative Hughes.
Oh, thank you. Thank you so much, Madam Chair. And Anthony, can you speak a little bit? I don't know if you heard the testimony before about Allied, but whether online training appropriate would resolve the problem of, the hoops and not getting paid on time. And secondly, going to a computerized, online program, would that resolve the issues with Allied?
I'm not sure. So Allied, we compare them with Sunset Shores. They're under the same waiver and everything like that. And Sunset Shores is sending out the EVV and everything and all of that. I don't know what's going on with Allied, if it's the staffing or if the people just don't care. But people have been doing the EVV for over a year now, and they're still having problems. I know one woman personally. She's a member of the union. She's one of my good sister union members, and she sends her fax over 5 different ways because Allied still says they don't get her EVV. They just sent an email today saying that they were having issues and everything like that. And then they resent another email saying, oh, everything was corrected, but people still aren't getting paid. They might not get paid on a Friday, and then all of a sudden, Allied might find the information or whatever and then try to pay them the next day, but it's still hell. Excuse my language. It's still hell. Even switching over to the EVV, it's still been a problem. It hasn't resolved much of anything. I'm honestly afraid to completely switch over to EVV because I can't afford to not be getting paid. I have 3 people. 2 of them are through Allied. I can't afford to not get paid. I'm still waiting on them to send my paycheck for Miss Lynn and my direct deposit when they claim they have not gotten it. I've been working with her since August, but I've only been getting paid with her since October because they couldn't find my application.
So basically you're testifying that you've been given unpaid labor, uncompensated labor, and that Allied's sitting on that income that's owed you. So that
they told me that it was
like wage theft.
Yes, they told me it was nothing that they can do, and that if I wanted to pursue it, I would have to go after her. I'm not going to do that to her. I'm not going to sue an elderly lady who needs assistance. That just sounds really crazy and baffling to me that they would even do that. That's an attack on her. That's letting her down. So like I said, I volunteered for over a month, literally sending my application in multiple times, multiple times, even to the point where Miss Lynn was witnessing it. When they finally processed it, because like I said, I had to go through hoops and get to the case manager, and she got me an emergency hire. They finally processed it, and I sent my timesheet over. They said they didn't receive my timesheet, but they had my bank account information. So I'm gonna go send the timesheet over again. I get a check in the mail. So I waited until I got back with Miss Lynn. I said, remember they said they didn't get my timesheet, but they got my bank account information? She said, yeah. I called them again. I said, hey, I just got a check in the mail. You guys say you have my bank account information. What's going on? Oh, we don't have your bank account information. We don't have any of that. So I sent it over again. This was in October. I still don't have that direct deposit information. I still have to wait for that check all the time.
Yes,
So,
I
like
think Representative Abercrombie may want to speak to you on that. Representative Abercrombie?
Thank you,
Okay.
Madam Chair.
Hi, Anthony. Thank you for being here today. Just a quick question for you. Have you started or not started EVV yet?
I'm afraid. I have not started. I'm totally afraid.
So let me tell you, I think that you're going to be very happy with it. A lot of PCA providers who work for the DDS population, which is the Department of Developmental Services, were
Yes, I know
little,
my work for them.
yeah, a lot of them were afraid at the beginning also about EVV, but EVV, what it does is your information goes directly to Allied. So you don't need to go through your consumer anymore, which will make it more efficient. So I urge you, because I know that the PCAs in your population are the last to go on EVV. It is something that's been implemented over the last 3 years here in Connecticut, and your workforce is the last to be part of this system. I hope that you give it a try. I think you're going to be very happy with it. I haven't heard from any employees that are using it that are not happy. As far as the Sunset, the other program, that they only do DDS, which is a much smaller population. We are looking at if there's anything that they're doing that we can incorporate under Allied. We will definitely do that. But just keep in mind that the population they serve is like a quarter of what Allied does. So it's not really apples to apples. So just so that you're aware of that. And then the third thing is Allied is up for the renewal of their contract because of COVID. Most DSS contracts have been extended for 1 year. I think that that's what they're going to be doing with Allied, but it's not an automatic renewal for Allied. Allied will still have to go through the process of applying for the contract. And if there are other providers out there that think they can do it better, they are free to apply for it. So the state has a very open contracting process. So it's not a given that Allied will be the contractor in the future. So I hope this helps.
Thank you so much, Representative Abercrombie. But I also have personal friends who have been on the EVV with Allied since last year, and they got off because Allied could not get it together. So I don't know if maybe a whole year of doing it has improved, but I know, like I said, I know one woman who she still has been doing it for 1 year, and she sends her timesheets over 5 different ways because the EVV was not working for her with Allied. Like I said, I don't know if it's the staffing up there or if it's people that are in that building who just really don't care, because when you call them, they're rude. They're even rude to my consumer. They talk down to her like she's nothing. So I think it's a staffing issue up there. I'm not saying that they're not capable of doing their job. The people that they have doing it, the people that they're having processing payroll and everything like that, they're not doing what they're supposed to be doing. They're just not. And I know this for a fact.
And I'm not denying that, Anthony. I'm not denying that there's a problem with Allied. I totally agree with you. The thing you have to understand is, as a state, we don't have a choice with EVV. This is a federal mandate that came down 4 years ago. Your
No, I totally
particular,
understand that. I totally understand that. And I'm totally willing to go to EBV. What I'm saying, because I honestly think it makes life much easier, and I'm all about the planet, let's save the trees. But I personally think that you all need to do something to reprimand Ally and hold them accountable for when they just keep screwing up. They just keep screwing up and they don't care. They really don't care. You call them, you're on hold for over an hour, sometimes 2 hours out the day. I have 3 people I take care of. I don't have the time in my day to wait on hold for Ally to figure out what's going on with EBV or what's going on with the timesheet or what's going on with this or what's going on with that. They don't even care. They don't even want to give you the answers. They called my consumer, Miss Lynn. You see, she's in the hospital. They sent her to the hospital because they were aggravating her so bad with the application that it became overbearing for her. Too overbearing. So all I'm saying is you guys need to reprimand them in some type of way. I'm not saying I'm not willing to meet Allied halfway. Sometimes you'd rather work with the devil you know than find somebody completely new. But they have to hold themselves accountable. They have to do more. If I'm out here doing what I'm supposed to be doing, they have to do more. There has to be some recommendation, something, some consequences for them, because I have a consequence. When I don't get paid on a Friday, there's the consequence for me. I have a late fee, I have rent, I have a car note, I have car insurance, I have all this stuff that, we're supposed to have to make it through this world to survive. I also have to eat at the end of the day. And I'm over here testifying because I don't have health insurance. So we got to fix this.
Anthony,
so
I get it.
Anthony, let me just
Yeah.
say, I hear you. I'm not disagreeing with you at all. I hear you, and we're going to do the best we can to fix it. Thank you, Madam Chair.
Thank you. Thank
So
you. Have a
Anthony, I
blessed day.
just want to say on the bill that we had, there was a fine. It doesn't seem like much when people are making large mistakes, but we have heard you. We've heard you all through COVID-19 for the next year, or the past year on PPE and all the issues. And I got to tell you, people have been fighting for you. It may not look like that, but I tell you, we were fighting hard. And I don't think there's anybody who was not fighting for you because we understand the work you do and the importance of it. So I just want to thank you for taking time to give us testimony, and thank you for taking care of Miss Lynn. Have a
Thank
good
you
day.
so much. You too. Have a blessed day.
You too, dear. Next is Sandra to get.
Yeah.
Are you
I'm
there,
here.
Sandra?
Yes, I will need an interpreter, please.
Hola
You'll need an
Sandra, aquí
interpreter?
estamos. Sí, para
Ok.
interpretarle.
Sí, muy buenas tardes, miembros del Departamento de Salud. Estoy aquí a favor de la ley SB 956 porque he tenido el año pasado el peor año de mi vida. Me he contagiado de COVID 2 veces.
Discúlpeme, Sandra, déjeme.
Sí.
Buenas,
No,
good afternoon, members of the committee. My name is Sandra Trigueros. I am here to testify in favor of SB 956 and to tell you the story of the worst year of my life because I contracted COVID.
Yeah. Me contagié de COVID 2 veces y debido a eso tengo muchas complicaciones médicas que hasta el momento no he podido resolver por no tener seguro médico.
I contracted COVID twice, and up to this point, I have not been able to fully get better. I have had many complications, and because I don't have health insurance, I haven't been able to seek care.
Yeah, I have cita. He estado viendo doctores, pero hasta el momento no me mandan a ver especialistas, pero debido a que no tengo seguro médico, me posponen las citas y hasta el momento no han podido resolver realmente el problema que tengo y me afecta mucho.
I have seen doctors who then refer me to specialists who, because I don't have health insurance, are not able to help me, and they keep delaying my appointments, and I have not been able to get the treatment I need.
Ya es casi un año de que me enfermé por primera vez y ahora en febrero fue mi segunda vez que me complicó más mis condiciones preexistentes que tengo de salud.
It has been a year since I first got COVID. And then in February again, when I got it the second time, it was worse and I had complications because of my pre-existing conditions.
Me gustaría que hubiera algún seguro médico. No estamos pidiendo que sea gratis, sino que sea accesible para personas como yo, que yo sé que hay muchas.
We are asking today for access to health insurance. We don't want anything free. We are asking for the opportunity to have access so that we can pay. And it's for many people, not only for me.
Desgraciadamente conozco muchas personas que han pasado por lo mismo, han perdido sus trabajos y están enfermos como yo, que no he podido trabajar todo este tiempo y es muy difícil.
I know many people who are in the same position who have lost their jobs in the pandemic. And we have all had a very hard time and need health insurance.
Gracias.
Thank you.
Thank you for your testimony. I don't see any questions. Thank you.
Gracias por su testimonio, Sandra.
Errol Mesquita.
Hello, everyone. Good afternoon, Madam Co-Chair Senator Moore and House Representative Abercrombie, ranking members and members of the Human Service committees. My name is Errol V. Mesquita. I am a Bloomfield resident, and I am currently obtaining my master's degree in social work at the University of Connecticut. I also come from a family of immigrants. I strongly support Senate Bill 956 and the provision of medical assistance to individuals regardless of their immigration status. It has been reported that there are about 140,000 undocumented immigrants living in Connecticut, and within that 140,000, they identify as Hispanic or Latinx. Husky Medicaid is known for providing comprehensive health care with basic benefits such as preventative care, doctor visitations, women's health care, and other essential resources required to provide an adequate lifestyle. However, marginalized communities are constantly battling systemic barriers throughout their daily lives. The COVID-19 pandemic serves as another barrier of their daily stresses, and excluding this community out of their healthcare coverage will not only cause a detrimental damage to our communities, but it will also prolong the fight against COVID within our state. A small quote from our Statue of Liberty states, "Give me your tired, your poor, your huddled masses yearning to breathe free." Well, currently in this pandemic, marginalized communities are suffocating and they are being hit the hardest. This country has a representation of being the melting pot of immigrants, families, and individuals who sought for a brighter future when they're now seen dim. And I believe we still are that land of golden opportunities. And in this matter, there's a choice to provide life to that statement. And with this decision, I believe it's now time for the huddled masses that are yearning to breathe from the chokehold of several oppressions that they're facing today to breathe freely. And I thank you all for giving me this opportunity to testify today.
Thank you, Errol. Very concise. Thank you. I don't see any questions for you. So have a great day. Rosalba Montoya, followed by, I'm going to look again for Mario Diaz if he's here.
Rosalba Montoya o Mario Díaz. Rosalba Montoya, la vemos, pero no la escuchamos.
I see Rosalba on the screen, but.
Yes, la senadora Moore dice que la ve en la pantalla, pero no la escucha, Rosalba Montoya.
Guadalupe, ¿podrías activar tu micrófono?
¿Estoy lista? Ahí estamos, ahí sí la escuchamos. ¿Guadalupe? Sí. Ok, yo le voy a traducir.
Hola,
You can
buenas
go.
tardes.
Good afternoon.
Mi nombre es Guadalupe García,
My name is Guadalupe Garcia.
residente de New Haven,
I am a resident of New Haven,
miembro de Unidad Latina.
member of Unidad Latina.
Proyecto de ley SB número 956.
Bill 956 is what I'm supporting.
Una ley que proporciona asistencia médica a ciertas personas independientes.
It's a law that supports certain people regardless
de su estatus migratorio.
of their immigration status.
Ok, nuevamente es mi nombre Guadalupe García. Les voy a dar mi testimonio.
My name is Guadalupe Garcia, and here is my testimony.
Muchas gracias, estimada representante, miembros del Comité de Trabajos y Servidores Públicos.
Thank you very much, representatives, members of the committee, and public servants.
Llevo viviendo aquí en Estados Unidos 17 años en este país.
I have been in the United States for 17 years in this country.
Trabajé por 14 años en un hotel que se llama Hotel Omni.
For 14 years, I worked at the Omni Hotel.
En el que tenía un seguro médico.
And there I had health insurance.
Por el cual perdí por culpa de la pandemia.
And I lost it because of the pandemic.
Por dicho hotel, también perdí mi seguro médico.
Because of the hotel, I also lost my health insurance.
Mi testimonio por la cobertura de seguro médico.
My testimony is for coverage of health insurance.
Hacia yo que soy inmigrante.
For me, who is an immigrant.
Yo dependía mucho de un seguro.
I was very dependent on health insurance.
Y a hoy les pido, por favor, señora senadora, que me urge un seguro.
And today I ask you, please, Miss Senator, to give me health insurance.
Por la cuestión es esta. Uso lentes.
The situation is this. I wear glasses.
Al que ya tengo que cambiar más de 2 años que no me revisa un oftalmólogo.
And it's been 2 years since I was able to see an eye doctor to get a new prescription.
He tenido mucho dolor de cabeza.
I have had deep headaches.
Me duele demasiado. He pasado con mucho dolor tan terrible en los ojos.
With a lot of pain in my eyes.
Que hasta terminan hasta rojos.
And they become very red.
No tengo para comprarme unas gotas.
I can't afford eye drops.
Que me cuestan $100.
Because they cost $100.
Y esas gotas son muy especiales.
And those eye drops are very specialized.
Ya que tengo eczema, ya que tengo problema más en un ojo de eczema, visión borrosa.
Because I have blurred vision in one of my eyes.
Ok. También tengo problemas dentales.
I also have issues with dental health.
Me duelen mucho.
Señora García.
Sí.
Favor de resumir su testimonio. Le queda 1 minuto, por favor.
Por eso mismo les pido a los señores senadores que me urge de verdad un seguro médico.
That's why I ask all the senators to please.
No es justo que por medio de un empleador yo tenga un seguro.
To please provide health insurance. It's not just that I can only access health insurance through an employer.
Yo quiero que ustedes sean unos héroes y brindar a todos los inmigrantes un seguro esencial para todos.
You need to provide health insurance to all immigrants.
Muchísimas gracias.
Thank you.
Thank you.
Gracias, Guadalupe.
I see no
Gracias,
questions
señorita.
for you, Rosalba. Thank you for your coming on. Next is
Gracias por
Greg
su-
Myers, followed by Doris Perez, followed by Kathleen Flaherty. Is Greg Myers here? Moving on to Doris Perez. Kathleen Flaherty.
Can you guys hear me, see me?
All right, Doris, is that you?
Yes.
Yes, Doris. Go
Hi.
ahead, go on.
Yeah. I'm not great with public speaking here, so I do apologize if I stutter a bit. I'm from Meriden. I am unfortunately a PCA, not by choice. I say that because I am the caregiver for my mother, my father, and my sister. I am hired through Allied, or my mother, I guess, to take care of my mother. The only reason I am a PCA is because it's really hard to keep healthcare workers in staff. After they make a certain amount of money, they are worried about losing their food stamp or their healthcare. So I have a very high turnover. And it's unfortunate because many of them have been wonderful, wonderful PCAs. And at the current moment, I'm sorry, I feel like I should own a house because I can't do anything. I mean, these girls are not getting paid enough to pay for their own insurance, for their own daycare. Now, so I mean, I knew when I took responsibility to take care of my family, because we just don't put our family in nursing homes. That I would have to care for them here and there because aides would call out. But it's overwhelming at this point. I suffer now from mental health. I'm sorry.
Doris, what bill are you testifying for?
It's for the wages and health insurance. For
956.
Yes. So
give yourself a minute. Give yourself a minute. It's okay. It's emotional. If you're taking care of 3 people and they're all family members, I can't imagine what that's like. So just take a moment, take a deep breath.
Like 1625 may sound like a lot, but once you hit a certain bracket, the women are losing, and the gentlemen are losing their Husky or their Medicaid. And 1625 is not enough for them to come out of pocket and pay for their own health insurance. I mean, I think it would really, this will not just help the PCAs take care of their family with the wages and insurance, but it will also help people like myself who fought to get my parents into these programs. I have my father who had a stroke. He's a complete total. I mean, he's with it, but he's a complete total. I'm his power of attorney along with my sister, who helps out when she can. She works for the Red Cross. I am the legal guardian of my younger sister who's autistic. She's almost 40, but she's the youngest. And I take care of my mother. My mother has her own legal, she does her own thing, but she has muscular dystrophy, and basically she can't even cook because she couldn't burn the house down. I'm sorry, I'm just getting, what else was I gonna, I totally didn't even say everything I wanted to say. I'm here 24/7 right now. I feel like a hostage in my own home. I really don't know what else to say. I think I'm done. I'm sorry.
Don't apologize for being emotional. And you're probably really overworked and stressed. So we're all here, and you have a lot of allies here, both coming in to give testimony, but also in the legislature. So I want to thank you for at least trying to, we feel your pain. I don't want you to think that we don't understand or we don't know how bad it is. A lot of people are struggling. So that's why we're having this hearing today. Doesn't matter how many people are on, it just shows how many people need our help. So thank you, Doris. I hope your day improves. All right?
Thank you.
You're welcome.
Thank you.
Next is Greg Myers here? Then I'll go on to Kathleen Flaherty.
Hello, Senator Moore, Representative Abercrombie, members of the Human Services Committee. My name is Kathy Flaherty. I'm the Executive Director of Connecticut Legal Rights Project. We represent people who are eligible for mental health services from the Department of Mental Health and Addiction Services. And I'm here to offer testimony on 4 bills today. I did submit written testimony, so I'll keep this brief because I know you have a lot of people to hear from. Very much in support of Senate Bill 956. I think the people who would be most affected by that bill have spoken far more eloquently than I ever could. So I urge you to support that bill. 957, I did submit written testimony in favor of. If indeed it is contrary to federal law, I wouldn't want to see the state violate federal law. 980, I appreciate the concept of that, but I'm not sure having friends who get coverage under the MedConnect program and clients who work with it. I've never heard anybody complaining about the MedConnect program in terms of its income and asset limits. MedConnect is for people with disabilities who are capable of working. And in fact, when I was at Statewide Legal Services and talking to somebody who had a spend down because they were on Husky C, I said, if you can get a job where you get some kind of pay, you can convert over to MedConnect, which gets you Medicaid. It's the spend down, it's Husky C that needs to change. So some of my colleagues from Legal Aid have sent you in testimony with suggested substitute language for 980, where you look really at the changing the income and asset limits that put people into that spend down. But the bill I really want to talk about today is 6560. I understand because I have served on the PCA Workforce Council for the last 8 years, the problems that we have with some personal care attendants getting paid. And I am not here to defend state agencies. You all know me. I am not here to defend state contractors. You know how critical I am of them when they are not doing their job properly. But what I am here to do is to testify in support of the concept of self-direction. I think this is a suggestion you don't often hear from me. I think this committee ought to consider putting forth a bill that establishes a working group, because I don't think a public hearing, us all speaking 3 minutes at a time, gives the opportunity for the issues to be fleshed out. Get all the relevant stakeholders around the table. The PCA Workforce Council has like quarterly meetings. That's not enough to figure out what's going on here, but I think there is a way to effectively address this. I don't think the Bill and Labor Committee did it. I read your bill too. I'm not sure your bill gets where we need to go either. I think you need to get all the players, including the union, including the state agencies, including consumer employers, and including PCAs around a table where we can get all the issues out and figure out what we need to do going forward to fix this, because it is a situation that needs to be fixed. I just don't think this bill is the way to do it.
Is that in your written testimony?
The working group suggestion isn't, because I kind of thought about that as I was sitting here listening to the testimony today.
Do you want to send us something after on that, Kathleen?
I'd be happy to.
I put in my notes, but if you could see my paper, you'd say,
No
I'm going to
problem.
figure it out later.
I will be happy to send that in writing to you.
All right, thank you. Thank you for your testimony. I don't see any questions for you. Thank you.
Thanks.
Rebecca Tamsin.
Hello, Senator Moore.
Hi, Rebecca.
Senator Moore, Representative Abercrombie, and distinguished members of the Human Services Committee. My name is Rebecca Tamsin. I am the Supervisor of Counseling Services at Masonic Home Health and Hospice, and I oversee all of our social workers statewide. It is my privilege to be speaking with you today on behalf of our organization. I am in support of Senate Bill 957. Masonic has a census statewide of almost 1,500 patients combined for home health and hospice. Medicaid patients represent about 20% of this total census. Currently, Medicaid does not reimburse for social work services within the home health care setting. At Masonicare, we are fortunate enough to be able to use our donated funds to cover the cost of social work visits for Medicaid cases. Last fiscal year, our agency covered $15,000 of social work visits for the Medicaid population through our donated funds. Oftentimes, social work services are desperately needed by patients who have Medicaid. These cases are often complex, need lots of follow-up, and the state DSS caseworkers simply do not have the time to assist. Hour-long wait times on the phone and limited access to state caseworkers create barriers for patients to receive the help that they need. In some cases, people who have Medicaid have no access to a computer, internet, copier, fax machines, have no means of transportation, and have a very limited support system. During our social work visits, we have been able to assist patients with getting their benefits reinstated, help with redetermination paperwork, assisting patients in applying for waiver programs, and coordinating other community resources to maintain the needs of our patients within the home setting. Helping our patients who struggle with health, financial, psychosocial, and emotional issues is the essence of what a medical social worker does in the home setting. Addressing these issues helps to ensure that patients remain in the setting of their choice, which almost always is their own home. The cost savings to keeping patients out of the ED, hospitals, and nursing homes would be a benefit to the state. Having Senate Bill 957 passed would help to ensure that even more patients with Medicaid could get the medical social work services that they need in home. Thank you for the opportunity to provide testimony.
Thank you, Rebecca. And I'm very familiar with Masonic Care. I've met with your leadership, and you do wonderful work. Thank you.
Very good, thank you.
Next is Eden Al-Masood, followed by Hiram. Eden there?
I'm here.
Hi, Eden.
Hi, good afternoon.
Would you pronounce your last name for me? Because I probably butchered it.
My name is Eden Al-Masoud.
Thank you.
Thank you. Distinguished members of the Human Services Committee. My name is Eden Al-Masoud, and I am a registered voter in New Haven. I am an organizer with the SMEA Collective of New Haven and a physician working at Yale New Haven Hospital. I stand in support of SB 956 with clear language that extends eligibility to Husky programs to all Connecticut residents, regardless of immigration status. You've heard a lot of data and reasons to support this bill, so I will share some of my personal story. For years of my childhood, I was uninsured. I have been on my own since I was 14 and did not have the resources to navigate health systems. I know what it is like to be sick and be afraid to seek care because it means making a choice between buying food or paying rent and my health. I know what it is like to let a condition worsen until there is no choice but to go to the emergency room. No child, no person should have to make that choice. And yet, in my role now as a healthcare worker, I continue to see countless patients who have waited for months or years before seeking care. During that time, their conditions deteriorate and the cost of their visit ends up being far more than preventative care would have been. During my last shifts in the Yale New Haven ER, I met a young man struggling with his experiences of trauma, which manifested as a mental health condition and substance use disorder. He did not have any outpatient treatment with primary care or mental health, as he is undocumented and excluded from Husky. He stayed in the ER for 4 days as we tried to get him into the only rehab program in the state which would accept him without insurance. There were still no beds available, and we discharged him to the street with no further options but to return to the ER. With the support of friends, food stamps, and Medicaid, I was able to get jobs, go to college, and then medical school. As a medical student, I needed mental health support and was able to access it because of state Medicaid. Without those resources, I would not be testifying here as a physician today. Those experiences helped me better understand and care for my patients. but I am tired of not being able to appropriately care for my undocumented patients because they are unjustly excluded from health insurance options. It is my moral imperative as both a physician and a community member to fight for the inclusion of all our neighbors in access to affordable health care, and it is your duty as elected officials to listen to those who are most directly affected by this issue and take action to expand Husky coverage to all Connecticut residents. There's a healthcare emergency in our state that requires urgent action to address this issue of racial and economic justice. There's no way to justify the continued exclusion of human beings from healthcare access. COVID-19, like other health conditions, continues to kill people regardless of borders, immigration status, or language. We must also expand healthcare access regardless of immigration status. Thank you for your time, and a call on the Human Services Committee to support SB 956 with clear language to include all Connecticut residents.
Thank you, Eden, for your testimony. Did you say you're a doctor?
Yes.
Thank you, doctor. I think you earned that title. All right, have a good day. I don't see any questions for you. Next is Hiram.
Hiram Fuchs, yes.
Fuchs, yes. Good afternoon.
Good afternoon. Greetings, Senator Moore, Representative Abercrombie, and the distinguished members of the Human Services Committee. My name is Hiram Fuchs. I'm a Connecticut State Marshal, and I'm here to comment on raised House Bill number 6562. And if it's okay with the committee, I'd like to read the letter that I submitted to the committee yesterday as part of my written testimony. Dear Committee on Human Services, my name is Hiram Fuchs, and I'm writing a comment on raised House Bill number 6562. I have been a Connecticut State Marshal since 2012 and a member of the KPS unit since 2014. I have direct knowledge of this system, and I'm offering my perspective on the direction I feel this committee should go. I believe the state should create a task force to study child support related issues, but I feel the scope of their work should go beyond just the technology related to the collection of monies. In my years serving these warrants, I have come to believe that the system is fundamentally flawed. The most significant issue, in my opinion, is the notion that a person can be arrested and jailed for owing money. I understand that a KPS warrant is based on violating a judge's order, but in practice, it amounts to a modern-day debtor's prison. Everyone on this committee should know that when an individual is arrested on a KPS warrant, they end up in the same jails as those accused of violent felonies. Most of our arrestees land at the Hartford Correctional Center, which is a level 4 high security facility. The drive to jail is often a long one, and oftentimes an arrestee will tell us their story. What we hear is a recurring theme of drug and alcohol addiction, physical health problems, mental health issues, and criminal records that prevent meaningful employment. Many arrestees state that they want to pay the debt, but it has become so insurmountable they cannot make any headway. Ironically, when an individual is arrested, they face losing their job when they don't show up to work the next day. This can be especially problematic when the arrested individual is the breadwinner for another family. Even arresting an individual for owed support is no guarantee that it will ever be paid. We once arrested the same individual 3 times in a 6-month period. On his 3rd arrest, he stated that the second time we arrested him, he spent 2 months in jail. His biggest concern going in this time was that he gets a top bunk. The ability of the court to arrest individuals who are in contempt is a powerful and necessary tool. What we need to move away from is the use of mass incarceration to try and solve this problem. I feel this committee should take a hard look at what the system costs Connecticut, both in real tax dollars and the impact it has on our population. We aren't the only state or the only country dealing with this. Maybe there is a better way to go. Thank you for your time and consideration. Respectfully, Hiram Fuchs, Connecticut State Marshal, number 464, Middlesex County.
Thank you, Hiram. I don't see any questions for you, but I appreciate your testimony.
Thank you very much.
Have a good day.
You too.
Next is Abby Bellows, followed by Rachel Bamber.
Hello, Senator Moore and fellow members of the Human Services Committee of the Connecticut General Assembly. My name is Abigail Bellows, and I'm a student intern with Planned Parenthood's Generation Action Program. I am also a senior at the Sports and Medical Sciences Academy in Hartford, Connecticut. I stand in support of SB number 956, an act providing medical assistance and support from all Husky programs to all who reside in Connecticut, regardless of immigration status. As a teenager growing up in the suburbs of Essex, Connecticut, I was extremely sheltered from the harsh realities of the world around me. I never had to worry about what would happen if anyone in my family got seriously injured or sick. And I did not recognize that this healthcare security was not available to all Connecticut residents. That is until I started school at SMS State in Hartford. Going to a magnet school in the city opened my eyes to the cruel treatment that immigrants are exposed to in this new community. I met someone whose story I would like to share. This community member describes the inhumanity that her family was treated with after giving birth. This family was undocumented, coming to America for a better life. They came to America pregnant and undocumented. Upon giving birth to their child in the hospital, they were greeted with disdain. Shortly after giving birth, the hospital staff realized the family lacked insurance and documentation. Mom and baby were sent to a holding cell in Connecticut jail to be deported back to their country. A member of the family, also undocumented, went to retrieve the baby in hope of providing a better life in America. And in this process, all three of them, including the baby, were sent back to their home country. As a young woman who has been sheltered and secure my entire life, I was appalled at the cruelty this family was treated with. Why is my health more important than that of undocumented families? Healthcare should be a right, not only for the privileged, but it's a human right. And I, for one, am no more human than the family or any other undocumented families in America. So why is it that I get to feel more secure in my health and well-being? Being born in America is not a choice, so why are we punishing those who seek the same freedoms we reap every day? After hearing this story and others like it, I urge the committee to support SB number 956 to extend Husky eligibility rules to all Connecticut residents, regardless of immigration status. Thank you for your time.
Thank you, Abby. And what do you do for Planned Parenthood, your outreach?
I'm in their Generation Action program, so this is one of my projects, was working with this bill and getting it passed.
Thank you. I used to do outreach for breast and cervical cancer for Planned Parenthood.
They're a great organization to work with.
We're kindred souls. Thank you.
Thank you.
Next is Rachel Bamber, followed by Sandra Duard. Hi, Rachel.
Good afternoon, Senator Moore. I'm here in support of SB 957, an act concerning Medicaid coverage of in-home counseling. So Senator Moore, Representative Abercrombie, and members of the Health and Human Services Committee. I am Rachel Bamber. I'm a licensed clinical social worker currently working with Day Kimball Healthcare at Home up in the Northeast corner. I've been in the healthcare field for 21 years, with the last 13 providing home health and hospice care. I've had the privilege and honor of working with economically diverse populations throughout Windham and New London counties. Previously, I worked in nursing homes where on a daily basis, I would hear, I wish I could just be home. As a social worker, we are a vital part of the home health care team. The nurses we work with are fantastic at identifying the needs of our patients, but they do rely on the social workers' knowledge and expertise to navigate the complex processes that link our patients to the much needed support services. With chronic illness, injuries, and disabled members of our community, providing for their basic human needs, including food, shelter, health, security, mental health, respect, and self-respect, are part of our vital role. These basic needs are key components of social determinations of health. All too often, the agencies that are caring for the most vulnerable people whose poverty, illness, and limited access to care and community-based supports, without social work services, this could result in catastrophic outcomes. Many agencies provide free social work visits to link their patients to the programs and services to help relieve the situation. As legislators, I'm asking for your help in helping our communities with policies and practices that support the important efforts of all of the social workers providing this service. I'm going to share a patient that was near and dear to my heart. She was 52 years old, lived alone, had such severe lung disease, she couldn't even walk 10 feet to make herself a sandwich without getting completely short of breath. This led to increased anxiety and depression. Her mental health was definitely suffering because of the physical ailments and limitations she had. I referred her to a program in the state, the Community First Choice program. It took about 2 years of advocacy and phone calls to the state for her assessment to be completed and services to actually start. Shortly after, at about 2 years and 3 months after the original referral, her health deteriorated to the point where she was admitted to hospice and pretty quickly passed away. I was fortunate enough to care for her and assist during this difficult time. I helped.
Excuse me, I'm sorry that your 3 minutes are up. Can you please summarize?
Yes. This example I shared is very telling of the importance of not only supporting the mental health care, but also the physical limitations that impacted this woman and many others like her. Thank you for allowing me to testify in front of you in support of Bill 957.
Thank you, Rachel. I don't see any questions for you. Thank you for your time and your testimony.
Thank you.
Next is Kara O'Dwyer. Hi, Kara.
Hello, good afternoon, Senator Moore, Representative Abercrombie, and members of the committee. I am here testifying today on behalf of the bill to get rid of Allied.
What bill would that be, Kara?
I have been a personal care attendant for 6 years now, under various direct care waiver programs administered by both DESS and DDS. And I've cared for 5 different consumers, people of various ages and disability. And with all of these positions, I have unfortunately been at the mercy of the fiscal intermediary, Allied Community Resources, in regard to the hiring process, which takes way too long, payment of my wages, which is completely inconsistent, and my consumers' continuity of care. I'm here today to ask you to discontinue their contract with the state of Connecticut and help thousands of PCAs throughout Connecticut, as well as the people we provide services for. For 6 years, I've had to endure countless hours on the hold, trying to reach Allied to hunt down my paychecks and copies of my documents, to find out why I haven't been approved to work after weeks or even months of submitting my application. At one point last year, just before the quarantine, my consumer's budget ran out and I wasn't notified for 2 weeks, and I could never be compensated for the hours that I worked during that time. Every time myself, my consumers, or their authorized representatives have an issue with Allied, we wait on hold for at least an hour. And then they blame us for things such as the timesheets being too light, too dark. They never got it, even though we submitted it multiple formats. They invent imaginary overlaps in time. A coworker and I, a couple months ago, we almost didn't get paid. They called our consumer on Wednesday and they said, hey, did so-and-so work from 11 a.m. to 3 p.m.? Yeah, okay. And did Kara work from 9:30 p.m. until midnight? And he said, yeah. Well, we have to fix an overlap. What overlap? There's 6.5 hours in between our shifts. And so the girl was like, oh, I'm sorry, there was no overlap. My coworker is the one who pointed out that there was an issue, and then I have to call people I didn't see. My mom is also a PCA who works a second job. And between us both working 2 jobs, we still can barely afford to make a meet.
Excuse me, I'm
Because
sorry
Allied-
I'm sorry to interrupt. Your 3 minutes is up. Will you please summarize?
Okay, thank you. So our expenses don't go away just because the system in place is broken. And for far too long, we've had to deal with things that people shouldn't have to deal with. We deserve to be paid. We're essential frontline healthcare workers. So please pass House Bill 6560 so that we can hold Allied responsible. Thank you for your time.
So Kara, thank you. And you know, we're aware of the problems with Allied, but this is not to get rid of them. It's what we try to do is place a penalty to make them move quicker on this, you know, and get some of this done. And the commissioner who was on first today talked about, I feel like I'm having a deja vu moment, Kara, with this. You know the feeling? Like we really have to
day in and day out.
Yeah,
for at
we keep
least a
saying
year.
we really need to get some traction here and really hold them accountable for getting payments to people on a timely basis, because your other people don't wait for their money, you know, to pay their bills. The grocer's not going to give you your food and tell you we'll come back later when you get the money. So I hear you. I hear you.
And if I could just verify, I know there was some discussion about EVV. I have been trying to switch over for the past almost 3 months now, and they keep sending me conflicting numbers. I was able to log into the system one time, and then I got locked out and I couldn't request a new password, and their customer service is only open Monday through Friday, 9 to 5. You could be in the middle of the conversation with a rep and the phone lines cut off at 5 p.m. on the dot. And they just had a maintenance issue with the mobile app today. It was resolved within about an hour. But in the meantime, people who didn't know that the error was happening and couldn't clock in or out of work, that's not okay. So I don't know, I hope that it's not just a continuation of the issues we have with Allied.
Well, that's why we're doing this, so it's not a continuation, but thank you for your time.
Thank you for
Work
hearing
you
me.
do in our communities too. I appreciate that.
Always.
All right, take care.
Thank you.
Next is Richard Bemagletti, followed by Jaco Chinchilla. Richard, I see you. Good afternoon, Richard.
Good afternoon. Can I see me?
I can't see you, but I can hear you.
There we go.
Now I see you.
Sorry for that. Thank you. And good afternoon. And now the view is blocking my. My name is Richard Famiglietti of East Haven, Connecticut, and I'm testifying today in support of Raise Bill number 980, an act eliminating income and asset limits for the MedConnect program for persons with disabilities. I have been and still employed at the Center for Disability Rights on the Medicaid for the Employed Disabled program when it began in October of 2000. The Med program currently has an income limit, of $75,000 a year and an asset limit of $10,000 for single and $15,000 for married. While this seems pretty generous, it is still kind of limiting. For instance, for me or anyone to try to save up for a down payment for a home, family, kids, college, the asset limits kind of prevent you from doing that if you need extensive care under Medicaid. However, that's not the same issue as when somebody's going to retire, when they're coming off the Med program. So we have all these protection of the assets while you're working, but as soon as I come off the Med program, if I retire, I am still going to need those services. And then I'm going to be put on a spend down. And just to give you a perspective, if you're not familiar, if you're making roughly around $30,000 a year, you buy the Medicaid premium for roughly $100 a month. If your income is between $1,000 and $1,500 a month, your spend down is about $300 a month as well. So you're living on $800 a month in some cases, where you have to pay your rent if you're meeting your spend down. So the income limits for Husky C, an asset has to be removed or raised or something so that people coming off the med program or people who can't work and are just on Husky C can afford to live in the community. And I also want to add, I did not submit testimony, but as a previous Money Follows a Person transition coordinator, I have directly seen these issues with Allied for the last 3 years, not just this past one. That's all I have to say. Thank you.
Thank you, Richard. Let me see if we have any. We have no questions, but I thank you for taking the time to bring testimony. Thank you.
You're welcome. Thank you.
Jaco Chinchilla.
Keiko Chinchilla. He was on and now I don't see him.
I will come back, okay?
Okay.
Ariana Shapira, followed by Gretchen Raffia. Ariana, are you here? Gretchen, I see you. Do you want to go next, Gretchen? Hi, dear.
Thank you. Thank you, Senator Moore. Good afternoon.
Good afternoon.
Senator Moore, Representative Abercrombie, and honorable members of the Human Services Committee. My name is Gretchen Raffa, Senior Director of Public Policy, Advocacy, and Organizing with Planned Parenthood of Southern New England, testifying in support of Raised Senate Bill 956, an act providing medical assistance to certain individuals regardless of immigration status. As the state's largest provider of family planning and sexual and reproductive health care to nearly 62,000 patients last year at 14 health centers across the state, we believe all people should have access to quality, affordable, and compassionate health care, regardless of who you are, where you live, your income, if you have health insurance, or your immigration status. Our state continues to confront simultaneous crises of the COVID-19 pandemic and systemic racism that has driven racial disparities in healthcare access and health outcomes. Now more than ever, people need access to health insurance and health services. Yet thousands of people, including immigrants in our state, still lack access to quality, affordable healthcare. This is always unacceptable, but even more unfair and cruel as we reflect on the 1-year anniversary of a global pandemic that has claimed so many lives and left so many people with lifelong health concerns. SB 956 is just one policy intervention to address the coverage gap by incorporating solutions to provide public health options for immigrants in our state and making sure undocumented immigrants and families who are currently shut out of healthcare market have an option. People who are denied healthcare coverage because of their immigration status depend on healthcare providers like Planned Parenthood, who provide affordable, comprehensive primary and preventative health care. And because many immigrant women can't access private or public health coverage, they are less likely than US-born women to access preventative health care, such as Pap tests, cancer screening, STD and STI screenings, and birth control. Healthcare is a fundamental human right that should be guaranteed to all people in our state. Opening the state's Husky Health Program will allow all income eligible residents access to essential and life-saving care and work towards eliminating disparities in our healthcare system caused by systemic racism and economic inequity. Undocumented immigrants in our state are paying roughly $145 million in state and local taxes every year. In effect, undocumented taxpayers are funding a state healthcare program that they themselves can't use. It's unjust. Immigrants deserve equal and fair opportunity to access the very programs they help fund. No one's healthcare should be compromised or healthcare access denied because of their immigration status. Expanding healthcare for all people in our state is the right thing to do. We can and we must do it. We've heard courageous residents in our state come before you today. You're going to hear so many more people sharing their personal stories about the human impact of the lack of access to healthcare. I hope that the legislature and administration have the courage to act because there are policy solutions to address this problem. Investing in people's healthcare now will have long-term public health benefits for all communities, and we know the dire human consequences of inaction. We strongly urge the committee to support SB 956 and take another important step in addressing health inequities in our state and bring us closer to achieving healthcare for all. Thank you for your time and consideration of this important and much needed legislation.
Thank you, Gretchen. Well, I hope we have the courage. I believe we have the political will, but do we have the courage? So thank you.
Thank you,
checking to see
Senator.
if there's any questions for you. There's not. So thank you for your testimony.
Thank you. Have a good
Have a
day.
good day.
You too.
Jaco, I see you. Are you able to talk?
Jaco,
Hi,
¿está ahí para
yes.
hablar?
I'm Jaco's wife. He's stuck at work and he doesn't have any service, so I was hoping I could read what he wrote in Spanish, if that's okay.
Can you read it in English?
He only wrote it in Spanish.
Oh, okay.
I can translate.
Okay,
Okay.
That's fine.
Okay. Estimados miembros del Comité de Servicios Humanos de Connecticut,
Esteemed members of the Committee of Human Services of Connecticut,
me llamo Jaco, soy un padre, un esposo y residente de Connecticut.
my name
y
is
soy,
Jaco. I am a father and a resident of New Haven, Connecticut,
y soy indocumentado.
and I am undocumented.
Estoy a favor de SB 956, una ley que proporciona asistencia médica a ciertos individuos sin importar el estado de inmigración, con un lenguaje claro que extiende las elegibilidades a todos los programas FOSCI, a todos los residentes de Connecticut, sin importar su estatus inmigratorio.
I am in favor of SB 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all Connecticut residents regardless of immigration status.
Soy de Honduras y llevo casi 7 años aquí. Entré como un menor de edad al país, conocí a mi pareja aquí y llevamos casi 5 años juntos y tenemos 2 hijos pequeños.
I am from Honduras. I arrived as a minor here in the United States, and now I am with my partner, and we have 2 children, and we have been together 5 years.
Desde que llegué me puse a trabajar y continúo a trabajar para apoyar a mi familia.
Ever since I arrived here, I started working, and I have been working to support my family.
Al no tener acceso a seguro médico, casi me cuesta la vida. Pasé tiempo evadiendo al médico, aunque mi esposa me quería llevar al hospital. No quise por temor a los costos.
Not having health insurance almost cost me my life. I had avoided going to the doctor because of not having health insurance, even though my wife insisted that I should go.
Apenas si podíamos pagar la renta, los biles y cosas esenciales. Imagínate un gasto del hospital. Me aguanté lo más que pude hasta que me comencé a poner peor.
We could barely keep up with rent and all the other bills, and imagine on top of everything else to have to pay for hospital bills. So I waited as long as I could until I couldn't wait any longer.
I lost my job, perdí mi trabajo y mi familia sufría porque solo mi esposa tenía que mantenerlos y ella tenía que ir a la escuela y trabajar y cuidar a los niños y yo no podía.
I lost my work, and my wife had to be at home with the kids, taking care of them, and I couldn't do it.
Okay. Poder tener acceso a ese seguro médico podía haber prevenido muchas cosas que pasamos.
Having access to health insurance would have prevented many of the experiences we had.
Lamentablemente, tardaron mucho en diagnosticar lo que tenía. No hacían los exámenes que tenían que hacer. Solo me pasaban de un médico a otro, me hacían preguntas.
Unfortunately, they took a long time to give me my diagnosis. They kept sending me from one doctor to the next, and they would not give me answers.
Hasta que hicieron, al final, después de hacer pasaron varios meses, hicieron un MRI, lo cual ahí vieron que sí había un problema, pero no se veía todo. Hicieron una cirugía de emergencia. Después de eso,
After many months, they finally did an MRI that showed what was wrong and they had to do an emergency surgery.
lamentablemente la primera cirugía no funcionó porque trataban de hacer los exámenes más leves o menos costosos. Entonces tuve que entrar a una segunda cirugía después de varios días de sufrir.
Unfortunately, the first surgery did not work. They kept trying to do only tests that I could afford, and they had to do a second surgery.
En fin, si hubiese tenido seguro médico, me hubiese sido más fácil el proceso y no hubiese sufrido mi familia ni yo.
If I had had health insurance through all this, the process would have been a lot simpler and easier, and we wouldn't have suffered, my family and I, so much.
Ese proyecto ayudaría mucho, no solamente a mí, pero a las personas de la comunidad. Muchas veces uno, aunque esté enfermo, va al trabajo y se aguanta. Imagínate cuántas personas estarían contagiándose. Yo, por ejemplo, si me quedo en casa.
This bill would help us, and not only us, but a lot of people in the community. Imagine how many of us are not or are going to work and not staying home when we're sick, and how many people we can get sick because of doing that.
Sí, sería una gran ayuda poder tener este beneficio porque uno nunca sabe cuándo lo va a necesitar. Si ya estamos pagando por este beneficio, ¿por qué no nos incluyen?
It would be very important to have this benefit. And if we are already paying for this benefit, why are we not included?
Creo que esto va más.
Señora, favor
Sí.
de resumar su testimonio.
Ok, creo que esto va más allá del estatus migratorio y los derechos al humano. No solamente cambiaría mi vida, sino la vida de muchos residentes en Connecticut que también están pagando por este beneficio, pero que no nos beneficia a nosotros. Apoyo al SB 956.
This would go beyond immigration status. This is about human rights, and it is about being able to access healthcare so that we can be well. I'm sorry, me repite la última parte que me dijo, perdón.
No solamente cambiaría mi vida, sino la vida de muchos residentes en Connecticut que también están pagando por este beneficio, pero que no nos beneficia a nosotros. Apoyo a la SB 956 con lenguaje claro que extiende a la legibilidad a todos los programas de Husky y residentes de Connecticut.
Gracias. Many of us are already paying for this benefit, and we need to be included. I support SB 956 so that we can have access to healthcare.
Thank you.
Thank you for your
Gracias por su
testimony
tiempo.
on behalf of your husband.
Gracias
Thank
por
you.
su testimonio en nombre de su marido.
Gracias. Thank you.
Thank you. I don't see any questions. I see Ariana's here, Shapiro.
Yes, thank you so much. I apologize. I was having computer issues before. Dear members of the Human Services Committee of the Connecticut General Assembly, my name is Ariana Shapiro. I live in New Haven, and I work for All Our Kin, a nonprofit that supports hundreds of family childcare providers across Connecticut. Family childcare providers run small childcare businesses out of their homes. They're licensed, they're regulated by the Connecticut Office of Early Childhood, and they ensure that high quality childcare is available to thousands of our youngest children. I'm speaking on behalf of All Our Kin today in support of SB 956 with clear language to extend eligibility of all Husky programs to Connecticut residents, regardless of immigration status. Family childcare providers are and have always been essential workers. Every single day, family childcare providers offer safe, nurturing care to young children. They ensure that parents can enter and remain in the workforce, and they provide economic benefit to their communities. COVID-19 has shown us more clearly than ever the importance of family childcare. While childcare centers were closing down at the beginning of the pandemic, it was family childcare programs that kept their doors open, providing that critical care to the children of frontline workers. even as they support Connecticut in the midst of this public health crisis at a great personal risk to themselves and their families. Many family childcare providers face the additional fear of knowing that they do not have access to health insurance themselves simply because of their immigration status. For these essential workers, this bill is literally a matter of life and death. Take, for example, the story of Viviana, an undocumented family childcare provider from West Haven, who I know well. She kept her doors open during the pandemic until the day that her husband started coughing, experiencing shortness of breath and pain in his chest. When they went to the emergency room, they were denied care because he didn't have a fever at that point in time. And she felt the real reason was discrimination because of their lack of medical insurance and their immigration status. Their family was very anxious and fearful, and she closed her childcare program while her husband quarantined at home for 3 months with worsening COVID symptoms. Meanwhile, they were on a payment plan to pay for an emergency room visit for treatment, for not receiving any treatment. And trying to keep food on the table for their 3 young children with now no source of income. Of course, being undocumented, they were also not eligible for the stimulus payments or for any of the small business loans, even though Viviana is a small business owner. Finally, a specialist found months later that Viviana's husband had long-term lung damage from going undiagnosed for so long. The family was desperate and they decided to move to Florida, thinking that the warmer weather would help his lungs and that the economic situation would be better. Our community lost an essential high-quality childcare program because of this. I actually just spoke to Viviana today. I told her about the possibility of SB 956 passing, and she said, it's been really hard for her in Florida, and she's considering coming back. This might be just part of the motivation that she needs to come back to our state. SB 956 will ensure that many of our state's essential workers and their families, like Viviana's, will not have to decide between their health and their economic survival, a choice that no one should have to make. All Our Kin strongly urges the committee to vote in favor of SB number 956, with the understanding that this bill will expand access to Husky to all Connecticut residents, regardless of their immigration status. Thank you for your time.
I don't see any questions for you. Ariana, where are you located? Orchid, is that in Bridgeport?
We're located in New Haven, but we have offices in Bridgeport, Stamford, and we also serve the Danbury community.
Okay, thank you for your testimony. I'm now going to turn this over to our Representative Garibay. Thank you.
Thank you, Senator Moore. Moving on to Kelly Hernandez. Are you with us today? Okay, I don't see her. So we're going to move on to Dr. Suzanne Lagarde.
Members of the Human Services Committee, my name is Dr. Suzanne Lagarde. I am the CEO of Fairhaven Community Healthcare, a federally qualified health center in Greater New Haven that cares for over 22,000 predominantly low-income minority patients. I'm testifying today in favor of SB 956, an act providing medical assistance to certain individuals regardless of immigration status. I doubt that anyone will deny that we have all just gone through one of the most challenging years of a lifetime. COVID has left its mark and its scars on every single one of us. It truly amazes me that despite this life-changing experience, there remains hesitation on the part of some legislators as well as DSS to move forward on SB 956, which would provide healthcare coverage to the majority of undocumented residents of Connecticut. Had this legislation been in place prior to the current pandemic, lives would have been saved. Nearly 25% of our health center patients are undocumented. However, they are not the people that I worry most about. I worry about the tens of thousands of undocumented residents who do not seek our care or any type of medical care. For many, they do not seek care because they fear receiving bills, which they won't be able to pay. Despite widespread misconceptions, you need to know that HRSA, who is our regulatory agency, requires federally qualified health centers to bill the uninsured, albeit on a sliding scale. Many immigrants in our community have paid the ultimate price for this lack of coverage. They have paid with their lives and the lives of their loved ones. In many instances, their care was delayed and that delay cost them dearly. I do not understand the thinking of those who want to deny these people the most elementary of human rights. These people clean our homes and our workplaces. They grow our food, they pick up our garbage, and they care for our children. They also contribute significantly to our tax base, contributing over $140 million in taxes annually. Despite this, we turn our backs and deny them one of life's most precious assets, namely good health and the freedom from worrying about lack of health care for their families. To be clear, our health center does not provide two types of care, that is care for the insured versus care for the uninsured. We provide the same level of compassionate quality care to all. However, the lack of any financial support from the state for the roughly 5,000 patients who have no insurance impacts our organization's ability to provide the highest possible care to all. It impacts our ability to pay competitive wages and undertake innovative but unreimbursable programs such as integrated behavioral health and remote patient monitoring. We literally take from Peter to pay Paul all the time. So to naively assume that denying care to our uninsured neighbors benefits the rest of us by being fiscally prudent is sorely misguided. In conclusion, I return to where I started this discussion, namely recalling the horrors of the COVID pandemic. We have said and heard time and time again through this pandemic that we are all in this together. This could not be more true than when we discuss the importance of providing healthcare to our undocumented neighbors. Keeping everyone healthy not only saves the lives of the insured and the uninsured alike, it is simply stated the right thing to do. Thanks very much for your time.
Thank you so much, Dr. Lagarde. Compelling testimony. We do have a question from Representative Hughes.
Thank you so much, Madam Chair, and thank you, Doctor. Would, you know, your oath is, as a doctor, I'm sure, to do no harm. Would you say that this violates your oath in terms of policy harm?
Without question, I think it violates every characteristic of who we are as human beings, let alone the Hippocratic Oath. Again, as I said 2 minutes ago, these are folks who work side by side with us, without whom we all collectively would have a very hard time moving forward. And they pay taxes, and yet it just feels cruel to me. It feels totally wrong, and it's cruel. And I would love to think that as a citizenry, that the citizens of Connecticut can do far better.
And would you say that extending this coverage to undocumented is critical to our whole survival and recovery as Connecticut community?
I think we all know that intrinsically, right? I mean, just look at COVID, right? Those of us, we've all been touched by COVID, whether our loved ones, our friends, our colleagues, hopefully most of them recovered, but some did not. There's no question that you hear this all the time. The more of us who are infected, the more likely you and I and everybody else is going to get infected. So we don't live on islands. We are very much integrated in one network where we work together, we play together, we eat together, and to think that we can segregate segments of society in the way this is segregating it without an impact on me or you or anyone else on this call is incredibly naive.
Thank you, Madam Chair, and thank you for your testimony.
Thank you.
Thank you, Dr. Lagarde. Many of the doctors that I've spoken to say the same thing that you're saying, that they want health care for their patients. They want to be able to not worry about that piece. They just want to heal people and take care of them. So thank you for your testimony today.
Thank you. Thank you for your time. I appreciate it.
Thank you. Neri Tan. Is Neri Tan on?
Hello?
Hi. Do you need a translator?
Yes, please. Mary, soy Jonathan, va a ser el traducir. Sí, no sé si me ven.
Yep. Mr. Tan, go ahead.
Sí. Buenas tardes. Miembros del Comité de Servicios Humanos. Mi nombre es Neri Terán, soy residente de New Haven, soy miembro de la Unidad Latina en Acción.
Hello, members of the Human Services Committee. My name is Neri Tran, and I am a member of ULA.
Yo quiero dar mi testimonio a favor del proyecto de ley SB 956 por el derecho a la salud para todos, sin importar su estatus migratorio.
And I am here today to support SB 956.
Estimada senadora, miembros del Comité de Trabajo y Servicios Públicos, me mudé hace 6 años y he vivido en el área de New Haven por 16 años.
I was a New Haven resident for about 16 years before I moved.
6 años en Hamden.
And 6 years in Hamden.
Mi esposa y yo somos inmigrantes, no tenemos documentos. Tenemos 3 hijos, fueron nacidos aquí en Estados Unidos.
My wife and I are immigrants who are undocumented, and we have children who were born here.
Mi hija mayor tiene 21 años. Lleva 2 años sirviendo en las Fuerzas Armadas de los Estados Unidos y ella se siente muy orgullosa de estar sirviendo a nuestro país.
My eldest daughter is 21 years old, and she has been proudly serving in the armed forces for 2 years now.
Mi hijo tiene 17, otro hijo tiene 17 años, va en high school, es un excelente estudiante, lleva buenas calificaciones, el próximo año irá a la universidad.
My son is 17, he is a high school senior, he carries very good grades, and next year he will be attending a university.
Nosotros trabajamos en una fábrica desde hace 21 años, pero la fábrica no nos ofrece seguro médico.
I have worked for a factory for about 21 years now, but the factory does not offer health coverage.
Tristemente, el último año, mi esposa ha ido varias veces a la sala de emergencia con dolor en la vesícula y sangrados.
Sadly, recently, my wife has made several trips to the emergency room due to a lot of bleeding.
Cuando fuimos a la sala de emergencia, los médicos nos comunicaron que ella necesitaba una cirugía, pero cuando el hospital se enteró que mi esposa no tenía seguro y era indocumentada, le dijeron que no la iban a operar porque no era una emergencia y no era cuestión de vida o muerte.
When she was being treated, they realized that she did not have healthcare coverage, and so in turn they didn't proceed with the treatment because they didn't deem it as life-threatening.
Mandaron a mi esposa con mucho dolor y esto pasó con sangrados, y esto pasó 3 veces.
3 times they sent my wife home in so much pain.
Finalmente pude conseguir un seguro médico, comprar un seguro médico, pero por él estoy pagando $370 al mes, pero tiene unos deducibles muy altos, $4,000, y aparte los copagos.
I was able to purchase some form of coverage, but it's very costly and it has a very high deductible of $4,000.
Al mismo tiempo de estar pagando ese seguro, también estoy pagando las facturas médicas de mis hijos, porque no calificaron para el Husky A y ellos tienen el Husky B.
In addition to also paying for that premium, I'm also paying other bills for my children because they were unfortunately not able to qualify for Husky.
Y todo esto porque supuestamente tenemos unos ingresos altos, pero realmente no es así. Estamos al día con nuestros gastos.
And this is because our income is slightly above the eligibility, and so in turn we don't qualify.
Con permiso, señor Tan, favor de resumir su testimonio.
Ok. Yo tuve COVID y todavía estoy sufriendo las secuelas, pero no puedo dejar de trabajar porque tenemos muchos gastos, los cuales incluyen la hipoteca de la casa, los impuestos, los cuales son muy caros, más las facturas médicas.
I had COVID and I'm still recovering from the symptoms. And unfortunately, I have to keep working because I have a lot of bills to pay, such as like house bills and everything.
Mi esposa va a necesitar otra cirugía en el futuro y no sé cómo la vamos a pagar porque no voy a poder seguir pagando el seguro. Estoy sufriendo mucha ansiedad y no puedo dormir
I'm suffering a lot of anxiety because my wife needs further surgeries, and I am unsure of how I'm going to be able to pay for even more cost.
Uno de mis hijos también está sufriendo ansiedad. Hemos sido honestos y nunca hemos mentido sobre nuestros ingresos. Y el día que necesitamos ayuda, nadie nos las brinda.
My son also has anxiety, and we have always been truthful about what we can afford.
Nos pone muy triste ver cómo a nuestros hijos preocupados por no poder hacer nada por nosotros, en especial mi hija que está en las Fuerzas Armadas y lejos de nosotros.
And it makes us as parents feel bad because we have our children feel bad that they cannot help us out, especially our daughter who's in the armed forces.
Necesitamos un seguro médico accesible y, si se puede, gratuito para todos. La clase trabajadora está sufriendo. Necesitamos un rescate económico para la gente trabajadora. Gracias por escuchar mi testimonio.
We are a family of workers, and we need healthcare coverage. And thank you, everybody.
Thank you, Mr. Tan, for sharing your story with us. I'm so sorry that you and your family are going through this. Are there any questions?
I've been here for 22 years, and we have been working very hard. We buy a house, we pay in taxes, and now we're afraid that we can lose everything just because we don't have insurance. So please help us.
Okay, thank you so much for that testimony.
Thank you.
Okay, moving on to Carla Esquivel. Is Carla here?
Yes, I am here.
Do you
Buenas
need-
tardes.
Okay, the interpreter would need,
Yes, please.
Estoy aquí.
okay.
Buenas tardes. Mi nombre es Carla Esquivel, miembro del Comité de Servicios Humanos. Soy residente de Stanford. Soy miembro de Unidad Latina en Acción.
Good afternoon. My name is Carla Esquivel. Good afternoon, members of the Human Services Committee. I am a member of the organization ULA.
Yo quiero dar mi testimonio a favor de la ley SB 956 por el derecho a la salud para todos sin importar su estatus migratorio.
And I would like to express my support for Bill SB 956.
Vivo en Stanford hace 15 años, soy mamá de 2 niñas y pertenezco a Building One Community, grupo de padres Power, y pertenezco también a la Alianza Nacional de las Trabajadoras del Hogar.
I am a Stanford resident. I am also a member of Building One Community and another organization in the area.
Quiero contar mi historia. Quiero hablar de la importancia que es tener un seguro médico. Siempre en nuestra comunidad se ve más afectada porque no todos podemos tener acceso.
I want to share my story and express why I support everyone having access to healthcare, especially within our community that has been significantly impacted by COVID.
Cuando resulté embarazada de mis 2 niñas, pude ver la importancia de tener un seguro médico y de tener que pagar $3,000 por cada cuidado prenatal, cuando mi esposo y yo no estábamos trabajando.
When I was pregnant with my 2 kids, I realized the need to have healthcare coverage. Each time it costed about $3,000, and there was a time where both my husband and I, we weren't working as much.
Fue difícil con cada embarazo que pasé. No recibimos ninguna ayuda y tenía que trabajar jornadas muy largas de trabajo, arriesgando mi salud, sin importar a que algo me sucediera.
But we had to pay a lot of medical bills, and I had to work really long hours, which scared me because I worried about my own health and well-being during that time.
Arriesgando mi maternidad, es importante que se nos pueda escuchar todo lo que vivimos y así ustedes como legisladores puedan aprobar esta iniciativa.
And you as legislators can help support this policy and in turn help us out too.
otorgando un seguro médico más en esta pandemia. No tenemos acceso ni a algo tan simple como un seguro. La salud mental, la salud dental, prenatal, postnatal. Además, creo que en mi caso representa a muchas mujeres.
Sorry, was someone speaking?
Go ahead.
And so my case is very similar to that of other women in terms of like the issues that we have to deal with. And I had to worry a lot about my own well-being during while being pregnant.
Soy la voz de muchas mujeres embarazadas que han tenido el mismo resultado y se han visto afectadas de una u otra forma.
I am speaking as the voice of many pregnant women who had gone through similar issues and have had to suffer the consequences of it.
Sé que son unas personas bondadosas y quiero que se pongan la mano en el pecho y que sean ustedes quienes defiendan nuestros derechos y nos ayuden a tener un seguro médico para los inmigrantes.
And we ask you to please stand tall and support this policy that would help us have healthcare coverage.
Gracias por su apoyo.
And thank you so much for your support.
Señora Esquivel, muchas gracias por compartir su historia y la de muchas mujeres. Se lo agradecemos mucho. Does anyone have questions?
Gracias. Agradezco todo su apoyo y estoy segura que vamos a tener la noticia que más esperamos como un seguro médico. Gracias.
Thank you. I hope for your support and to hear the good news that this bill did pass through and provided us healthcare coverage. Thank you.
Thank you. Seeing no questions, we'll move on to Sadie Martinez. Is Sadie here?
Sadie, ¿estás aquí?
Okay, if she comes on later, we can hear her testimony. Danielle Delmonico.
Good afternoon, all my representatives and senators. I really do take great thank you for taking this time back to back, even last week, yesterday. I'm going to try to be quick and abrupt. My name is Danielle Delmonico. I live here in New Haven, Connecticut. I'm a PC worker for my mother who has MS. I'm here speaking today about the House bill of 6560. I became a PCA in 2016 when my mother broke her shoulder and I was caring for her. Agency on Aging, her social worker, introduced me to the PCA program and told me I could get paid to be her provider. Within the first 3 months into the program with Allied as my payroll, began pay issues, late or wrong about 4 times. Then they claimed that they never received even any of my timesheets. Now, I'm in my own office. I have a fax machine right here. When this started happening, I actually contacted the CEO of Allied in late 2017 with Carol Bonnet to let her know about these issues. She kindly asked me if I wouldn't mind sending my timesheet to 3 different fax numbers and a PDF. It has never changed. It has stayed the same since then. And since then, I'm on pay week 205, and they have messed up my payroll 53 times. What this causes is every single Sunday, I have to process this 5 times. When you really think about it, I've been using the EVV SAN data program and call in and call out since the end of February 2020. And yet I still had payroll issues with Allied. I've only been with my 1199 members only for the last year and a half. Prior to this, I called upon myself to contact BB&B, Department of Labor and Employees, and all of them are aware of Allied. All of them are aware of how bad their consistency rate is when it comes to payroll. It also comes down to you are spent 3 hours with a tutor from Allied who gives you a gigantic pamphlet, booklet. And of course, this is for my mother and for me to learn how to do the timesheets, numbers and extension numbers to call and reach if you have any problems. And we never could get anywhere. And once again, this is still the same consistency for the last 4 years with Allied. And for me, I mean, I have my own fax machine, but what about everyone else? And then on top of it, my anxiety of every Friday, now today's Thursday, you always wait for a confirmation call from Allied. You will never receive.
Excuse me, I'm sorry to interrupt, but your 3 minutes are up. Please summarize.
I needed to give you at least some detail. You're not having to process one timesheet every week, Mrs. Hull. I have to do this every week. The anxiety, the turmoil that this company puts, not just me, but all of my brothers and sisters that are PCA workers, whether they're late, whether they say the timesheet never arrived, to know that you can never get anywhere when you get on the phone with Allied is crucial for all of you to hear today. You're hearing this over and over. And the reason is because now there's just more of us to show you in Zoom. I hope that you think about this bill to hold Allied, they need to realize their consequences because it's our bank accounts with the direct deposits getting the late payment charges. It's my money coming out for that fax machine or for someone that has to go pay to have it faxed. And now we have EVV. And if I've been doing it since February of 2020, and you've messed it up, how many times? There's a problem here with Allied Payroll Company. And they get too much money. They've been under the coat and behind blind masks of not wanting to look at this problem. So I'm sorry if my minutes went just a little too long, but I feel that, yes, you're hearing this monotonous, but I'm a person that finally will hire an attorney and take it upon myself for the grievance and the headaches that I get from this payroll company and how the Workforce Council for the PCA customers, consumers, do nothing about it. So if you could do anything today, please consider, talk it over with your fellow men and women sitting in these chambers that have these rights as representatives and senators that can actually pass a bill 6560. I thank you, and you have yourself a good weekend coming up. And I hope your paycheck comes in on time tomorrow.
Thank you, Ms. Delmonico, for your testimony today. The one thing you learn, one of the few things in life that you just don't mess with is the person's paycheck. So totally understand how frustrating that can be. Is there anyone that has any questions? Seeing none, again, thank you for your testimony. Moving on to Mr. Ubaldo Garcia. I did see him in there somewhere.
Sí,
Adelante. Yes, I am here.
Ok. Buenas tardes, miembros del Comité de Servicios Humanos. Mi nombre es Ubaldo García. Soy residente de New Haven. Y quiero dar mi testimonio a favor del proyecto de ley SB 956 por el derecho a la salud para todos sin importar su estatus migratorio.
Good afternoon, members of the Human Services Committee. My name is Ubaldo Garcia. I have lived in New Haven for 20 years. I want to give my testimony in support of SB 956 for healthcare for all, regardless of immigrant status.
Hace año y medio Fui víctima de un gran crimen. Un hombre que conducía ebrio me atropelló mutilándome la pierna derecha y dejándome con fallas en mis riñones.
A year and a half ago, I was victim of a terrible crime. A person driving drunk ran me over, mutilating my right leg and leaving me with kidney problems.
Ahora necesito atención médica de por vida, además de una prótesis que me permita volver a caminar de nuevo para llevar una vida ligeramente normal.
Now I need medical care for the rest of my life, as well as a prosthesis that would allow me to start walking again to carry on a more normal life.
Pero esto me resulta completamente difícil, ya que no cuento con un seguro médico y no tengo ninguna ayuda del gobierno, ni manera de costear mis múltiples medicamentos y citas médicas con especialistas.
But this is extremely difficult since I do not have insurance, and the government doesn't give me any help to pay for my many medications and medical appointments with specialists.
Lo cual es una gran ironía porque por un lado el gobierno rechaza cualquier ayuda que solicito, pero por el otro pagamos impuestos que se destinan a pagar salarios de todos los servidores públicos y que son los que hacen estas leyes tan injustas, ya que no es cuestión de discriminación o del ser inmigrante o racial.
This is a great irony because on the one hand, the government excludes me from any assistance, but on the other hand, we pay taxes that end up paying the salaries of public officials who make these laws that are so unjust. And this is not only a matter of discrimination against immigrants or on the basis of race, the problem goes much further.
Sino que el problema va más allá. Todo se resume a que es un sistema clasista y opresor, porque en este país nuestra salud es solo un negocio y no una prioridad.
The problem goes much further because this is a classist and oppressive system where our health is just a business and not a priority.
Por lo cual exigimos que mejoren las políticas públicas de salud en donde sea accesible para todos, sin importar su estatus o cuánto dinero lleves en tu bolsillo, que sea por humanidad y no por un negocio.
This is why we demand better public policies in healthcare, so that healthcare is available to all regardless of their status or how much money is in their pockets. It would be available to them because they are human, and it would not be a business.
Cuando perdí la
Señor García,
Sí,
favor de resumir su testimonio, por favor.
sí, claro. Cuando perdí la pierna, la indemnización del seguro del borracho que me cercenó la pierna solo llegó a pagar los gastos médicos de emergencia y al no tener seguro médico no recibí ningún descuento, no sobró ni $1 para mi sustento o rehabilitación y al sistema de salud no le importó mi seguridad ni de cubrir una prótesis para tener una vida mínimamente normal.
When I lost my leg, the insurance payment from the drunk driver who amputated my leg was only enough to cover the emergency medical costs. I did not receive any discount. There was not even a single dollar to help me pay the bills or go through rehabilitation. And the healthcare system did not care that I lacked insurance and did not care to cover a prosthesis to be able to have a minimally normal life.
Hoy no trabajo ni me puedo sustentar una prótesis. Cuesta más de $40,000. Hoy no puedo ni pagar mi cuenta de gas, menos podré tener una prótesis adecuada para que me reinserte en la sociedad. Por eso hoy pido lo justo y en sus manos está aprobar una ley más equitativa.
Today, I cannot work to support myself or to support the cost of a prosthesis, which costs more than $40,000. I can't even pay my gas bill now, much less an adequate prosthesis so that I can re-enter society. That is why I'm asking for what is just. You have the power in your hands today to pass a more equitable law. Thank you.
Muchas gracias.
Por eso hoy pido lo justo y en sus manos está aprobar una ley más equitativa, tal vez decidir entre la vida y la muerte para personas como yo que no tenemos seguro médico. Piensen en las personas y no en las empresas. Muchas gracias por su tiempo.
Today, the power is in your hands to choose between life and death and to choose people over profit. Thank you very much.
Thank you, Mr. Garcia. Agradecemos mucho que cuenten su historia. Does anyone have any questions of Mr. Garcia? Seeing none, thank you. Gracias.
Ok, gracias.
Moving on, Fatima Rojas.
Yes. Sorry, my internet connection is slow. So dear members of this Human Services Committee of Connecticut General Assembly, my name is Fatima Rojas. I stand in support of SB 956 legislation and act providing medical assistance to my immigrant community regardless of their immigration status. I came to this country from Mexico 17 years ago. I am undocumented and unafraid. I have a partner and together we have 2 daughters. I have been active and vocal in my community in New Haven and Connecticut since I arrived here. I am a proud organizer and founder of the Semilla Collective of New Haven. When I arrived to this country, neither my husband and I had access to healthcare. We faced different illnesses and healthcare injuries like the flu. I twisted my foot and injured my back. And what we had to do back at that time was to take care of ourselves with home remedies to avoid the huge debt. And I know that there are more people like me doing that currently. We had a car accident that we're still recovering from with a huge debt. I also have hypothyroidism, and I've been dealing with that. I was dealing with that back in the time without access to a proper healthcare. That made me a pre-diabetic person. Those illnesses were connected and one led to another. My kids in that time had Husky, but the question is, what is the point to have only the kids covered with healthcare if the parents that are taking care of them, like in my case and my husband, are sick and without access to healthcare? What's the point of only have kids covered? There is no point. I also had close friends that they had to go back to Mexico because they needed, one of them needed a transplant, a kidney transplant. And just the lack of access and the waiting and all the huge debt, they was going to spend their whole life paying for a transplant. Today, the person that went to Mexico is not with us anymore. It was too late and didn't make it. So today I know that for my family, it's a different story because thanks to my job, I now have access to healthcare. The question is, what about the rest of my undocumented immigrant family? We are essential workers and we are excluded. I'm sick and tired of crumbs. The undocumented community makes this state vibrant. We make this country vibrant. Healthcare is a human right. It's a basic human right. We know all of those. We know.
Excuse me, your 3 minutes are up. Please summarize.
Yes, thank you. So we as community will fight for this legislation to pass. No more deaths for the lack of healthcare. The time to extend Husky is now. So I call upon the Human Services Committee of the Connecticut General Assembly to stop the suffering of your people and pass SB 956 legislation without exclusions. Thank you for your time. Gracias.
Thank you very much, Ms. Samia, again, for coming and testifying in your story. Does anyone have any questions? Okay, seeing none, thank you so much for coming. Are you ready, Senator Moore?
I am, thank you.
I'm gonna hand it back over to you.
Appreciate it. Next is Juan Fonseca Tapia, followed by Olivia Rinks, followed by Chelsea Ohassian. Juan?
Yes, ma'am. I'm sorry, I'm just having trouble with my connection. Dear members of the Human Services Committee of Connecticut General Assembly, my name is Juan Fonseca Tapia. I am an EMT and a community organizer from Danbury. I stand in support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all Connecticut residents regardless of their immigration status. Today, I will not try to make a case for the committee members to see, acknowledge, honor, and respect the humanity of undocumented immigrants, because I hope that you already do this as public officials serving in this committee. I worked as a medical assistant in a urgent care in Danbury last March. While I work as medical assistant, I witnessed the pain, trauma, and fear undocumented immigrants experience when they walked into the exam room. Often, patients were more scared about their eligibility, their ability to afford the care that they were seeking, than the illnesses that got them to go to the urgent care in the first place. While I work at this urgent care, I witnessed a broken system rooted in racism and designed to exploit and profit off of the trauma and lack of access to healthcare that undocumented immigrants experience. 90% of the patients that I saw in this facility did not have a primary care physician because of their ability to access healthcare coverage. Each patient paid around $125 for being seen by a medical provider. Some physicians automatically order a pregnancy test for all women. This pregnancy test costs $35, while this test can be bought at a CVS pharmacy for $5. The patients paid $15 for a single Tylenol or ibuprofen, while pharmacies sell 225 capsule bottles for $14.99. And the list goes on. Most times patients left the medical facility with empty packets or bills for over $200. For years, lawmakers and politicians have used the monetary cost of services like healthcare to deny access to healthcare and other social services, yet they said that they care about our community's well-being. 529,000 people have been killed by a failed public health infrastructure and a healthcare system that legally discriminates and harms groups that have been historically violated, marginalized, and killed by systems rooted in racism and white supremacy. Allowing all members of our community, regardless of their status, to access affordable healthcare is the first step we must take as a state to build healthy communities and generational health that can be passed on to the next generations that will come after us. Many people continue to hold on to the idea that we will go back to normal, yet their privilege does not allow them to see that there was never such thing as normal. Denying affordable healthcare access to thousands of people will never allow us to build a safe and robust public health infrastructure that we need in the state. Strong public health
Excuse me, your 3
infrastructures.
minutes are up. Can you please summarize? Thank you.
Yes, I am about to summarize, ma'am. The strong public health infrastructures designed to do prevention instead of treatment will save our municipalities money and allow us to be prepared to protect our communities and save lives if we find ourselves facing other public health crises like COVID-19 pandemic. I am asking you to support SB 956 with clear language to allow all people to have access to healthcare. Thank you for your time.
Thank you, Juan. Appreciate your time and your testimony. I don't see any questions for you, but thank you.
Thank you.
Next is Olivia Brinkes. If not, Chelsea Ohanian.
Hi.
Hi, Chelsea. Would you pronounce your last name for me? Because I know I got it wrong.
Yes. We say Onesian in my family. It's a lot easier
Onesian?
than it looks.
Onesian?
Yes.
Okay.
Yeah.
Welcome.
Thank you. Good afternoon, members of the Human Services Committee of the Connecticut General Assembly. My name is Chelsea Onesian, and I'm a graduate student at UConn School of Social Work and a resident of Farmington, Connecticut. I stand in support of SB number 5956, an act providing medical assistance to certain individuals regardless of immigration status, but with modifications that would ensure that this legislation extends Husky eligibility to all low-income residents regardless of immigration status. I am a second-year MSW student at UConn right now with a concentration in community organizing. This past year, I have been interning at the Greater Hartford Family Advocacy Center at St. Francis Hospital. Most of my work has been centered around child and family rights in the culturally diverse city of Hartford, Connecticut. As a white woman in academia from Farmington, I have been feeling somewhat disconnected from the communities directly impacted by my work at the Family Advocacy Center, especially throughout the COVID-19 pandemic. Currently, I've been assisting with several IRB research projects on child abuse and child neglect, and I have observed a lack of consensus on standardized definitions and standardized evidence-based assessments for child abuse, child maltreatment, and child neglect within state agencies and across state lines. This lack of consensus has created an immediate disconnect between helping providers and the communities being served. I believe effective change is possible, but only if we can involve those community members with direct lived experience in the decision-making processes. This ambiguity can also lead to misinformation and distrust in government agencies, as many individuals in underserved communities have received conflicting information from healthcare and helping providers around child safety. Many cases of child neglect could be prevented if parents in underserved communities had equal access to quality healthcare services. I believe that no human is illegal or alien. The current mistreatment of immigrants in this country directly violates the Universal Declaration of Human Rights in several articles, including immigrant community members and other vulnerable community populations under Husky would indirectly reduce rates of child neglect by shifting the narrative of child neglect to a more supportive approach to parents and families. As it is currently written, SB 956 leaves out many of our immigrant community members, including low-income parents and children under Husky, and low-income elderly and disabled individuals under Husky C. These are some of our most vulnerable community members. Based on my experiences as a healthcare provider, I believe it is essential that they be included in this legislation. I urge the committee to modify the language of SB 956 to extend current Husky eligibility rules to all Connecticut residents regardless of immigration status. I support SB 956.
I'm sorry, you're wrapping up.
Sorry, yeah, I'm on my last sentence.
Oh, thank you.
Yeah. With appropriate modifications to include all low-income community members, and ask the committee to support this legislation as well. Thank you so much.
Thank you, Chelsea. All right, keep up the good work. Do good.
Thank
All right?
you.
Get in good trouble. Thank you. Next is Evelyn Majano Montiel, and I think you'll have an interpreter.
Yes, please.
Evelyn, aquí estoy.
Okay. Mi nombre es Evelyn Majano Montiel, vivo en Bridgeport, Connecticut. Hace 4 años a mi esposo le diagnosticaron gota. Una mañana después de tomar su medicamento para la gota, se despertó con un dolor extremo y su espalda y cuello completamente torcidos.
Hello, my name is, I'm sorry, I lost my place a little bit. Hello, thank you to the Human Services Committee. About 4 years ago, my husband woke up in a lot of pain and his back was completely hurting him.
Este es un pequeño testimonio. Yo soy a favor de la ley SB 956. Este es el testimonio de un caso que le sucedió a mi esposo. Nosotros pasamos de, a él le diagnosticaron gota y después de pasar un día con fuerte dolor extremo en la espalda y cuello, nosotros fuimos de centro comunitario a centro comunitario para que nos ayudaran con el caso de mi esposo.
And I am here today to support SB 956 and also to share the my husband's own story. And one day when he was experiencing a lot of pain, we ended up having to go to different centers to try to figure out what was happening.
Durante todo esto, él no pudo pararse y no podía caminar. Él estuvo con muletas, vio a muchos médicos, especialistas. Como no tenía seguro médico, mi familia tuvimos que pagar de nuestro bolsillo. Íbamos de neurocirujano, urólogo, especialistas, acupuntura y fisioterapistas.
And so my husband was experiencing pain all day and we had to go to specialist after specialist, but because we didn't have healthcare coverage, we had to pay it completely out of pocket.
Tuvimos que pagar una tomografía o scan, tuvimos que pagar alrededor de 3,000, 1,000 por análisis de sangre, 200 por radiografías, cada visita a los especialistas eran de 500 en adelante.
And we had to pay for his x-rays, which was about $3,000. We had to pay an additional $1,000 for an analysis. And each time we went to the specialist, it included also paying for the visitation too.
Finalmente, un neurocirujano diagnosticó a mi esposo con una hernia en los discos y ordenó una cirugía de emergencia.
And finally, he was able to get diagnosed and he needed to get a surgery.
Como no teníamos dinero, el hospital nos dijo que teníamos que pagar alrededor de $50,000 de nuestro bolsillo para la cirugía.
Because we didn't have healthcare coverage, the hospital told us that we had to pay the $50,000 still.
Porque mi esposo es indocumentado.
Because my husband is undocumented.
Finalmente el hospital.
Ajá. Por favor, resumar sus testimonios, por favor.
Ok. Bueno, tenía que pagar alrededor de $40,000 y pues finalmente hallé una trabajadora social del hospital de Bridgeport que nos ayudó a pedir el free care.
And I ultimately had to pay $40,000 out of pocket. And fortunately, we were connected to a social worker from the hospital who was able to help us out.
Mi esposo no trabajó durante 1.5 años y tuvimos que ir pagando esa deuda poco a poco.
And my husband, because he was unable to walk, couldn't work, and we had to pay off that medical debt still.
Unos familiares, unos amigos tuvieron que prestarnos dinero para eso. Incluso todavía yo debo dinero que presté para poder realizar la operación de mi esposo.
And some of our friends helped us out with some of that payment, but unfortunately, we still have medical debts to be paid.
No soy la única persona indocumentada que está pasando por esto.
I am not the only person who is experiencing this.
No es justo que no podamos acceder a la atención médica.
It's unfair that we can't receive proper medical treatment.
No es justo que mi esposo haya tenido que sufrir durante meses.
And it's unfortunate that my husband had to suffer for so many months.
Y todavía debamos miles de dólares al hospital.
And yet still we owe thousands of dollars in medical debt.
Muchas gracias, Evelyn Majano.
Thank you. Thank you.
Thank you, Evelyn. Let me see if there's any questions for you.
Okay.
It's not. All right. How is your husband now?
¿Cómo está tu esposo ahora?
Él está un poco mejor.
He's a little bit better.
Seguimos entonces en las clínicas comunitarias.
We go to healthcare centers.
Okay, that's good. Well, thank you so much for coming today, for giving us your testimony. Appreciate it.
Y muchas gracias hoy por compartir su testimonio con nosotros. Lo agradecemos.
Muchas gracias. Buenas tardes.
Thank you. Good evening.
Next is Karina Therese Cervantes, followed by Jillian Warjeko, and then Christina Kane.
Hi, good afternoon. Dear members of the Human Service Committee of Connecticut General Assembly, my name is Karina Torres Cervantes. I'm a student at Southern Connecticut State University from Meriden, and I am a former DACA recipient. I stand in support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status, but with modifications. SB 956, as currently written, leaves out many in our immigrant community. It leaves out low-income parents and children under Husky A and low-income elderly and disabled folks under Husky C. I support modifying SB 956 to include all CT residents that qualified under the full current Husky eligibility. My family and I have been in Connecticut since we immigrated from Mexico in 1994. We have all been undocumented until 2013 when I was the first to apply for DACA. In those 19 years, there were no yearly checkups unless asked for by school, no trips to the emergency room, or any referrals to specialists. We cured fevers, infections, and sprains at home with TLC. Luckily, we never reached a moment where ER trips were inevitable. In 2013, I became eligible for and obtained my DACA status. I became eligible for healthcare for the first time in my life when I was 24 and began to work full-time after receiving my DACA status. It felt great to be able to see a doctor without having to worry about the bill. However, this joy is short-lived when I think about my parents. My parents have lived in the United States, Connecticut specifically, more than they have lived in their home country. They continue to live paycheck to paycheck, often having 2 full-time jobs to survive. The wear and tears on their bodies remind me that they will not be here forever, and as you can all probably relate, I see them aging a little more each day. I worry about the toll on their bodies as they continue to do manual labor, often topping 12 hours a day into their 50s. My dad is currently diabetic with high blood pressure, and my mom is anemic and also struggles with her blood pressure. Some days she sleeps off the headaches that may possibly be due to her high blood pressure or anemia because she doesn't want to pay the copay for the clinic they attend. She'd rather put it towards a bill. My dad currently had his foot crushed by a boulder at work and waited 3 days to seek medical attention. He wasn't ready to pay the bill at the ER. When I saw it, I just wanted to cry. It showed me the superhumans my parents continue to be. My mother and father sacrificed it all for me. Now, as a resident, soon to be a citizen, I present my story to you all with hopes that I can make a difference in this bill to include people like my parents who continue to work as hard as other Americans, because that is actually how they see themselves, for a chance to have some relief when it comes to healthcare. As a soon-to-be social worker, I was taught to live by the code of ethics. Well, one of them is dignity and worth of the person. I don't believe this is outlandish or exotic. I believe it's simply common sense. Undocumented people lose their dignity and self-worth to come to a country they believe will give them a better life. They pick up any job that comes their way and take any insults or discrimination that comes their way, especially because of the language barriers. But it is up to us now more than ever to dispose of these labels. We are not our status. We are human beings who deserve affordable basic rights. I would like to leave you with the fact that the American Immigration Council stated in August of 2020 that there are 120,000 undocumented immigrants in Connecticut. That is 23% of the immigrant population, but only 4% of the state population in 2016. I would like to thank you for your time and reiterate that I support SB number 956 with the modifications above and hope the committee will make those changes. Thank you for your time. Karina Torres Cervantes.
Thank you, Karina. That was some great testimony.
Thank you.
And there's nothing like telling your own story, and it's a success story is where you are when given the opportunity.
Absolutely.
So thank you. I don't see any
you.
questions for you.
Okay.
Have
Thank
a
you
good
so
day.
much. You too.
Jillian? Jillian? I don't see Jillian. I'm going to move on to Christina Kane. Okay. Jonathan Gonzalez Cruz.
Hello.
Hi, Jonathan.
Hello. Thank you, Senator Moore, Representative Abercrombie, and members of the Human Services Committee for allowing me to testify today. My name is Jonathan Gonzalez Cruz, and I am an undocumented immigrant from Mexico, and I am a proud graduate of UConn's Master of Quantitative Economics program, and I am also on the Stakeholder Advisory Board for the Costco Benchmark project that Connecticut is running. Although to clarify, I am representing my own views today. And so I simply wanted to share insight into the data that, that I have. First, I want to talk about the barriers in place right now in Connecticut. In private insurance, they could deny you if you don't submit a social security number. The ACA failed to include undocumented immigrants in the healthcare marketplace. And Husky also denies both undocumented immigrants and certain immigrants with status not being able to qualify for Husky. In turn, this is what the data says. In Connecticut, 3.1% of US-born people are uninsured. That number jumps to 31.3% of non-citizens, such as green card holders, and then also it jumps higher to 52% for undocumented individuals. As a colleague of mine, Kathy from Planned Parenthood once said, immigration status is acting as a social determinant of health, and the data clearly shows it here. To further add to that, in 2018, there were about 60 to 60,000 uninsured undocumented individuals, factoring in the 52%. And in total in Connecticut, there are about 180,000 total uninsured people. What this means is that in Connecticut, 1 in 3 uninsured people are undocumented. And as such, this bill will help reduce that uninsured rate drastically. More so, I want to reference something that the commissioner mentioned earlier, which was that because they wouldn't be able to get the federal cost sharing money, that they don't support it. However, respectfully, she failed to acknowledge that right now the undocumented community is cost sharing with the Husky program, because in 2014, our economic activity was 3.1 billion. We paid 145 million in state and local taxes, 253 in federal taxes, and we had a spending power of 2.7 billion. And so in turn, our community is helping fund Husky, and yet we are ineligible for it. So in turn, we must do the right thing to address both the uninsured rate that's significantly high in our communities, and also acknowledge the fact that our undocumented community right now is subsidizing health coverage for others, and yet we are being told that because of our status, we can't qualify. That is very morally wrong. And I know that the question of like, how are we gonna pay for this is on everyone's mind, but I ask that you reframe that, because we are paying for it, yet we don't have access to it. Because the commissioner referenced the governor's bill, I also want to reference a bill that would help also pay for this, and it is honestly like taxing the rich. Connecticut is known to have some of the highest income inequality, where down the road in Westport, we have billionaires who are making significantly much money. And in truth, they can afford to be taxed a little higher. So everyone, especially during a pandemic, can have healthcare coverage. If the concern is that we're going to lose economic activity, that is simply incorrect by the fact that they are still here and they are simply not going to move away by being taxed a little bit higher. So in turn, I asked this committee to do the right thing. We are in a pandemic. Please help cover every single person in the state and also tax the rich.
Thank you, Jonathan. I'm going to read your testimony again. Did you submit it in writing?
I am going to be submitting in writing, yes.
Please, please. Thank you. Great argument. Next is Leslie Blateau, Tamara Nunez Del Prado, and then Amilda Barhahath. Hi, Tamara.
Hi,
I see you.
Hi, how are you? Voy a necesitar un intérprete, por favor. Buen día, con mucho gusto de hablar con usted, señora senadora Moore. Un placer de volverla a ver. El día de hoy no estoy solamente hablando por mí, sino estoy hablando por muchos miembros y muchas personas a las cuales he escuchado en estos últimos 6 meses. Yo soy Tamara Núñez del Prado, una defensora de derechos humanos con maestría en derechos humanos, género y otros estudios. Trabajo hace
Good
más de 20
afternoon.
años.
Una pausa, Tamara. Good afternoon, Senator Moore. It's a pleasure to greet you today. My name is Tamara Nunez del Prado. I want to speak with you, not just for myself, but to share some of the stories that I've heard. Adelante, por favor, pausadamente.
Trabajo hace más de 20 años en derechos humanos con poblaciones en situación de vulnerabilidad y al igual que ustedes, en algún momento en mi vida he estado del otro lado del escritorio. He sido servidora pública, funcionaria y he sido autoridad en los temas de derechos humanos en mi país. Esto
I
ha
have been
hecho que-
working, Tamara, I have been working for 20 years in human rights issues, and I've also been in your shoes as a public servant in my country in the Human Rights Department.
Esto ha hecho que mi trabajo sea muy sensible con las poblaciones en situación de vulnerabilidad. En
So
estos
I'm very
últimos-
sensitive. So I'm very sensitive to people in vulnerable situations.
En estos últimos 6 meses he tenido que escuchar muchas historias que a partir de la pandemia ha desvelado una inequidad social.
In the last 6 months, I've heard many stories that have exposed the systemic equities in the system.
Estas inequidades sociales han mostrado que muchas personas, por un tema de salud y por no acceder a un seguro médico, han perdido sus trabajos, se han quedado sin la posibilidad de poder sanar. Mucha gente ha perdido no solamente el ánimo de vivir, sino que han muerto. No hay una familia que no tenga un muerto el día de hoy.
People have lost their jobs, leaving them without health insurance and healthcare. People have lost their lives. There's hardly any family that doesn't know someone who has died in this crisis.
Muchas veces pensamos que esto no nos puede llegar, pero la verdad es cruda. El día de hoy en Estados Unidos, por cada persona blanca que muere, mueren 8 personas latinas y mueren aproximadamente 10 personas afrodescendientes. Esta injusticia debe cambiar.
Many of us think that this crisis won't touch us, but the crude reality is that for every white person dying of COVID, about 8 Latino people die of COVID and about 10 Black people die of COVID. This is the sad reality.
Y si no hacemos
Señora
algo...
Tamara, favor de resumar su testimonio, por favor.
Ok, voy a tomar mis 3 minutos y bueno, la intérprete va a seguir haciendo su trabajo. En este sentido, creemos que la comunidad latina, la comunidad migrante debe tener oportunidades, mejores oportunidades, pues que si estamos sanos y sanas podemos trabajar mejor y podemos seguir aportando a este país como trabajadores esenciales y enfrentando a esta pandemia.
We believe that Latino people, migrant people need this right to healthcare so that we can continue working and serving this country and pulling this country out of the pandemic.
Sobre todo cuando solamente en el estado de Connecticut las personas indocumentadas aportan más de $400 millones y no reciben una devolución de parte del estado porque lo hacen a partir de su número TIN y no del número social.
And overall, because in Connecticut, undocumented immigrants pay $400 million in taxes every year and get nothing in return because they pay their taxes with a TIN number instead of a social security number.
Por eso, en ustedes como representantes, servidores públicos, senadores, está la oportunidad de cambiar nuestra historia, pues que sabiendo que existe esta cantidad de muertes y el no hacer nada puede subrayar en delitos de lesa humanidad y de un genocidio, porque el no hacer nada y quedarnos callados seremos cómplices de todo esto.
And this is why you, as senators, as representatives, and as public servants, you can change this reality. Doing nothing, inaction, is complicit with a crime against humanity, with a genocide.
Así que en ustedes está ser nuestros héroes y no los villanos. La historia los va a recordar como las personas que han sido capaces de cambiar este sistema y de dar una oportunidad para que podamos tener un seguro básico, pero digno, para poder seguir haciendo nuestras vidas y defendiendo ante la pandemia como trabajadores esenciales.
And so let you be the heroes. You can be the heroes to guarantee this basic human right, dignity, healthcare with dignity, so that we can go on living our lives and being essential workers throughout this pandemic and beyond the pandemic.
Muchas gracias por darme la oportunidad de hablar por los que no tienen voz, por los que siempre han sido vilipendiados y no han tenido la oportunidad de ser escuchados.
Thank you very much for letting me speak on behalf of people who haven't been heard, who need to be heard. Thank you very much.
Thank you. Let me just check to see if I have any questions for you. I don't. Thank you. Appreciate it.
Muchísimas gracias.
Bye bye.
Bye bye. Imelda Barajas, followed by Allison Martinez Carrasco.
Imelda
Miramar.
está ahí.
Who was that? I'm sorry.
Sorry, I was just asking if Imelda's here, but I do not see her.
Okay. I'm going on to Yarimar Cortez.
Hi, everyone. I'm here.
Hi.
Hi. Sorry. Thank you all for taking the time for this public hearing. My name is Yanimar Cortez. I'm excuse me, sorry. I'm a resident from New Haven, and I'm one of the many undocumented people in the state and in this country that have gone through their life without health care. I am also currently the New Haven organizer for Connecticut Students for a Dream, which, as what we have heard, is a youth-led statewide organization that fights for the rights of undocumented youth and their family. Today, I stand in support of SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all Connecticut residents, regardless of status. So I'm just going to share a little bit of my story. I know we all have heard like many stories and many other points and facts. I want to share a little bit of what has happened in my life and why healthcare is so important. I think it should be expanded to all. So growing up with healthcare obviously was very terrible. Growing up undocumented in general was very terrible. My mom would always have to estimate how much she had enough in order to pay for simple things like a checkup when we would go to school or something. I would always watch her be worried when, like, it was three of us, right? Three daughters. So I would always watch her be worried when she would come up to pay, thinking she didn't have enough. My parents have also had to go through pains and suffer like things because they didn't want to go to the hospital because they know it would be costly, and they wanted to save that money for when we had to go seek medical attention. I remember that this certain story comes up. I remember one day we were at the park with my family. My mom accidentally fell and hit her leg on a rock and opened like her whole leg up, and it was like bloody, and it was a really deep cut. And my sisters and I obviously were super scared because we saw blood and we saw that it was really deep, and we suggested to go to the hospital because that's what we hear in school, right? We hear that like if someone's hurt, you go to the hospital, you seek medical attention. But instead of my mom saying yes, she just shook her head and was like, it doesn't hurt that much, I'll be fine, we can go home. And so for the next couple months and weeks, I saw my mom like not being able to use her leg fully, being able to be in bed rest for weeks. And I also saw her and my sisters be worried about and concerned that her leg would be infected. And she treated it with home remedies. And as of now, it has like a really bad scar and it really didn't get to heal. But I always remember that moment because that moment reminds me of what it means to not have healthcare in this country, what it means to be undocumented. It simply means living in great fear and always living with suffering in your life, especially with no health care. And, you know, maybe to you all in this committee or the legislators that hear it, this bill might just be another bill that you have to have a long hearing for, or it might just be a bill that you have to bring a strong case, right? Because it's very controversial. I don't know how to say that word. It might just be a bill for y'all, but to me, and I know to a lot of the undocumented community, it's more than that, right? It's us being able to not live with fear. It's us not seeing our family members die with things that they could have get preventive health care, they could have been saved. It means a piece of that humanity that has been stolen from this country from us being brought back. And I know that money is always used as an excuse to continue killing and stealing our Black and brown and undocumented humanity. But I'm sure y'all are aware, many of us have said it before in this hearing, that our undocumented people contribute an estimate of like $1.8 billion in state.
Excuse me, your 3 minutes are up. Please summarize.
Yeah, state and local taxes. And just in general, money shouldn't be used as an excuse for people to save people's lives, right? We have a lot of money for enforcement, so let's find the money to provide healthcare for all. That's it. I stand in support of SB 956 with clear language to extend current Husky eligibility to everyone regardless of immigration status, and ask that y'all in the committee support this as well. So thank you for your time. Me, Yennewer Cortez.
Thank you, Yanamar. You've echoed some things that I've said. I hope you're not eavesdropping on my conversations. You've repeated some things that I've said over and over again. I appreciate your testimony and I understand where it's coming from. And I want to let you know that we are all serious about this. We wouldn't invest this type of time and effort in making sure you had interpreters and that everybody's voices was heard, because everyone's voice is important. So thank you for that testimony. I'm going to turn this over now to my co-chair, Representative Abercrombie.
Thank you, Madam Chair. Thank you. So I think we're going to go back to Allison. I think we skipped over her by mistake. I apologize. Welcome, Allison.
Thank you. It's all right. Good afternoon, Representative Abercrombie, as well as Senator Moore and members of the Human Services Committee. I'm Alison Martinez Carrasco. I am a student at the University of Connecticut. I have been living in Connecticut for 23 years as an undocumented immigrant from Ecuador. I am in full support of SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs for all Connecticut residents regardless of immigration status. There is a history in this country of denying immigrants healthcare and a pathway to citizenship, which stems from racism, xenophobia, that was supported by eugenics. Some examples include the Chinese Exclusion Act of 1882 and anti-immigrant explicit actions that kept anyone out who was not connected to being white, Anglo-Saxon, and Protestant, dating back to 1896 with European migration. I name this because anti-immigrant sentiments still exist today, and they reinforce that as immigrants, we should not have a say in our health and autonomy over our bodies. At the end of my testimony, I do include citations for further readings to support the information I provided around the anti-immigrant policies and their ties to eugenics in case anyone wants to read further about them. I want to also name how denying immigrants access to afford our doctor visits devalues our existence and shows that our survival is not of importance, as if we were simply disposable. I see this with the jobs immigrants take at restaurants, hotels, and really any place where our labor and productivity is of demand, but not our humanity. That is the message I receive when my immigrant parents continue to clean people's homes and places of work to make ends meet, but cannot prioritize or afford their preventative healthcare visits. Every time my dad's health declines, I worry that his doctor visits will become more unaffordable. I was testifying for a similar bill last legislative session. At that time, my mom had not been diagnosed with lymphoma cancer. We are now at a time where she has been diagnosed recently, and I always wonder if that could have been prevented had we had the money and time more available in order to give closer attention to my mother's health. My concerns have especially grown since the COVID-19 pandemic started, seeing as how undocumented immigrants are kept out of COVID-19 relief programs, but are essential workers. Giving all immigrants, regardless of immigration status, access to healthcare would give us one less thing to worry about.
Excuse me, you're 3 minutes up. Please summarize.
Thank you, I will. I fully support SB number 956 with clear language that extends current Husky eligibility rules to all Connecticut residents, regardless of our immigration status. And I ask the committee members, really everyone in the legislature, to also support. Thank you so much.
Thank you, Allison. Well done. And I think I speak for the whole committee when I say we're going to keep your family, especially your mom, in our thoughts. So thank you for being here today. We appreciate it.
Thank you.
Sean Hain. Sean, oh, I see him.
Representative Abercrombie, I believe that this person will need interpretation.
Okay.
Yes, and I've turned off the phone. You should.
Interpreter, are you there? This is interpreter speaking. Hello, good afternoon. My name is Nia, and I'll be your Burmese interpreter 349341. I'll interpret everything you say and keep it confidential. How may I help you?
Oh,ကျွန်တော်စပြောလို့ရပြီ
What's up, Joe Yavi?
ကျွန်တော်နာမည်ကတော့ဟိန်းမော်ဟန်ပါမင်္ဂလာပါအားလုံး
My name.
So interpreter, I just want to make sure you.
Good afternoon, everyone.
Interpreter, I just want to make sure you had made a comment about confidential. You know you're on a live feed on YouTube, correct?
This is interpreter speaking, ma'am. Please go ahead. Yes.
I want to just make sure you understand you're on a live feed on YouTube.
This isn't okay. I go to my young people and over now YouTube မှာ အကုန် live ဖွင့်နိုင်ဆိုတော့အားလုံးသိအောင်လို့ပြောပြတာဒါအားလုံးအဆင်ပြေပါနော်
ဟုတ်ကဲ့ပါခင်ဗျာဟုတ်ကဲ့ပြေးပါတယ်
Yes, ma'am. That's
Okay.
fine.
Oh, good. Okay, please proceed.
ဟုတ်ကဲ့
Okay,
ကျွန်တော်
ဆက်ပြောပါ
ဟုတ်ကဲ့ကျွန်တော်တို့မိသားစုကတော့2019ကမှဒီ Connecticut ကိုပြောင်းလာတဲ့ဒီတော့တရားဝင်နေထိုင်ခွင့်ရတဲ့မိသားစုပါကျွန်တော်တို့မိသားစုဝင်4ယောက်ရှိပါတယ်ဆိုတော့အဓိကကျွန်တော်အခုဒီမှာကြုံတွေ့နေရတော့အဲ့လိုမျိုးဒီခုလိုမျိုးဟိုတက်တိခံချက်တာလို့ပေါ့လေကျွန်တော်တစ်ခါမှတော့မလုပ်ဘူးပါဘူးเนาะဒါပေမဲ့လည်းကျွန်တော်အတက်နိုင်ဆုံးနဲ့အပိုလိုမရှိအဖြစ်မှန်ကိုပဲပြောပြမှာပါ
Yes, our family moved to United States into Connecticut in 2019, and we have 4 people in family member in our house, and I have never done this kind of testimony before, so this is my first time doing it, and I will tell you what my experience is.
ဆိုတော့အဓိကကတော့ဟိုကျွန်တော်တို့ကအဓိကတော့ကျွန်တော်မှာစီးချိုယောဂရှိတယ်ပေါ့နော်အဲ့ဒါလည်းအဓိကပါနောက်တစ်ခုကကျွန်တော်တို့ဒီ Husky program ကိုလည်းရှောက်ဖူးပါတယ် ကလေးနဲ့ကျွန်တော်ရဲ့ကလေးနှစ်ယောက်ကတော့ရပါတယ်နော် hash insurance ခေါ်မလား medical cover ခေါ်လာတော့ကျွန်တော်လည်းသိချတော့မသိဘူးနော်ကျွန်တော်တို့ကျွန်တော်နဲ့ကျွန်တော်မျိုးသမီးတွေကတော့မရပါဘူးဘာဖြစ်လဲဆိုဒီ Connecticut မှာနေတာ9နှစ်မပြည့်သေးလို့ဆိုတော့အကြောင်းပြချက်နဲ့ပထမတစ်ခေါက်တုန်းကတော့ညင်းထားတာရှိပါတယ်ဆိုတော့အဓိကကတော့ကျွန်တော်မှာအစည်းအဝေးယောဂရှိတာကတော့အဓိကပါအဲ့တော့စီးချိုယောဂရှိတဲ့အတွက်အခုလောလောဆယ်တော့ကျွန်တော်အဲ့ဒီ Heaven Free Clinic မှာပြနေပါတယ်ဆိုတော့အဲ့ဒီမှာပြတော့အဲ့ဒီကဆရာဝန်မတွေကကျွန်တော်ပြတာတော့အဆင်ပြေပါတယ်ဒါပေမဲ့လည်းဒီစီးချိုယောဂရဲ့နောက်ဆက်တဲ့ယောဂတွေဖြစ်လာတဲ့အခါမျိုးတွေမှာပေါ့နော်ကျွန်တော်အဲ့လိုမျိုးကုန်ကြစရိတ်တွေမတက်နိုင်လို့အဓိကတော့အဲ့ဒီအတွက်ကျွန်တော် health insurance ဖြစ်တာပါဒီ Husky insurance ပေါ့နော်ဘာလို့လဲဆိုတော့လောလောဆယ်ဒီဒီ pandemic ပေါ့နော်ကမ္ဘာ့ကပ်ရောဂါကာလအတွင်းမှာဟုတ်ကဲ့
Okay, the main thing is I do have a diabetes. So I have diabetes health issues. So I applied for the health program and two of my children received the health insurance, but we did not, which is my wife and myself. And they said I have to be here 5 years in order for me to receive that. So I didn't receive that. But currently I'm going to seek out for the Medicare, which is to take care of for my diabetes, and they're stating that there's many outcomes from diabetes. There's other health issues that coming up. I do need to expense for that. So it's actually delaying my healthcare services with this diabetes. Ma'am, how can I help you out?
ကျွန်တော်မှလည်းအဓိကအဲ့ပေါ့နော်ဒီ Heaven Free Clinic မှာပြတဲ့အခါမှာကျွန်တော်အတီးကြကြည့်ပေးတဲ့ဆရာဝန်ကလည်းမရှိတဲ့အတွက်နောက်ပြီးအဲ့ဒီဆေးရုံသွားတာလည်းကျွန်တော်ဝေးပါတယ်ကျွန်တော်နေတဲ့နေရာနဲ့ဆိုလို့ရှိရင်45မိနစ်လောက်သွားရတယ်ပေါ့နော်အဲ့လိုမျိုးဆိုတော့အဲ့လိုမျိုးအခက်အခဲတွေလည်းရှိပါတယ်နောက်တစ်ခုဒီလို pandemic ကာလအတွင်းမှာလည်းလောလောဆယ်အလုပ်ကမရှိတဲ့အတွက်တငယ်ချင်းတွေအကူအညီနဲ့ပဲလောလောဆယ်မိသားစုကရက်တည်နေရတာဖြစ်တဲ့အတွက်အဲ့ဒါကြောင့်အဓိကအဲ့ health insurance ကိုလိုချင်တာပါ
Well, I mainly want to have insurance for undocumented which is for our family, because right now the care that I'm receiving is really far from where I supposed to go, which is where I can get nearest location clinic which I cannot get. So what I'm getting is a bit far from where I live, 45 minutes, and it's due to the pandemic. I don't have anyone who can drop me off, and it's a bit difficult for me to communicate with doctors who doesn't speak the language that I do, the same language. So I just want to let you know that without the health insurance for our family is giving a hard time for us to doing the daily life activities, which is going out of commute, which is 45 minutes long, and no work with the pandemic, and is a bit hardship on our family. We just want to let you know that we are facing a lot difficult during this time.
Thank you, Sean, for your testimony, and thank you for being here today. If you'd like to translate that'd be great.
ကောင်းပြီကိုရှာရင်ကျေးဇူးအများကြီးတင်ပါတယ်ဒီကိုရောက်လာတဲ့အတွက်ကြောင့်အကိုရဲ့ဒီတတိကံဒီလိုထွက်ဆိုမှုတွေကိုပေးတဲ့အတွက်ကျွန်တော်တို့ကျေးဇူးအများကြီးတင်ပါတယ်ကို
ဟုတ်ကဲ့ပါကျွန်တော်လည်းကျေးဇူးတင်ပါတယ်
Have a good day.
Yes, we appreciate you, ma'am. Thank you. Okay.
Thank you.
ကောင်းသောနေ့ဖြစ်ပါစေ
ကျေးဇူးပါ
Imelda, I think I saw you. Imelda, you're up next.
This is interpreter speaking, ma'am. Thank you for using our service. Interpreter 349341 disconnecting. Bye-bye.
Imelda, adelante. ¿Podría activar su micrófono?
Okay.
Adelante, Imelda.
Okay. Estimados miembros del Comité de Servicios Humanos de Connecticut, buenas tardes. Me llamo Imelda Barajas, soy madre y vivo con mi familia en Hartford, Connecticut. Soy indocumentada.
Good afternoon, honorable members of the Human Services Committee. I am a mother, I am a Hartford resident, and I am undocumented.
Estoy a favor de SB 956, una ley que proporciona asistencia médica a ciertos individuos sin importar el estado de inmigración.
I speak today in favor of SB 956 to provide health insurance to determined individuals regardless of immigrant status.
En el año 2006, yo tuve una experiencia muy traumante en la sala de emergencias del hospital de Hartford. Yo llegué.
In 2006, I had a very traumatic experience in the emergency room in Hartford Hospital.
Yo llegué con un dolor muy fuerte en el estómago que me hacía ponerme helada. Mi esposo me abrazaba para hacerme sentir bien, pero era demasiado el dolor. Cuando llegué...
I arrived with a very severe pain in my stomach. My husband embraced me to help me deal with the pain.
Cuando llegué, me pasaron al frente para tomar mi información. No había intérpretes. Entonces, a señas les dije cómo me llamaba y qué era lo que tenía. Un dolor muy fuerte en mi estómago.
When I arrived at the hospital, they asked for my information, but they had no interpreter. They asked why I was there. I said a pain in the stomach.
Nunca me pasaron a una sala a que me tomaran la presión ni a preguntarme qué tanto era el dolor.
They never admitted me into a room to take my blood pressure or to ask me about the pain.
Como no tenía seguro médico, me mandaron a esperar mi turno. Yo pensé que viéndome cómo sufría, me iban a atender, pero no.
Because I had no insurance, they sent me to wait. I thought that they would provide care, but they did not.
Otras personas llegaban y las atendían porque ellas tenían seguro médico. Y
Other people arrived and got care because they had health insurance.
Y yo seguía esperando ahí para ver si ellos se conmovían de lo que como yo estaba y me atendían, pero no. Ahí seguí.
And I continued waiting to see if their hearts would be moved, but no.
Yo me sentía morir del dolor, tan solo de recordarlo. Eso es algo tan doloroso para mí pensar que pude haber muerto ahí en esa sala de emergencias.
I felt that I might die from the pain, and just remembering it is very painful to think that I could have died.
Empezaron a
Señora, le queda 2 minutos. Por favor, de resumir su testimonio.
Ok. No sé cuánto tiempo pasó. Solo sé que yo llegué allí a las 11 de la noche y estuve allí hasta por la madrugada y ellos nunca me atendieron. Yo entonces...
I don't know how long I was there waiting. I just know that I arrived at 11 at night and I was there until the wee hours of the morning and they never provided care.
De ahí yo le dije a mi esposo que nos fuéramos a casa porque ellos no me iban a atender. Como yo no tenía un seguro médico, no lo iban a hacer.
So I told my husband that we should go home because they were not going to see me because of a lack of health insurance.
Por un momento perdí yo el conocimiento y ni eso los hizo a ellos atenderme.
And for 1 second, I lost consciousness, and that made them finally attend to me.
Entonces, decidimos regresar a casa y pasamos por Walgreens para comprar unas pastillas para calmar el dolor.
sorry, they still did not attend to me. So we went home and we went to Walgreens to buy pills for the pain.
Otra vez no, me sucedió otro suceso donde yo tuve que ir a una clínica comunitaria porque los periodos que yo tenía eran demasiado dolorosos.
On another occasion, I had another experience. I had to go to a community health center because during my menstrual period, I had too much pain.
Entonces, yo tuve que esperar una semana para que ellos me pudieran dar una cita con un doctor. Y yo pensé que iba a ser para un ginecólogo, pero no. Ellos me mandaron con un doctor general.
I had to wait a week to get a doctor's appointment, and I thought they would send me to a gynecologist, but no, it was with a general doctor.
Interpreter, excuse me, ma'am. Interpreter, could you tell her that, ask her if she could summarize? Her time is up.
Señora Imelda, se está acabando el tiempo. ¿Podría resumir, por favor, y llegar a la conclusión?
Ajá, sí, bueno, yo solo les digo que en verdad necesitamos este seguro médico porque tan solo de pensar que no nos van a atender, tenemos miedo de enfermarnos y no solamente soy yo, son miles de personas que están en la misma situación. Y queremos que por favor ellos aprueben esta ley. Sería un alivio muy grande tener un seguro médico accesible, por lo menos tener un doctor que nos pueda atender en una emergencia. Así nosotros estaríamos más seguros seríamos más confiados. Por eso apoyo la ley SB 956 y espero que el comité vote a favor. Gracias por su tiempo.
To sum up, we truly need this health insurance bill. We are afraid to get sick because we do not have insurance. And it's not just me, it is thousands of people in my situation. I call on you today to approve this bill. It would be a big change to have affordable health care for everyone. It would give us security and safety in our lives. I urge you to pass SB 956, dear members of the committee. Thank you very much.
Thank you for your testimony. Representative Hughes has a question.
Just real quick, Imelda, did you receive a bill for your time in the hospital for that emergency stay till the wee hours?
Muchísimas gracias, señora Imelda. Una pregunta, ¿a usted le envió una factura por su visita a la sala de emergencias?
No, ellos, ¿cómo me van a mandar una factura si ellos nunca me atendieron?
No, how would they send me a bill if they never even admitted me?
Thank you. I just wanted to know. Thank you so much.
Muchas gracias. Solo
Thank
quería
you for your
aclarar.
story. Yes.
Gracias por contar su historia.
Thank you for being here. Have a great day.
Que pase buenas
Laura.
tardes.
Gracias, igual.
Thank you.
Laura Nelly, followed by Camille Kritzman. Hi,
Hey.
Laura.
Hi, thank you for having me. My name is Laura Nally, and I'm a pediatric endocrinologist testifying in support of SB 956. This testimony represents my personal views. So I've been a physician for over 10 years. When I first became a physician, I vowed to protect the health of all people, irrespective of their immigration status or social circumstances. And I've cared for undocumented children in the hospital in the state of Connecticut who are newly diagnosed with diabetes. My job as the attending physician is to ensure that the patients have received the appropriate education and training to be able to go home and manage diabetes safely. However, I've had to prolong a patient's hospital stay because they had no way to obtain health insurance and the insulin they needed to survive. I want to be clear when I say that we do not have a stable source of medications for these children and that their ability to live depends entirely on donations, which are not a sustainable solution. Most children with diabetes cannot survive without access to insulin, and going just 24 hours without insulin could cause them to be hospitalized with life-threatening diabetic ketoacidosis. So as someone who has lived 30 years with diabetes myself, I understand how hard it is to navigate the healthcare system, even when you speak English and have health insurance. I also know that many undocumented individuals are afraid to reach out for help. Our healthcare system is frequently dictating the treatment that I can give a patient and taking away my power as a physician. So you now have the opportunity to save those children that have no access to the medications and medical care that they need. And just to look at the bigger picture, our healthcare system is currently profiting off of people staying sick and not having access to insurance. Various players in the healthcare system make more money if people have to pay out of pocket rather than negotiated prices through private health insurance and through the Husky program. Rather than denying healthcare coverage to individuals who need it because of cost, we need to start fighting back against those profiting from the healthcare system before healthcare is no longer affordable for any of us. Thank you for your time.
Thank you for your testimony. We do appreciate it. Seeing no questions, have a great day. Camille, followed by Angel, followed by Bridget.
Hi, good afternoon, members of the Human Services Committee of Connecticut General Assembly. My name is Camille Kritzman. I'm a case manager at IRIS, Integrated Refugee and Immigrant Services in New Haven, Connecticut. I will be testifying on IRIS's behalf. The clients that I work with consist of mostly undocumented residents, asylum seekers, and legal permanent residents, most of whom are ineligible for Husky coverage currently. I'm testifying in support of SB 956, but with modifications. SB 956, as currently written, leaves out many in our immigrant community. It leaves out low-income parents and children under Husky A and low-income elderly and disabled folks under Husky C. We support modifying SB 956 to include all Connecticut residents that qualify under the full current Husky eligibility. Furthermore, in 2014, Connecticut immigrants contributed an estimated $1.8 billion in state and local taxes and $3.3 billion in federal taxes. Undocumented immigrants alone pay millions of dollars into state and local taxes every year, taxes that are then appropriated to fund Connecticut's Husky program. Yet my clients who have been paying into the system for years cannot access health coverage due to Husky's limiting eligibility rules for immigrants. This is a public health crisis, especially during a pandemic. Unable to access primary care when health issues arise that are too urgent to ignore, most of my clients get a ride to the emergency room. This causes an unnecessary strain of time, resources, and effectiveness of the emergency services. According to a Yale study published in February 15, 2020, providing medical coverage for all Connecticut residents would be more cost-effective to the state and prevent thousands of deaths. SB 956 with modifications addresses this public health issue and takes the strain off of emergency services in our state. As I mentioned, the majority of the clients I work for are uninsured. Most of my clients have thousands of dollars in medical bills, and many have chronic medical needs that have gone untreated due to lack of insurance. I'm going to share some of these stories today with permission from my clients that demonstrate the unnecessary danger and stress that being uninsured can cause. A single mother who has been a Connecticut resident for the past 15 years has diabetes and was laid off in the pandemic. She used to work cleaning a factory at night, and that shut down in April 2020. She hasn't been able to find another job other than cleaning houses occasionally. She is facing eviction because she has had to choose between paying hundreds for her insulin and staying alive or paying rent. A family of 5 where the father has AIDS. The family relies on independent non-for-profits to access treatment for the father. Even still, with help from these organizations that drop the price for the medication, the family is stuck weekly deciding between purchasing food for their 3 kids or medication. A single mom of 3 who's been a Connecticut resident for 19 years. The 33-year-old son is deaf, blind, and mute. It was determined that he needed brain surgery. Unfortunately, the care needed is economically unfeasible for this family, so his health has continued to deteriorate. His mother has to stay at home and care for her son, while her 2 teenage daughters work to support the family and have put their education on hold to be able to do so. A family with a single mother of 5, where the son was in a devastating car accident when a drunk driver hit him at full speed, destroying his car and injuring him. He panicked as the ambulance came because he was afraid he would not be able to afford the ride to the hospital. The family will not be able to pay the $9,875 bill that the hospital charged him.
Excuse me, your 3 minutes are up. Please summarize.
Okay, we have the opportunity with SB 956 to change this reality for thousands of Connecticut families. This bill is a matter of life or death for thousands of Connecticut residents. At IRIS, it is our goal to work with immigrant families who have made Connecticut their home to meet their basic needs as they strive to be self-sufficient and thrive in their communities. It is not possible for our clients to reach this goal without access to health care. This is why we stand in support of SB number 956 with the modifications mentioned that would include all Connecticut residents, regardless of immigration status, and hope the committee will make those changes. Thank you for your time, and I implore the committee to vote favorably.
Thank you. Thank you for your testimony. Seeing no questions, have a great day. Up next is Alan, Angel, followed by Bridget, followed by Alan, who I see are all here. Angel?
I'm sorry. Thank you. Good afternoon, Senator Moore and Representative Abercrombie. I hope I pronounced your name right. And members of the committee, my name is Angel Halls and I am from Ansonia. I care for a consumer with physically disabilities and I'm one of her lifelines. I am a PCA because I care about people and I love taking care of people as being that lifeline for them. Not only am I a lifeline for the person I care for, but the work becomes a lifeline for me. I am sick and tired of worrying about whether I'm going to get paid every Friday, not just for myself, but it breaks my heart to hear these stories from the fellow PCAs every single week. I suffer from anxiety already, and being an essential worker during the pandemic, it's already stressful. Wondering whether I'll be paid and listening to the fear and stress from so many of my members, my union's brothers and sisters, just add to the anxiety. Today is Thursday, and I am guaranteed you that thousands of us are worrying whether will we get paid confirmation calls tonight. But if we don't, there's nothing we can do about it because Allah will already be closed and going home for the day. Not only does Allah process 6,000 timesheets late every single year, but we also don't get our pay stubs reliable. Many PCAs like me need pay stubs to verify our income for housing or Husky. Because we make so little to begin with, that we have no choice but to rely on these supports. But when Allah doesn't provide our pay stubs, we can be in danger of losing housing or Husky. Once I've waited 2 months to get my pay stubs, which I needed to verify my income for housing. I'm here today, not just because I'm tired of the disrespect towards me, but I'm tired of the disrespect towards my brothers and sisters across the union. If the state really value our work, they would have gotten rid of Allah a long time ago. PCA's majority Black and brown women like me, and we should not be working for free. That's slavery. Something needs to be done. Please pass HB 6560 and allow us to hold Allah accountable. Thank you.
Thank you, Angel. Thank you for your testimony and thank you for your work. Seeing no questions, have a good evening. Bridget, followed by Alan.
Hello, can you guys hear me okay?
Yes, we can.
Okay. Dear members of the Human Services Committee and the Connecticut General Assembly, my name is Bridget Espinoza and I'm a documented college student, C4D member, and a daughter of frontline pandemic workers from New Haven. I stand in support of SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language and that extends eligibility to all Husky programs to all Connecticut residents regardless of immigration status. First and foremost, thank you all for the opportunity that we are being given. After years of howling in the darkness, we are being brought to attention, especially at a tragic time like this, we can all agree. For us to be heard is not our goal this time, though. We are shooting for change. Understanding and hearing our voice is what we really truly are seeking for here. I'm a current 20-year-old female who is pursuing a nursing as her major. Some may look into the field for the benefits or even pay, but not I. My major was decided as soon as I realized that nothing in this world will keep me from giving my time and love for caring and treating those in my community. Although this country can't say the same for me, I have been challenged throughout my whole life. Once I explain my story, you will see my ambition to help those, even though my society will rather exclude me. I arrived at only 2 years old, so I don't recognize any other place to call home like your very own United States of America. Having no health insurance, having no social security, or any type of legal resource can make me act angry towards this country. But it was the opposite. My actions that you all may have not expected. At only 14 years old, I was dedicating summer after summer to help my young youth with their needed academic growth. I bought experience. I was tutoring those in my community way before I could even apply for a legal job. Shadowing my very own elementary school nurse because she was the one of the very first to have faith in me. I'm sorry. And not only for that aspect of the economy, but this time I want to be counted for the sake of my health. I could have given up after the continuous rejection I received, but it only made me more passionate. If you all close your eyes for a quick minute, just a quick second, you see darkness, correct? That's what I see and feel. It was the spring semester of my freshman year of college. I was seated in the very front row of my biology class. After discussing the human eye and the trauma most people face, I was one of many few young teens to be diagnosed with some severe high myopia, meaning that on documents I am labeled legally blind. I was 3 when my parents handed me my first pair of glasses. Already at 3 years old, I already knew my 3-year-old self had a very significant eyesight. I have to be prescribed very, very thick glasses. I woke up one day, my eyes almost touched the tip of my nose. Not only did I lose strength, but it brought me to my biggest fear. All I saw was darkness, pitch black, literally pitch black. My professor reported me to the nearby clinic because I mentioned to her that I didn't have health insurance. When my pupils were being dilated and checked, I was given an exam. All I remember was that the general doctor at the clinic and the nurses freaked and called the ambulance. Rushed me to the ER. I did not have to see my parents or siblings because you see, that's the thing about pain. You don't have to see it. You can already feel it. I fear because all those years of hard work that were given to me and my recognition, because of my vision, have completely left me. The surgeon told me in his own words, having no health insurance will slow the process of surgery. I recommend you seek help. The longer we wait, the higher the chance you will get for permanent vision loss. That's
Excuse
no
me,
surgery.
your 3 minutes are up. Can you please summarize? Thank you.
Sure, that no surgery will be able to. So the point here today is that many of us undocumented youth literally give our all to, meaning education, our money, our time to the community. And unfortunately, they don't do the same. So I'm very grateful to be here today and talk to you all because I know you guys are all very, very important political figures in the state. And I really hope you guys take in consideration of all our time and our words, and for the young people like me and for the whole population of the immigration to please think about us in our future. I support SB number 956 with a clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of immigration status. And I ask for the committee to support this legislation. Thank you for your time. Bridget Espinoza.
Thank you, Bridget. Great job testifying. Seeing no questions, have a great night. Alan, followed by Karen, followed by Rebecca. Good evening, sir.
My name is Alan Dornan, and I'm here today representing the Connecticut Immigrant and Refugee Coalition and United Action Connecticut and myself. So much of what I planned to say it's already been said. And I feel a little bit inadequate as a white man of privilege being in the presence of all these people who are struggling just to survive. I also want to give a shout out to all of you state legislators. I'm almost 82 years old, and never in my lifetime have has it been so difficult and unfortunately so dangerous to be an elected official. So for the past 1,080 days, I have been advocating for my immigrant sisters and brothers on the street corner near my home in Wethersfield. Perhaps some of you have seen me when you're driving by. I like to call myself the old immigrant activist. So I'm here today simply to urge you to pass Senate Bill 956 with amendments to offer Husky insurance to to all undocumented immigrants in Connecticut. Through Father Thomas Walsh at St. Augustine's Parish in Hartford, I have had the good fortune to meet a very large immigrant community in the Park Street section of Hartford and have become very close to them. I know they are hard-working people and they are severely deprived. They certainly substantiate the argument that they are disproportionately deprived in this COVID-19 environment. And in addition, I think that we need to understand that these immigrants, from an economic point of view, contribute mightily to the economic, social, and cultural well-being of the state of Connecticut. Statistics prove that out. Connecticut has been known as one of the more friendly immigrant states in the country, and I hope that you'll pass this bill and keep that reputation growing. My dream is that Connecticut will become known as the immigrant state, and that we will be the example of how a diverse population succeeds in both a moral and economic sense. Thank you.
Thank you, Alan, and thank you for waiting all day to testify. We do appreciate it, and we appreciate your advocacy from your community. So thank you for being here today. Seeing no questions, have a great day.
Thank you.
Karen, followed by Rebecca, followed by Leah. Hi, Karen.
Hi, glad to be with everybody. I've really enjoyed the testimony. I think this is important that we're doing this. I think the facts, first I should say, my name's Karen Warinsky. I'm a volunteer with Medicare for All Connecticut. And I think the facts are compelling. This is the moral thing to do. It's the humane thing to do. And I'm supporting SB 956 today. I'm just gonna mention a few facts that have come my way through the group Medicare for All. And definitely we feel that the Husky All Parts should be expanded and put into play. So the language should be modified to clearly expand Husky eligibility to all low-income residents, regardless of immigration status. I know I've been lucky throughout my life to mostly have insurance, but even with decent plans, there have been times where we've struggled to pay certain things. And I cannot imagine being in this position that many of the people today testified have been in. I think an important fact to remember is that 52% of the undocumented immigrants in our state are uninsured. Compare that with the nearly 6% of the rest of the population. It's not fair, it's bad. And by covering all these immigrants and people in this situation, you're also helping the general population to stay healthy, especially with, not just with the pandemic, but in general terms. Restricting patients from accessing healthcare until their medical conditions are advanced leads to more expensive treatments. When people wind up in the emergency room, we know how those costs are passed on to the public. And hospitals become in trouble from that. So there's a lot of reasons that we can, shore this up and fix this problem. There was a figure mentioned this morning that the total cost in the state for insuring low-income citizens is $6.6 billion, and that the federal government reimburses over 60% of that. And the other figure that came out that struck me was that it would take about 195 million per year to do this legislation to cover these people. These are big figures to a person like myself, but I know that 195 million is just a fraction of nearly $7 billion that's already spent. So I feel like it's just a matter of will. There needs to be some will to get this done. And that's kind of all I have to say. Also, I'd like to point out that several states have expanded their programs recently, and those include California, Illinois, Massachusetts, New York, Washington, Oregon, and Washington, D.C. Connecticut is such a leader in so many ways. We should also be leading on this, this initiative. And so those are some of my points. Medicare for all is really the ultimate goal. That's how I feel. That's how our group feels. And thank you for your time today.
Thank you, Karen. Thank you for your testimony. We do appreciate it. Seeing no questions, have a great afternoon. Rebecca, followed by Leah.
Hi, yes, thank you, Representative Abercrombie, Senator Moore, members of the Human Services Committee. My name is Rebecca. I am a medical student in my final year at the Yale School of Medicine. I live in and vote in New Haven. I'm also the director of a student-run free clinic based out of Yale called Haven. We serve uninsured patients in the greater New Haven area and primarily patients who are barred from health insurance due to migratory status. I'm here to stand in support of the Senate Bill number 956. And I know many providers have talked about, the economic impact and how not providing insurance to immigrants is not only very costly, but just overall inhumane. And I really want to echo those comments. I also grew up in an uninsured household, and I saw the physical and emotional effects on my own family. It's hard as a child overhearing your own mother in the bathroom crying, not knowing the context because she doesn't know how she's going to afford a surgery that she really needs. And that's something that has always stuck with me from my childhood, and unfortunately something that I see repeat in so many of the patients who come to our clinic. I've sat crying with patients who don't know what to do because they've been denied care or are in incredible medical debt. It's really hard to see. So at our clinic, we see the full extent of what having or not having health insurance really means, and how unnecessarily difficult it is at every single step of the way. And so, our clinic has created a patchwork of services, but it is certainly not enough. I get calls on a daily basis from patients who, in some way or the other, even if they apply for special programs, they still get denied care, medications, specialty services. We're the only free clinic in Greater New Haven, and so we pick up a lot of patients who are on the verge of medical emergency and can't afford care at FQHCs, despite the really good work that they do. And during the pandemic especially, we've seen patients unable to pay that sliding scale fee or the discounted medications there. And so we've picked up that bill, and it's not uncommon that our patients tell us that they've been forced to make the decision in between paying for rent, food, and for the families, and paying for their own medications. So the most common things that we see are patients who have not been on their medications for years. They have some, diabetes, hypertension. They come in at a point where we can no longer see them in our clinic. They're at the point of emergency, and so we send them directly to the ER, which, as many have said, is a lot more costly than what it would have costed just to give them a stable supply of medications and regular follow-up. And in the most extreme of cases, we've had a patient, for example, in the hospital right now who's been there for 2 months because she has end-stage renal disease. She needs dialysis, and there's no outpatient dialysis centers in Connecticut. And so she is stuck there because she has no other options, and it's costing the hospital and the public hundreds of thousands of dollars, likely by the end of her time in her hospital stay. And so these are the cases where, oftentimes a student-run clinic, we cannot handle. These require such a higher level of care, but it's really difficult for us to sometimes even transfer care to an FQHC because the system is so overburdened.
Excuse me, your 3 minutes are up. Please summarize.
Yes, ma'am. So, this kind of patchwork Band-Aid system that we have, it's really truly inhumane. It's disorganized, it's inefficient, it's rooted honestly purely in discrimination. And the fact that we can get away with the subhumane treatment of immigrants in this country. And I really believe Connecticut can do better. So I urge the Human Services Committee to support this bill. It would be an incredible step towards health equity in the state. So thank you.
Thank you, Rebecca, and thank you for your service and everything that you do, especially with the free clinic that you run. Thank you very much for that. Seeing no questions, have a great afternoon.
Thank you.
Leah, followed by Shanice.
Hi, good afternoon. Good afternoon, Representative Abercrombie, Senator Moore, members of the Human Services Committee. My name is Leah Schechter, and I'm a physician in my second year of residency training in the Yale Primary Care Internal Medicine residency program in New Haven. And I'm very grateful for the opportunity to share with you why I strongly and wholeheartedly support Senate Bill number 956. I'm the daughter of an immigrant. My mother came to this country from Ecuador in the 1970s, and she was fortunate enough to arrive already with resident status. Many of my patients are not as lucky. Some of the most demoralizing experiences I've had as a new doctor have happened while caring for patients who are undocumented and uninsured. Recently, while working in the hospital, I met a young undocumented man whose liver was failing. And he came to the hospital after having a life-threatening bleed related to his liver disease. We replaced the blood he lost, banded the large bleeding veins in his throat, coordinated follow-up appointments. But when I went to review his medication regimen with him before discharge, he looked at me and asked, how much is all of this going to cost? Our team worked together trying to solve this riddle of how he could afford a month's supply of only the most necessary medications with various assistance programs that we could offer him. In the end, he could afford it, just barely. And I imagined him struggling to solve this riddle of survival each month and the month after that. Several weeks later, he bled again. And this time we couldn't save him. And when he died, I felt angry and trapped. Angry that each step of the way for this man, who's a father, a worker, an active contributor to our community, was paved with injustice, and trapped in a system that asks me to care for those who are most vulnerable and then makes it impossible. What if he could easily afford his medications? Would he still be alive? Or what if he were eligible for a liver transplant, something that's unimaginable for those without insurance? Every person should have the right to access basic medical care, regardless of documentation status or ability to pay. And if moral appeals fall short, as many people have mentioned, think of the cost that could be saved if this man had access to preventive medicine instead of heading to the emergency room when it was arguably too late. So this is not an uncommon story, but I hope one day that it will be. And I think this bill is a crucial step towards that goal. So I fully support SB number 956, and I ask the committee to please support this legislation as well. Thank you so much.
Thank you, Leah, for sharing your story. And let me just say on behalf of the committee how sorry we are for your loss and what you do every day and having to look at these patients and families and go through this with them. So thank you from the bottom of our heart for everything you do. We do appreciate it. Seeing no questions, have a great afternoon.
You too.
Shanice, followed by Robert.
Hi, good afternoon, everybody. My name is Shanice. I'm a resident of Connecticut. I'm writing in support of the bill SB 956. This bill will allow income eligible families access to Husky Medicaid program, regardless of immigration status. To me, the undocumented community holds the weight of the United States on their back. For instance, undocumented individuals are caring for our parents, our children, growing our food, packaging our goods, and more. At times, these jobs risk their physical health, performing back-breaking and dangerous tasks in toxic, unsanitary conditions like that of factory farms. Their mental health is often compromised as well. Some employers take advantage of the employee's status and underpay and overwork them and prevent them from having paid sick days. While people who are undocumented are trying to make ends meet in their own home, they end up supporting all of our families too. Furthermore, they also end up supporting the U.S. economy. The New American Economy Research Fund found that in 2014, Connecticut immigrants contributed an estimated $1.8 billion in state and local taxes and $3.3 billion in federal taxes. The undocumented immigrants alone pay roughly $145 million in state and local taxes every year. taxes that are then appropriated to fund Connecticut's Husky program. Yet despite their contributions, many immigrant communities cannot access health coverage due to Husky's limiting eligibility rules for immigrants. In turn, tens of thousands of families and individuals with no coverage cannot receive the proper care and treatment they deserve. This is a massive public health concern. Expanding Husky's eligibility to be inclusive of all immigrants, regardless of the status, will help equalize access to healthcare coverage and help reduce the uninsured rate in Connecticut. This year at a health conference, I learned about an undocumented mother with 2 preteen sons. Her boys must watch their mother get so sick that she can finally receive care through the emergency room. This is the only way she can receive dialysis. Every couple of days, she comes close to dying because of her inability to receive regular dialysis treatment. Once again, Connecticut has the opportunity to stand up for the immigrant community and to pioneer human right gains across the United States. I'd also like to say, if you listen closely to what people are saying, they're saying that everybody is deserving of healthcare. It's a human right. I believe Husky should be expanded to every Connecticut resident. I'd like to say, if we're worried about money, a lot of money will be saved from people not having to go to the emergency room. I'll also say that money can be pulled from military, millionaires and billionaires through Connecticut through taxes. I'm sure some millionaires and billionaires didn't like that just now if they're on the call.
Excuse me, your 3 minutes are up. Please summarize.
Sure. And we'd be saving money from people who go into the criminal justice system, kids that end up in foster care. So there is money. It's just about if we're willing to overthrow the racist policies that have been existing since this country has been existing after the white settlers that came here, and carry on the legacy of racism and discrimination and xenophobia. Thank you.
Thank you, Shanice. Thank you for your testimony. We really do appreciate it. Seeing no questions, have a great afternoon. Robert, followed by Demetrius, followed by Luis. Welcome, Robert. Sir, you're on mute.
There we go. Chairwoman Abercrombie and Senator Moore, if you're there, and members of the distinguished and important Human Services Committee. My name is Bob Fishman, and I am the Executive Director of the Connecticut Immigrant and Refugee Coalition. We're often known as CIRC. A number of you have known me during my many years as the Executive Director of JFAC, and I'm pleased to see again many of you in my new role as head of CIRC. My enduring passion is to help new Americans and to encourage our state to do all it can to welcome these fine people into our fold. In this spirit, let me take a moment to outline our CIRC's mission and how Senate Bill 956 dovetails nicely into the work that we do. CIRC has been around since 1996. This is our 25th year. We're a nonprofit dedicated to advocating and working every day to help legal immigrants, undocumented immigrants, refugees, and asylees. Some of you may be familiar with our Immigrant Day ceremony every year at the Capitol. The event honors immigrant members of the community who have made good and benefited the state through their life's work. We're about helping good people. Our organization prides itself on its nonpartisan, non-denominational platform. And indeed, our board is comprised of citizens and naturalized immigrants coming from different diverse ethnic, social, religious, political beliefs, all united behind the idea that sound immigration policy is in everybody's interest. So too, we do believe that SB 956 modified and enhanced, providing health insurance coverage to all the state's undocumented residents, is in the broad public interest. These uninsured folks, often caught in limbo status due to any number of life adversities, are still our neighbors. They're valued members of the community, and like any of us, sometimes when life hits us with challenges not of our own making, we have to rely on a safety net. And in public health crises like COVID-19, all of us must care for our own well-being by also enabling our neighbors to do the same, so that what is preventable does not spiral into a matter of life and death. I recognize the state faces many budgetary challenges that even with a new administration in Washington, help from Washington may not be coming quickly. Indeed, this bill is being raised today is yet another reminder of the lack of sensible federal policy that keeps so many immigrants in a legally precarious position. If we had better policy, we would not need SB 956. Alas, important stopgap measures are desperately needed. This is a beautiful proposal that demonstrates that we in Connecticut can do better to set a national example of how we treat all people who call our beautiful state home. I close by saying how grateful I am this proposal is being considered, and that whatever the outcome, it's so important to have this public discussion on the best ways of helping our fellow residents, not only to weather this public health crisis, but in bringing them into the fold, what it means to be part of the Constitution state. And I thank you, and I hope you can see behind me is our brand new signs. And let me see. And I guess you have to read it backwards, but keep families together. It's our new logo. We're very proud of it, and our website. Thank you very much.
Thank you, Robert. Thank you for your testimony, and thank you for your advocacy. I don't see any questions, so I'm just going to say have a great evening. Thank you so much.
Thank you.
Demetrius, followed by Luis, followed by Urka. I hope I said it right. Demetrius? Demetrius, I see you.
Can you hear me now?
Yes, sir.
Okay, but I see Bob Fishman there. Okay. Hi. Do you have my picture, my photo? Am I turned on?
No, we don't, sir. We don't see you on the screen. We just hear you.
Okay, let me just, here you go. Hi, how are you? Chairwoman.
Hello, former state rep and colleague. It's nice to see you.
Great to see you, and I want to thank you for doing this and spending so many hours already on this public hearing. It's very difficult, and of course, under the circumstances of pandemic, it's even a lot more difficult than I was encountering when I was chairing committees back then. My name is Dimitrios Giannaros. I'm the chair of the Immigrant Heritage Hall of Fame and vice chair of the Connecticut Immigrant and Refugee Coalition. Among other things, I'm a professor of economics, as you know, and I've never done anything at the Capitol without really presenting the economic perspective on issues, because I taught for 35 years a course called Economics of Public Policy. So I had the obligation in my mind, at least, to speak from an economic perspective, and I'll make some references, in fact, today. From a humanitarian point of view, there's no excuse, there's no question that every human being should be covered for healthcare and provided preventative care so that all of us are safer and better from a healthcare point of view and economic point of view. It is totally crazy from an economic point of view to have employees go to work sick, or go to work and leave in the middle of the day because they're sick, or simply not be able to perform up to par, or infecting others, as it's happening now with regards to the virus that we are all confronting. All of these are costs to society, to the economy, and to the state because the income is going to be less as a result of what I just mentioned, because productivity and economic production and income will be less, tax revenue will be less. So if we can prevent all of that, actually we will end up with more economic activity, more employment, more income, and more tax revenue that will more than pay for all the costs that we're talking about in covering healthcare for people that are not covered at this point or do not qualify. The economic and social costs, of course, justify, in my opinion, coverage for all. But earlier in the day, you had the commissioner, and you asked, I think Senator Moore or somebody asked, what is the cost to cover all the what is intended in this particular bill? I've done the calculations as you were speaking, and we're really talking about 8.1% of the total Medicare cost of the state, because the rest of it is paid by the federal government. If we were to finance 195 million, basically we're increasing the Medicare cost, the part that the state is covering, by 8.1%. But since they already have $50 million in the budget, we're talking about a 6% increase on the Medicare cost to cover the bill that we're talking about. Another thing that I did some calculation on, and of course, as I said, I look at things from an economic perspective because the costs and benefits, as was mentioned earlier by one of the speakers, Jay Sitlik, who I know well, and he's a very smart man. If you take the $195 million that the commissioner talked about, the cost of this particular bill, as a percentage of the state's budget, we're talking about 0.85%, or if you already account for the 50 million that's already in the budget, 0.63%, that is less than 1%, 0.63%. And if you were to cover all immigrants, 100%, for all healthcare costs, and I'm talking about the undocumented now, who are, in our state, we have an estimated population of 120 million undocumented immigrants. If you were to pay for all of their health care costs, it would be about 2 to 3% of the budget, maybe 3.5%.
Excuse me, your 3 minutes are up. Please summarize.
Yeah, and I'm going to wrap up because as you see, I'm getting excited now. But because the undocumented immigrants, they already, half of them are already covered for healthcare. We're really talking about a total of an increase of 2% in the overall budget. So the bottom line is that if we were to save all the costs that we are encountering by not treating people, they are less productive and more healthcare costs. We lose people, they die, or they become less capable to work, as we heard so many great testimonies today. If we save all of that by investing in healthcare and preventing all these things from happening, actually the state will gain revenue and we will have a net benefit rather than a net cost based on economic cost benefit analysis. So I strongly support SB 956 without any question. It is a smart investment, and I would support that at any time, anywhere for that matter.
Thank you, Representative. Thank you for your testimony. Representative Hughes?
Oh, thank you, Madam Chair. I just wanted to clarify, you said 120 million undocumented. I think you meant 120,000 in Connecticut.
I did say million, and I did mean, thank you for correcting me.
I just wanted to set the record.
120,000, yes.
Yes, 120,000.
Yeah, it's 3.4% of the state population.
And we know that there's about at least over 50% uninsured. If we invest in 2% of the overall Medicare Medicaid budget, it would more than cover the cost savings from not covering the
if we were to cover the rest of the undocumented fully 100%. Without having to worry about those who are already covered, the cost to the state would be the equivalent of 2% of the state budget. That's what I meant.
Of the state budget.
Yeah, what I was talking about before was for the 195 million.
Oh, 100. Mm-hmm.
Yeah, yep. Which relates to this particular budget. That would be 6% of of the Medicaid cost that the state pays.
That the state pays. Okay. Do you
Yeah.
have those figures in a document that you're submitting with your
I
testimony?
I calculated this because I was listening to the testimony and I thought this would be interesting and good to have. I can send it to you. I'll type it up and I can send it to your clerk there so they can pass it on to you.
Thank you so much. This is
Sure.
very helpful. Thank you, Madam Chair.
Thank you, Representative, and thank you, Representative Demetrius. It's so nice seeing you, and so happy to see you're doing so well. I think it's been well over 10 years, so
Yes,
it's a nice
thank you.
surprise to see you.
Yeah, I think we were overlapped for about 3 terms, 6 years.
I think so too, yes.
And
I
I'm
do,
following
yes.
you and some of the other members on the committee. You're doing a fantastic job. Thank you.
Thank you, sir. Thank you. It's so nice seeing you. Have a great night.
You too. Thanks.
Luis, followed by Iruka. I hope I'm saying it not right. Luis?
Hi, good afternoon, members of the committee, distinguished Madam Chair, Representative Hughes. My name is Luis Luna. I am an organizer with the Connecticut Working Families Party. I'm also a member of the Semilla Collective, and we heard some of our friends testify. I'm here, and I stand in support of SB 956, an act providing medical assistance to certain individuals, regardless of immigration status. I will submit my testimony, and I just wanted to just share that last Friday I had an accident, and I messed up my knee, and I was able to see a doctor. Earlier this afternoon, I was able to go see the orthopedic surgeon, and they're scheduling an MRI for my leg, and then they might do surgery on my knee. And I'm mentioning this because I have insurance, and I was able to get medical care. So this makes me think about my own family. I come from a mixed status family. I have family members who are undocumented. I have family members who don't have access to healthcare, don't have access to the stimulus check, don't have access to any other type of federal aid. And I'm also thinking about my brothers and sisters here in Connecticut who are undocumented and who also don't have access to to medical care. I think we understand that healthcare is a human right, and with the pandemic, we have seen that workers we have redefined workers. We have redefined who are our essential workers, those who take care of our children, those who take care of our elderly, those who grow our food, and those who are in the front line, making sure that we continue to move forward and fight against this pandemic. So with that, I just want to, I will submit my testimony, but I just wanted to just kind of bring out the fact that we are here as a resilient community, as a strong community, as a community that has really seen the brunt of this administration, and often the immigrant community is forgotten. And we are in a moment where we can vote this bill out of this committee. We're in a moment where your fellow colleagues, both in the Senate and the House, can in fact vote for this bill and can get this bill passed. So many members of my family, many members of my community have access or can have access to health insurance. We have heard from folks like Evelyn. Evelyn is one of my friends, and she testified a little while ago, and she owns thousands and thousands of dollars. And I was able to get an MRI, but her husband wasn't able to get an MRI. So they had him wait months and months and months until his conditions got a lot worse. So with that, I'll stop right there, and I really urge this committee to vote in favor of SB 956.
Thank you, Luis, and we hope you make out well with your knee as you go forward. Seeing no questions, thank you so much for being here, and have a great evening.
Thank you.
Iruka, followed by Maricela, followed by Nayeli. Could you say your name? I'm just curious if I said it even close.
My name is Iruka. Good afternoon, everybody, members of the Human Services Committee. I live in New Haven, Connecticut. I'm a member of SMEA Collective, and I'm here to stand in support of SB number 956 with clear language that extends eligibility to all Husky programs to all CT residents, regardless of immigration status. Healthcare is a human right. Everyone deserves healthcare. We need to extend this human dignity and respect to everyone. I work at a soup kitchen in New Haven and some other harm reduction organizations. Every day I meet undocumented folks, including some who are on the street, unhoused, or housing insecure, who have chronic medical complications and cannot get the care that they need. They had to live with extremely difficult conditions that could have had a solution through preventative care, but they're instead denied care and dignity, violating their human rights and putting them in dangerous situations every day, and even putting them at the risk of death. They're going through literally heart-wrenching and inhumane situations every day due to this lack of access. It's not okay that folks don't have access to healthcare. It will never be okay or justifiable in any way. This is a literal disgusting violation of human rights, and it needs to change now. And this is why I'm here to stand with my undocumented brothers and sisters in support of extended eligibility to all Husky programs, regardless of immigration status, as the bare minimum of care that we can extend to happen. And this needs to happen now. So thank you for listening to my testimony.
Thank you so much. We do appreciate it. Seeing no questions, thank you very much. Have a great afternoon. Maricela?
Yes, Representative Abercrombie, I believe that Maricela is not going to testify.
Okay, then we will move on to Nayeli, and I think you're here to testify, to translate for her.
Yes.
So just tell her welcome and you can proceed.
Bienvenida, Nayeli. Adelante.
Buenas tardes, miembros del Comité de Servicios Humanos. Mi nombre es Nayeli García. Soy residente de West Haven. Soy miembro de Unidad Latina en Acción.
Good afternoon, members of the Human Services Committee. My name is Nayeli Garcia. I am a resident of West Haven and a member of ULA, Unidad Latina en Acción.
Yo quiero dar mi testimonio a favor del proyecto de ley SB 956 para el derecho a la salud para todos, sin importar el estatus migratorio.
I want to give my testimony in favor of SB 956 for the right to health care for all with no regard for immigrant status.
Mi historia es, quiero contarles la historia de una integrante de mi organización.
My story is, I want to tell you the story of a member of my organization.
Ella es residente de Westbrook y vive en Connecticut desde el año 2011 con sus hijos.
She's a resident of Westbrook, Connecticut. She's lived there since 2011 with her children.
Son indocumentados. Su hijo de 16 años está estudiando y saca buenas notas. Su sueño es ser médico.
They are all undocumented. Her 16-year-old son is studying high school and gets good grades. His dream is to become a doctor.
Diana espera que su hijo pueda llegar a ser una persona que ayude a este país, pero no es fácil, porque él vino a este país cuando tenía 7 años y es un indocumentado.
Deanna hopes that her son can become a person who helps this country, but it's not easy because he came to this country when he was 7 years old and he is undocumented.
Ni Diana, ni sus hijos, ni yo están con un seguro médico. A veces sus hijos han estado enfermos y por miedo a los biles no los ha llevado al médico.
Neither Diana nor her children have health insurance, and sometimes her kids have been sick, but because she was afraid of the bills, she did not take them to the doctor.
Como yo, Diana es trabajadora del hogar, limpia casas, es madre soltera y trabaja todos los días para llevar comida a la casa.
Just like me, Diana is a domestic worker. She cleans houses. She is a single mother who has to work every day to put food on the table.
Hace un año tuvo una caída en el trabajo. A raíz de esa caída ha estado por un año con la pierna y la rodilla hinchada.
And a year ago, she fell on the job. And because of that, for a whole year, her leg and her knee have been swollen.
A raíz de esa caída, ha estado por un año con la pierna y la rodilla hinchada. Estuvo 3 meses y medio en cama sin atención médica. A los 4 meses de la caída, por fin logró tener una cita con el médico.
She spent 3.5 months in bed with no medical care. And finally, after 4 months after the fall, she got an appointment with the doctor.
La cita fue muy tarde porque no contaba con un seguro médico ni contaba con ninguna ayuda de parte del empleador. El no ser atendida les generó muchas secuelas que no debió tener.
The appointment took so long because she didn't have health insurance and she didn't have any support from her employer. And because she did not get the care in time, it created a lot of repercussions that she could have avoided.
Pasó mucho
Señorita
tiempo.
García, por favor, resumar su testimonio.
Sí, pasó mucho tiempo para obtener una cita por el mismo problema porque no daba citas con especialistas. Cuando uno no tiene seguro médico, hay que aplicar a algunas organizaciones de caridad para que brinden ayuda médica.
The problem is that if you don't have insurance, it's very hard to get an appointment with a specialist. You have to apply to some charity organizations.
En algunos casos aceptan la aplicación, en otros no. En el caso de Diana, gracias a Dios le ayudaron, pero llevó mucho tiempo.
So you apply to different charities, you hope that they take your application, they reject your application. Finally, thanks to God, a charity helped Diana, but it took too long.
Se enfermó luchando para que le ayudaran. Aún así, ahora sigue con la pierna hinchada. Todos los días terminó amarrando la pierna, que le duele para poder estar bien un poco.
She got sick fighting to get care and she still has her leg swollen. And every day she ties up her leg, which is in pain, to feel a little bit better.
A pesar del dolor, tiene que salir a trabajar todos los días para llevar la comida a casa. Es madre soltera. Para las trabajadoras del hogar que limpiamos casas, cuidamos a niños y cuidamos a ancianos, no hay ninguna ley que nos brinde derechos o nos proteja. Nuestro trabajo es esencial, pero subvalorado.
And even though she's in pain, she has to go to work every day to put food on the table. She's a single mom. For domestic workers like her and like me, we clean houses, we care for children, we care for elderly, and there are no laws that protect our rights. Our work is essential, but it's undervalued.
Yo también limpio casas y creo que como seres humanos y como indocumentados y como ciudadanos, todos merecemos tener un seguro médico. Gracias.
I also work as a house cleaner, and I believe that as human beings, as undocumented people, and as citizens, all of us deserve to have health care. Thank you.
Thank you. Tell her thank her for her testimony, and we wish her all the best.
Muchas gracias por su testimonio.
Perla, followed by
Gracias.
Hector, followed by Angela.
Hi. Hello.
Good evening.
How are you? Dear members of the Human Services Committee of Connecticut General Assembly, my name is Perla Vanessa Cardoso. I am a resident from New Britain, Connecticut. I am a first-generation child of immigrants. I am a community organizer here in New Britain at Connecticut Students for a Dream, a youth-led organization that fights for the rights of undocumented youth and their families. I stand in support of SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all Connecticut residents regardless of immigration status. I'm here to ask you to take immediate action to open up the Husky healthcare program for all individuals regardless of their citizenship status. I've seen my parents, family, and community struggle paying their healthcare bills. I know of folks of the community who have been turned down by doctors because of their immigration status. It is unfair. With more than 130,000 estimated undocumented immigrants residing in our state, this is a massive public healthcare concern. Early treatment effectively reduces the amount an individual will pay for healthcare in the long term by preventing health issues from developing further. Undocumented immigrants in our state pay roughly $145 million into state and local taxes each year. These undocumented taxpayers are funding state healthcare programs such as Husky, our Connecticut residents use, but due to their status are unable to access any of these health programs. As taxpayers funding state health programs, undocumented residents deserve an equal and fair opportunity to access the very programs they fund. Now I'll share a personal story. I come from a mixed status family. So my parents are undocumented, my older brother's undocumented, and they've been here for over 21 years, right? 21 years of paying taxes, 21 years of going to medical visits and leaving with $300 of bills to pay, right? And that's for every time that they have to go, right? And this one really hits home because, again, like even though we say we pay taxes, that doesn't mean that doesn't make us less human, right? So like my mom, she worked at a nursery, plant nursery 2 years ago. And 2 years ago, she had an accident and she injured her already messed up knee, right? Shortly after that, she got laid off, right? So after she got laid off, she had to go keep getting checkups. And eventually now 2 years later, it led her to having arthritis, severe arthritis, right? Which could have been avoided, right? And not only that, right? My father as well, he has his own landscaping company, right? And even with that, right? He always comes
Excuse
home.
me, your 3 minutes are up. Please summarize.
Sure.
Thank you.
Right. And yeah, right. So I feel like these are many stories that you'll keep hearing and that you've heard all day today. But with that, I stand in support of SB number 956 with clear language to extend current Husky eligibility rules to all CT residents, regardless of immigration status. And I ask the committee to support this legislation. Thank you.
Thank you, Perla. Great job. Seeing no questions, have a good evening. Hector Castro? No Hector. Angela Bellis?
Hello.
Hi, Angela.
Hi. Oops, sorry.
We can't
Thank
see you, just so you know, Angela.
That's okay. I'm pulled over in a parking lot. Hi, my name's Angela Bellis. I'm a member of Connecticut Mutual Aid East of the River and Uniting for a Safe Inclusive Community, and I live in Manchester. I am here in support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all Connecticut residents regardless of immigration status, because healthcare is a human right. I currently have healthcare coverage as a graduate assistant at UConn, but I lived without health insurance for years. And during these years, I didn't have a PCP. I didn't go to a dentist for a decade. I didn't seek medical advice when I was ill because I couldn't afford to. This is not a unique story. Clearly, we've heard this over and over today. It is well documented that uninsured individuals are less likely to seek medical care until it is urgent and therefore more dangerous and more costly. I am also the daughter of an immigrant. And when I was a teenager, my father became very ill and went to see a doctor for the first time in decades. He was eventually diagnosed with non-Hodgkin's lymphoma. My father struggled through rounds of chemotherapy and radiation treatments and eventually kidney failure. When I think about these years and all of the pain and suffering my father experienced, first with cancer, then after his first heart attack, and later in life with chronic kidney disease, another heart attack, and finally years of dialysis, I'm grateful that he had access to health care that extended his life for 25 years beyond his initial cancer diagnosis. My 6-year-old daughter only got to know her papu because of the health care and interventions he received through multiple organ failures. Do you have any idea how much dialysis costs out of pocket? How much 10 days in the hospital costs? Most of us can't dream of being able to pay the $100,000 plus hospital bill or a year of dialysis out of pocket. The additional stress of crushing medical bills while dealing with life or death medical issues only further exacerbates human suffering and racial health disparities. I'm testifying today because my father actually did have access to quality health care, and it extended his life, improved his quality of life for years. And I know that everyone should have access to preventative, interventional, and life-saving healthcare, regardless of immigration status. Our immigration system is grounded in white supremacy. My father's story is very different because he happened to be born in a European country, and the US quota system for immigration has overprivileged white European immigrants migrating for the same reasons anyone migrates: for economic opportunity, to escape the violence of poverty, to escape the violence of war and civil conflict, for love. It is long overdue that Connecticut ensures that our immigrant friends and neighbors, the same essential workers holding up our economy, our food systems through a global pandemic, have access to preventative and life-saving health care. This was true before the COVID-19 pandemic struck, and in the midst of a global pandemic, passing SB 956 is imperative. I'm also speaking today as a member of CT Mutual Aid East of the River in USIC, because many of my friends are not able to take this time away from work or family obligations to speak to you. And many of my friends and our members are scared or intimidated by this process for a variety of reasons. I'm here in support of—
Excuse me, Angela, your 3 minutes are up. Please summarize.
Sure. Just like a lot of other folks said today, I have folks in my life who get that $10,000 emergency bill from the hospital and can't pay it and don't have healthcare access, and no one should have to live that way. I'm here for and with those friends because healthcare is a human right, and we need to codify access to healthcare coverage to Husky, regardless of immigration status, into Connecticut law. I support SB 956 with clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of immigration status, and I ask the committee to support this legislation. Thank you.
Thank you, Angela. Seeing no questions, have a great night. Drive safely.
Thanks.
Jaleesa? I don't see Jaleesa, so we will move on to Allison. Hi, Allison.
Hi, Representative Abercrombie, Senator Moore, members of the committee. My name is Allison Weir. I'm with Greater Hartford Legal Aid. I've submitted my written testimony in support of SB 956. You've already heard so many more eloquent personal stories about how important this is. I just want to use my time to call the committee's attention to a couple of some disparities in how Husky A, Husky B, Husky A, C, and D are identified in appropriations as compared to Husky B. In sections 1 and 2, which address to Husky A, Husky C, Husky D, as well as Husky A for pregnant women, the extension is limited to within available appropriations. But in section C for Husky B, is extended regardless of immigration status. I imagine this will probably get, it might have been an oversight in drafting, and it'll probably get cleared up when it gets to appropriations, but I just wanted to call your attention to it. Otherwise, I think this is an important bill for not only the individuals you've heard from, but also for public health, and basically making the state a better, fairer place. So I urge you to support the bill.
Thank you, Allison. Thank you for your testimony.
Have a good night.
Seeing no questions, have a great night. Jorge? Jorge? I don't see him. Colleen? There she is. Hi, Colleen.
Hello, good evening to you all. Thank you for hearing me. Dear members of the Human Services Committee of Connecticut General Assembly, my name is Colleen Fitzgerald. I'm a resident from Granby. I am the daughter, sister, niece, and spouse of immigrants. I stand in support of SB number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs, to all Connecticut residents regardless of immigration status. As I said, I was born in the US, but live in a family of first-generation immigrants. I spent about 10 years of my childhood in Connecticut, growing up in Granby, attending Catholic schools in Simsbury and West Hartford. Then I moved on to college in Maine and eventually moved abroad to Argentina, where my current spouse is from, and that's where I experienced life as an immigrant myself. I want to share a little bit about my experience in Argentina briefly before I bring it back to Connecticut. You see, as an artist and community activist, my income over the last 6 years has never been stable, but I continue to do this work because it is essential to a healthy society. In Argentina, there is universal health care. So as an immigrant, albeit privileged coming from the US, but without much money, it was a comfort to know I could always go to a public hospital whenever I needed, regardless of my immigration status. Nothing was ever asked of me to have access to these services. And that gave me an immense peace of mind. I was able to use the public health system in several emergency and non-emergency situations. Fast forward a few years, and I have brought my Argentine husband to live with me in my home country. We went through this process of immigration and extremely hostile anti-immigrant sentiment that's currently plaguing our country. But here we are. As two young, able-bodied and hardworking people, we are doing all that we can to live a decent life here. Unfortunately, the pandemic caused us both to lose jobs that we secured a few months prior, and we currently rely on government-provided social safety nets. We were both uninsured for several months as we lost our jobs and had to move quickly from New York to Connecticut. Our biggest worry during this pandemic was going to the hospital without health insurance and falling into medical debt. Let me say that again. Our biggest worry was not dying, but falling into crippling debt during this crisis. Things should not be this way. Luckily, in December 2020, we signed up for healthcare through Access Health, and I was able to get Husky Health as a US citizen, but my spouse was not eligible due to not living in the country long enough. And while the healthcare remained relatively affordable for him, our differing immigrant statuses meant different access to affordable healthcare. While I know the US is a ways away from the universal healthcare I experienced in Argentina, I'm hopeful that my home state can lead the way towards a more equitable system. Healthcare is a human right, but that's not how it's treated here. If you have the economic resources, you will get quality care. If you are poor, an immigrant, undocumented, you will not have access to the same care. And coming from an immigrant, from a family of immigrants, I know just how hard immigrants work to get by in this country. And they truly work harder than most people, most citizens. But our social services often exclude them, especially those who are undocumented. We must make sure that everyone has health care, and it is for this reason I support SB number 956 with clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of immigration status. And I ask the committee to support this legislation. Thank you very much for your time tonight.
Thank you, Colleen. We appreciate you taking the time to come and testify, and we hope you have a good evening. Next, we're going to move on to, and I hope I say it right, Zusli, followed by Julio, followed by Tanner. Representative Garibay is going to cover. I have another meeting starting at 6 until Senator Moore returns. So I'm not sure if I see, oh, there. Zusli, you're up next. Number 109.
Hola.
Do you need an interpreter?
Yes, please.
Okay.
Hola, Suseli.
Hola, mi nombre es Suseli González. Pertenezco al grupo de Chapinas Unidas en Stamford, Connecticut.
Good afternoon. My name is Suseli Alvarez. I'm a member of the Chapinas Unidas group in Norwalk and Stamford, Connecticut.
Sí, yo he tenido mucho problema desde que yo vivo acá porque no he tenido seguro médico.
I've had a lot of problems since I've been living here because I have not had health insurance.
Mi esposo es un ciudadano americano desde el 98 y él siempre ha pagado sus taxes.
My husband is a US citizen since 1998 and he has always paid his taxes.
Al principio él me pagó seguro, pero él no gana un gran dineral.
Initially, he paid for health insurance for me, but he does not earn a lot of money.
Tengo 2 niños acá y me ha costado mucho porque los he tenido con cesárea y he estado muy enferma.
I gave birth to 2 children here and it was very hard. I had C-sections and it was complicated.
Hace 4 años empecé con sangrado vaginal y me han hecho varios exámenes, ultrasound, CAT-scan, y debo miles de dólares ahorita.
4 years ago, I had vaginal bleeding and I had to have various exams, ultrasound, CAT scan, and I owe thousands of dollars for those tests.
Yo pago una cuota de 100 mensual, pero me están cobrando que tengo que pagar. Yo no puedo porque también me dio el coronavirus y me quedé sin trabajo.
I pay a rate of $100 per month, but I can't pay it anymore because of the coronavirus pandemic. I've been left jobless.
Me están iba de llamar que necesito un papá Nicolau y la mamografía porque yo tengo familia que han tenido cáncer de pechos y por el miedo que me suban más los biles, yo no puedo ir.
I need to get a pap smear and a mammography because I have family members who've had breast cancer, but I can't pay for the bills. I don't know how I'm going to do it.
Mi esposo me dice, ya no puedo con más porque la verdad solo él ha tenido el cargo.
My husband says he can't pay the bills anymore.
Y pues ese es mi testimonio porque siempre me han tratado mal. El año pasado también, antes que me diera el coronavirus, se me infectó la garganta con llagas y yo llegué mal con fiebre y no me quisieron atender porque me dijeron que no tenía seguro.
That's my testimony. I've always been mistreated by the health system. Even before coronavirus, I got an infection in my throat and they did not want to give me care because I did not have insurance.
Y pues yo por eso yo les pido que por favor que si nos aceptan para que nos den seguro para igual pues mis niños tienen seguro privado y pues a ellos sea como sea se les tiene que pagar porque ellos sí necesitan estar en total con sus vacunas y todo se paga, la dentadura, todo lo de ellos.
I ask you to please accept us to have free health insurance or affordable health insurance. Some of my children have to pay private insurance because they have to get vaccinated. They have to keep up to date on their vaccinations and their care.
Pues ese es mi testimonio. Les pido que por favor ayuden para aprobar la ley.
Well, this is my testimony, and I ask you please to help pass this law.
Okay, thank you so much, Ms. Alvarez. Gracias for your testimony. We're so sorry for your pain. Is there anyone that has a question of Ms. Alvarez?
Muchísimas gracias, señora Álvarez. Lo sentimos mucho por su dolor. ¿Alguien tiene una pregunta para la señora Álvarez?
González es mi apellido, perdón.
Perdón, González. Sorry, her last name is González.
Okay, it was wrong on the paper. I apologize.
Lo siento.
Gracias.
De nada. Seeing none, we'll move on to Julio Leon.
Good evening. Can you hear me?
Yes, we can hear you.
All right, awesome. Chair Abercrombie, Chair Moore, and honorable members of the committee, thank you for the opportunity to testify before the committee in support of Resolution SB number 956. My name is Julio Leon. I am a current student at the UConn School of Social Work, and I'm also a resident in Hartford. This pandemic has confirmed and expose the many disparities and inequities within the economic and healthcare system that affects low-income communities of color and undocumented folks. According to research done by the New American Economy Research Fund, the problem is the following. In 2014, Connecticut immigrants contributed an estimated $1.8 billion in state and local taxes and $3.3 billion in federal taxes. Undocumented immigrants alone pay roughly $145 million into state and local taxes every year, taxes that are then appropriated to fund Connecticut's Husky program. Yet, despite their contributions, many immigrants' communities cannot access health coverage due to Husky's limiting eligibility rules for immigrants. In turn, tens of thousands of families and individuals with no coverage cannot receive the proper care and treatment they deserve. This is a massive public health concern. Expanding Husky's eligibility to be inclusive of all immigrants, regardless of status, will help equalize access to healthcare coverage and help reduce the uninsured state rate in Connecticut. Why should this bill be supported? Number one, healthcare is a human right. Number two, preventative care will save money. And lastly, people are waiting and in need of crucial support in these times that we're living in. Families are lacking the ability to afford healthcare and are getting into debt, and many are uninsured. No one should have to worry about how they're going to afford their next medicine, their next doctor's visit, or life-threatening surgery. Thank you for your time, and I urge the committee to pass SB number 956, and may justice rain down like waters, and may it be so. Thank you for your time.
Thank you so much, Julio, for your testimony. Is there anyone that has a question? Seeing none, I want to thank you again. I'm going to now turn it over to Senator Moore, who's back with us.
Thank you, Rep. Garibay, and thank you to Rep. Abercrombie. Next is number 112, Tanner Bomberback.
Thank you, Senator Moore, Representative Abercrombie, and members of the committee. My name is Dr. Tanner Boomersbach, and I'm a physician working across New Haven County. I stand in support of Senate Bill 956, but with the modifications that others have mentioned to include all Connecticut residents that qualify under the current Husky eligibility. I work as a psychiatrist in a public clinic for children and young adults with psychiatric disorders. Every day, I care for undocumented individuals who have overcome unimaginable challenges early in their lives and have managed to contribute to their communities in truly inspiring ways. Yet, these children and young adults are unable to access affordable health care simply due to their immigration status. As their doctor, I struggle to get them necessary health services, including preventative primary care visits, medications to treat their psychiatric conditions, and referrals to specialists. One college student I work with, who is undocumented, has a serious condition that causes her to experience seizure-like episodes multiple times a day. For the last year, she has not been able to see a neurologist to diagnose these episodes simply due to her undocumented status. These episodes have significantly impacted her school studies, her job opportunities, and her ability to stay involved in her church, which is her favorite activity. Last month, after struggling with these seizure-like episodes for several years without appropriate medical care, she had to take a leave of absence from her college classes. I believe that if she had had insurance and was able to see a neurologist for her condition, she would be able to continue college and achieve her goal of becoming a social worker to help other young adults facing similar challenges. I struggle knowing that while my undocumented patients have the right to go to school in Connecticut, they do not have the right to basic health and healthcare in Connecticut. And today I'm urging you to join 6 other states, including our neighbors in Massachusetts and New York, to pass Bill 956. Passing this bill is not only the right thing to do, I also believe it makes financial sense for our state. I would just like to highlight again the Connecticut Health Foundation analysis that Jay Siklik sent over to your committee that showed that expanding Husky A and B to undocumented children in Connecticut is estimated to cost about $11 million for year 1 and about $14 million for year 2, for a total of $25 million over the biennium. In 2017 alone, Connecticut hospitals provided $1.66 billion in unreimbursed and uncompensated care, similar to the expensive care provided to many of my patients who are undocumented every time they have to go to the emergency room because it's the only way they can get life-saving care. I realize that passing this bill in the midst of our state's budget deficit is a difficult ask. But as others have said so well, this is an issue of healthcare access, of healthcare equity, and of basic human dignity. And for all these reasons, I support Senate Bill 956 with clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of their immigration status. And I urge the committee to pass this bill. Thank you so much for your time.
Thank you, Doctor. I apologize for your mispronunciation of your last name. It's nighttime eyes, so I need to shift my glasses to nighttime.
That's okay. It's a
I
tough
don't see
name.
any questions for you, but I thank you for your testimony.
Thank you.
Sarah Lemaster, followed by Julia Rosenberg. Sharon Thornston.
Oh, sorry, I was waiting for Sarah. I'm here.
Oh, Julia, okay.
Thank you.
Are you doing it with Sarah?
No, no. I just didn't know.
Oh, you're waiting for Sarah to come on to see if you would come on next, right? Okay.
All right, thank
Hi,
you so
Julia.
much. Thank you so much, Senator Moore, Representative Abercrombie, distinguished members of the Human Services Committee. Good evening, and thank you for listening for all of today. I'm a pediatrician. I'm originally from Connecticut, and I returned to my home state to practice medicine in New Haven, and I stand in support of SB 956. As a pediatrician, I worry and I care for the children I see, but I worry even more for those whom I do not see. Many of whose stories you have heard and will continue to hear today, as our fellow Connecticut residents share stories of delayed and missed healthcare and the costly and difficult consequences. I am so thankful that so many of our neighbors who have shared their stories today, and to all of you for listening. I just wish I could have heard these stories much earlier, in my office, not here when it's far too late. It's clear that I and so many others as physicians are unable to achieve a simple mission right now, which is to provide compassionate care that is needed for vulnerable children and families. With regular healthcare, children and parents build trusting relationships with their clinicians. Parents turn to physicians to promptly identify everything from developmental delays to mental health disorders to medical problems. All of this, which is even more concerning during the COVID-19 pandemic. The relationship that's built from consistent and reliable care can reduce unnecessary and expensive emergency room visits, hospitalizations, and preventable illnesses. And we know this from the research. Children's health suffers without insurance coverage. Compared with their uninsured peers, insured children avoid risky behaviors, they do better in school, and then have better school attendance and more successful careers. And then they have better health as adults with fewer costly and painful and chronic conditions like you've heard about today. For many undocumented Connecticut residents without insurance who have already faced significant trauma, serious problems may only come to medical attention when it's too late. That results in costly and sometimes dangerous consequences that should have been preventable, from hospitalizations to permanent disabilities. With SB 956, Connecticut has the opportunity to join 6 states, as my colleague just mentioned, California, Oregon, Washington, Illinois, our neighbors, Massachusetts and New York, and also Washington, D.C., who already provide undocumented children with the healthcare that they need. And with SB 956, Connecticut also has the ability to lead the way to ensure that all residents, regardless of documentation status, can receive the healthcare that they need. Ensuring all residents, regardless of documentation status, is an upfront investment that will ultimately result in a brighter and healthier future for Connecticut's next generation. Passage of SB 956 will benefit not only Connecticut's children and families, but also the health and well-being of our state and its future. Thank you all so much for the opportunity to testify, and thank you very much to so many who have shared their stories today.
Thank you, Doctor. Thank you, Dr. Rosenberg. I don't see any questions for you. Appreciate you.
Thank you.
I'm going to go back and see if Sarah Lemaster is here. If not, I'll move on to Sharon Sheldon Tillman. Sheldon. I'm going to ask you to hold on a moment because I see Sharon Thornston. I see her, but I don't see her. Sharon, are you there?
Yes, I'm here.
Okay. You're up next. You're up now.
Oh, I'm up now?
Yes.
Okay. How about now? Do you see me now?
I do see you now.
All right.
But can you hear me now?
Yes.
I see you
I
now.
know. I had an incoming call and I was like, oh no, I panicked. And then I guess I tapped the screen and then my sound went out and I was like, oh no, they're not going to be able to hear me.
I can see you and hear you.
Well, good evening. How are you doing?
Good,
All
thank you.
right. It's been a long day, right? Okay. I'm going to turn my phone sideways. Can you still see me?
Yes.
All right, great. All right. My name is Sharon Thorstensen, and good evening to the Human Services Committee, and thank you for this opportunity to speak before you to testify. And Senator Moore and Abercrombie and distinguished members, I guess. I'm a consumer employer, and I receive PCA services in my home, and I'm very grateful for them, believe me. I became disabled 8 years ago due to I have demyelinating spinal cord disease, in which this past year I've progressively worsened, and I am now bedridden and wheelchair bound, and it's hard. And so there's days that I get really bad like tremors and muscle spasms or really bad stiffness, and I cannot tell you, the pain is just horrific. And so I'm grateful that I have the program. So what part of my testimony is in regards to Allied, it's the whatever that name is for them, intermediary or fiduciary, whatever. They do the payroll for the PCAs. And since I got the program 4 years ago, I have lost, I counted after last week's testimony, I had 19 PCAs who quit because of Allied. And the last 3 were all at the same time 2 years ago, because it was 6 weeks that they had to wait. And we faxed and we emailed, and they even drove up to where the Allied is and brought them in hand, and even had a signed receipt that they had brought them there, and they still did not get paid. And so they had families, they got children and everything, and so it's a domino effect on everybody when they don't get paid. And then it takes away from me, because I'm the employer, self-directed here, consumer, and it puts a strain on me and my health and takes away from me, And so I really ask this committee, please, if we could hold Allied accountable, maybe perhaps they would make sure that people get paid on time. And even my recent PCA, he didn't get paid it was only the week before I testified, the week before, and they held it up for 2 weeks, and there was nothing wrong with the timesheet. And we began the electronic verification system. I can only imagine that it's only going to get worse with that. So please, I ask the committee, can we please hold them accountable? Because we don't have a case manager to turn to. And so we're kind of on our own. And then, we rely on the PCAs, but we're in the same boat, So if you could please pass HB 6560 and hold Allied accountable. Ideally, it would be nice to get a different payroll company, but I understand their contract's going to be ending in, I think, June, if I'm not mistaken.
Excuse me, your 3 minutes are up. Please summarize. Thank you.
I am. Thank you. So in summary, please support passing HB 6560. I greatly appreciate it with all my heart.
Thank you. Thank you. And we are going, when we get through with this, we will look at and we are really trying to do something to hold their feet to the fire.
Okay.
Make sure that this is done on a timely basis. We understand. Thank you so much for your testimony.
And thank you. All right. You have a good night.
You too, dear. Sheldon Tubman. Sheldon, is that you talking baby talk? Or is that coming from someplace else? Sheldon, we don't hear you. Sheldon, it sounds like you took some helium and decided to start talking. Is he gone? Did we lose him?
I think he's going to try to log back on, Senator Moore.
Okay, so we'll go on to the next one. It's Nika Zerzavan, and then Stephen Karp. I see you, Stephen. But I don't hear you.
Hi, I'm Stephen Weinstein Karp, Executive Director for National Association of Social Workers, Connecticut chapter. I'm here to speak on 957. You have written testimony from me on the value of social work services in home care, and you'll hear from and have heard from social workers who do perform that work. I want to respond to Commissioner Gifford's comments this morning and use my time for that purpose. The commissioner points out correctly that clinicians, licensed clinicians, are paid by DSS, including for home visits. What's not pointed out is you can't find them. There are almost no private clinicians who are going to go out to someone's home. And it's not because they don't care about people at home, it's because it's financially completely unsound. The amount of time that is spent in travel that's unreimbursable just does not make that feasible. Social workers are in people's homes every day, even in this pandemic, but they're all social workers who are connected to agencies and are salaried. I would also point out that even if you can find somebody, an individual clinician to go into a home, it is not best practices to do that in terms of home care patients. By having a social worker come out from the agency itself, you have integrated and coordinated healthcare. It's very important because you're not just dealing with someone's behavioral or mental health, you're also dealing with a whole host of physical health problems that have made that person homebound. To not have that connection between the nurses, the physical therapist, the occupational therapist, all coming out and coordinating, integrating through the same agency, you really are losing, the client is really losing out in terms of benefits. We do believe that this is also an issue of mental health parity. I mean, in terms of physical health care is being covered, but behavioral health care is not covered by Medicaid. To us, if not a violation by statute, it's really a minimum violation of spirit, if you will. It's also very difficult to find social workers who are trained in the field of aging. So once again, even if you can find individual practitioners, you're going to have a very difficult time finding someone who has the right specializations. Home care agency social workers are very much connected and trained in working with older adults. They're connected and trained in working with people with addictions. So the training is very important, and the agencies are the ones who have those individuals available. Now, in the DSS written testimony, it does say, it's not in the budget. Well, it's not in the governor's budget. That doesn't mean it can't be in the legislature's budget. Now, we surely understand the issue that Medicaid, CMS Medicaid rules do not currently include behavioral health. Our reading is that doesn't mean that Connecticut cannot do that. It does obviously mean that there's not going to be that matching federal share. I think that's an issue for the advocates to sit down maybe with DSS and to see whether we can get our congressional delegation on board. It's unbelievable that behavioral health is not covered in home care in Medicaid. But nonetheless, the importance of social work services and also the importance of saving dollars for the state. There's a very clear connection between body and mind. So if you have people going on the physical healthcare side, but you don't have someone properly trained and capable of providing the social work services and the behavioral health services, you are probably going to be elongating for many people the recovery time.
Excuse
And
me,
that-
excuse me, your 3 minutes are up. Please summarize.
Sure. So let me just say that in terms of that whole body and mind, that it's just costing the state more. And finally, I do want to say that we do support 956. We have submitted testimony to that effect. And I thank you for your opportunity to speak to you tonight.
Thank you. And we'll look at your written testimony also. Appreciate it. I don't see any questions for you. I just wanted to
Representative
thank you.
Abercrombie has her hand raised. Senator Moore.
Okay. Representative Abercrombie?
Hi, Steve.
How are you,
It's
Representative?
so great to see you, and thank you for being here tonight and testifying. So with the issue with the social workers being included in Medicaid, I think the way the language will probably read is if it's permissible under federal law. Tracy Wodach is actually checking into her association to see if there are some states that are able to cover it under Medicaid. The reality is we really do need to get the reimbursement from the feds. There's just not enough dollars to go around. But I'm very hopeful that maybe we're going to find a solution to it. But I want to thank you for being here, and it's been a pleasure working with you through the years.
Well, thank you. And anything we can move to move this forward is a positive.
Thank you. Is there anyone else? Thank you. I'm going to go back to Sheldon.
Yes, can you hear me now?
Yes.
Great, thank you. I'm really sorry about that.
That's okay.
Good evening, Senator Moore, Representative Abercrombie, and other members of the Human Services Committee. My name is Sheldon Taubman. I'm an attorney in the Benefits and Elder Law Units of New Haven Legal Assistance. We support 956, which will expand Husky to include residents regardless of immigration status. I know some people testified incorrectly that the bill does not cover Husky A and D. I'll be happy to explain why it does if somebody asks at the end. We also support 6560, an attempt to address the problems with Allied. And I do want to say that the EVV solution that the commissioners referred to this morning is definitely going to make matters worse. It really made matters worse when it was imposed for home care workers who work for agencies, and these people don't have any back office to help them. So the problems will only get compounded. But mainly I want to speak with you about 980. SB 980 removes all income and asset limits from the MedConnect program, which already has very generous and income asset limits. But the bill does nothing to address the far lower income and asset limits for Husky C, covering many more elderly and disabled people who are not able to work. MedConnect, otherwise known as the Working Persons with Disabilities Program, is an important Medicaid program, which for people who are disabled and are able to regularly work every week, some number of hours, provides full Medicaid coverage at an income limit of $75,000 per year and assets of $10,000 for a single, $15,000 for a couple. But contrast that with Husky C, also for disabled people as well as elderly, and not able to regularly work. In most parts of the state, the income limit is $10,620. That's 83% of the federal poverty level. And consider Husky D at 138% of poverty level, or Husky A for adults, 160%. And the asset limits are $1,600 for one, $2,400 for a couple. So you can see it's a way more stingy program. It has an income limit about 1/7 of MedConnect, assets of about 1/6. And MedConnect only works if you can regularly work. So we really need a solution for this problem. And one solution is that you could set the Husky C limit at Husky D, which is again 138% of poverty. That's about $17,616 a year. That's still only about 23% of the current $75,000 income limit under MedConnect. But with this change, many people who can't qualify now for Husky C, except by spending down their excess income, and I think most of you understand that process, would newly have access to Medicaid and avoid having ailments unaddressed. And I know some people will say, well, but these people are on Medicare, right? So they can get those services. Well, yeah, but there's all kinds of things that Medicare doesn't cover at all, like dental and vision and most home care, medical transportation. So there's no coverage for that, and people cannot meet their spend downs. There was testimony submitted by somebody by the name of Susan Salter. I urge you to look at it. Her adult son is on the MedConnect program, but she's terribly worried he'll worsen and be unable to work anymore, in which case then his income limit will plummet, to 1/7 of what it is now. We really need a solution for this. I'd be happy to help provide alternative bill language to accomplish this. I do want to say that the asset limit for MedConnect should be addressed. Asset limits don't work. They don't work. They won't work in MSP. They really don't work for MedConnect. But the real issue is Husky C. And finally,
Excuse me, your 3 minutes are up. Please summarize.
Yep, I just want to say that I'd be happy to explain about 956, the nightmare of the statute reference there, but only fast. Thank you.
Yes, Representative Hughes, thank you.
Thank you, Madam Chair. I would like you to clarify about that and also clarify about Husky A and D, expanding that the current bill language does include that, you think?
Yes, and we spent a lot of time studying this, and I think there's a lot of confusion, totally understandably, because what the bill says is that, this is in section 1, it says that within available appropriations, the commissioner shall, section 1 says 17B-261 of this general statute is amended to say that we're going to provide within available appropriations benefits to undocumented or people who are not otherwise eligible. So you have to turn to 17B-261. And 17B-261 is what it is it's sort of a statute. It's a nightmare, like I said. And the reason it's that way is that over the years, the Medicaid program, of course, is very complicated. And it started as a couple of small things decades ago. And over the years, as changes were made, it was glommed onto. So now if you read it, 17B-261 subsection A is really, in all honesty, incomprehensible, but except to lawyers like me and my colleagues. But if you do look at it, I'll tell you where exactly you see that C and A are covered. So it refers to the fact that people are eligible if they have income below the benefit amount paid to a person with income under the Temporary Family Assistance Program, which is, the specific language is the standards for eligibility for medical assistance are at 143% of the benefit amount paid to a household of equal size with no income under the Temporary Family Assistance Program in the appropriate region of residence. So what that is, it doesn't say in the statute, but everybody at DSS understands that's the medically needy income level. So the medically needy income level is set at 143% of the TFA payment amount. That is how you get to the income, the MNIL, which applies only to Husky C, except there's a disregard. So that's your Husky C part. And the Husky A part is that in 2 different places in this very long statute, it refers to individuals under 19 can be covered up to 196%. And then it talks about caretaker relatives and parents, and it uses it actually says 150%, but there's another 10% in there. So that's how you get to Husky A for kids and parents. So between all those things, the bill does cover the basics of Husky A, B, C, and D. Although, as my colleague Allison testified earlier, it's a little odd that only B is an entitlement. The rest are all appropriation limited. In general, the entitlements are at the lower income levels, and then the higher income levels like Husky B would be appropriation limited, but that's the way it's written right now.
Thank you for that. Through you, Madam Chair, the MedConnect, as working for decades with people with disabilities, we know that their income and working is very insecure. They're like literally the low men on the economic totem pole. And there's all kinds of cliffs then that would jeopardize their access to basic health care, and they already have often compromised health systems. So again, that is another reason why fixing that Husky C limit for working people with disabilities would, in my mind, be an economic investment savings in the long run, because Yeah, and like you said, asset limits don't really work in this day and age, and they don't really save us money. So, yeah, thank you for clarifying and testifying specifically on that. Thank you, Madam Chair.
Thank you. Are there any other questions, comments? No, I don't see any. Thank you so much for your testimony.
Thank you.
Next, Nika. Sarah
Yeah.
Bazan.
I'm here. Thank you. One moment, sorry. Dear members of the Human Services Committee of Connecticut, my name is Nika Zarazvand, and I thank you for hearing my testimony today in favor of Bill SB 956. My family and I moved to the US from Iran in 2006. It wasn't until my brother was born with multiple health conditions that I realized what it meant to have access to healthcare. At the age of 10, 11, and 12, I knew exactly what it meant to see 10 different specialists before finding a doctor who was willing to avoid doing open heart surgery on my 1.5-year-old brother. We were extremely lucky, to say the least. My brother had a 50-50 chance of survival with any of the other specialists before the one who was willing to find another way to save his little heart. And even then, there were complications. This hearing today, and the last 4.5 years I have lived in community with undocumented Connecticut residents, asked me to entertain the possibility of my family not having had access to even one specialist. And I simply cannot fathom how my brother or any other child would be alive, much less have a greater chance of survival. When my father lost his job, we were still able to take him to routine heart and lung visits. I am describing my family's experience to demonstrate how difficult it already is for those of us with status who experience medical conditions that are rare and require years of access to specialized care. What this country and unfortunately our state says to undocumented families who have paid into programs they have never benefited from to go through what my family went through and pay every penny to their name because they don't have access to specialized care and can't even get the referrals. The rhetoric we have always heard is that there is no money to expand these programs. And this rhetoric says to all of us clearly that our state and our entire national economy would not run without exploiting undocumented workers and denying them health care. This cannot be the case. This was a crime and a violation of human rights long before we entered a pandemic that made it crystal clear how our health is interconnected. But for undocumented frontline workers who did not have health insurance, we asked them to pay the cost of keeping businesses afloat with their health while putting their lives on the line. No human being should have to demonstrate why they need or are deserving of healthcare, but to tell tax-paying immigrants that they cannot qualify for the programs they pay for is clearly exploitation. If it were any other entity collecting money from people without recirculating the funds, we would unequivocally call it stealing, and this is happening in broad daylight in our state. I'm trusting that the committee will elevate our testimonies to reach policymakers and legislators. I want to share the words of one of these individuals who is not able to be here today, but has been a frontline worker in constant contact with the virus for the past year without healthcare or safety nets and lives with chronic pain like myself. He says, "My pain is everyone's pain, and your pain is my pain in return. If we don't have empathy for the suffering of others and only care about ourselves, we won't be able to make progress in any area. The journey is to see that regardless of where we come from or how we look or the language we speak, we all share this facet of being human beings and suffer from human pains, from someone's back pain to the decay in a larger health system that COVID has brought to light." Thank you.
Thank you. Thank you. I appreciate that. I don't see any questions for you. Thank you for your testimony. The next is it Bridget Rivera, followed by Catherine Newton-Jones, followed by Rosella Aquino.
Hi, yes, here. Bridget, yes. Dear members of the Human Services Committee of Connecticut General Assembly, my name is Bridget Rivera. I am an undocumented student and resident in Hartford. I am undocumented and unashamed, and I stand to support SB 956. My family has lived in Connecticut for more than 10 years, and we have never had health care. My father is sick, and I just want you to envision seeing your mother endlessly cry of desperation because the love of her life is painfully hurting. For my family, having access to healthcare would allow me to continue to pursue post-secondary education and would bring peace of mind. No more having to rely on over-the-counter medication or seeing the people I love being an unbearable pain. Opening access to healthcare will save lives. Healthcare is a human right, and it is unacceptable that undocumented people can be organ donors but not receive organ transplantations themselves. It is unacceptable for the state of Connecticut to take undocumented people's labor, money, and bodies without consideration for their existence as human beings. Health is a collective issue, and as we all know, there are 120 undocumented individuals, and to not offer healthcare access to them is deliberately neglecting their well-being and the well-being of the community. Making COVID-19 testing available is not enough, and relying on community health services is not enough. Healthcare access is preventative care, and it is a well-known fact that preventative care is cost-effective. Additionally, I respectfully ask the committee to be skeptical of the data gathered by the DSS. Their total cost assumes all individuals will take advantage of the opening up of healthcare access, and as much as I wish that were true, that's unrealistic. Additionally, through just one Google Scholar search, you will learn that immigrants actually come into the country with better health than U.S. citizens, and that this is once again not taken into consideration in the cost analysis report by DSS. Lastly, before hearing commentary by the state that the state is in debt and there are budget cuts, I must ask every single member, calling out to Representative Mastro Francesco, Representative Case, Representative Wood, what is the cost of a human life? What price is too much to pay to save the life of a child, to save the life of a mother? What price is too much to pay to save the life of your child, to save the life of your mother? I reinstate that the state of Connecticut is capable and would benefit from providing access to healthcare for undocumented immigrants because it can serve as a form of preventative care that is cost effective. It would acknowledge that healthcare is a human right regardless of one's decision to migrate. And given that the health is a collective issue, it would contribute to the health of a community. The time to act is now. Thank you for your consideration.
Thank you, Bryce. I do want to say to you, it's not appropriate to call out any individual. No one has taken a vote here. Everyone is listening to the testimony. So thank you for your testimony. Any questions from anyone? Thank you. Thank you, Bryce. You made some really good points. I didn't realize that about organ donors.
My name is Bridget.
Bridget?
Bridget,
okay.
Yes.
Bridget?
Yes.
Bridget? Thank you, Bridget. The next is Catherine Newton-Jones. Rosella Aquino. Michael Herbert.
Senator Moore, I believe Rosalia Aquina is here and she needs an interpreter.
Hola, Roselia. Roselia, podría... Adelante, Roselia.
Buenas tardes.
Good afternoon. Adelante.
Buenas tardes, miembros del Comité de Servicios Humanos.
Good evening to the members of the Human Services Committee. My name is Roselia Aquino.
Soy miembro de la Latina en Acción.
I am a resident of the city of New Haven and a member of ULA.
Rosalia.
Roselia, no te escuchamos.
Yo quiero dar mi testimonio a favor del proyecto de ley SB 956.
I'm giving testimony in favor of SB 956. No te escuchamos, Roselia, más fuerte.
Por el derecho a la salud para todos, sin importar su estatus migratorio.
For the right to health for all.
Como dije anteriormente, mi nombre es Roselia Aquino y quiero pedirles de favor y decirles por qué necesito un seguro médico.
I want to ask you, please, and explain to you why I need health insurance.
Hace más de un año, a ver,
More than 1 year ago,
hace más de un año, a mí me dio un dolor de estómago y fui a la clínica, pero solamente me recetaron unas pastillas, pero los dolores me siguieron.
more than a year ago, I went to the clinic with a strong stomach pain and they just gave me some pills, but the pain continued.
Tuve que ir al hospital de urgencias del Yale. Sí me atendieron, pero no me hicieron ningún tipo de estudios.
I had to go to the emergency room at Yale Hospital and they did see me, but they would not give me the tests.
Porque me dijeron que no tenía un seguro médico. Pero aún
Because-
así me mandaron un bill de $2,890.
Because they said I did not have insurance. And even after that, they sent me a bill of $2,890.
Y me volvieron a mandar de regreso a la clínica con mi doctor primario. El
And they
doctor,
said-
el doctor me transfirió para que me hicieran una coloscopía.
They sent me back to the health center to my primary care doc, who referred me to get a colonoscopy.
Para que me hicieran una coloscopía. Cuando llegué a la cita de la coloscopía, me dijeron que no me lo podían hacer porque yo no tenía un seguro médico. Y hasta la fecha no me han atendido por falta de un seguro médico.
But when I went to the appointment for the colonoscopy, they would not give it to me because I did not have insurance. And to this day, I haven't had it.
Y pues no he podido conseguir alguna organización o algún programa que me puedan apoyar para hacerme los estudios, porque según ellos es muy caro.
And I haven't been able to get any charitable organization or special program to get the tests that I need because apparently these are very expensive.
Y pues yo sigo con los dolores fuertes, pero también otra cosa, que los biles siguen llegando. También fui a urgencias por el COVID-19 y lo mismo, no me hicieron estudios, todo me dijeron que estaba bien por no tener un seguro médico.
I continue to have strong pains, severe pains, and the bills keep coming. And during COVID, I went to the emergency room and again, they would not perform the tests because I did not have health insurance.
Me están mandando otro bill por eso del COVID y no puedo pagarlo por el momento porque no estoy trabajando. Por eso les pido a todos ustedes que por favor aprueben el seguro médico.
Señora Roselia. Señora, por favor, resuma su testimonio, por favor.
Okay.
Sí, déjame traducir, por favor. She said the hospital sent her a bill for the care for COVID, and she can't pay it because she is jobless. So she asks you to please approve this bill. Para terminar, Roselia.
Pues sí, les pido de favor que aprueben el seguro médico porque es una necesidad para que ayuden a los cientos de familias que como yo somos trabajadores esenciales y así y personas como yo puedan hacer sus estudios y curarse y seguir trabajando. Muchas gracias por escucharme y espero su comprensión de todos ustedes para que nos puedan otorgar ese derecho humano que tanto anhelamos.
So I ask you please to approve this bill for hundreds of families like me and people who are essential workers and people who can't get the medical tests that they need. I hope that you understand our stories. I thank you for listening to our stories. I hope that it will move you to create this human right that we so yearn for. Thank you.
Thank you for your testimony. I don't see any questions for you. Thank you. Have a
Muchas
good evening.
gracias. Feliz noche. Muchas gracias por su testimonio.
I see Catherine Newton-Jones. Are you ready? I'll go to Michael Herbert. Raquel Smith. Antonia Rodriguez.
Buenas tardes.
Hi, I will be interpreting for Antonia Rodriguez.
Thank you.
Buenas tardes, miembros del Comité de Servicios Humanos. Mi nombre es Antonia Rodríguez Rodríguez. Soy madre de familia y soy madre de una ciudadana americana y soy inmigrante originaria del estado de Tlaxcala, México.
Good afternoon, members of the Human Services Committee of the Connecticut General Assembly. My name is Antonia Rodriguez. I'm a New Haven resident. I'm an immigrant, and I'm a mother of a family. I am originally from Tlaxcala, Mexico.
Hace 19 años que yo vivo en New Haven, Connecticut. He pagado taxes, he aportado a este país, pero desafortunadamente por ser inmigrante no tengo servicio médico. Muchas veces no he ido al médico poniendo mi vida y mi salud en riesgo.
I've lived here for over 19 years, and over the course of those years, there have been many times where I've put my health at risk out of not being able to go to the doctors or seek medical assistance because of my legal status.
Las veces que he tenido que ir al médico, ya sea por mí o por mi pareja que padece de alergias, mis consultas médicas, recetas y medicinas se nos hacen demasiado difícil al tener que pagarlas. En esas ocasiones hemos sufrido económicamente porque hemos tenido que disminuir nuestros gastos en casa.
In the times that we've had to go to the doctor, especially my partner who suffers from many life-threatening allergies, we've had to cut back costs at home because we are not able to afford the medical care and the cost of food and living expenses.
En este país nos etiquetan fácilmente como ilegales y extranjeros, lo cual nos deshumaniza como individuos. Aunque no sea ciudadano, eso no impide que no sea humana, que no sienta, que no sufra o padezca. Yo y todos los demás merecemos el derecho a tener atención médica.
In this country, we are labeled as foreigners, illegals. They dehumanize us and strip us away from our humanity. Myself and all the other undocumented folks in Connecticut deserve the right to healthcare.
Y por eso yo apoyo la SB 956 con modificaciones y espero que la comisión vote a favor por el acceso a la salud y un derecho humano.
And in conclusion, that's why I support Senate Bill 956 with rewritten language that clearly states the expansion of current Husky eligibility rules to all Connecticut residents. And I ask the committee to support this legislation.
Thank you for your testimony, Antonia.
Gracias por su
I don't see
testimonio.
any questions.
Muchas gracias. Espero que podamos escuchar noticias buenas, que tengamos acceso al servicio médico. Espero que se toque en el corazón todos los senadores y todas las representantes que nos están ayudando para que tengamos un buen servicio a la comunidad inmigrante. Gracias.
Thank you for listening to my story, and I hope that you guys make the right decision and find it in your heart to give us access to the healthcare that our community needs. Thank you.
Thank you. Number 120, Catherine.
Yes.
Jones.
Yes. Good afternoon, Senator Moore, Representative, can't pronounce that name, and members of the committee. My name is Catherine Jones Newton. I am a consumer in the Medicaid waiver program that lives in New Haven. In 2012, I broke my hip in a bad car accident, and my mobility has been limited ever since. I have been able to stay in my home and live as much as a normal life as I possible, thanks to the help of home care workers who are paid. Wait a minute. Oh, excuse me. Who are paid by Allied Community Resources. I am here today to testify in support of House Bill 6560. Being able to receive service in my own home has had a great impact on my quality of life. After being in the facility for 6 months, I know the difference that it makes to be able to be in my home where I feel secure, comfortable, and happy. My home care workers help me in every part of my life. They help me move, take a shower, make sure I take my medication, get my groceries, clean my house, and a million other small things that I might need throughout the day. They also become my friends, and they support me in my times of need, and I do the same for them. Ally has paid my home care workers for the past 8 years, and I have seen the problems with Ally increasingly getting worse. Last year, for example, I faxed the timesheets to Ally and kept the fax confirmation sheet. However, on that day before payday, Ally called to tell me that they couldn't find the timesheets. But one of my workers, that worker then had to refax them herself with the cost of $6. She still didn't get paid on payday. Instead, she had to wait over a week to get paid. My home care workers had to go around borrowing money to cover her bills, plus the late fees she incurred on top of them. In fact, I had to lend her money to get through. During another pay period, we had additional problem. When I called Ally, they told me that both my PCAs would get paid. Then I got an automated text saying there was a problem with when I called, they told me that my 2 PCAs had an hour overlap. Except they were wrong. There was no overlap, and my PCA timesheet was filled out correctly. However, it didn't matter. They still held one entire week of pay for one of my PCAs. Because the time had been correct to start with, I simply submit another timesheet showing the same exact hours with an hour on the top of the sheet, and they paid her a week late. She was so frustrated she wanted to quit, and I don't blame her. I have taken a lot of time and effort in finding my PCAs, training them, and building trust and rapid. In turn, my PCAs make me feel secure, comfortable, and happy in my home.
Excuse me, your 3 minutes are up. Please summarize.
Okay, but they can't be secure, comfortable, and happy if they can't pay their bill and support their families. And I do not want to lose them over someone else's tragedy. In completeness, our home care workers work hard. They deserve better. Please pass the bill 6560. Thank you for your time.
Thank you, Ms. Newton Foster. I'm sorry, Newton Jones.
Oh, thank you.
Any questions for you? Thank you.
Thank you.
I have Brissa Cruz, followed by Kisi Najera, followed by Orlis Guzman.
Good afternoon, members of the House Services Committee of the Connecticut General Assembly. My name is Brisa Cruz, and I am a student at Eastern Connecticut State University. I'm also a resident of the city of West Haven, and I am undocumented. I stand in support of Senate Bill number 956, an act providing medical assistance to certain individuals regardless of immigration status, with clear language that extends eligibility to all Husky programs to all Connecticut residents regardless of immigration status. I am a senior studying criminology and political science in hopes of becoming a lawyer. My parents migrated to the US in early 2000s in hope of giving me a better future and more opportunities than the ones they were afforded in Mexico. During the first few years in the US, my parents did not have a car. They would have to take the city bus to get to work or ride a bike. One day after my father's shift, he was riding his bicycle back home when he was hit with a car. The car ran his legs over, and the people that had witnessed the event called 911. He was then transported to the hospital via ambulance and had to undergo surgery. The surgery was successful, but it required him to be off his legs for a couple months and to be able to make a full recovery. This meant that my mom was the only one working when we only had one income coming in. A month after his surgery, we received the hospital bill in the mail. The bill was huge. The incident took place in 2002, and it wasn't until just last week that my dad was finally able to pay off the complete medical bill. He had been making payments to the hospital for over 15 years. My father isn't the only one who has had to seek medical help, and because of our inability to access healthcare, have become indebted. This is a story that is all too familiar and is seen in far too many families across Connecticut. There is a number of times in which my parents have become sick and wait until it gets pretty bad before they even consider seeking medical attention. They try all the home remedies and exhaust every single other avenue before going to the doctor's office. They know that there is a high cost that comes with walking into that doctor's office. Healthcare should not be a luxury that could only be afforded to some. It should be available to everybody regardless of their status. If this bill were to pass, it would mean that me and my family and my community would be able to seek medical attention at the first sign of a problem rather than waiting until it gets worse. It would mean that a trip to a doctor's office would no longer be something we fear, but rather something we do annually. We shouldn't have to make GoFundMe pages and rely on the kindness of strangers over the internet to help pay our medical expenses. I support SB number 956 with clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of their immigration status. And I ask the committee to support this legislation. Thank you for your time.
Thank you, dear. You did a beautiful job.
Thank you.
I don't see any questions for you, but thank you so much. Next is there Kizzy here? Or Kaisi? I apologize if I'm pronouncing it wrong. Orlis, I see you. Orlis Guzman? Guzman?
Oralis Guzmán.
Sí.
Adelante.
Buenas noches, estimados miembros del Comité de Servicios Humanos de Connecticut.
Good evening, members of the Human Services Committee of Connecticut.
Mi nombre es Oralis Guzmán, soy madre y vivo en Hartford, Connecticut y soy indocumentada.
My name is Oralis Guzman. I'm a mother who lives in Hartford, Connecticut, and I am undocumented.
Estoy a favor de la ley SB 956.
I stand in support of Senate Bill 956,
la cual es una ley que proporciona asistencia médica a ciertos individuos
an act providing medical assistance to certain individuals regardless of immigration status,
sin importar el estado de inmigración.
Regardless of immigration status.
Con mi hijo se me ha hecho bien difícil porque no tenía seguro médico, el cual es asmático y padece del colon.
With my son, it's been very challenging for him to not have health insurance. He has asthma and his medicine costs are very expensive.
Los medicamentos me han salido de $300 a $400.
His medicine costs $300 to $400.
Al principio tuve muchos problemas porque los especialistas no lo querían atender por no tener seguro médico.
At first, I had many difficulties trying to get him to be seen by specialists because he did not have health insurance.
Por parte mía, tengo muchas facturas que al día de hoy no he pagado por cuidado médico.
For me personally, I also have many medical bills that I haven't been able to pay.
Muchas veces me ha tocado elegir entre comprar medicina o pagar los biles.
Sometimes I've had to choose whether to pay my medical debt or to pay for the bills.
Siempre me llaman para cobrar las cuentas, aún así estando en pandemia.
And even now, being in the pandemic, I keep getting calls from debt collectors.
En el hospital debo más de $6,000, por el cual yo tuve una emergencia.
I owe $6,000 to the hospital because of a medical emergency I suffered.
El cual yo no podía caminar, tampoco no podía respirar.
I couldn't stand up and I had difficulty breathing.
Me dolía todo mi cuerpo.
My whole body was in pain.
Sentía que me iba a morir.
And I thought I was going to die.
Llegando al hospital, tardaron mucho tiempo en atenderme.
When I arrived at the hospital, it took very long until anyone attended me.
Ya que lo primero que le piden a uno es el seguro médico.
And the first thing they asked was if I had health insurance.
Al no tener seguro médico, me trataron de menos.
And once they found out that I didn't have health insurance, they treated me less.
También hace 4 años, tengo 4 años ya de que no me he hecho el Papá Nicolau.
It's been 4 years since I had a pap smear.
El cual es muy costoso.
And it's very expensive.
Estoy a la espera de un programa para ver si me cubren para poderme hacerme el Papá Nicolau.
I'm currently on the wait list for a program that will help me get the pap smear I need.
También debido al COVID-19, tuve el COVID-19 y debido a esta enfermedad, mis células blancas quedaron bajitas.
I contracted COVID-19 and due to the virus, my white blood cell count has been very low.
El cual necesito tratarme con un especialista de hematología.
And now I need to see a dermatologist.
De hecho,
Guzmán, con permiso, por favor, resuma su testimonio, por favor.
Sí, está bien, ya estoy por terminar. Sí, el cual no he visto ni un especialista porque no tengo seguro médico.
I have not gone to see the specialist because I don't have health insurance.
Vivir sin seguro médico me da mucha ansiedad y mucha depresión.
Living without health insurance makes me anxious and depressed.
Gracias por escucharnos y gracias por su tiempo.
Thank you for listening to me and thank you for the time.
Espero el apoyo del comité para que voten por la ley SB 956.
I hope that the committee votes favorably for Senate Bill 956.
Que tengan una maravillosa noche.
Have a great night. Muchas gracias.
Senator, you're on mute.
Sorry. I wanted to ask Orla if she uses the federally qualified health centers for any services.
Señora Oralis, tienen una pregunta si es que usted ha podido tener acceso a las clínicas que reciben fondos federales.
Disculpe, se ve el audio.
Perdón, la senadora tiene una pregunta si es que usted ha podido ser atendida en una clínica que recibe fondos federales.
Sí, yo voy a la clínica que se llama Charerok Health Center.
Yes, I have been able to go to the Charter Oak Health Center.
Pero aquí tengo el referido.
And I have the referral right here.
Donde necesito ver el especialista.
Very good.
Where-
Because for the clinical breast exam and the PAPS, the community health centers will do that for her, for the cervical cancer test also, just so she's aware of that. All
Okay.
right.
Quiere que usted sepa que la clínica le puede ofrecer el examen y cualquier tipo de examen para cáncer cérvico.
Sí, yo por eso yo fui, pero me dijeron que no, que tenía que esperarme para que saliera el programa.
I went and they said that I had to wait or get on a waiting list for the program.
Well, just get enrolled. To get enrolled. But I
Dice
just
para-
want to make sure that she's aware of those services for her.
Okay. Ella solo quiere que usted sepa que existen estos programas, pero sí, que sí hay una espera también.
Okay, muchas gracias.
Thank you. Thank you.
Thank you.
Have a good evening.
Tengo una buena noche.
Gracias igualmente.
Marta Gomez, Brian Mezek, Thana Hickinson, in that order.
María, ¿estás ahí, María?
No, Marta. Marta, Brian, Thana.
Yeah, her other name is María. Sorry.
Whose
María,
name
¿podrías
is
activar
María?
tu micrófono?
Is she here?
María Gutiérrez está ahí. ¿Podría activar su micrófono?
Sí, ahora me escucha.
Sí, adelante.
Good evening.
Buenas noches, adelante.
Buenas noches. Oh my Lord. No saqué la hoja de donde hice ¿cómo se dice?
I did not print out my testimony,
Pero igual yo sé que fue lo que yo escribí. So yo estoy, oh my gosh, I'm in trouble.
Oh, she has 3 minutes to speak from her heart.
Tiene 3 minutos para hablar del corazón.
Ok, lo único que yo quiero dejar saber y deseo de verdad, estoy de acuerdo con que se apoye un seguro médico para todos los emigrantes, porque yo, como muchos, tenemos un problema médico. Yo tengo problemas de presión arterial y porque no tengo seguro médico ni seguimiento, no puedo continuar con el tratamiento que debo seguir. Y mi preocupación es...
Perdón,
Dígame.
perdón, ¿podría tomar una pausa para traducir?
Sí.
Sí. All I want to say is to ask for your support to expand healthcare. For so many people like me, I have high blood pressure and I don't have health insurance to get the treatment that I need.
Continúo.
Sí.
Ok. Y mi preocupación es que yo tengo 4 hijos, es que a mí me pase algo y dejar a mis hijos solos. Esa es la primera So, preocupación. Y así como yo, hay muchas madres. So, y
My-
familias.
My big worry is that I have 4 children, and what if I left them alone? And there are many families in my situation. Continúa.
Lo único que yo de verdad, pues sí, así como yo, hay muchas personas que sí lo necesitan. So, me gustaría que se tocaran el corazón y de verdad yo pienso que la atención médica es algo necesario, no solo para inmigrantes, sino para muchas personas que no tenemos los ingresos para poder tener un seguro médico. So, ahora mismo yo debo biles de mis emergencias que he estado por mi condición, entonces no puedo pagarlas. Si pago eso, no pago mi renta o mis biles. So, es muy importante el seguro médico para muchas personas emigrantes, en especial de bajos ingresos.
So the only thing that I ask is there are many people like me who need this. I hope that your hearts are moved today. This health insurance, health care is necessary, not just for immigrants, but for everyone who can't afford it. I have bills, I have medical bills that I can't pay. If I pay the medical bills, I can't pay the rent. Continúa.
No sé, yo sé que Estados Unidos y Connecticut es un estado muy generoso, en especial acogen muchos a nosotros los emigrantes. Y yo sé que se puede hacer más y si hay unión y también yo pienso que es algo que es necesario y que se puede hacer si hay voluntad. Claro que sí.
So I know that the United States, and especially the state of Connecticut, is very generous. I know that Connecticut is a welcoming state for immigrants. And if we unite, we can do this.
No, solo tengo que agradecer que ojalá y que todo nos favorezca a muchos como yo y como muchos que de verdad lo necesitamos. Y pues muchas gracias por todo y que Dios los bendiga.
I hope that we can get this bill approved. I want to thank you so much for listening, and God bless you.
Thank you, Marta.
Muchas gracias,
Thank you.
Marta.
Gracias, Marta. Hasta luego.
Very good. Art is the best way.
I know, perdón, I'm sorry.
That's okay. Don't apologize.
Es
Thank
bueno
you.
hablar del corazón. Muchas gracias.
Next is Brian Messick.
Hi.
Hi, Brian.
Hi, Senator Moore, Representative Abercrombie. It's good to be with you. My name's Brian Messick. I'm a Connecticut State Marshal based in New Haven. I've been watching this afternoon and been learning a lot about the work of your committee. I'm here on behalf of the State Marshals Association. We represent marshals across the state. And I'm here to testify on a bill that hasn't really got much attention today. It's HB 6562, an act concerning child support enforcement. The bill, it's geared towards increasing child support collection and setting up a task force to study technology. And we've submitted written testimony on this and also offered some substitute language that we feel could improve the system. State marshals sometimes get overlooked in state government. People forget about us. So what I want to do with our time, my short time this evening, is just to highlight the role that state marshals play in our child support system and what we do for the state. For DSS and for support enforcement, state marshals serve capias warrants. Those are civil arrest warrants that bring people into court who fail to appear. There's approximately 30 state marshals who are specially trained to do this work. They're trained at the Connecticut Police Academy to make the arrest. And we save the state money because we only receive compensation when they make a successful arrest. So when we saw HB 6562, I had some discussions with our union and our marshal members this week who serve these capias warrants. And I just want to quickly share some of their insights with the committee. Just quickly, first is the marshals that do this kind of work, the men and women across the state, they really are an asset to the state. They put out their own time, their own finances, their own safety to do this kind of work. It requires extra insurance and equipment costs. So they're really financially and personally invested and doing this work for the state. However, I want to bring to the attention of the committee, we lack some vital tools. We don't have any access to criminal justice information systems that exist. So this bill 6562, it proposes to get a couple of the DSS officers who also execute this these warrants and this work access to the collect system. But state marshals really need access to this also, the state's information sharing systems that are already in place. We've tried over the years to get access to this data. We really need your help of the committee and the General Assembly, perhaps a task force to be able to figure out how we can really empower and equip the state marshals with technology. It's 2021. These systems are in place. We should be able to do this. So I think there's really a great area of opportunity here to improve the system and the marshals that are doing this work. Our state marshals are serving a vast quantity of these warrants. So we really would appreciate your help if we could figure out how to do this. If not in this session, in future sessions, and really get this over the line, we would appreciate it. So I'm happy to answer any questions you might have from the committee members. And I thank you for your time.
You know, Brian, thank you so much for that. I think the bill is doing something else, but you know, I know Representative Abercrombie is so good. I can tell by her posture when she wants to ask a question or she has a comment. Representative Abercrombie, and then Senator Berthel.
My senator knows me so well. Sorry, my other Zoom is ending. So Brian, thank you for being here. And just for clarification, so originally it was going to be a task force, but as we were investigating, we had a task force back in 2014, 2015, and not all of the recommendations had been implemented. So what we're looking at, and this is where you can be helpful, is any of your thoughts on things that we should have been doing through those recommendations. And I would be more than happy to send them to you so that we can implement them. One of the things that we were told from DSS was it was the computerized updated system. They finally got permission through DAS, which is, as you know, no agency can do any work without the support of DAS. They finally got a contract on that, which according to DSS, Department of Social Services, will be able to implement a more smooth system under child support. So did we get your written testimony with some of your thoughts?
We did. We put in written testimony. What piqued our interest with this bill was it was specifically a task force to study how technological improvements could improve the system. And I did hear the testimony earlier today from the commissioner that they have systems in place. We don't know if that has anything to do with us and the warrants we serve. The marshals that do this kind of work are doing it really on an old-fashioned kind of basis, the paper. They get a paper warrant, a picture of the person, and maybe a data sheet, and go get them. So we don't have any access to the state's criminal justice system. So we have no idea if this person was recently released from prison, if there's another criminal warrant out against them, if they have a history of violence against police officers. So I think there's an opportunity to get the marshals plugged into that system. I know many years ago, maybe in 2014, we tried to get access to collect, and there was some federal issues. So I'm sure those things can be untangled. I'm willing to put in the work, and our group that's affiliated with Council 4 really wants to get this over the line, but we're going to need your help to do it. I think we could improve the system that the marshals are already working really hard at with technology.
So the systems you're talking about, yes, those are the ones that just got approved through DAS for DSS, Department of Social Services. So they're supposedly, and I always say supposedly because nothing's in stone in this place, it should be up and running by May. DSS should have all their ducks in a row and have the system up and running. In your testimony, and I apologize because we received a lot of testimony and I haven't had a chance to look at yours. Do we have contact information for you?
I don't think it's on the testimony itself, but you could certainly reach out to me or Marshall DiLorenzo in Hartford County, and we can.
So if you could send an email to either Senator Moore or myself, we would be more than happy to give you our email addresses with your contact information. It would be easier that way for us to be able to track you down. I would love to share with you some of the recommendations that have not been implemented, and also kind of connect you with DSS about the computerized system. I think, and I'm going to be honest with you, where it may get a little challenging is we're human services. Anything that has to do with you as the state marshals has to go through the Judiciary Committee,
Correct.
which we have no say on. My understanding is when we did the task force, a lot of the recommendations that had to go to Judiciary did not get out of that committee. So there's a whole different mindset, if you may, when it comes to what we do in human services and what they do on the Judiciary Committee. So, but I would love to, and I think I speak for my co-chair, I think we would love to work with you on this issue, because our numbers here in Connecticut are not as high as they should be when it comes to child support. And I think that we could do a better job of it. So if you want to send us an email, we would be more, and if you want, I can give you my email address real quick right now, if that would be good for you.
Oh, I can get it after the call too. I don't want to take
Okay.
I can find it. And I appreciate that. And I think there's also a public safety component too. I think they're kind of the final say on who gets some of this data in the database.
I think so too.
We want to do the work to get it over the line. We know it's going to be a chore, but I think we could set up for the years ahead and marshals that get added in the future to really have a system that's beneficial for everyone.
Yeah, and the main thing is having this dialogue, which I think is great. So thank you for being here. Thank you for your help, and I look forward to working with you on it. Thank you, Madam Chair.
Thank you.
Senator Berthel.
Thank you, Madam Chair. Brian, thank you for being here. We're in our 9th hour of this hearing. I hope you haven't been on since 10 o'clock waiting to speak with us. But I did take a look at your testimony in addition to the many great things that the chair just spoke to. I think there's some common sense in the substitute language that you provided, and I'm glad that my colleague, Representative Abercrombie, and the co-chair have agreed to take a better look at this. The work that you do is very important, and there is absolutely room for improvement in terms of the work that you guys do. In part, and that's not the only thing the Marshal's Office does, obviously, but this is an important piece of what your services to the people of our great state. So I look forward to furthering the dialogue with you, as well as one of the ranking members on this committee. And thank you again for being here and for providing your testimony and the substitute language as well. Thank you, Madam Chair.
Thank you.
You're welcome. Thank you, Brian. I agree with both of my chairs here that I think it's much deeper, some of the things that you're asking for, but I feel as though while we're looking at this, maybe we can get it right, by working together from one committee to another. So thank you for your testimony.
Thank you very much. Appreciate it.
You're welcome. Is Fana Hickinson?
Fana, I'm present.
Hi, Fana. How are you?
Good.
Good.
Should I just jump in?
Yes. Please.
All right. Good evening, everyone. Dear members of the Human Services Committee of Connecticut General Assembly, my name is Fana Hickinson, and I'm a resident of New Haven and a teacher at a New Haven public high school. I am here to join the chorus of united voices insisting that all of our residents, regardless of immigration status, be afforded their basic human rights. And this is a fact. Access to affordable health care is a human right. Just thinking about the past testimony, it would also be awesome if we could work on ways to make sure that people have jobs so that they can pay for child support rather than criminalizing them. As such, it is imperative that we bring your attention to the many residents of Connecticut who need SB 956 to be passed, especially during this unprecedented pandemic and global crisis, in order to be able to survive and thrive both now and beyond this moment. SB 956, an act providing medical assistance to certain individuals regardless of immigration status with essential modifications, will undoubtedly positively impact the lives of individuals in our state. Those who are vital parts of our communities, many of whom have been on the front lines of the COVID-19 pandemic, who would have the stable health insurance and affordable access to care they need. While the impact on individual lives is hugely significant, it does not have to be the only incentive today. Ensuring that all of our citizens have access to Connecticut's Husky program only strengthens our communities, our state, and our nation. Speaking from my experience as a public school teacher in New Haven, it is certainly true that our community is only as strong as those most vulnerable within it. The COVID-19 pandemic has proven as much. I think it is appropriate to bring our attention to the promises that our state makes to its students and to their families. Our state's Board of Education rightly points to the fact that hold child models for K-12 education directly connect the health and safety of our students and their families to their academic achievement and to our society's overall success and prosperity. How can we expect our students to meet their potential if they themselves or their caretakers do not have access to their basic human rights? How can we be in service of equity if we do not address the needs of all students? SB 956 is an opportunity to act so that our legislation matches our purported values. Live Unafraid is not just a hashtag or a request. It is a call to uphold the rights that we claim to believe in and to support our most vulnerable community members, who also happen to be some of the most deserving. Each of us, including undocumented immigrants, has the right to live unafraid of an emergency trip to the hospital, of exorbitant medical bills, and the right to be supported by timely, affordable, preventative options for healthcare. I am here today to stand in full support of SB 956, including the proposed modifications that extend eligibility to all Husky programs to all CT residents. All immigrants are essential, just as it is essential that we pass this bill to provide all with the care they need during this public health crisis and into the future. Thank you for your time.
Thank you. I don't see any questions for you. You're an educator in New Haven?
I am. I teach at New Haven Academy.
Thank you so much.
Thank you.
Liz Gustafson.
Hi, Senator Moore, Representative Abercrombie, and distinguished members of the Human Service Committee. My name is Liz Gustafson, and I am the State Director of NARAL Pro-Choice Connecticut. And I am here this evening to testify in strong support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status. As a state that prides itself on leading the fight for reproductive freedom, we have been provided with an opportunity to act on behalf of health equity and expanding reproductive healthcare access for all. Healthcare is a human right, and everyone deserves access to high quality, affordable healthcare regardless of their race, gender, sexuality, zip code, immigration, or economic status. This current healthcare system is one that is built upon decades of burdensome and discriminatory policies, and it is clear that barriers continue to put access to essential and quality healthcare out of reach for many. Research by the Guttmacher Institute found that among those who are of reproductive age, the percentage of non-citizens who are uninsured is nearly 3 times higher than their naturalized and US-born counterparts, which underscores the importance of ensuring no one is left behind when implementing policies that expand access to healthcare. Barriers and exclusion from coverage harms everyone's health, and our state has the responsibility to ensure every resident, regardless of immigration status, can exercise their basic right to protect their health, their family's health, and their economic well-being. Immigrant communities face a number of systemic barriers, such as lack of reliable transportation, language barriers, and also restrictive immigration policies. Expanding access to quality, affordable healthcare coverage is just one crucial step towards addressing ongoing reproductive injustice and health inequity. Early treatment effectively reduces the amount an individual will pay for healthcare in the long term by preventing health issues from developing further. And as taxpayers funding state health programs, immigrant communities deserve an equal and fair opportunity to access the very programs that they fund. Furthermore, insurance coverage is even more critical now as we continue to navigate the ongoing COVID-19 pandemic, as people are now seeking care in an overburdened healthcare system in unprecedented circumstances. Advancing the sexual and reproductive health and well-being of families and communities requires action from policymakers, and SB 956 is one step we can and should take to support all residents who continue to be shut out of the healthcare system. And storytelling is a powerful and essential tool for change, and courageous testimony provided in today's hearing has only affirmed that our state's immigrant residents and their families cannot wait. We all deserve access to essential healthcare and dignity and respect when doing so. I urge the committee to vote favorably in support of SB number 956 with clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of immigration status. Thank you so much for your time and consideration as we are hours into this hearing. I really appreciate it.
Thank you. Thank you, Liz. I didn't see any questions for you.
Okay, thank you.
Your testimony. Thank you so much.
Take care.
Jennifer Orlando,
Yes.
followed by Nishant Pandey.
Yep. Can you hear me?
Yes, I can.
All right. Good evening, Madam Chair and distinguished members of the committee. My name is Jen. I am a social worker and student from New Haven, and I stand in support of SB 956. I was born in the United States, and my husband, an immigrant, joined me in 2020 after several years of navigating the spousal visa process. When I lost my job during the COVID-19 pandemic, I was fortunate to be eligible for Medicaid. Yet some of our most hardworking residents who happen to be undocumented immigrants cannot say the same. My husband, an immigrant and US resident of less than 5 years, is also not eligible for Husky, despite us meeting the income requirements. This puts a burden upon my family. Although my husband can now buy insurance because he has the privilege of having a social security number, this process took months. While we were waiting, I asked the Access Health Office and Department of Social Services about his eligibility for emergency Medicaid should something happen. Every representative I spoke to did not know about such a program. Turns out, after some research, emergency Medicaid isn't something that can be pre-approved. Instead, you basically have to show up to the hospital with a life-threatening emergency and hope that some of the bill or all or whatever may be covered once submitted to a review team at DSS. Our situation isn't as extreme as members of the undocumented community face, because ultimately my husband now has a social security number. However, this process was truly eye-opening. I know what it feels like to not be able to sleep at night because you're worried someone you love might become sick or injured. Any number of situations could easily have bankrupted us should my husband needed medical care during this time. During this time, I've also worked an internship at a school, which is mandatory for my social work program, and I could have easily brought home COVID. A misconception persists that immigrant rights do not affect the lives of US citizens, when in reality, over 50,000 citizens living in Connecticut live with at least one family member who is undocumented. 1 in 20 children also live in a household with one undocumented family member. I am a 33-year-old grad student paying my way to become a clinical social worker and public servant. I shouldn't have the added anxiety or of worrying what happens if my husband gets sick or hurt. Both of us having health insurance means we can invest in our futures here in Connecticut and focus on our careers, our families, and our communities. And I only want everyone in our state to be able to say the same thing. I support SB 956 with clear language that extends Husky to undocumented immigrants and new immigrant residents. And I urge the committee to vote favorably for this legislation. Thank you for your time.
Thank you, Jennifer. Representative Hughes.
Thank you, Madam Chair, and thank you for going into the social work field. You have a unique perspective from being in one of those families directly impacted, but also striving to be a provider. And we're seeing the compounded impact on those providers that are on the front lines, as well as undocumented family members. Can you say something about your husband? Are there people who say, don't go to the hospital because you won't get care. See, that's what I'm hearing about, is that people talk to themselves, talk to each other, and then, you know, even though there is technically a way to get emergency life-saving care, if people don't know about it, and even the hospital emergency room doesn't really offer that, how is that accessible? Can you speak to that?
Sure. I mean, he has the privilege now of having a social security number, so we haven't gone, you know, years without insurance. But being a social worker, I am familiar at least with some of the local resources. So say he got, you know, a sinus infection or needed antibiotics or, you know, something that's not life-threatening, we probably would have gone to the Fairhaven Community Clinic. But, you know, when you're at home during a pandemic and, you know, all these things are going wrong, your mind always jumps to the worst possible scenarios too. So, you know, what happens if he gets sick, or what happens if he gets in an accident when we're driving to the grocery store, or, you know, all these different things. Yeah, like, I don't know what we would have done. So I hope that helps.
It does. Thank you. Thank you, Madam Chair.
You're welcome. Thank you, Jennifer. Nishant?
Hello there. Hello there to the senators and the members on the committee there. My name is Nish Pandya. I am a pediatrician at Yale Hospital, a resident of New Haven, and a immigrant myself. I stand in support of Senate Bill 956 with the modifications that would ensure this legislation extends Husky eligibility to all low-income residents, regardless of their immigration status. I would like to echo many of the calls the wonderful speakers before have made to consider health equity for Connecticut residents, while providing access to care for residents who belong to the Connecticut community, are contributing to its well-being as well. COVID has taught us painfully that illness does not spare anyone based off of their documentation status. And as a society, we all suffer when we pick and choose who has access to care. Using broad strokes as a pediatrician, I view this bill as being crucial to improving the health of children, because it will help their health in the short term immediately, but also their health as adults. Looking at studies in other states that have expanded Medicaid for children. Children with Medicaid have a 22% reduction in high blood pressure as adults. It will improve educational outcomes for students. They are less likely to drop out of high school and more likely to earn a bachelor's degree. And it will increase their financial outcomes and increase the amount they will contribute in taxes when they become adults. But when I think of this, I think of the patients I've taken care of. I've taken care of children who are undocumented and children whose parents are undocumented. And I think we have heard many incredible firsthand accounts. One perspective I would like to add is when I was caring for a child in the emergency room, he came after a motor vehicle accident. After we stabilized him, I took some time to talk with him about what his concerns were, what he stressed about at home, and what kept him up at night. And despite having facial lacerations, a head injury, and feeling the effects of the motor vehicle accident, the number one thing that kept him up at night was feeling stressed his parents could not access care. Despite being acutely sick himself, the thing he worried about was his parents being unable to access care because their illness was not deemed an emergency, yet they were dealing with chronic pain and chronic illness, unsure of what steps to go next. Being sick is a burden on children, and they should not have to carry the burden of their parents' illness when the state does not provide them the ability to access care. That's not fair for the child. That's not fair for the family. And that is why I strongly support Senate Bill 956. And I hope the committee views and votes favorably on this. Thank you so much for your time.
Thank you for your testimony.
Thank you.
I don't see any questions for you. Thank you, though.
Thank you so much.
Sheila Mulvey, followed by Adelina Camacho, followed by Ty Wren. Sheila, I see you. But I don't see you.
Can you hear me now?
I can hear you, Sheila. Yes, thank you.
Okay, thank you, thank you. I am Sheila Mulvey of Plantsville, and I'm here to speak to raised bill 6560, timely payments to personal care attendants. I am the employer representative designated by a family member who receives services through the Department of Developmental Services, Self-Direct, Medicaid waiver. I've served for 9 years on the PCA Workforce Council, and I am solely speaking as an employer and not for any affiliation. The Self-Direct program is very unique and a groundbreaking approach for persons with disabilities to live their lives with freedom, to choose where they live and how they live in the community. This is an enormous right of choice that never existed before, and we must work together to preserve it. I think we have heard, all of us have heard today, the complexities of the issue before us. Considering this, I strongly support the suggestion of Kathy Flaherty to develop a working group because it is such an important and complicated issue that we need to get it right for the benefit of all involved. Disruptions in the workforce can weaken a program, and we do not want that to happen here. Our fiscal intermediary is Sunset Shores, and for over the past 12 years, I and our devoted staff have never experienced anything but professionalism and helpful treatment from them. With the new electronic verification system coming into place, eventually we'll be replacing all timesheet submittals. I'm optimistic that we will see less payment issues, but we should continue to work on training of the mechanics of the jobs offered and educational opportunities for employers, again in the mechanics and on the labor laws in Connecticut. Please excuse me for changing some of my testimony, but I was so compelled by what I heard today. I just wanted to make a few changes there. And I want to thank you very much for listening to me.
Thank you, Sheila. I want to thank you. I commend you for not just giving your own testimony, but for listening to what other people have to say, so people understand the decisions we make are not just based on a couple of people, but that other people are having input. So thank you.
Yes,
I
thank
don't
you.
see any questions for you, so have a good evening.
Yes, you too. Thank you.
Thank you. Adelina Comancho. Ty Ren.
Hello.
Hi, Ty. Is it Fernandez or is it Ren?
Ren. It is Ren. Fernandez Ren. But
okay. You can give your testimony. Thank you.
All right. Thank you very much, Senator. So, dear members of the Human Services Committee of the Connecticut General Assembly, my name is Ty Fernandez Ren. I'm from Waterbury and a first-generation nutmegger. First and foremost, I stand in support of SB number 956 with clear language that extends eligibility to all Husky programs to all CT residents, regardless of immigration status. My personal stake in this is that my mother immigrated here from Portugal at 16 to this state and was not a citizen until her adult years. I don't even want to think about how, if she were injured at that young age, that under these current rules, her health would not be covered. She came in the 80s. She was sold the story of the American dream, and here we are in 2020, and our state can't even cover those same immigrants coming to Connecticut, dreaming for more for themselves and for their families. My question is, what must a person do to earn the right that is healthcare? Must they go to both high school during the day and then at night to learn English? Must they Americanize themselves to fit in? Must they work hours after night school cleaning bathrooms to help with income? Must they rush into a marriage for a green card simply to stay in the country? These are all things my mother had to go through and my family had to go through. I firmly believe healthcare is a human right for all. Who are we as mere humans to determine if a person lives or dies, suffers or thrives, all because of their relationship to the state, just for some healthcare? The Connecticut I know is made up of immigrants, both documented and undocumented. And for the Connecticut I know, everyone deserves the safety and comfort of knowing that one bad accident might not end their career or livelihood. I support SB number 956 with clear language to extend current Husky eligibility to all CT residents, regardless of immigration status, and I ask the committee to support this legislation. I'm really just here today to embrace the space where we, the public, are able to speak our pieces to you and be heard. I hope you're able to listen to the plethora of people in support of our state's immigrants, and that we may maintain the care the state has provided in the past for people like my mom, and expand that to make Connecticut as inclusive as possible. Thank you for your time. Muito obrigado y mantener salud durante esta pandemia. Thank you.
Thank you, Ty. So we've accomplished a part of what you've asked because we have listened to many voices. So thank you, yours included. Thank you. I don't see any questions for you. The next is Camelia Guza Chavez.
Yes, thank you. Dear members of the Human Services Committee of Connecticut General Assembly, my name is Camila Guiza Chavez. I'm a resident of New Haven, a member of Samia Collective, and I work at an organization that provides job training and a space to organize for refugee and immigrant women from the Middle East and Latin America. I stand in support of SB number 956 with clear language that extends eligibility to all Husky programs to all Connecticut residents, regardless of immigration status. I'm not undocumented, but many of the most important mentors, friends, and leaders in my life are. There should be no question in the minds of legislators based on the powerful words that have been shared today and the vast turnout in support of this bill that the current system is not working and makes the simple act of living more precarious and dangerous for many members of the undocumented community across our state. I grew up deeply understanding how critical having access to healthcare can be in the life of an individual and of that individual's family and their community, as my mother was diagnosed with a chronic degenerative disease when I was 12 years old. While there's no cure for her disease and she was told from the beginning that her life would never be the same, she could at least manage her symptoms and slow down the pace of damage to her nervous system through injections she'd have to give herself every day. These alone cost thousands of dollars per week. If we had not had health insurance through my mother's work, I don't know what we would have done. There's just no feasible way that we would have been able to prioritize my mother's health without going into mountains of debt. In the more than 10 years since her diagnosis, my mother's health insurance has allowed her to pursue different kinds of care, from traditional to alternative medicine. So even though her body will never be the same as it was before her diagnosis, the ability to explore these different ways of healing so she can live life as fully as possible has given her some sense of agency and power over her own body and future. And as scientific research around my mother's disease evolves, again, only because of her health insurance, she's able to avail herself of new medicines when they're made available. Today, she no longer has to give herself daily injections, but instead can get monthly medicine transfusions at a nearby hospital where they know her name, her medical history, and where she's treated with respect. This kind of access to care is what every human being deserves. Every human being deserves to live with the confidence that if something happens to them, if their bodies get sick, like human bodies do, that they'll have a net to fall back on, that they won't be left behind by the community they live in, call home, and help to sustain. And undocumented immigrants do help to sustain our communities, not just materially through literal tax dollars, but also through their ideas and presence and perspective and creativity. As Fatima Rojas said before me, the undocumented community makes this state vibrant. Not providing healthcare to the undocumented community is a choice, and it's a criminal choice to knowingly violate basic human rights. I urge you all to use the power that you have to stand with the undocumented community and make the choice to prioritize human life over profit and pass SB 956 without exclusions. The time is now, and our community will continue to fight until we win. Thank you. Thank you for your time today.
Thank you, Camelia. Camelia, can I ask you, what is Samia?
Sorry, Samia?
Samia, what is that?
Samia Collective. It's a collective in New Haven, and many, many other people on this call. I think it's 16 people today at the public hearing who testified with Samia Collective.
Yeah, I don't think I saw it before, but I don't think I asked anybody what it was. So thank you.
Mm-hmm.
Any questions? Seeing none, thank you. Next is Shannon O'Malley.
Hi.
Hi, Shannon.
Good evening, and thank you, distinguished members of the Human Services Committee, for the opportunity to testify tonight in support of Senate Bill 956 with the modification to include all Connecticut eligible residents. My name is Dr. Shannon O'Malley, and I'm an assistant professor and a pediatrician in New Haven and New London, and I specialize in taking care of children who need to be hospitalized. I've also cared for children in a refugee clinic in Connecticut, volunteered as a health educator with Connecticut's local refugee resettlement organization, and have done immigration advocacy work at the Texas-Mexico border. I write today with my own opinion, and I do not write representing the opinions of those with whom I work, but I would like to add very proudly that Yale New Haven Children's Hospital has submitted written testimony in strong support of this bill. So as a child and immigrant health advocate, as a physician, as a resident of Connecticut, and just as a human being, I strongly support Senate Bill 956 because access to healthcare is a human right. Aside from this ethical and moral imperative, this bill just plain makes sense from a financial and public health perspective. Though I believe wholeheartedly that every single person deserves healthcare, I'm going to focus the rest of my testimony on what I know best, children. Based on the most recent data, we estimate that about 13,000 undocumented children are currently living in Connecticut. And they're living in families that make income eligible for Husky. So they would be eligible for Husky, but because of immigration status, they do not qualify for Husky. Their families most often otherwise cannot afford to purchase insurance or pay out of pocket. Research has shown, as well as the powerful lived experiences of those testifying today, that those without insurance are understandably more likely to delay or even be turned away from care, resulting in worse long-term outcomes and greater financial and human health costs. This is why many of my primary colleagues, as Dr. Rosenberg has recently testified, do not get to see these children in the clinic, but I do as a doctor who works in hospitals. Instead of being able to receive our standard preventative care, families are forced to wait to seek costly and complex care in the hospital. As an example, I recently cared for a child who became ill after infection with COVID. Quickly, we discovered he was in heart and kidney failure. The family did not know the child had any health issues because he never had a well child visit with a pediatrician who most likely could have caught these issues before they became life-threatening with basic and inexpensive screening, and potentially have prevented his hospital admission and his need for now lifelong dialysis or transplant. He needed to stay for almost 4 months or 120 days in the hospital, or 2,880 hours. This is the equivalent of almost 2/3 of an entire school year. And as many have previously pointed out in their testimony, it's frustrating that our current legislation supports the fact that all children deserve a free education, which I believe, but the fact that only some children deserve to be healthy enough to enjoy it. Not only will this bill save on an individual level, as the example of my patient shows, but also on a greater public health level. Undocumented children are a considerable part of our future of the state. And we know that children without insurance and without access to regular medical care have worse school performance without the insurance, worse school attendance, worse health as children, and worse health as adults, and therefore worse earning potential and taxes as adults.
Sorry, your 3 minutes are up. Please summarize. Thank you.
So please help ensure these children, as all children should, have access to healthcare and the ability to lead happy and healthy lives and reach their full potential. Thank you for your commitment to child and immigrant health. Please support Senate Bill 956.
Thank you, Dr. O'Malley.
Thank you.
I don't see any questions for you. I appreciate your testimony. Thank you.
Representative Wood has her hand up, Madam Chair.
Representative Wood?
Thank you, Madam Chair, and thank you, Dr. O'Malley. Question for you on, I've learned a lot in this testimony today. Question to you on how many patients you know in the New Haven area take advantage of the federally qualified health centers, just a rough percentage, and how many don't know they exist?
Yeah, so I work mostly as an inpatient pediatrician. So I would say, of the patients that I'm seeing that come to the hospital with these conditions that could have been prevented, most of them are not seeing outpatient pediatricians. But I do work very closely with some of the other general pediatricians who have testified tonight, and I'd be happy to get you a better estimate of how many we have in our clinics and how many they feel like know about potentially some free or discounted care.
I hate to add work to anybody's plate. We're also, plates are so full, only if it's convenient and it comes your way, but I appreciate your testimony and certainly appreciate your work.
Thank you. Yeah, I'd be happy to do that. I can send you some estimates.
All right, thank you. I appreciate it. Thank you, Madam Chair.
You're welcome. Thank you. Thank you, Dr. O'Malley. Next, I have Teresa Sandoval Schaefer, followed by Anthony Barroso, followed by Megan Fountain.
Thank you. My name is, can you hear me?
Yes, Teresa.
My name is Teresa Sandoval Schaefer. I am a resident from Hamden, an immigrant from Mexico, and a member of the Semilla Collective New Haven. I stand in support of SB 956 with clear language that extends eligibility to all HOSKI programs to all Connecticut residents, regardless of immigration status. I am a naturalized citizen. I am not undocumented, but I am here to speak on behalf of the thousands of undocumented immigrants that reside in the state of Connecticut and that every day work so hard to contribute to the society and the economy of our state. It's time to recognize that undocumented immigrants are not invisible. The United States government wants to pretend they don't exist so they can be left out of government stimulus and programs. But they are not invisible. They are the essential workers that have been cleaning up at hospitals, clinics, office buildings, public spaces, etc., risking their own and their families' lives during a pandemic. They are essential workers that have been growing, preparing, serving, and delivering our food, so privileged people like me and all of you legislators can safely work from home. And yet these essential workers have also been left out of one of the most essential human rights, access to healthcare. Now, access to healthcare is particularly critical for undocumented immigrants because the nature of their jobs puts them at higher risk of injuries, because having long work days for very low wages puts them at higher risk of chronic debilitating diseases. But especially during the COVID pandemic, leaving anyone out of healthcare access is immoral and repugnant. Lack of access to healthcare could be the difference between surviving or succumbing to COVID-19. But even for those that survive, about 30% are considered long haulers and may suffer sequela for months, years, or possibly the rest of their lives. I am a COVID-19 survivor and a long hauler. Since I got COVID a year ago, I haven't been able to perform strenuous activities without feeling out of breath. I can't even go hiking or walk long distances without having to pause to breathe. Thankfully, my job doesn't require this kind of stamina, and I have access to healthcare in case I need it. But we need to recognize this is a crisis, and this is not the time to keep anyone out of healthcare access. As you listen to the testimonies and make a decision about supporting SB 956, please know that we don't need a Hispanic Heritage Day. What we need is not a Margarita or a Taco Day. All we're asking from you is to recognize our humanity. Please support SB number 956 with clear language to extend current HOSKI eligibility rules to all Connecticut residents, regardless of immigration status. Finally, I just want to say that nobody is safe unless everybody is safe. Thank you.
Thank you, Teresa. I don't see any questions for you. Thank you. I hope you continue to get better from, I know there's after effects and after COVID-19. So I hope your body heals.
Thank you so much, Senator.
You're welcome. Anthony, are you actually going to give testimony? I know you've been interpreting for people. Are you going to give testimony also?
Yes, I am.
Okay, so you're next.
Thank you, Madam Chair, and thank you, members of the Human Service Committee of Connecticut. My name is Anthony Barroso. I'm a student, I'm a parent, and I'm a resident from New Haven, Connecticut. I'm also a recipient of DACA and a member of Connecticut Students for a Dream and the Semilla Collective. I stand in support of Senate Bill 956 with modifications to the language so that it clearly extends eligibility to all HUSKI programs to all CT residents, regardless of their immigration status. I was born in Ecuador and came to the United States when I was 7 years old. I have lived in New Haven for most of my life and experienced the many barriers of being undocumented until I received my work authorization through DACA, which, by the way, was an organizing win from the immigrant community. Being undocumented has impacted many aspects of my life. For example, when I was in high school, I did not think going to college was a possibility because I knew I wasn't eligible for any financial support from the government, and my single mother did not have the means to financially support me with tuition. I also avoided after-school activities that could cause injuries, such as sports, out of fear of getting hurt and putting my family in a difficult financial situation by having to pay out of pocket for medical costs. Overall, being undocumented in the US means living in constant fear of getting sick, encountering police, or worse, being separated from your loved ones, something that I personally experienced. A lack of status also limits one's ability to provide for yourself and your family. I know this all too well. I had my son when I was 18, and I started working multiple jobs to keep up with the cost of providing for a family and paying for living expenses. At one point, I found myself working 3 jobs, with some days working 19 to 22 hours straight. One night after leaving my last job around midnight, I fell asleep behind the wheel of my car and barely missed the gas pump as I crashed into a Jersey barrier located in the parking lot of a gas station close to my apartment. I woke up disoriented and in pain, but my first thought was not if I was okay, but that I needed to leave the situation because I was scared of the police coming and scared of being handed over to ICE. I called a friend and they picked me up and they insisted I go to the emergency room where I had x-rays and other diagnostic evaluations. At the time, I did not have health insurance and I was in the facility for less than 4 hours. Fortunately, I was determined to be okay, just slightly bruised. My car was totaled, but then a couple of weeks later, I received a bill from Yale for a total of $8,000. I panicked. I knew there is no way I could afford that with an infant son while working bare minimum wage jobs. My story is not unique. Immigrants all across the US face unfair barriers to healthcare that they need. Lack of coverage, no language access, fear about immigration status, and discrimination in doctors' offices and other aspects of the health system all make it more difficult for immigrants to get preventative and long-term healthcare. Ensuring that all immigrants can access Medicaid will take away one of the many barriers for care to immigrants. And that is an important step towards health justice in our state. The COVID-19 pandemic has also highlighted the inequities in our society. Many people have lost their jobs, and undocumented people are excluded from all forms of safety nets, including unemployment, stimulus checks, and various other services.
Excuse me, your 3 minutes are up. Please summarize.
Throughout the pandemic, I've organized and been in community with many undocumented families through the state, and I've listened to countless stories of people who developed chronic illnesses such as diabetes, heart disease, or become disabled due to untreated injuries or cannot afford life-saving medicine. I know our people are resilient and will find ways to stay in solidarity with one another, but we should not have to suffer like this. Access to affordable healthcare is a human right and should not be negotiable. So in conclusion, I urge the committee to pass Senate Bill 956 with clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of immigration status, without exclusions. Thank you for your time.
Thank you, Anthony. And I want to thank you personally for hanging in there with us all day doing that interpretation for people. Appreciate it. Thank you.
No problem.
Next is Megan Fountain, Tawana Galbraith, Ann Pratt. Megan. Tawana. Ann Pratt, you're up.
Good evening, Senator Moore, Representative Abercrombie, members of the Human Services Committee. I am the Director of Organizing at Connecticut Citizens Action Group, and I am also the co-chair of the Medicaid Strategy Group. And I'm here to support the bill that we've all been listening to and others have testified in support of 956 with all of the caveats that you have heard every speaker mention. And I just want to say, I had prepared testimony, but I just want to say it has been incredibly powerful to be here tonight and to hear the stories that we've all heard. I am both tortured and inspired by the courage of people who have been on this call tonight. And I'm in this work, been in it for 40 years. And I think I just am so incredibly sick that this is the reality for so many of the people in our communities. So what I'm going to add to the conversation is that some of the obstacles that have been put forth to making this happen have been financial ones, that we do not get a federal match on opening up Medicaid to undocumented. And I'm going to say that there's a way to make this happen, and we do not want to let that stand in our way. There are ways in which are being proposed in Senate Bill 842 that basically puts a tax on insurance companies to help provide subsidies. So that's a way. There are two bills that are going to be heard in Finance Committee that is about restructuring our tax structure and creating it more equitable. That is a way. It can create an enormous amount of resources. And this is what we need to be putting our money into, addressing these stories and this existence of health inequity. We also have 17 people in this state, 17 people in this state who over the last 10 months during a pandemic have increased their wealth. That is increased, not gained, but increased their wealth by close to $4 billion. That is a lot of money for 17 billion people, and our state suffers and is hurt by the fact of this inequity in healthcare. And it's just wrong. And we can do something about it. We can. You all who have sat here, listened, experienced what I have experienced with you, and we can figure out how to do this. So that's all I got to say. We are in support of this bill. And I thank you, Senator Moore and Representative Abercrombie, for holding this hearing, and of course, for every single story that has been told tonight.
Thank you, Ann. I appreciate you. I know the work that you've done. I think I met you the first year you started. So I appreciate that. And when we sit here, for 10, 12, but I'm on hours, we hear the stories of people's real lives and how they're living and the stressors of not having insurance and what happens and living with these what ifs all the time. So we hear them. This is a public hearing, but you hear them every single day by being out and about. With it. And that's what we have to figure out. What are the solutions to get this done? So I appreciate your testimony.
And I just want to add, I also just moved to Southbury, Connecticut, and I see my senator is here, and I'm happy that he's listening to that as well. So this is good. I just wanted to put that into, hello, Senator. I'm glad that you're listening to this.
Thank you, Ann. I don't see any questions for you. Thank you. Next is Jose Ramirez, Jesus Morales Sanchez, and Juan Carlos Pozo. Jose? Jesus?
Hello. Hi.
Hi, Jesus.
All right. Good evening, everyone. Thank you for this opportunity to speak. My name is Jesus Morales Sanchez. I'm a community leader and I'm a volunteer with Connecticut Insulin for All, as well as the Semilla Collective in New Haven. And I'm also a youth development specialist and educator at Planned Parenthood of Southern New England. I'm a US citizen. I'm an immigrant from Mexico, and I come from a mixed status family. What that means is that my family has family members that are of different immigration statuses. I'm here to testify in favor of SB 956, as this bill could be the difference between life and death for people in my community, including my family. I was diagnosed with type 1 diabetes on October 6th of 2018. At the time, I was uninsured and unemployed. At the time of my diagnosis, I had lost over 100 pounds in just a few months. Being 6 foot tall, I weighed a total of 130 pounds. So I was skin and bone, effectively. I was able to get the testing and treatment through that I needed through the Fairhaven Community Clinic after waiting for 1 month to get an appointment. Then they were able to prescribe insulin through the 340B program, while I waited months to be able to navigate the bureaucracy as I tried to recover from nearly dying from undiagnosed diabetes. And ultimately, I was eligible to sign up for Husky D, as I was unemployed at the time. Well, these safety nets are far from perfect. They were effective at keeping me alive, and I'm very thankful for that. I often joke with my family that we were lucky that it was me who got sick, because had it been any one of my family members that are undocumented or the ones that literally just got a permanent resident card, they would not have qualified to a lot of these safety net programs. So these safety nets allowed me to get the care that I needed, the medication that I currently need to stay alive at an affordable price. And they were the reason why I'm here today. I also need to acknowledge that all of this was available to me because I had recently been naturalized a US citizen. Today, as such, I have the luxury of having a full-time job that offers me health benefits through a private insurance company. My monthly insulin prices, these 3 pieces of medication, without insurance, the list price would be over $1,800 for a month supply of my medication. $1,800. This does not take into account the needles that I need to administer the medicine, does not take into account the glucose meter and the test strips, does not take into account this little device that makes controlling my diabetes a lot easier and manageable. Unlike type 2 diabetes, which also runs in my family, my mom has been a type 2 diabetic for years, for over a decade. Type 1 diabetics are insulin dependent for the rest of their lives. Our pancreas does not produce insulin anymore. We will need insulin for the rest of our lives. And without it, a lot of us can die. I'll be close. I'm close to closing. We'll die within a matter of hours. In a state where more than half of an undocumented population is uninsured, it is also in the times of a global pandemic, it's been painfully obvious that we need to expand affordable healthcare, regardless of immigration status, because illnesses like type 1 diabetes, they don't know about people's race. They don't discriminate about because of people's ethnicity or immigration status or socioeconomic status. Then why should healthcare? I'm asking you, please, to support an act providing medical assistance to certain individuals, regardless of immigration status, ensuring that everyone that would qualify to any of the Husky programs can do so. Because for me, Husky was a lifeline. It was able to save my life. And while, yes, the 340B program made my medication affordable, right now that's another fight that we're doing at the federal level. As insulin companies, the same producers of these life-saving medication that hold a monopoly.
I'm going to ask you to please.
Yes. Withdrawing from this program, limiting the access to life-saving medication. So with that, that's my testimony. Thank you so much for listening.
Thank you, Jesus. I don't see any questions for you, so I thank you for your testimony.
Thank you.
Mark, Juan Carlos. Is Juan Carlos here? Then I'll go to Mark Kosnoff. Angie Soto. Richard Kremer. It's all yours, Josh.
Senator, I see Richard.
Do you?
I do. He's on the bottom. Richard, can you hear the senator?
Well, we'll come back to him if he does, okay?
All right. No, I'm here.
Oh, okay. All right, Josh, you'll be next.
I haven't been here the full time as you all have. And I will say that I've been astounded by the 6 or 7 hours that I've been here. I'm Pastor Rick Kramer. I serve in urban, multi-racial, multi-ethnic church, Grace Lutheran, in the Asylum Hills section of Hartford, which is the part of Hartford that has the largest proportion of immigrants and refugees. I truly and fully, unconditionally support Bill number 956 with the recommended changes. That is, all residents being permitted to receive all aspects of the Husky programs. I'm going to skip most of what I said, but I want to, what I wrote. I want to say what an incredible day it's been. And I want to thank the people who have the courage, who are people that do not have papers and are standing up and talking about their lives. What courage. I come from Rhode Island, where I served a multi-racial ethnic church in Providence. And the difference between Connecticut and Rhode Island is dramatic. And I'm so glad to be here back in Connecticut. I just want to say a few things. One is, most of our ancestors came here looking for a safe place to live and begin a new life. Today's immigrants and refugees are no different, save where they come from, their race, and their ethnicity. After the horrors of recent years, even after the horrors of recent years, our immigration system has been long broken, and people all over the world are looking for a place for their families and a safe place. I've been to Nogales. I've crossed the border there. I've been to Tucson in the federal courts. I've gone to Nicaragua and El Salvador. There's a reason for people coming to this country, and those reasons are only stronger than they were back when I was doing that in Rhode Island. Life in the shadows, afraid to be identified, fearful of being deported, and afraid to seek health care for fear that their identities would lead to their hopes, to the end to their hopes for their families and relatives. Those are areas of grave concern. There are very limited ways that people in these circumstances can get much needed basic health care. Emergency room hospitals are filled and they're stressed. So when the people in the emergency rooms, and I've been there with people, say, hey, this is all we can do. It's almost always a factor of the stress level that they're living with. But also there aren't any rules or laws like this particular one that would help somebody who didn't have the ability to have health insurance.
Excuse me, sir, your 3 minutes are up. Please summarize.
Okay, I just wanted to say that Connecticut has shown remarkable leadership by being a source of asylum to those in need and giving them a chance. So providing these services and doing so for all of those people that are doing all the jobs that nobody else would do and getting paid so little can at least be given proper access to healthcare. Thank you. And thank you for all the work that you're doing as a committee.
Thank you, Pastor. Let me see if I have any questions for you. All right, well, thank you so much. Next is just say if there's Josh.
All right, Representative Abercrombie, Senator Moore, and members of the Human Services Committee, thank you for this opportunity to testify in support of SB 956, an act providing medical assistance to certain individuals regardless of immigration status. I support this bill with the addition of clear language that extends eligibility for all Husky programs to all Connecticut residents regardless of immigration status. My name is Josh Pollock. I'm the minister of the Unitarian Universalist Society East in Manchester. I'm a leader with the Recovery for All campaign. Our church is among those in the state who identify as sanctuary congregations. We are committed to supporting undocumented immigrants in any way we can. Echoing my colleague Richard from Grace Lutheran in Hartford, I want to give us just a note of gratitude to all of you on the committee who've been sitting here this long day listening to testimony, and also to the undocumented people who are testifying, telling their stories. I'm deeply grateful to them. What they're explaining to us is that, like citizens, undocumented people get sick and require medical attention. We've been hearing this testimony all day long. Undocumented people suffer injuries, develop cancer, heart disease, diabetes, mental illness. When these things go untreated due to lack of access to healthcare, they can get worse. They can make it impossible for a person to work and support their family. They can land people in the emergency room. They can result in death. SB 956 takes this reality seriously. It is a very caring bill. It is a justice-seeking bill. It is a loving bill. And it is a bill that will, if it becomes law, get undocumented people access to the medical care that they need. Having said that, I was under the impression that as it's written, it doesn't go far enough. I was intrigued with Sheldon Tubman's testimony earlier, arguing that he actually believes all the Husky programs would be open to all qualifying undocumented people if the bill becomes law. If he's right, then hooray. And if he's not right, then I think it's critical that this bill be amended to include clear language that extends eligibility for all Husky programs to all Connecticut residents, regardless of immigration status. I am convinced our state can afford the cost, and I urge all elected officials to take to heart the Recovery for All campaign's revenue proposals. If you're concerned about costs, consider those proposals. We cannot forget that healthcare is a human right, regardless of immigration status. There are abundant revenue options available in Connecticut to provide this human right to undocumented people. Please support SB 956. And again, thank you.
Thank you. I was ready to say amen there for a moment there. Thank you. I don't see any questions for you, but I appreciate your testimony.
All right, you got about 40 more to go. Good luck.
We'll be here. We're here till we're done. We're here. Thank you.
Good night.
Simone Radovan. Elizabeth Gonzalez.
Hola.
Hola.
Hola, buenas noches.
That's the extent of it for me now. Okay.
Thank you. I need an interpreter for me testimony, please.
Yes,
Hola,
there's one here for you.
Yo puedo ser tu interpretada.
Ok, muchas gracias.
Claro.
Bueno, buenas noches a cada uno de ustedes. Mi nombre es Elizabeth González, soy una madre, hija, madre y esposa. Bueno, soy madre de 4 niños y esposa. Una mujer trabajadora y pago mis taxes.
Good evening, committee members. My name is Elizabeth Gonzalez. I am a daughter, mother of 4 children, and a wife and a working woman. And that's it.
Soy una, vivo en New Haven desde el año 2001 y soy una inmigrante más.
I've lived in this country since 2001, and I am just another immigrant.
Pidiéndoles que se tomen el corazón en las manos y nos brinden su apoyo a todos los que necesitamos seguro médico.
Asking you to place your hand on your heart and give us your support to all of us who need access to health insurance.
Mi historia en un breve momento. Hace 2 años perdí a mi padre por falta de un examen físico como tenía que ser.
2 years ago, I lost my father due to not receiving adequate preventive health care.
Yo lo llevaba a clínicas, a exámenes, pero desgraciadamente no lo hacían correctamente por lo mismo, por no tener un seguro médico.
Every time I brought him to a clinic or tried to get an exam for him, they would deny us because he lacked health insurance.
Y quiero decirles más que nada que somos personas que perdimos a nuestros familiares por falta de un seguro médico y que seguimos perdiendo.
And I want to emphasize that we are people who have lost loved ones due to a lack of health insurance, and we continue to lose our loved ones due to a lack of health insurance.
Que somos seres humanos con sentimientos, que tenemos dolor, tenemos una vida y sobre todo tenemos familia que dependen de nosotros.
We are conscious human beings who feel pain and feel hurt.
Que no somos robots y aún así necesitaríamos un mantenimiento.
We have family that depend on us, and we're not robots. We need care. We need access to take care of ourselves.
Y que pido, bueno, estoy en apoyo de la ley 956, en la cual espero de todo corazón que seamos todos los inmigrantes beneficiarios de esta ley.
And I support Bill 956 with the intention that it includes everyone in the undocumented community to have access to healthcare.
Y más que nada por todos nosotros que estamos sin un apoyo, que no tuvimos ningún apoyo monetario por la pandemia, que organizaciones como Colectivo Semilla, como ULA y como otras tantas nos han dado más que el mismo gobierno.
And additionally, to all the folks who have been financially distressed, who have been experiencing the pain of the pandemic, we have found support and community from organizations like the Semilla Collective, like ULA, and many others that step up when the government doesn't do what they should.
Que siempre nos han discriminado de alguna forma. Así que les doy las gracias por su atención, por el espacio, y les pido una vez más que con el corazón en la mano nos toman en cuenta también.
And I ask you to please, with all your heart, give us the access to healthcare. It's what we need. And thank you for listening to my words.
Gracias, Antonio.
Thank you, Elizabeth.
Claro, muchas gracias, Elizabeth.
Representative Hughes.
Oh, thank you, Madam Chair. I just, gracias, Elizabeth, and I wanted to say how sorry I am for the loss of her father and all the preventable deaths in our community. And now that we know this is happening, we must do better. So I just wanted to offer my condolences.
Quise dar mis condolencias por su padre y por la pérdida de toda la gente de nuestra comunidad que hemos perdido por no tener acceso. Y ahora que sabemos que esto es un problema, tenemos que hacer algo, tenemos que hacer un cambio. Solo quise decir mis palabras de condolencias.
Gracias.
Thank you.
Thank you. Carlos Marino, followed by Alexis Garcia, followed by Jenny Cornejo. Kelly Whitnar. Kelly.
Hi, thank you. Members of the Human Services Committee, thank you for the opportunity to submit testimony regarding Raised Bill 956, an act providing medical assistance to certain individuals regardless of immigration status. I am an associate research professor at Georgetown University's McCourt School of Public Policy. My work is focused on health coverage for low-income children and families, especially Medicaid and CHIP at the Center for Children and Families. I submitted written testimony summarizing my research and observations as other states have advanced legislation to cover more children and families. And it is my understanding that members of the committee have seen a brief I authored specifically on expanding Husky A and B that was funded by the Connecticut Health Foundation and mentioned in earlier testimony by Jay Siklik. As the committee now knows, after lots of testimony, under federal rules, Medicaid and CHIP coverage for non-citizens is generally limited to certain lawfully present immigrants or certain emergency services, though many states have taken advantage, like Connecticut has, of federal options to cover more immigrant groups. States have also implemented coverage programs with state-only funds to reach immigrants regardless of citizenship status. States have also used state-only funds to fill gaps in coverage, such as for lawfully residing pregnant women and other adults who are in the 5-year waiting period. The experience of other states, most recently Oregon, makes very clear that having a robust outreach campaign is critical to reaching newly eligible immigrant groups, especially given the anti-immigrant climate perpetuated by the Trump administration. Therefore, I believe that when working through this bill, members of the committee should consider adding funding for an outreach campaign, relying on community-based groups to reach the needed populations. And I understand that there are limited resources for this bill and for other priorities before the committee, but I believe that when estimating the costs of expanding Husky to undocumented individuals, it's really important to remember that not all eligible individuals will enroll. I heard some of the testimony earlier today from the department, which made sense in terms of a starting place and estimating the costs, looking at the Migration Policy Institute data to understand the size of the undocumented population. That's also the group I would turn to. And then the per member per month costs as they described. However, it's really important to also think about the participation rate. Even with a robust outreach campaign like the one conducted in Oregon, only about 1/3 of eligible children enrolled in the first year, the majority of whom were transferred automatically from their emergency Medicaid program. Therefore, it's important in the fiscal note to account for an enrollment ramp-up period and bear in mind that reaching every eligible individual may never be possible. So in thinking about the total costs, I think it makes a lot of sense to start with the total number of potentially eligible people, and then turn to the participation rate, which is a piece that is often overlooked before computing the total costs based on those per member per month estimates the department provided earlier. Thank you for this opportunity to testify.
Thank you. Thank you. Are there any questions? Seeing none, I just want to say thank you. And thank you. We'll look at the report. I did not get a chance to look at it, but I will. Thank you. Next is, I'm going to go back up and see. I see Juan Carlos. Juan, do you want to unmute? Okay.
¿Me escucha ahí? Can
Yes.
you
Do you need an interpreter?
Yes.
Is there an interpreter
Sí.
here?
Hey, I can interpret.
Thank you.
No problem.
Primero, quiero agradecerles por la oportunidad de poder manifestar a ustedes, miembros de este Comité de Servicios Humanos.
First, I'd like to thank the committee for the opportunity to share my testimony tonight.
Mi nombre es Juan Carlos Pozo, soy de Ecuador. Mi esposa se llama Vanessa y mi hija Montserrat.
My name is Juan Carlos. I'm from Ecuador. And my wife and daughter as well.
Ok, mi testimonio es este. En Ecuador, y cuando mi hija tenía 6 años, un dolor de cabeza hizo que el doctor descubra un tumor en su cerebro.
When my daughter was 6 years old, the doctor discovered that she had a tumor.
Ella tuvo 3 cirugías en el cerebro. La tercera cirugía es la que cuando le pusieron una válvula, es la que le hizo vivir, porque me dijeron que no había nada que hacer, pero como gracias a Dios, ella está bien, pudo vivir.
She underwent 3 surgeries for her brain, and in the 3rd surgery, they placed a valve that saved her life. Thank God, today she's still alive.
Nuestra situación, la situación económica en nuestro país es muy difícil e hizo que tomemos la decisión de venir acá a América por el bienestar de la salud de nuestra hija. Porque aquí hay mejores equipos, aquí hay mejor medicina, aquí hay mejores médicos, sin desmerecer a los profesionales de mi país.
Due to the economic situation in our home country, we made the decision to immigrate to the US because of the quality of care and the specialists that exist in this country.
Nosotros sabíamos que íbamos a ser una familia indocumentada, pero hemos hecho todo por nuestra hija.
We knew that we would be undocumented, but we wanted to do anything for our daughter.
Cuando mi hija vino acá, tenía 9 años, ahora tiene 16. Durante los últimos 7 años ha necesitado mucha atención médica de psicólogos, neurólogos, neurocirujanos, oncólogos y pediatras.
When my daughter came to this country, she was 9 years old. Now she's 16. And in the course of that time, she has seen neurologists, specialists, surgeons, and various other medical staff.
Hemos pedido ayuda al programa gratuita que tiene el Hospital Yale, pero como todos saben, los costos por lo general no siempre están cubiertos en su totalidad. A veces la atención nos ayudan, pero a veces nos niegan. pero igual tenemos que, por nuestra hija, pues pagar a veces las facturas que nos llegan.
We've applied to reduced fee programs provided by Yale, but even so, the costs are still a lot, and we've had to do what we have to do and pay out of pocket to save our daughters' lives.
Señor Corso,
Sí,
¿me permite, por favor, de resumir su testimonio, por favor?
Bueno, estaba tratando de comentar todas las cosas que pues pasamos con nuestra hija aquí en este país, pero del cual también estoy muy agradecido por todo lo que me han sabido ayudar. Pero me gustaría tener una cobertura de salud continua todo el tiempo para no estar, unas veces tengo que pagar de mi bolsillo. Es muy duro la situación durante este año y medio, ha sido duro para mí debido a la pandemia. Yo trabajo en restaurante, mi esposa también, y pues se cerraron los restaurantes, estuvimos sin trabajo. Entonces lo que yo pido a ustedes, miembros, de todo corazón, es que nos ayuden con esta ley que parece que se está promoviendo, para ver si es que podemos tener una ayuda, ya que mi hija necesita ser atendida y vista de por vida. Ella después de las 3 cirugías, quedó discapacitada. Es la única hija que tenemos y pues queremos hacer todo por ella. Es nuestra única hija.
So I wanted to share with you all the story of my daughter and how we have gone through great lengths to try to save her life and give her a better quality of life. We need access to affordable care. It would mean so much to our family. It would help us and give us the support we need, especially during this trying time. My wife and I have lost our jobs in restaurants, and we just want to do whatever we can for our daughter. She has become disabled after the surgeries that she received, and we need more support. We need access to healthcare.
Y pues, si es que se logra conseguir esta ayuda para mi hija, pues estoy muy agradecido de todo lo que este país nos ha dado hasta el momento. Soy muy, muy agradecido de América.
And if we receive the support and access to affordable care, my family and I will be very gracious and very thankful to the state and to this country for all the benefits that it has given us. Señoría,
muchas gracias y pues gracias por la oportunidad nuevamente.
Thank you. Thank you for your testimony.
Thank you very much.
And I hope your daughter, we get what you need for your daughter to kind of soften this journey for you. But thank you.
Thank you, guys.
We don't really have that many, so I'm going to go through the list of what we have left. Okay. Next, I would have Sana Shah.
Dear Representative Abercrombie, Senator Moore, Senator Berthel, Representative Case, and esteemed members of the Human Services Committee. My name is Sana Shah, and I'm testifying today on behalf of Connecticut Voices for Children. Connecticut Voices for Children is standing in support of Senate Bill 956, an act providing medical assistance to certain individuals regardless of immigration status, with modifications to include the coverage of our low-income children and parents under Husky A, and low-income elderly and disabled individuals under Husky C. Connecticut's most vulnerable communities, particularly low-income families and people of color, are more likely to be exposed to adverse social determinants of health. Included among these individuals are undocumented residents. Undocumented families, because they are also largely excluded from Connecticut's health insurance system, are in a particularly unique position of vulnerability under the pandemic. As many individuals in this hearing have highlighted today, research tells us that a lack of access to health coverage and inequities in healthcare lead to poor health outcomes. Coverage gaps raise healthcare costs for both hospitals and community from delayed patient care seeking, which can also worsen patient outcomes. Unfortunately, an estimated 120,000 undocumented immigrants residing in Connecticut are prohibited from buying into Access Health Connecticut and are ineligible for Medicaid, Medicare, and other health coverage programs. Even though COVID-19 has exacerbated this pre-pandemic injustice, it is necessary to eliminate disparities in insurance coverage, because if corrective action is not taken, this harm will deepen and continue to persist for generations to come. Immigrants make incredible contributions to our state, but are consistently punished and denied access to human rights, such as basic health care, because of their legal status. In addition to having limited access to healthcare, they are ineligible to participate in other anti-poverty programs such as SNAP and TANF. Throughout the pandemic, undocumented families and mixed status families have been largely excluded from 6 congressional spending bills designed to help residents through the many economic challenges. Connecticut's immigrant workers drive economic growth and contribute more than $120 million in state and local taxes every year, and many are on the front lines of the pandemic. Sadly, they are denied basic human rights and the coverage and protections necessary to avert death, especially during the pandemic. What's more, insured individuals will be more likely to seek testing and treatment and other needed care, which is especially important now more than ever. Everyone should have an opportunity to attain optimal health. Expanding coverage to all residents is the right thing to do and necessary to advance health equity. I'm the daughter of an immigrant, and I'm just so grateful to share space today with such incredible individuals who have elevated their personal stories to underscore the importance of this legislation. We urge members of the committee to honor those stories and pass Senate Bill 956, an act providing medical assistance to certain individuals, regardless of immigration status, with modifications that expand eligibility to all residents. Thank you for your time and consideration.
Thank you, Santa, for staying with us and your testimony. I don't see any questions for you. If I missed somebody, raise your hand. Thank you very much. Have a good night.
Representative Hughes.
Representative Hughes.
I just want to make sure you submitted your testimony, Sana, and those statistics that you cited, and that we have that in writing. Thank you. Thank you. Thank you, Madam Chair.
You're welcome. So I went over to somebody, but I see Angie now. Angie, would you like to give testimony?
Yes, of course. Good evening, everyone. Dear members of the Human Services Committee of Connecticut General Assembly, my name is Angie Hidrobo Castillo. I'm a resident of Danbury, Connecticut, and I'm also undocumented. I stand in support this evening of SB 956, an act providing medical assistance to certain individuals regardless of immigration status. I was born in Cuenca, Ecuador, and migrated to the States when I was 12 years old with my parents and my younger siblings. Most people think that the only barrier that the undocumented community face is access to higher education. Truth is that our community faces multiple barriers trying to access basic human rights like healthcare. My family and I have been living in the United States for over 12 years. And since our arrival, we have always relied on over-the-counter medicine and homemade remedies. Before turning 18 years old, my siblings and I were part of this free children's clinic where we only had access to annual checks up, but nothing beyond that. Throughout my middle school years and my high school years, my parents never visited a doctor or had a yearly checkup. First, because their income didn't allow them to spend beyond rent, food, clothes, and school items, but also because they never qualified for any medical insurance program. On multiple occasions, we had intense stomach, bone, teeth, and muscular pain. But regardless of our pain, we refused to go to the emergency room. We knew that a visit to the ER will leave us in debt, and we didn't have access to any health insurance. So we never had any primary care doctor, but today I'm most concerned about my mother, who's 49 years old, and my father, who's 52. Even though at this moment, my father holds a private healthcare insurance card thanks to his current job, I know that his situation can change in years, months, or days, as he can get laid off or have an accident. My father's situation is very unique, but it's a very unique one. I don't think anyone should wait until they're over 50 for a miracle to happen, as my dad recently got this private health insurance from his construction job. On the other hand, my brother, who's 21 years old, have been recently diagnosed with asthma, which the doctor mentioned that it could be due to the after effects of COVID. His medicine is over $300 and his weekly income is half of the amount. Having access to healthcare will give my family and my community the opportunity to live a long, healthy life, which in no way should be a privilege. Today, I hope that my family's story and my community's one impact you and this committee, the Human Services Committee, and rises SB 956 in favor. Again, I'm in support of SB 956 with clear language to extend Husky eligibility rules to all Connecticut residents regardless of immigration status. And I ask the committee to support this legislation. Thank you.
Thanks, Angie. Let me say, I don't have any questions for you. Thank you for your testimony. Have a good evening.
Thank you, you too.
Sarah Pacino.
Hi, good evening.
Good evening.
Senator Moore, Representative Abercrombie, and members of the Human Services Committee. My name is Sarah Buccino, and I am here to support SB 975. I am a licensed clinical social worker and the manager of social work services at Hartford Healthcare at Home, the largest home care agency in Connecticut. I have worked for Hartford Healthcare for the last 7 years, and during this time, I have observed an increased need for social work services, especially for our Medicaid patients. The Department of Social Services does not reimburse home health social work interventions with Medicaid clients because they are encouraged to utilize DSS workers for linkage to entitlements and benefits. Many home health patients have difficulty accessing DSS in person and via telephone and do not have an assigned worker. Their questions are often left unanswered and their needs unmet. Home health social workers are clinically trained and licensed professionals, not only providing linkage to community resources for basic needs, but also providing psychosocial assessments and treatment plans to meet all patient needs. Home health social workers have an advantage that no other setting can offer, the ability to observe patients in their home environment. Seeing patients where they are the most comfortable allows home health social workers to complete the most comprehensive psychosocial assessments. Home health social workers are highly trained and through observation can skillfully identify unspoken needs and challenges that most likely would not have been uncovered in another setting. With this vantage point, they are also able to identify and timely report any signs of abuse, neglect, or exploitation, which can go unnoticed outside of the home. Without being in the home, items like living conditions, family caregiver interactions, or a food insecurity could also be overlooked and left unaddressed. For this reason, home care social workers are often called upon by colleagues in hospitals, doctors' offices, state-funded programs that are requesting home visits to observe and assess what they cannot. Home health social workers have always been well-equipped to address complex psychosocial needs. Now more than ever, COVID-19 related uncertainties and its aftermath has presented our patients with many more challenges. Crisis situations, grief, PTSD, isolation, anxiety, depression, and really just how to survive. Home care social workers have been able to witness the emotional and social toll of COVID-19 up close and connect these patients to much needed supports, resources, and have helped them adjust to a new sense of normalcy. Hartford Healthcare's home care social workers conduct an average of 60 visits per month to Medicaid patients, which equates to approximately 720 unpaid visits last year. Knowing that our Medicaid patients often have the most complex cases, it is unfortunate that home health providers have never had a reimbursement rate for social work interventions. The value of social work is recognized in other settings as all other mental health professionals are reimbursed for providing social, emotional, and psychological services needed, yet Connecticut home care social workers are not reimbursed for the same or similar services.
Excuse me, your 3 minutes are up. Please summarize.
Yep. For these reasons, I urge you to support SB 957. Thank you.
Thank you, Sarah. I don't see any questions for you. So I just thank you for your testimony. Next, I have Carmen Lachey. Carmen. I see her on the screen. Carmen.
Sí, estoy aquí.
Do you need an interpreter?
Sí.
Sí. Hola, and sí. That's it for me now, please.
Buenas
Don't
noches.
get carried away because it's getting late that I suddenly have, through osmosis, have picked up another language. All right. All right. Is there enough interpreter here?
Sí, I can interpret.
Thank you.
Buenas noches, estimados miembros del Comité de Servicios Humanos de Connecticut.
Good evening to the esteemed members of the Human Services Committee.
Mi nombre es Carmen Lanche. Vivo en la ciudad de Norwalk por 10 años.
My name is Carmen Lanche and I've lived in the city of Norwalk for 10 years.
Soy madre de familia, tengo 2 hijos y un esposo.
I'm the mother of a family. I have 2 children and a husband.
Y vengo a dar mi testimonio a favor de la ley SB 956.
And I'm giving my testimony in favor of the bill SB 956.
Y les voy a contar la historia de mi esposo.
I'm going to tell you my husband's story.
Mi esposo se llama Rodrigo y él tuvo una caída hace 2 años.
My husband is named Rodrigo and 2 years ago he fell. He had a fall.
Se fracturó su pie y su tendón de Aquiles.
He fractured his foot and his Achilles tendon.
Durante todo ese tiempo asistió a las clínicas comunitarias, lo cual le mandaron solamente medicinas para el dolor.
During this time, he was going to community clinics and they were sending him only pain medication.
Cuando se pidió y se insistió en que le mandaran al ortopédico, dijeron que con una bota se le pasaría, pero no fue así.
Perdón, ¿usted puede repetir la última cosa que dijo?
Sí, que le mandaron una bota de protección para que le ayudara, pero no le ayudó para nada.
So when he went they sent him a boot to protect his foot, but it didn't help at all.
En las siguientes citas seguían con lo mismo.
In the following appointments, it was the same.
Hasta que ya han pasado 2 años, mi esposo necesita una cirugía y cada vez que le dan cita para la cirugía le preguntan por su seguro médico.
Until now, it's 2 years later and now he needs surgery, and every time they try to make the appointment for surgery, they ask him for his medical insurance.
El problema se hizo crónico porque se quedó discapacitado para toda su vida.
The problem has become chronic and he will be disabled for the rest of his life.
La fractura que sufrió se le curó, pero no se le formó donde tenía que formarse normalmente. Se le curó, se le salió los tendones para un lado y él tiene mucho dolor hasta ahora.
So the fracture healed, but it didn't heal correctly. So all of the tendons are on one side and he's in a lot of pain.
Él era un esposo amoroso, cuidadoso de su familia y ahora se quedó cojo para toda su vida.
He is very caring, loving husband, and he's going to be in this situation for the rest of his life.
Cada día sale a trabajar y sufre porque como pinta casas, al subirse a las escaleras le da mucho dolor y se le hincha.
Every day he would go to work, he paints houses, and because he has to go up on the ladders, he was in a lot of pain.
Todo esto provocó también que se le dañara su estómago con sus preocupaciones de que no lo operaban su pie.
All of his worries about his foot caused anxiety and stomach problems for him as well.
Ha estado también por año y medio esperando que lo operen de unos quistes, dicen que no es cancerígeno. Cada vez le hacen biopsias, pero le dan largas para operarse porque siempre le preguntan si tiene seguro médico.
So there's things that they're worried about that potentially are carcinogenic, and they want to do surgery, but every time they try to make the appointment, they keep asking for his health insurance.
El sufrimiento no solamente para él, es para toda la familia.
So he's not the only one suffering, the entire family is suffering.
Ayer mismo le hicieron una biopsia, le cortaron una parte de su estómago para ver si todavía no tenía cáncer.
Yesterday they did a biopsy. They cut out part of his stomach to see if he still did not have cancer.
Y ahora con el COVID, pues yo no lo puedo acompañar a sus citas médicas y es muy doloroso para mí verlo sufrir.
And because of COVID, I can't accompany him to his medical appointments, and it's very hard, very painful to see him suffer.
Pienso que a veces en los hospitales piensan más en el dinero que en la salud de la persona.
I think sometimes hospitals are thinking more about money than about the health of people.
Es horroroso ver que cada día mueren personas porque no tienen seguro médico.
It's painful to see every day that people are dying because they don't have medical insurance.
Y esta pandemia lo ha dicho todo. Han muerto muchos inmigrantes latinos y afrodescendientes debido a que no tienen seguro médico.
And this pandemic has shown that there have been many people, many Latino people that have died for lack of medical insurance.
Señora
Ustedes.
Lancha, señora,
Sí.
por favor de resumir su testimonio.
Ustedes como representantes, como políticos, están ahí para hacer el bien por su comunidad. Espero que aprueben esta ley, ya que mucha comunidad inmigrante y no inmigrante la necesita. Seguro médico para todos, sin importar el estatus legal de las personas. Mi nombre es Carmen Lanche y hablo a favor de la ley 956. Y pertenezco a la organización Comunidades Sin Fronteras. Gracias.
You all, as representatives, as politicians, you're responsible for the good of the people. And I urge you to pass the SB 956 bill. And I'm speaking from Communities Without Borders.
Thank you for your testimony. I'm sorry for the journey that you're on and your husband's health. I hope he heals. And I appreciate you sharing the details of what it's been like to go through that, even during COVID, and hoping that we can get to some resolution to address some of these issues that we've heard tonight. So thank you. Are there any other comments?
Dice gracias por su testimonio y se sienta mucho la experiencia que ustedes están experimentando. Espera que se recupera pronto su esposo.
Gracias. Espero que ustedes también hagan y actúen a favor de la comunidad que tanto necesita esa ley.
She said, I thank you, and I hope that you vote in favor of this bill to support the community.
Thank you, Carmen. Good night. Next I'm going to go through the list. It's Jose Sanchez, Laura Garcia.
Yes, I'm here.
Yes, Laura, you can go.
Okay. Hola, buenas noches. Mi nombre es Laura García. Gracias a los miembros del Comité de Servicios Humanos. Buenas noches. Gracias por prestar atención sobre mi testimonio de la importancia de tener hosking para todos.
Good evening. My name is Laura. ¿Puedo traducir? Perdón.
Yes, I'm gonna cut some paragraphs and I'm gonna stop.
Okay. My name is Laura Garcia, and I'm testifying tonight for the Bill SB 956 to pass Husky for immigrants.
Es un tema de derechos humanos. Vivo en Norwalk, Connecticut desde hace 7 años pagando mis taxes como cualquier ciudadana. Hoy estoy aquí no solo por mí, sino representando a varios miembros de nuestro grupo llamado Chapinas Unidas y Unidad Latina en Acción.
So I've been living in Norwalk for 7 years. I pay my taxes, and I'm here representing. ¿Cuál es su grupo, Laura?
Chapinas Unidas.
Chapinas Unidas is the group.
Anuda. Me represento a mí
And
misma,
ULA.
una víctima más. Represento a mi hijo Matías, que murió en mi vientre a las 39 semanas de embarazo.
I'm also here representing my son Matthias, who died was stillborn at 39 weeks of pregnancy.
Represento a esas mujeres que hemos sufrido discriminación por no tener acceso a la salud. En
I'm
noviembre
representing all the women who haven't had, who suffered for not having access to healthcare.
En noviembre pasado mi hijo murió por no ser escuchada.
Last November, my son died for not being heard.
A pesar de eso, tengo que seguir luchando con el dolor de la muerte de mi hijo y con todas las consecuencias que se derivaron debido a una malpraxis durante mi embarazo.
In spite of that, I'm still fighting, even with the pain of losing my son and knowing that it happened because of malpractice during my pregnancy, medical malpractice.
Me quejé muchas veces de síntomas que yo tenía. Por ejemplo, pasé vomitando todo el embarazo y dije que por favor me pudieran dar pastillas. Me mandaron unas pastillas que costaban $1,000 por el seguro médico.
So I had many complaints of symptoms during my pregnancy. For example, I was vomiting a lot during my pregnancy, and I asked for some pills for that. They sent me pills that cost me over $1,000 because I didn't have insurance.
Entonces le dije que yo no podía pagar esas pastillas. Eran $1,000 y me mandaron otras que sí las pude pagar, pero no me funcionaron. Seguí vomitando.
So I said I can't pay $1,000 for pills. So instead they sent me different pills that I could pay for, but they didn't help and I continued vomiting.
Igual tenía muchas cesuras y les dije que si me pudieran mandar algo y lo que me dijeron fue ve a CVS y compra Tums.
When I asked for pills, they said to go to CVS and buy and to get Tums.
Cuando a mí me hicieron el examen de glucosa y me preguntaron si yo quería hacer el examen de síndrome de Down, iba a tener un costo de $700 más porque yo no tengo seguro.
So they told me to go get a test to check about Down syndrome, and they said it would cost over $700 because I didn't have insurance.
Y para mí lo primordial es la salud de mis hijos. Entonces yo dije que sí, que no importaba, que yo iba a pagar ese examen.
The most important thing for me is the health of my children, so I said, yes, of course, I'll pay for that test.
Me hicieron el examen y resulta que perdieron mi sangre. La perdieron. Y cuando regresé a hacerme nuevamente, me dijeron que ya era demasiado tarde para el síndrome de Down y ya no lo podían volver a hacer.
So when they did the test, they found that they said that there was a problem with the blood and it was too late to do the test for the Down syndrome at that point.
They lost my blood test.
Thank you.
Yo también padecía de diabetes gestacional y después me resultaron muchas cosas. Las uñas se me pusieron moradas.
So I had many other symptoms. My nails became bruised.
Y me quejé y en lugar de mandarme a hacer test, lo único que me dijeron fue es frío.
So I complained a lot, but instead of sending me to do tests, en vez de enviarte a hacer pruebas, ¿qué Laura?
They always say, oh, it's for the cold. That's why your nails are purple.
Because it's cold.
Fue algo fuerte para mí y todavía no puedo recuperarme por mi hijo. Estuviera conmigo.
It was really hard for me and I still can't recover from the loss of my son.
Señora García, por favor, resumar su testimonio.
Okay, so I asked for other clinics. I went to America and they say they don't have gynecologists. I don't know how to say that. And
gynecologist.
Yeah, I asked for them and they say they don't account with gynecologists, and I asked to other clinics and they don't do nothing on me too. They do wrong with me only because I don't have insurance. I meet with other girl that she went to the same clinic and she's pregnant, and because she has insurance, she complained about this terrible clinic. It's a community clinic, and she complained with her insurance and they changed her clinic because she have insurance. And it's not fair that now my son is here only because I don't have insurance, because they don't listen to me when I complain all the time, just because I don't have insurance and because I don't have the money, I don't have the status. It's not fair that my kid is here now. So please, we don't deserve this. We don't deserve that our kids dying because they don't listen to us. I went to so many places. I asked for help and nobody listened to me until my kid died, and I almost died too. Thank you so much.
If I can just correct a translation that was made earlier because it will help give more context. She suffered from gestational diabetes and preeclampsia, which is why she had fetal demise.
Thank you. I'm so, there are mothers on here, there are fathers, grands, I have great grands. I'm so sorry for your loss and what you had to go through, and that if it could have been avoidable if you had insurance. You know, all these stories combined really give a story of healthcare in the United States in the year 2021, what people have gone through. And I totally understand that some people are undocumented, but we are human, and many of these people that we've talked to today have talked about paying into systems. They pay their taxes, they contribute to society, and I don't know where these places are, where people are going to and they're being treated, but you know, it breaks my heart to hear that this is taking place in 2021 in Connecticut. I'm really sorry for your loss, and I know we have to do better. We have to do better. Representative,
I just wanted to ask the name of your baby.
It's Matias. So I just want to say that for him and so many other babies that probably their moms are not like me and don't have the first to say what is happening, but it's not, because it's not only me. I know so many women that they went to the same clinic and they treat really bad. They treat really bad. They don't care. So please, because I don't want to see any more moms suffering what I'm suffering now, with my kid next to my bed, no life in one urn like this. Thank you so much.
Thank you
thank you, Laura, for sharing.
Thank you.
Representative Hughes for that. Okay. Is there a Byron Arvello?
Yes, I'm here.
Yes, you're next, Brian.
Okay. Thank you for having me here. Thank you for staying late. I know it's late. It's been a long day. My background is to have my mom, my dad, and my sister. They're here just supporting me like always. To make sure, my name is Byron. I'm from Danbury, Connecticut. I'm in favor of this bill that's gonna help us with a husky for immigrants. A little about me. I belong to the class of 2020 with a major of biochemistry, ACA's approval, and a minor on mathematics. I graduated from Western Connecticut State University, and I'm currently doing my master's on Rutgers University and I'm doing my research on the public health research institute in Newark, New Jersey. My research is about DNA. We're trying to find mechanisms of how DNA gets transferred from the membranes. The reason why I'm talking about my life is because I've been in school all my life, and I have to pay for the insurance every year. In order to be in school, you are forced to pay insurance. Therefore, I've been paying $3,000 yearly for private insurance. Only my master's program is $50,000. So you can estimate how much I pay for insurance. This is my 6th year in the university. Working today on the Research Public Center on Newark, New Jersey, working with science. I never thought how important it was to have insurance until this pandemic. I always only paid insurance. Sometimes I don't even use, but I still have to pay in order to be at school, in order to be at the school. I get tested for COVID every week. My mom, dad, sister, they cannot even get tested because they don't have insurance. However, we've been filing taxes yearly as a family. My dad works as a truck driver and moving hay. He's a countryman. The hay has given him some fungi infections on the skin. My mom, it will go through endoscopy from the anus and the mouth this month. My sister works in a nail spa, trying to make women look beautiful with the nails. They're exposed to COVID every year, every day. And I don't think it's fair for us to not have insurance as a student. As a science, I think this is a huge topic something that needs to be changed, because health insurance should not be a problem today. The problem should be right now fighting with disease, research, trying to ways to improve the economy, and not having to worry about insurance.
Excuse me, please. Your 3 minutes are up. Please summarize.
Thank you for listening to me. I will get vaccinated on March 26th from COVID. My mom, dad, sister, they will not. Lastly, my sister was born with her lip and the palate. Her palate and lip are broken. She cannot even afford for a treatment. This is my reason. This is my reason why I'm applying for dental school. I still have 4 more years to go for dental school, and I still have to pay yearly $3,000 for my health insurance. You can change this today and help me to accomplish my dream and my family's health. Thank you.
Thank you. Thank you, Byron. First of all, congratulations to be at Rutgers and going to school. That opportunity, thank you for that. And hopefully we'll be able to change something. Your family must be very proud of you.
Oh, yes, thank you.
Don't give up. Don't give up. Help is on the way. All right. Thank you. Next is Catherine Kennedy.
Yes, good evening, Senator Moore, Representative Abercrombie, and members of the Human Services Committee. My name is Catherine Kennedy, and I'm a physician. I work in New Haven and reside in Brantford. I'm testifying in support of SB 956, provided there's clear language that extends eligibility for all Husky programs to income-eligible Connecticut residents, regardless of immigration status. I know the hour is late. I'm one of the last people here. And so as this public hearing draws to a close, I'm confident that you and everyone watching have had your hearts and minds opened by the courageous and heartbreaking testimonies we've all witnessed. After today, I'm hopeful that all of you will believe, as I do, that access to healthcare is a human right, that all people, young and old, are entitled to healthcare that includes preventive care services like vaccines and health screenings, and also specialized care to prevent minor health problems from becoming major health crises. So now that your hearts are open, the next step, as I see it, is to open your wallets, and obviously not your personal wallets. But what I'm asking you to do is to open a pathway for Connecticut to fund this critical bill. I say this because in 2019, similar legislation failed because that fiscal note was too high. I just want to highlight some numbers that have been shared earlier today. Commissioner Gifford testified that the cost for this Husky expansion would be around $190 million per year. She also mentioned a $50 million fund available for targeted Medicaid expansion efforts. We also heard other testimonies how undocumented Connecticut residents pay state taxes of $145 million annually. I just find it amazing that $145 million plus $50 million adds up to $195 million, and that's just a bit more than the cost estimate projected by Commissioner Gifford of $190 million. So I would suggest perhaps that a solution would be the most equitable pathway would be to use the state taxes generated by undocumented people here in Connecticut, plus the special Medicaid expansion fund to pay for this bill. We also have another potential pathway that emerged today when we learned that Connecticut will be the recipient of $10 billion as part of the federal COVID-19 relief package. Since SB 956 is only going to cost $190 million, can't we find a way to pay for this bill out of that $10 billion? In closing, if there are any lessons that I've learned during this pandemic, it's these. As a state, we are only as healthy as our least healthy members. And as a society, we are judged by how we care for our most vulnerable citizens and residents. And I honestly can't imagine any group more vulnerable than low-income, undocumented children and their families. And so I urge the Human Services Committee to please don't let this bill die in committee. Please add clarifying language to include all undocumented income eligible Connecticut residents. And please advance SB 956 out of this committee. Again, thank you so much for staying so late to hear all of us. Thank you.
Thank you, Catherine. Very well said. Very well said. And it's early. It's early. So we thank you for staying with us to give that testimony. I don't see any questions. So I'm going to call on Rosanna Ferraro.
Hi, good evening, chairs and members of the Human Service Committee. Thank you for the opportunity to testify in support of Senate Bill 956. I'm Rosanna G. Ferraro, and I'm the Policy and Program Officer at Universal Healthcare Foundation of Connecticut. I know it's been a long day for all of you, and I appreciate your time. At Universal, we believe healthcare is a human right, as you've heard many times today. And when we say universal, we mean everybody. Everybody should have access to quality, affordable, equitable healthcare, regardless of immigration status, especially now during a pandemic. When we say all immigrants should be covered under Husky programs, we also include all who are currently excluded, undocumented immigrants and adults who have been here less than 5 years. Undocumented immigrants are currently locked out of our private and public healthcare coverage system with terrible results, as you've heard here today. Opening up Husky programs is just one way we can ensure undocumented immigrants have access to coverage and care. Here at Universal, we've heard the story of a middle-aged, undocumented Hispanic man from Meriden. He lives in fear that he will only be able to receive medical attention if his life is at risk, and that he might develop a sickness that can become more severe with time because he lacks healthcare access and coverage. This is cruel, but a reality for many undocumented immigrants, and worse, as you've heard today. Black and Brown communities are hit hardest by the pandemic for a variety of reasons, including that Black and Brown people are being disproportionately in essential frontline jobs and are disproportionately suffering from conditions that can worsen COVID-19 infection. The crisis is a wake-up call for our healthcare system to change. It's time we start to think differently regarding healthcare and move towards keeping all Americans healthy, documented or not. The undocumented population in Connecticut has an uninsured rate of 52% in 2018. Comparatively, in 2018, Connecticut had a 6.3% uninsured rate. That is a substantial disparity. Expanding Husky programs to all, regardless of immigration status, would help address this disparity and bring us a step closer to health equity. For years, Husky has worked efficiently and effectively, providing low-income families access to health coverage with no cost sharing. This lack of cost sharing is critical to access because low-income families do not have the financial resources to afford healthcare coverage otherwise. By supporting the expansion of Husky for All, regardless of immigration status, Connecticut can take one step closer to universal healthcare. Please support this important legislation. It is not only the right thing to do, but the only way forward. Thank you again for your time.
Thank you, Rosanna. Any questions? Thank you. Next is Rosa Jimenez.
Buenas noches. Necesito a alguien que me traduzca, por favor.
Good evening. I need someone to translate, which I will do. Con gusto lo haré.
Thank you.
Buenas noches, mi nombre es Rosa Jiménez. Resido en New Haven, soy miembro de Unidad Latina en Acción, soy líder de mi iglesia y miembro de Connect.
Hi, my name is Rosa Jimenez. I'm a resident of New Haven and a member of Unidad Latina en Acción and also a member of my local church.
Soy madre de 2 hermosos hijos, me dedico a trabajo limpiando casas y resido 18 años aquí en Connecticut.
I'm a mother, I am a domestic worker, and I've been a resident of Connecticut for 18 years.
Mi petición sería que aprueben el proyecto de ley 956 para la atención gratuita, que sería de derecho humano para todos y que nos cambiaría la vida al 1000% a todos los inmigrantes.
And my request is that you pass SB 956 to make healthcare free and a human right for all immigrants, because it would change the lives of many of us.
Seré breve en decir lo que me ha sucedido y en qué ha impactado al no tener seguro médico aquí en este país.
I'm going to be brief about how this has impacted me. I don't have medical insurance.
Hace 3 años me detectaron arritmia cardíaca, en el cual porque no he tenido ni el dinero ni el seguro no me he podido operar.
And recently I had a visit to the emergency room for a cardiac issue, and I did not have money to pay for it.
Varias veces he ido a emergencia porque me dan seguido las crisis. Y ahora últimamente el doctor ya me dijo que es lo último que me tengo que operar. Y ahora estoy buscando por distintos medios para poderme operar. Pero es muy difícil el no tener un seguro médico.
And I've gone to the ER various times for these types of crises, and the physicians there always, tell me that I need to get the operation, but because I don't have health insurance and I can't pay for this operation because it's thousands of dollars, this has greatly impacted my health.
Yo estoy en este país desde el primer día que pisé esa tierra y agradezco a Dios y agradezco a este país. He pagado mis taxes como una persona que hubiese nacido en este país.
Ever since the first day that I walked on this land in the United States, I have paid my taxes.
Pero nunca a mí me han devuelto dinero para atrás. O sea, siempre pues he hecho mis taxes y aunque estoy por debajo de la línea de no ganar mucho dinero, nunca me han devuelto dinero a mí por mi hija.
And despite me paying my taxes and being under the income limit, I've never gotten money back from paying my taxes.
Solo le pediría a la senadora y a todas las personas que están al frente de esto que nos tomaran en cuenta. Créanme que nosotros venimos a este país no a ser una carga, sino a trabajar y a salir en adelante, porque desgraciadamente en nuestros países no tenemos esa oportunidad.
And I just asked the senator and everyone here who's listening that they please approve insurance for us and take our stories into account.
Espero que mi testimonio llegue a muchas personas que estamos hoy aquí en esta reunión y que nos ayuden. Primeramente oremos al Señor para que ustedes les guíen y se toquen el corazón y nos ayuden en esto, que nos beneficiaría a muchas personas que estamos aquí.
And I hope that all the people who are listening today know how much that this would change our lives and that it touches your hearts and allows you to make the decision to vote yes on this legislation.
Yo les agradezco mucho por el tiempo y por escucharme mi testimonio. Dios les bendiga grandemente y Dios bendiga a Estados Unidos por la oportunidad que nos dan de estar en este país.
I thank you guys for your time, and I'm thankful for being able to be here in this country, and I hope you all have a good night.
Thank you, Rosa. I don't see any questions for you. Thank you.
No veo ninguna pregunta para usted.
Gracias.
The next is George Centelas.
Yep.
Hi, George.
Hello.
Hi.
Good evening, dear members of the Human Service Committee. My name is Jorge Centelas, and I'm a student at Eastern Connecticut State University. I'm also a DACA recipient, and I stand in support of SB 956, the act providing medical assistance to certain individuals, regardless of their immigration status. Now, as a child, healthcare to me has always been associated with something that's unattainable if you don't have the financial means for it. A privilege many people have that I never did or had growing up. And I knew my family was not the most financially secure at the time. And because of this, there were moments where I would hide my injuries, my cuts, my sicknesses, and other forms of pain because I did not want to put that burden of high cost on my family. And I did this because I knew my family thought that just by ignoring these issues, ignoring the fact that they don't have insurance and to just work twice as hard and pay out of pocket, they could afford to support their children's health. It was a priority. And all the stories you've heard today is a result of that. And I knew the extent they were willing to go for me and my siblings. However, this idea of throwing more money at a problem and hoping for a solution doesn't work or isn't realistic. Doctors are human and they aren't perfect. You cannot expect something to be cured or fixed just by throwing more money at the problem and hoping it's enough. The high cost for treatments would at times even fail. Medical and health sciences is very complex and it isn't so simple. And because of this, in those moments, once they did pay the high amounts and it didn't lead to what they hoped for, at that point, the money isn't really a priority to them. What matters to them is if their loved one is all right, if they're okay. Everything else just doesn't matter to them. And we can't really, solve what science or doctors can do, but what we can control, what we can help is help support and alleviate that pressure that they have to make sure that when they fall, they have something to fall back on, a safety net. And Senator, my family is hardworking. They work just as hard as anyone else's family, yet they don't receive these same benefits that so many others are so fortunate enough to have. Healthcare is a human right, and I was mistaken to think of it as anything less. And I know this bill will support many people who are in need of such help, and I know it would have such an immense impact and positiveness in their lives. Thank you for your time. Thank you for listening to everyone's testimonies and stories. Thank you.
Thank you, George. I have no questions, so thank you. Have a good evening. So we're going to go back, and there's a couple people waiting. Jamie Myers McPhail. Jamie? Jamie? Okay, I'll go to Greg Myers and then I'll come back to Jamie. Or is that one and the same? Jamie or Greg? I see you both on the screen, but I can't hear you.
There we go. Can you hear me?
I can.
So should I give my testimony now?
Yes, please.
All right. I'm giving my testimony in support of 6560. Good evening, Senator Moore, Representative Abercrombie, and members of this committee. My name is Gregory Myers, and I've been a healthcare provider for over 20 years. My aunt is a nurse. My mother retired as a nurse, and my grandmother retired from Hartford Hospital as nursing staff. So you can kind of say that this is a family business and it runs in the family. I like helping people and being there for a person in their time of need. Currently, I care for a friend of mine from high school who got into an accident a few years ago. I bathe my consumer, check his wounds, cook, clean, and feed and groom him as well. I'm currently working nearly 80 hours per week because of all the PCAs have COVID or have quit. But supporting a family of 9 on a PCA's wages at $16.25 an hour is no small feat. You have to budget or someone may not eat. Since getting paid by Allied starting in 2019, I've had frequent problems, but this year, the problem becomes unbearable. Last month, I went 3 weeks without pay. I was owed 255 hours at one point, and it became a physical and mental strain upon me. I went 2 days without eating because I had no money. Ally owed me thousands of dollars, and I couldn't even get a hamburger or a sandwich. I was physically weak. I couldn't even catch the bus, as a matter of fact, because I had no money, and it was forcing me to walk to work, doing double shifts for 6 days a week. To this day, Ally still owes me 1 week of pay. Ally tells me they sent my payment to a closed account. My bank tells me that they've returned it to Allied, but Allied says that they've never received the check back. And in the meantime, where does that leave me? As a PCA, we deserve better. We provide comfort and assurance for our consumers, and yet we can't care for ourselves or our families. If we aren't paid for our week of work, it makes it very hard. So please, House Bill 6560, thank you for your time.
Thank you. Great.
Have a good evening.
You also. I don't see any questions for you. Greg, are you still having that problem though, where you haven't received your pay?
Yeah, I haven't received 85 hours yet, and one of my payrolls was a mistake. I put the 21st twice on the payroll, so they owe me 16 hours on that stub, and I'm trying to think. I think that's it, and hopefully I'll get paid tomorrow.
Okay,
I just got
all
a
right.
message. Hold on a second. It like paused you out. I couldn't even hear you.
Thank you, Greg.
You're welcome. Thank you.
All right, bye. Next is, let me get my bearings here. I think it's Caroline. Caroline, are you there?
Yes, I'm here. Hold on. Let me get to a place where I can turn on my camera. Hi. Hello. Thank you all for staying this late and listening to your testimony. My name is Carolina Boitoleta, and I'm here to testify in support of SB 956.
So wait, you're a twin, aren't you, Caroline?
Yeah.
Your sister was on earlier, so you're not on twice.
Different story. Yeah, my sister testified many hours ago.
Good evening.
Thank you all for staying this late. I really do appreciate it. I am undocumented. I lived in Danbury and Brookfield since 1998. I support expanding access to Husky to undocumented immigrants because I know firsthand the emotional, financial, and health toll that lack of access to health insurance has on individuals and families. Like I said, I'm undocumented, and in 2014, I had a medical issue. I had sudden severe stomach pain. That was the result of a stomach obstruction, and overnight my stomach ruptured. I was put in a medically induced coma, and I only learned what happened to me after I woke up in the ICU 2 weeks later, full of tubes and surgical scars. It was several weeks before I was lucid enough to think to myself, oh my God, how is my family going to pay for this? But I imagined that this financial aspect of it was always on my parents' minds. I spent over 7 months in the hospital before being discharged. Payment for my care came in many forms. GoFundMe, Zumba fundraisers, free care or charity care from the hospital. And thankfully, because I had a life and death situation, I qualified for emergency Medicaid. But once I left the hospital and my medical care was no longer life and death, I could no longer qualify for emergency Medicaid. But I still had a lot of medical needs. When I was discharged from the hospital after 9 open abdominal surgeries and dozens of invasive procedures, I couldn't eat or drink anything, and instead I was fed by a feeding tube into my abdomen and a permanent IV in my arm. And each came with the onset of a feeding tube and a pump, and I also in formula to go through the pump and go through my feeding tube. And I still had an open wound on my abdomen, which I won't describe. And I had 3 more bags, drains, and tubes into my abdomen to capture various kinds of fluid and output that were the result of the surgeries. That's a lot of medical equipment and a lot of medical upkeep for someone with no insurance who had to rely on hospital charity care. I stay in this limbo, unable to eat or drink anything for the next 2.5 years. In order for me to be able to eat and drink again, I needed to have a surgery, but the surgery was complicated, and there was no surgeon in the hospital where I qualified for charity care who was willing to perform the surgery. And since I didn't have insurance, I couldn't look for a specialist who could do the surgery. So for 2.5 years, I languished, unable to eat or drink, attached to a wall with a still open surgical wound on my abdomen. I don't like to think about how my lack of status or my lack of insurance kept me in the state of limbo, but sometimes I wonder if my lack of insurance and my status kept me from receiving the care I needed, and how those 2.5 painful years full of grief and sadness could have been avoided if I had access to care to put me back together again. One moment that sticks out in my mind is, for those of you who don't know,
Excuse me, I'm sorry to interrupt. Your 3 minutes are up. Please summarize.
I'll be quick. For those of you who don't know, a feeding tube it's the size of a pen and it goes into your abdomen. It's like a pliable tube. And one day after many years when I had this tube, a crack developed in it so that anytime I had to put water in it, it will leak. And I had to put my finger on the hole in the tube so that the water would not leak. I told my providers this, hoping they would change the tube, and they said, just keep watch on it. One day, I was tired of keeping watch on it, and I decided to get some super glue to put on the tube in my feeding tube so that it wouldn't leak anymore. And then it stopped leaking. But no one should have to use super glue to fix the medical equipment when it's something that could be easily fixed. And that's why I support SB 956. Thank you.
Thank you, Carolina. And you all have done a wonderful job of staying the course and fighting the good fight. So thank you. Let me see if there's any Yes, Rep. Dathan.
Thank you very much, Madam Chair, and thank you, Carolina, for coming back to the committee. I know you've been a couple times and your story is very compelling. Just wanted to check with you. If you would have, when you first started experiencing symptoms, what prevented you from going to get treatment? Was it lack of insurance?
My symptoms that started this whole thing was very sudden. It literally started one day, and 24 hours later, I was in a coma in the hospital. So it wasn't really anything that could have been prevented.
Okay, and no symptoms before that you would have been able to try to get treatment a little earlier?
Not until it was too late.
No, it was too late. Well, thank you for your fight, and I'm sorry, being a young person and having to go all through what you've gone through is horrendous, and I'm sure it's been a disruption on your studies, your family's work, and everything. And so I commend you for having the strength and energy to fight for this. So thank you for coming to testify today. Thank you, Madam Chair.
I will say that 6 months after I got health insurance, I was able to have the surgery to fix me, and I was able to eat and drink again after 2.5 years.
Oh, wow.
So
What
it was very easy to fix once I had insurance.
Yeah. Well, I'm so glad to hear that, Carolina. And you take care and keep up the good health. Thanks a lot. And thank you, Madam Chair.
You're welcome. Thank you, Carolina. The next is Stephanie Melgar Montoya.
Hi,
Hi, Stephanie.
good afternoon.
Do you need an interpreter?
Yes, please.
Estoy aquí.
Ok. Buenas noches, queridos, estimado Comité de Servicios Humanos de la Asamblea General de Connecticut.
Good evening, members, esteemed members of the Human Services Committee of Connecticut.
Mi nombre es Stephanie Melgar Montoya, soy una estudiante de Stanford High School, soy indocumentada.
My name is Stephanie Melgar Montoya. I am a student from Stanford High School, and I am undocumented.
Estoy a favor de la ley 956. Es una ley que proporciona asistencia médica a ciertos individuos sin importar el estatus de inmigración, con un lenguaje claro que extiende la elegibilidad de todos los programas de Husky a todos los residentes de Connecticut, sin importar su estatus inmigratorio.
And I am in favor of SB 956, which is a law that will be providing medical assistance to individuals regardless of their immigration status, with modifications that will allow it to extend to all CT residents, regardless of status.
Tengo 20 años, he estado viviendo en Stanford durante 2 años, soy un estudiante de último año en Stanford High School. Mis padres y mis hermanos llegaron hace 4 meses, somos de Perú y venir fue un gran cambio en nuestras vidas, pero todo eso en busca de un futuro mejor.
I'm 20 years old. I've been living in Stanford for the past 2 years, and I'm a senior in Stanford High School. My parents and my brothers arrived 4 months ago. We're from Peru. And coming here was a huge change in our lives, but everything was in search of a better future.
Cuando era pequeña me diagnosticaron problemas cardíacos. Estos eran soplo cardíaco levemente grande, el síndrome de Wolff-Parkinson-White y la anomalía de Epstein.
When I was a child, I was diagnosed with many heart problems. This includes a large heart murmur, Wolff-Parkinson's-White syndrome, and Epstein anomaly.
Siempre estuve en chequeos, electros, ecocardiogramas. Cuando tenía 11 años me hicieron un cateterismo cardíaco para cerrar el soplo de mi corazón y afortunadamente ese soplo se cerró.
I have always gotten checkups, EKGs, echoes. When I was 11, I had a catheter placed to close a murmur in my heart, and fortunately that murmur did close.
Pero lo que más me afectó en ese momento fue el síndrome de Wolff-Parkinson-White. Tuve muchas taquicardias que incluso me terminé en el hospital. A los 15 años me operaron del síndrome de Wolff-Parkinson-White en Lima, en la capital de mi país.
What has most affected me is Wolff-Parkinson's-White syndrome. I've had many tachycardias that I've ended up in the hospital for, and at 15 I had an operation for that syndrome in Lima.
Esa operación fue muy cara. Mi padre pagó solamente una parte, una pequeña parte, y el resto lo cubría mi seguro. Todo salió bien hasta unos pocos meses que volví a padecer este síndrome. Las taquicardias ya no eran tan fuertes, pero me dijeron que tenía que volverme a operar.
So that operation was really expensive. My father paid only a part of it, and the rest was covered by my insurance, and everything went well until a few months when the syndrome reappeared, and the tachycardias were so strong that they said I would have to get operated again.
A los 16 años me lo vieron operar, pero lamentablemente no funcionó porque reapareció.
And then at 16, they operated on me again, and it didn't work, and it came back.
Pero en los chequeos que me hicieron aquí, parecía que el síndrome de Wolff-Parkinson-White ya no estaba allí.
But from the checkups that I got here, it seemed like the Wolff-Parkinson-White syndrome was no longer there.
Pero ahora el médico me habló de la anomalía de Epstein y lo importante que era que me operara o podía correr algún riesgo si la anomalía crecía.
But now the doctor is telling me that it's the Epstein anomaly that I have that's important, and it was that he operated on me, or he would need to operate, or I could run some risk of that the anomaly would grow.
Esto no lo sabía ya que en mi país no me lo habían dicho, ni me habían hecho unas pruebas que aquí sí.
And this was something I didn't know from when I was in my country, and they didn't do any tests about that, but here they did.
Me dijo que la anomalía de Epstein era muy peculiar. Había pocos casos así y también me explicó que esta era que la operación era a corazón abierto y que los únicos lugares donde me podía hacer era en Columbia Hospital, New York City, y en Yale New Haven Hospital.
And he also explained that this operation would be open heart surgery, and the only places that it could be done were at Columbia Hospital and Yale New Haven Hospital.
Cuando me enteré me derrumbé.
Señorita Montoya, señorita, favor de resumir su testimonio, por favor.
Ok. Cuando me enteré de la operación estaba derrumbada y estaba muy asustada. No era solo el miedo de que la operación saliera bien, sino también el miedo de que cómo podría hacerme esa operación.
So when I found that out, I got really scared. It wasn't just a fear of the operation, whether it be successful or not. It was also the fear of not having the financial support and how the operation would turn out for me.
Solo tengo ayuda económica en Stanford y esos lugares no es muy difícil encontrar ayuda y tampoco aplico para Husky.
I only have the financial aid from Stanford, and I'm looking for other financial aid in 2 other places, and it's very difficult because this operation is very expensive, and I can't have Husky because I'm undocumented.
Por suerte, todavía ya ha pasado más de un año y todavía sigo buscando algún tipo de ayuda.
And it's been almost a year, and I still can't find any help, and I'm still looking for it.
I'm going to ask her to wrap, just to give us one last sentence, please.
Okay, una frase más dice, en resumen.
Ok. Mi hermana también sufre de anemia roja, pero ella sí tiene Husky, pero dentro de 3 años parece que se lo pueden quitar. Y por eso yo pido que es tan importante que todos tengan Husky, ya que es una ayuda entre humanos. Esto es es una ayuda entre humanos en momentos difíciles y delicados, ya que la salud es un derecho fundamental, pero a veces es poco accesible y muy cara.
My sister also suffers from red cell aplasia, and thanks to Husky, she is being treated at Yale New Haven Hospital, and that in 3 years when she turns 18, that will be taken away from her. And so in the case of my family and myself, this is why I think it's important to give Husky to all immigrants. Health is a fundamental right, but it's sometimes very accessible. It's very expensive and not very accessible for immigrants, and it would really be helpful to us and others in difficult and delicate moments in our lives. Thank you.
Thank you.
Thank you for her testimony. And, I don't realize how blessed a lot of us are with no ailments at all, for her to be so young and had been on this journey. So thank you.
Gracias por el testimonio, y muchos de nosotros no sabemos que tenemos una bendición como para no tener enfermedades. Y tú siendo tan joven, teniendo que enfrentar esas enfermedades es muy difícil.
Yeah.
Thank you.
Thank you.
Thank you. Okay, so Lisa Bergman.
Good evening, members of the committee. Thank you so much again for staying this late and for hearing all of our testimonies. I also just want to applaud the courage of all the folks who are testifying today, who are undocumented, sharing their stories. It's extremely moving. So thank you to everybody who's involved in this project. My name is Lisa Bergman. I live at 49 Livingston Street in New Haven, Connecticut. I'm testifying today as a member of the Connecticut Communist Party Winchester New Hallville Club in New Haven, and I stand in full support of SB 956, and I urge the members of the committee to do the same. I work in the healthcare field, supporting unionized food service workers in Connecticut in accessing health benefits. Many of these workers are undocumented. They are paying the same exact amount in taxes as their coworkers who were born in this country. However, they are unable to access state health programs such as Husky. During this past year, nearly all of the workers that I support in my job were laid off. I was able to support some workers in transitioning to Husky when they lost their jobs. However, the undocumented workers could not qualify for Husky and were left with no insurance once their employer stopped paying for their coverage. In these cases, I searched for free clinics for these members, but many free clinics are only open for limited hours or only on Saturdays and do not have specialized care that is needed for common chronic conditions such as diabetes and cancer. Many of these members who were undocumented ended up in the hospital soon after their coverage ended due to lack of access to their medication or other routine care. Beyond the unionized workforce, our undocumented community is usually doing the hardest jobs that include the fewest employer-paid benefits. This is the community that needs Husky the most. If our undocumented neighbors lack access to care for COVID, STIs, cancer, diabetes, hypertension, and other chronic conditions, our whole community is at higher risk for these illnesses. If SB 956 is passed, it would make our entire state safer for everyone. I support SB number 956 with the clear language to extend current Husky eligibility rules to all Connecticut residents, regardless of immigration status, and I ask the committee to do the same. Thank you so much for your time and have a great evening.
Thank you. Heather, is there anyone else? Don't leave me yet. Lisa, is there anyone else, Heather?
Just if you wouldn't mind calling Jamie Myers McPhail one more time, see if she can unmute herself.
Okay. I guess not. So, Lisa, you're the last one. What's your wish? You get a wish.
I wish for the bill to be passed.
Sprinkling dust. Thank you so much.
To the bitter end.
Thank you. All right, so I don't have anybody else on the screen left, and I want to thank everybody who was able to hang in here with us and come and go. I know how busy we are and going back and forth between the two, but I'm so glad that I got to hear like 90% of what people are going through in Connecticut, and I understand finance and what it costs, and I look at the cost of healthcare and what it costs us on the other side, and I think about these lives and how courageous. I mean, I don't know if I were undocumented that I would be so bold and brave to stand before people, have my face out there, my name, to speak up for what I believe in. But that's what people do when they ride hard and they believe in what they do. And they're not just doing it for themselves, but for other people also, and for generations. So I salute them no matter what the outcome is. I got to give them their kudos for being able to stand up and tell those stories and talk about their lives and how much they're suffering, and they continue on. So I thank everybody for coming on, giving their testimony, and I thank Representative Abercrombie for helping me do this, and Representative Garibay for sitting in for me during this hearing. If anybody has anything to say, now's the time. I'm getting ready to go have some dinner. Representative Wood, did you want to say something?
Oh, just thank you.
All right, then, for the good of the order.
Thank you,
Good night.
Madam Chair.
I move we adjourn.
Can I get a second and a third?
Second and a third.
Fourth.
Representative Master Francesco, I didn't hear from you. Come on.
It was a pleasure today listening. I didn't ask a lot of questions, but I was listening, I would say about 80% of the time. I was in between meetings, so good
All right.
forum today. Thank you.
Thank you. Good night, everybody.
Thanks, everybody.
Thank you,
Good night.
Heather.
Thank
Thank you to
you.
the interpreters.
Thank
You
you.
did a wonderful
interpreters.
job. That's
Thank
wonderful.
you, Heather, for
Thank you,
doing a
Heather.
great job.
Yeah,
We
thanks,
really
Heather.
appreciate it. And thank you, Lutz, for taking
And Luz
Moose as
also.
well.
Thank
Thank
you
you.
all. We couldn't do this
Yeah.
without you.
Welcome.
Thank
All
you.
right.
Well done.
Good night, everyone.
Thank you all.
Night.
Bye-bye.
Good night.